construction site and workers are not wearing face coverings, they're going to say, let's get the face coverings on right now. And if they see it happening, there's no problem, we move on. If we don't see compliance, of course, we reserve the right, if we need to use fines, if we need to take even more aggressive actions, we can. It's not what we want to do. We just want to solve problems. We just want to get these businesses up and running. We want to protect health and safety. If we can do that together the right way, that is absolutely the goal. And I believe overwhelmingly that's going to be what will happen. Okay, that's phase one. We're going to have a lot more to say on it, I assure you, over the next days, because we're still not there yet. I believe all indicators suggest it'll be announced in the first or second week in June. Businesses are paying attention. They're hearing from the state, they're hearing from the city, they're seeing that this is all coming down to this, so they have time to get ready. But we're going to work very closely with them to make sure all the details get worked out. But some of it will only get worked out once businesses are actually on the ground and open, and that's okay. We know we'll work it through in practice. That's phase one. Now, at the same time as we're getting ready to begin phase one, we're already looking ahead to the phases that will come thereafter. And one of the things I'm hearing the most from business leaders about is they're paying a lot of attention to what will happen with our schools, because that will say so much to them about obviously how the city is doing in general, but also if their employees can depend on sending their kids back to school in September, and that will tell them a lot about their business planning as well. We are doing work every single day, and I've said it really clearly. It's going to be a plan A to reopen school as normal, but with lots of other alternative plans depending on what the healthcare situation is. There'll be a plan B, C, D, I assure you. We are adamant, though, we want to work with the hope that we can get as close to a normal school reopening as possible for September 10th. We had a great conversation last night with our Education Advisory Council. Now, this involves a lot of key stakeholders in our public schools, folks in the Department of Education, the unions who represent the people who do the work of education, parent organizations, but also beyond our public schools, religious schools, private and independent schools. Higher education is represented by some of the leaders of the great higher education institutions in this city. We're all talking together about what it's going to take, and many, many organizations as well that provide support for our kids and our youth in a variety of ways. Everyone thinking together, what do we got to do this summer to get kids ready? What we got to do educationally, what do we got to do in terms of their health and their mental health, not just their physical health, their mental health. How do we hit the ground running in September? Incredibly good thinking going on, and more scenarios than you could count that people are preparing for, because we know it's the right thing to do for our kids to be ready and be ready to make quick moves depending on what happens with the healthcare situation. But I'm telling you, it's also going to be crucial to everything in Restart, everything in our economic recovery, to get the school equation right. So that conversation keeps happening every day, and I'm so thankful to all the members of that advisory council who are putting a lot of time and energy into helping us get it right and helping us figure out what will really work. Okay, now, we're thinking about where we move ahead. We're thinking about how we create a change for everyone in this city. And we're always thinking about the impact this crisis is having on the most vulnerable New Yorkers. So we plan to help everyone. The planning is universal. At the same time, we know some people are bearing the brunt. We know some people are particularly vulnerable. And certainly every day, but particularly in a crisis, homeless New Yorkers are vulnerable. So let's talk about what we have learned about this new effort in the subway system, the nightly cleaning, and the impact it has had on our ability to serve the homeless. We now have 3 full weeks of data, 3 full weeks of evidence, and it's pretty striking. So I want to give you an update. Since the beginning of the nighttime cleaning shutdowns, we have had 1,700 individuals accept help, 1,700 encounters that led to a homeless person accepting help. 506 unique individuals, so that means not multiple times, but people who specifically took help. 506 unique individuals accepted placement in shelter for some period of time. 281 are still in shelter right now. Now again, for all of us who have worked on these issues for a long time, 281 people have come off the street in just the last 3 weeks, and staying off the street is a remarkable number. And that is a beginning of something much bigger as we seek to end permanent street homelessness in this city. Very importantly, another 432 accepted hospital care to address medical situations. That's huge. So something in the midst of this crisis, in the midst of all the pain, all the challenges, something actually good has happened here where we're finding a new way to serve homeless New Yorkers, and a lot of them are accepting the offer and hopefully are well on their way now to changing their lives and living on the streets again. Now, I talked about some of the most vulnerable among us. I'll tell you, and this is another issue I've worked on for a long time, there's nothing more important to me than our children. This is what so much of the work of this administration has been about. And some kids deal with particularly tough circumstances. Some kids have to deal with, in their own homes, threats to them. And this is where our Administration for Children's Services comes in, and they do amazing work. And I want to highlight them today because they don't get enough attention, they don't get enough appreciation in any time. But I got to tell you how hard it has been for our ACS workers who go out there, our child protective specialists, the folks who focus their lives on protecting the lives of kids, and under very complex circumstances. Imagine what it takes to understand if a child is in danger in their own home and how to navigate that and how to protect that child. Very complex work, very trying, difficult work, and it's been made more difficult by the pandemic. People can't get out to homes the same ways, and obviously home life has been disrupted and it's become very tense in many homes. We've got 3,000 child protective specialists at ACS. They do the Lord's work. They do amazing work. And thank you to all of you. Thank you to everyone at ACS, because whatever your job is at ACS, it is about protecting and uplifting children. So I want to thank everyone at the Administration for Children's Services, and a particular appreciation to those protective workers. This is an important time to take stock. May is National Foster Care Month. It's a time to thank all of the folks who work in foster care as well, the caseworkers and the folks who choose to be foster care parents. Really crucial role in our society. Everyone in this area is unsung. We don't talk about the incredibly important role that foster parents play in the lives they have saved and turned around. We don't talk about the workers who make it possible. We should more often, because it's an area that really, really matters to a lot of kids who found themselves in a tough circumstance, but there are adults who are there to pick them up and help them move their lives forward. So thank you to all. Okay, it is time today to look at our indicators and thresholds. And number one, the daily number of people admitted to hospitals for suspected COVID-19. Good number today. Congratulations, New York City. We have to stay under 200. We're at only 59 today. So we're showing some real consistency there. That means what you're doing is working. Number two, daily number of people in our health and hospitals, ICUs. So we want to get under 375. We're at 421. We're getting closer. You see that trend line. We are getting closer every day. We're very confident we can get to where we need to be, but we've got some more work to do. And then indicator number three, percentage of people tested citywide positive for COVID-19. The threshold is 15%. If we stay below 15%, we can make it work. We can protect lives. We can keep the city moving. Here is a number that I am really happy to see. Happens to be my personal favorite number, number 6. And we have never been that low in these reports. This is a very good day, 6% positive, and we're doing more and more testing. I told you we're at 27,000 tests per day and growing constantly. Here's the interesting thing. A lot of folks have asked, as you do more testing, do you expect the numbers to go up or down? To date, as we do more and more and more testing, basically the numbers are going down. The more New Yorkers we're reaching, the better picture we're getting of what's happening in the city, the fewer people we're finding test positive as a percentage. That's a great sign for the future of the city. So congratulations, really good news on that number, a very good day. Okay, a few words in Spanish. Los esfuerzos de los neoyorquinos están dando fruto y ya casi hemos llegado al próximo paso en esta lucha. La primera fase va a poner a más neoyorquinos a trabajar de nuevo y va a mostrar que podemos mantener a raya a este virus. Día tras día, fase por fase, vamos a seguir ganando nuestro camino hacia más progreso. With that, we turn to our colleagues in the media. Please let me know name and outlet of each journalist.
We'll now begin our Q&A. As a reminder, we have also on the line Deputy Mayor Vicky Bean, Dr. Barbeau, Commissioner Steve Banks, President and CEO of the New York City EDC, James Patchett, and Commissioner Doris. First question today goes to Gloria from New York One.
Thank you, Mr. Mayor. Wanted to just ask if there is a specific date for this phase one that the city is looking at. I know you've said in the first or second week of June, but as businesses are looking at this and trying to prepare, is there a specific date that they should be planning on? My second question is about the budget and about what you talked about yesterday in terms of the city's borrowing capability. And from what I've reported on and my colleagues have reported on that's coming out of Albany is that legislators are concerned about the idea of giving New York City what they describe as a blank check without any real oversight over how that money would be spent. What could you say at this moment you would be willing to do as a compromise? Is it a financial control board kind of situation so that there is some sort of oversight if you are indeed allowed this borrowing capability?
Thank you, Gloria. So let's just do the history first. In the days immediately after 9/11, the legislature convened. Mayor Giuliani at that point asked for a borrowing capacity to protect the city going forward. And the legislature unanimously provided it, straightforward, with an understanding that the city was in crisis. The city needed that ability to keep providing basic services. There was no question about the importance of supporting New York City for the whole state and for all the people of this city. So that history is important because the city took that borrowing capacity, used it as needed, has successfully been repaying, and obviously we've seen the city succeed coming out of that tragedy, succeed in an unprecedented manner. So what do we know about New York City pre-coronavirus? We know that the city was at our all-time high in employment. We know that we had driven down crime to a level we hadn't seen since the 1950s. We know that New York City had become one of the great global economic capitals like never before, a great tech capital. Just in every way, shape, or form, New York City was on the right path. Much stronger fundamentals than even existed 20 years ago at the time of the tragedy of 9/11. But the city took that borrowing authority then, used it wisely, allowed it to come back strong. That's what I think can and should happen again now. Now that said, I always respect when there are concerns amongst legislators, and I was a legislator myself. So I've had good conversations yesterday with Speaker Carl Hastie, with Majority Leader Andrea Stewart-Cousins, and we're going to keep that dialogue going. I am very certain we'll come to something that makes sense for everyone. Very, very positive, productive conversations. So I'm not going to go into any details or projections. I'm going to tell you I'm confident we will get to a good solution so that we have that option. Again, the other thing, Gloria, is we don't want to borrow. We would only do it if we have to. But right now we have no guarantee of if, when, how there will be a federal stimulus to help cities and states. But we do have a guarantee we have to pass the city budget by June 30. And I want to keep city services going. I want to speed this recovery. We need resources to do that. So I'm quite confident we will work something out. On the restart date, no. The answer is simply no, Gloria. We do not have a specific date. I think I've given people plenty of warning multiple times now for days and days. You can expect it to be in the first or second week of June if the numbers continue to hold in most cases or progress. We've got one city threshold number we got to get below. I'm confident on that. We've got two numbers on the state indicators we got to get below. I'm confident on that. We got to get there. Every business that's paying attention knows it's coming, get ready for it. And as I said, we're going to do all these types of outreach and provide a lot of support. But we're not going to tell people the day in advance. The day it happens is the day the numbers tell us we're there. And then everyone would be authorized to move forward, and we will all work together to get it done.
The next is Juliet from 1010 Wins.
Oh, hi, good morning, Mr. Mayor. Good morning, all. So my question is this regarding what you were just talking about. There are some small businesses that are planning to reopen today, and some have already done so quietly. So are the guidelines you're talking about today applied to them, or is this the next phase? And can you supply a timeline for small business?
Yeah, look, Juliet, I know people are anxious. I know they're frustrated, but I really want to say, I have been doing these briefings constantly. The governor's been doing his briefings constantly. These guidelines really are clear from the state. The indicators, we've got the state indicators, we've got the city indicators. I think it's been abundantly clear what's going on and the basic timeline we're working on. And no, businesses are not supposed to make up their own rules and jump the gun. It's really clear. And you know what? If someone thinks that they are the people who get to make the rules for everyone else, I hate to inform them that's not how it works in a democracy. We are all in the middle of a pandemic. We're in the middle of a health crisis. The only way we have gotten things better is by all sticking together and following the rules, and it's working. As these numbers show, it's working. So, no, I'm not into free agents. I'm not into people deciding that they get to make the rules and they can do something everyone else can't do. Any business that attempts to open that should not yet be open, we're going to tell them, shut down right now. If they shut down and they don't attempt to reopen, fine. If they attempt to stay open, if they ignore the instructions, and we're talking about, the city agencies could go out there, I've talked about Small Business Services, Department of Consumer Worker Protection, Buildings Department, but also, obviously, Sheriff's Office, Special Enforcement, NYPD. If one of these agencies shows up and says, you need to shut down now, you're not working within the rules of the state and city, and they ignore it, well, that starts with a $1,000 fine. And we will keep escalating from there. You're just not allowed to be open unless you're allowed to be open. So if you're an essential business, you're allowed to be open. When phase one is formally declared by the state and city, that's when the next group of businesses can open. It's abundantly clear who falls under those categories. Anyone who's not clear, pick up the phone, call the state or call the city, and we'll tell you. But it's pretty darn clear, I think, looking at this information. So the bottom line is you don't get to jump the gun. And look, we're talking about phase one beginning in a week or two at this point. I don't think it's too much for people to be asked to wait until they get the all clear, to do the thing that's safe, to do the thing that's healthy. Because these numbers, these are about human lives. These numbers tell us what will work and what won't. So Juliet, that's the bottom line. If you follow the rules, you start in phase one, construction, manufacturing, wholesale, and the kind of retail that's not been covered by essential, but again, with restrictions, pickup, curbside pickup, or in-store pickup. Really straightforward. Anyone who decides they're above the law, they will feel consequences.
The next is Marcia from CBS.
Good morning, Mr. Mayor. How are you doing today?
Good morning, Marcia. How are you?
I'm good. I have actually two questions. The first one has to deal with childcare. Because of the COVID shutdowns, private daycare centers are in danger of closing for good. What kind of guidance and support has the city been giving these business owners so that they'll be able to open and help working families once the city reopens? And my second question has to do with your phase one reopening, where you predict that there's going to be about 200 to 400,000 people now coming back to work. My question is, how will they get to work? Have you been working with the MTA to figure out a transportation plan, or are you expecting them to take their own cars to get to work?
Thank you, Marcia. Great questions. I want to say, in a pandemic, in a crisis, we're going to do what it takes to get through this immediate time in the city's history. these next few months as we restart. And that is not implication for what the future of the city looks like. So when I say that for a reason, I know there's a lot of folks rightfully concerned about the future of mass transit in this city. We have to make the future of mass transit work. We are a mass transit city. We have to become more of a mass transit city in the future. But for the next few months, people are going to make their own choices. Some people are going to be comfortable in mass transit, some are not. We just have to be honest and real about that. And you may see people use their cars more in the short term if they have a car, or use for-hire vehicles, for example. But that's a short-term reality. The long-term future of this city is with devotion to more and more mass transit. The short-term reality is we are working with the MTA. To your question, Marcia, of course we're working with the MTA, and it's really straightforward. The MTA has made great strides in terms of the cleaning of the trains and the buses. That's great. Now we're seeing more and more frequency of service because they've gotten their personnel back. That's great. But we're still going to have to figure out how to limit the number of people in any specific subway car and any specific bus. And we're working with them on what's it going to take to do that. So that's the conversation happening right now as we anticipate phase one beginning. I think you're going to see a certain number of people who their only option is to take a subway or bus, and they'll come back to it, but we still have to set the right limits to make sure that experience is safe. We need social distancing, we need face coverings for folks in the subways and buses. We also, again, know there's some people just not going to be comfortable in the short term. I think to some extent it'll be a little bit of natural sorting out. A number of people will eventually come back to subways and buses, but they may not immediately. I think that's one of the things that will keep the ridership a little lower in the short term as we go through this transition. The second point about childcare, we absolutely need childcare to come back. It's necessary to a bigger restart, and yet at the same time, we got to do this carefully because by its very definition, it's an activity where a lot of people come together. So we're working on that right now. The city obviously directly subsidizes a whole range of childcare. We work very closely with the providers. We obviously provide right now support for essential workers in terms of childcare. We're going to be building out over time more and more childcare capacity, but that's going to be done with a health and safety focus. So we'll have more to say on it as we go further. But in terms of childcare looking like it normally does, just like schools looking like they normally do, that's months away. But we are going to work with the childcare providers to make sure that they do make it through, because we're going to need them deeply as we go through the phases ahead.
The next is Henry from Bloomberg.
Hello, Mr. Mayor. My question has to do with a bill that's going to be introduced in the council today that would require the city to locate sites where restaurants could operate outside. So this would require city workers to do all of this site scoping, as opposed to the restaurateur coming to the city with an application that details how they would operate and the city approving or denying the request. What is your view on this?
I have not yet seen the legislation, Henry. Look, I think the City Council shares the same value I do. We're really interested in the notion of outdoors being part of the solution for restaurants and bars. I'm very hopeful. This is not a phase one thing. I'm going to say as clear as a bell. Phase one, we've talked about the 4 industries that are affected by phase one. It's not yet time for restaurants and bars. But we're going to be working constantly with that industry to see what makes sense. And I'm hopeful that outdoors could be a big part of the solution. Whether it makes, to your question, which is a great one, whether it makes more sense for the city to delineate space or for the bar and restaurant owners to request space, that's one of the things we're talking through with the bar and restaurant owners. How do they want to do it? What do they need? And I've mentioned before, one of the things that keeps coming up in the conversation is how much capacity they need to actually be viable. If you've got to socially distance, and you need to run a business, so you need a certain number of customers, how much space is that really going to take to get to a kind of break-even point or better? So those are the conversations we're having right now. We'll certainly work with the council to sort out what the right approach is, but I want to first and foremost hear what the restaurant and bar owners think will work for them.
The next is Julia from the Post.
Hey, good morning, Mr. Mayor, and to everyone else on the call. 2 follow-up questions. The first on businesses reopening. We did 2 back-to-back stories about several businesses in Borough Park that opened. City Hall sent the sheriffs to shut them down. 12 hours later, they were back up and running again. So just wondering what the situation is there. Have you issued any fines? And then secondly, wondering why you aren't encouraging people to take mass transit more as you normally would. It seems to give the impression that there's a far greater risk when people go back to work during the pandemic.
Well, look, on the second question, Julia, no, I don't agree with that. I don't think it gives that impression in the least. I think, first, I'm talking to people all day long about what they're experiencing, what they're thinking. And what's quite clear is some people are comfortable going back to mass transit and others are not. And that's fine, that's normal. And we've heard from the essential workers, even before this, that they wanted to see improvements in mass transit. They wanted to see it cleaner. They wanted to see a more social distancing. They had seen some instances of crowding. We've been working with the MTA on all of this. And I think the deep cleaning, the nighttime cleaning is a good example of a smart move. We've got to figure out now, as you start to add more and more people to mass transit, how to ensure social distancing and face coverings, which become even more important as more people start to join the system again. Again, the good news is one absolute fixed piece of this equation is we are seeing more and more of the MTA workers come back and more service can be provided now. But one, I'm just listening to people and some are ready, some are not. Two, I'm not telling people, let's go rushing ahead with something if we don't have all the facts yet. I want to make sure that we have a plan with the MTA to guarantee what's the right number of people we can accommodate in the subway system, in the buses at this point as we go into a major new phase. So that's something we're working on right now. But I have confidence it's going to sort out in the short term because, first of all, a lot of people are not yet going to come back to work. They'll work from home if they can, even in phase one. Second, you're going to see a certain number of people not yet ready to go on mass transit. I'm confident we can make the pieces fit. But no, my message is mass transit is our future, but I want to get it right in this first phase, how much ridership we can handle safely. On the question of Borough Park, no, it's quite clear we've got 9 businesses. As my notes here say, I want to confirm this, but the Sheriff Department's been working on this, Sheriff's Office. 9 businesses shut down in the last 48 hours. If there is repeat offenses, so when I say shut down, they were told they could not be open, they stopped operation. If any of them are found in operation again, that begins with a $1,000 daily fine. If they're found in violation again, there's another fine, and it keeps escalating from there. So I don't have any examples of a business that was shut down by the city government and then attempted to reopen. If they do, they're going to get fined, and then if they keep doing it, worse. It is idiotic to try and open a business today that will be legally allowed to open in as little as a week or two. Hey, how about waiting till it's legal and safe, and then you can do it the right way. If you don't, you're going to suffer this kind of consequence. It makes no sense.
The next is Aaron from Politico.
Hi, Mr. Mayor. 2 questions. First one is about the budget. I have not heard you call for taxes on millionaires, taxes on the rich, mansion tax like you have advocated in the past when you're talking about now borrowing and or federal stimulus. Is that still something you support, or do you think that the current situation, has changed the dynamic and made it more of a concern about the possibility of rich people leaving? Second question to follow up on Marcia's question. I understand you're talking to the MTA. I understand, obviously people are individuals, they make their own choices. But is there any kind of plan for how many people can safely be on the subway? Is there an estimate of that? London puts it at 15%. Do we have any kind of number? And for those who can't safely be on the subway and don't have their own car, what is the guidance to them? What are they supposed to do? Is there any plan to use city streets to somehow make another transportation option?
Yeah, Aaron, great question. On that, we are working with the MTA to determine what exactly is the right amount of capacity that can be handled safely. That is absolutely the crucial issue here. When you think about you want to maintain social distancing, what is that number? And again, against the good backdrop of more and more service being available. So what's that number? How do we help facilitate keeping it to that number on any given subway car, any given bus? What's it going to take to make sure that that happens consistently? That's exactly the conversation going on right now. And we will keep working on that. There's a meeting this morning with Pat Foy to talk about how the MTA and the city can coordinate to achieve that goal. So absolutely we're thinking in that direction and trying to figure out the best way to put it into action. On the question of taxes on the wealthy, Aaron, this is not going to shock you. My basic view has never changed and will not change. Wealthy people in this country do not pay their fair share in taxes. I'll say it again. Wealthy people in this country do not pay their fair share in taxes. You'll notice in all the discussion of stimulus, the thing that you might have thought the House and Senate would do first, which would be to rescind the giveaways to the wealthy and corporations in the 2017 tax bill, well, obviously they're not moving to do that. So we got to be honest, this crisis has brought up immense disparities, not just the healthcare disparities, not just the racial disparities, but the class disparities as well. The rich keep getting richer even in the midst of this crisis. So I absolutely believe this is a fair time to talk about higher taxes on the wealthy. I don't see a context for getting it done immediately in Washington or in Albany, but I don't think this topic goes away because we're in the middle of a crisis.
The next is Michael Gartland from the Daily News.
Good morning, Mr. Mayor. How you doing?
Good, Michael. How are you?
I'm good. A couple of questions on the debt. What is the plan to pay back that additional debt the city's seeking? And have you had any conversations with the Cuomo administration about any restrictions they might want to put on that debt if that happens?
Michael, if you're talking about long-term borrowing, and again, the history is really clear. We have an exact historical template to work from. Almost 20 years ago, Mayor Giuliani sought from Albany the approval of long-term borrowing. He got it. Mayor Bloomberg implemented it. And that debt was paid off steadily and is a good example of something that was fiscally responsible but helped us as a city to keep moving forward. And the proof is in the pudding. The city's recovery after 9/11, the city's strength in recent years, the strength of our economy before the coronavirus. There's not a doubt in my mind. And by the way, Giuliani, a Republican, Bloomberg, an independent for most of his time as mayor or Republican, and me as a Democrat. All three of us would agree that borrowing was a good idea after 9/11. It worked exactly as planned. It helped put the city on a strong footing to go forward. Here we are again in a situation absolutely unprecedented, even broader in its impact, longer term in its impact than the horror of 9/11. This can only be compared to the Great Depression in terms of economic impact. Borrowing capacity makes sense as a last resort. It's long-term borrowing. So it is paid back carefully, slowly over time. We would only use that which we need. We've had, again, very productive conversations with the legislature. We've certainly been talking to the governor's team. We'll keep talking to them. But I want to establish really clearly that in a world in which we cannot yet depend on a federal stimulus, we have no idea. Again, I talked to Senator Schumer about this earlier in the week. There is no vote scheduled in the U.S. Senate. And I know he's not happy about that. I'm not happy about that. President Trump is not pushing the Senate. Leader McConnell is not acting. We have a budget deadline. We must have a new budget by law by June 30. So we have literally zero guarantee about if, how, when there will be a federal stimulus, how much it would be. We are, in fact, seeing our lost revenue grow, now at $9 billion between the current fiscal year and next, and growing. What are we supposed to do with that kind of impact? If stimulus is far from guaranteed, state government has already made cuts, will likely make more, a lot more, if there's no stimulus. What do you do if you don't have the option of some amount of borrowing? You have to do massive cuts. massive cuts to all city agencies. That will undermine any possibility of the right kind of restart and recovery. So borrowing the right way makes sense. I believe we will get there with all the stakeholders in Albany.
The next is Sydney from the Staten Island Advance.
Mr. Mayor, I wanted to know, what is your message to Staten Island Republicans who are rallying around the idea of opening Staten Island up before the rest of the city, and also calling to reopen specifically small businesses that might not be in phase one reopening industries? If Staten Island's hospitals hit the state and city's reopening goals before the rest of the city, why would you not allow Staten Island or any borough that hit those metrics before the rest of the city to reopen before other parts of New York City?
We're one city, Sydney. This is about health and safety, and this is about a very careful plan the state put together, the city put together to save lives. The results speak for themselves. We asked a lot of everyone. I was one of the first leaders in this country to call for shelter in place. I'm glad I did. Everything we've done with shelter in place, with social distancing, with face coverings, with the restrictions we put on business, has helped us to get to the point where we can have a safe restart and sustain it. Anyone who wants to be reckless with this restart, as some places in this country unfortunately have done, will be paid back potentially and tragically if they see a resurgence of this disease, which then will set us back much, much farther and endanger lives. So we're one city. We have our standards. The state is working with us. They see the wholeness of New York City. This is how we're doing it. These are democratically elected governments. People don't get to make their own laws. They just don't. So this is the way it happens, especially in a crisis. And we're not asking people to wait long for those in phase one. And then here's the other point. The better we do at phase one, the smarter we are about sticking to the rules, the faster we get to phase two. Phase two does not need to be a long time away if we do this right. So people need to hang tough so we can protect lives and reopen the right way.
We have time for two more today. The next is Kathleen from Patch.
Hi, Mr. Mayor. Thank you for taking my question today. My first question is about the subways. Are you talking about reserved seating on the subways? And is there any way to implement that in time for phase one? And my other question is about the situation in Central Park. There's been a lot of calls for legislation to make it a hate crime. New Yorkers of color. I'm wondering what your stance is on that.
By that video. It was literally an effort to criminalize being a black man in America. That's what I saw.
All right, everybody, so we are losing that shot there from New York City. Let's go out to the House right now, U.S. House, where they are conducting a hearing right now on how the federal government protecting federal workers during this pandemic.
Places themselves. A standard at this point would be an unproductive burden for businesses already struggling to reopen, potentially exposing them to unnecessary liability risks during an already challenging time, and would do little to advance workplace safety. Second, setting the standard just takes too long. On average, it takes OSHA 7 years to compile all the data necessary and meet all the regulatory requirements for issuing a standard. I know Democrats want an emergency temporary standard, or ETS, which, according to their bill, must be done in 7 days. The last time OSHA issued an ETS was in 1983, and that one was overturned because OSHA could not meet the statutory threshold requirements for issuance. Indeed, OSHA has lost more ETS cases in federal courts than it's won for the same reason. I know the Speaker included a provision requiring a standard in the bill passed by the House 2 weeks ago, a bill she created in her office without any consultation with the White House or the Senate, and on which we never had a hearing or markup in this committee, the Committee of Jurisdiction. No regular order and no effort to obtain bipartisan consensus. That's no way to operate the House with a challenge of this magnitude posed by the pandemic and our response to the pandemic. No wonder that bill is dead on arrival in the Senate. I also know the AFL-CIO filed a lawsuit last week to force OSHA to issue a standard. They filed a lawsuit. Expensive and time-consuming litigation against the federal agency responsible for protecting our nation's workers in the midst of a pandemic is unhelpful and very unlikely to succeed. And Madam Chairwoman, I take exception to your remarks about the witness's ability to talk about that lawsuit, matters involved in that lawsuit. No lawyer is going to let their client talk about something like that with pending litigation. It's a matter of every lawyer that has a client litigation like that is going to ask them to be careful about that. And to expect them not to follow their lawyer's advice is totally unfair to them. I must say that when I started preparing for this hearing with my staff 2 weeks ago, I was impressed, very impressed, with the diligence and speed with which OSHA has fashioned its response. Remember, we didn't even know about this disease 5 months ago. Their experience with past pandemics surely helped, and I'm glad they both followed and built.
All right, so Fox did take away that shot from us. This is a live look where we're expecting Speaker of the House Nancy Pelosi. When that happens, we'll bring it to you here on News Now.
Philanthropies, get them trained very quickly and get them out there to make an impact. I don't know if there's some individuals who are originally going to be hired and for some specific reason they won't be, or if there's any other individual matter that points up. If you give the details, you don't have to give the name, but if you give the details to our team, we'll certainly get you an answer on the individual situation. But what is clear is, as we've been building this rapidly, trying to figure out what's going to be most effective. Some things can be done by phone. I talked about it the other day, as did Ted Long, when we were going through the details of how this works. There's going to be work out in the field as well. There will be contact tracers who go out directly to homes to talk to people. So it is going to be a mix of by phone and directly in person. That's what we are doing as we're seeing what's going to work. That's how the plan is being built. So I am always keeping an eye on it, but what I'm seeing is something coming together really, really quickly and effectively that we are going to need to be the core of how we fight back this disease on top of everything we're asking people to do. Remember, the number one way to fight back is all the basic hygiene, the shelter in place, the social distancing, the face coverings, and New Yorkers are doing that. But the X factor here, as we start to reopen, is that strong test and trace effort. And it's going to hit the ground running in a very, very big way. And from everything I'm seeing, it's ready to make a huge impact in this city. All right, everyone, look, I'll conclude with the simplest point. You have earned your way to the gateway to phase one. We're not there till the day we declare it. But we are damn close, and that's because of you. That's because of the work you've done. And then once phase one begins, as I said, several 100,000 people come back to work. That's going to be very good for the people of the city. That's going to be very good for those individuals and their families. And then let's make that successful, and you get to phase two, and so on and so on. Everything is about doing what we've done the right way, sticking to it. But I want people to understand, you literally get to see the fruits of your labors. There's a lot of times in life where you work and you work and you work and you don't see the result, and it's really painful. This ain't one of them. This is one where you've done the right thing, and now you see things moving, and if we stick to it, you're going to get to see life start on its way back to a better reality real soon in this city. So keep doing what you're doing. Thanks so much, everyone.
And as we wait for more live events here worldwide on News Now, let's show you some of our sister stations from around the country.
here during the summer as we begin to reopen so many things across the state. She's been so dedicated to the children of this community and frankly to children all across the nation and set such a great example, and so it gives me great pride to have her standing here with us. I spent this morning in Meridosha with our Illinois Emergency Management Agency Director, Brigadier General Alicia Tate-Nadeau, and with our National Guard Adjutant General, Richard Neely. The community there has really pulled together to fight the floods. And even the Triopia High School football team got out there to help build up the levee and keep their neighbors safe. Over the last few days, nearly 60 members of the Illinois National Guard have worked with local emergency management officials to protect the community there by depositing 150,000 sand along the Illinois River to supplement local flood prevention operations. National Weather Service projections had indicated massive potential flooding in the area. This work has likely saved many lives and prevented hardship for hundreds more. I want to take just a moment to say that our Illinois National Guard is second to none in the United States. Throughout the COVID-19 crisis, hundreds of Guard members have played a crucial role in protecting Illinoisans, including those right here in East St. Louis, where rain or shine, the Illinois National Guard is operating our Metro East state-run drive-through and walk-up community testing center right here on the property. And that's what we're here to celebrate and call attention to today. I'm joined here at the community center by Mayor Robert Eastern, by St. Clair County Board Chair Mark Kern, East Side Health District Public Administrator Elizabeth Patton-Whiteside, Leader Jay Hoffman, Senator Christopher Belt, and Representative LaToya Greenwood. This testing center is one of 46 that we have across the region of Restore, Illinois. That includes our 27 federally qualified health centers. Each day, this drive-through site can receive up to 500 samples from anyone who needs a test. These are free for the public to access. Tests are available to any essential worker like a grocery store clerk, a nurse, or a pharmacy worker, any first responder, anyone with COVID-19-like symptoms, anyone with a compromised immune system, or anyone with known contact with a COVID-19 positive case. We want testing to be as easy as possible for Illinoisans. You can find a testing site nearest you. If this isn't the closest one to you, you can find it online at coronavirus.illinois.gov. Again, coronavirus.illinois.gov. And speaking of testing, over the last 24 hours, out of 17,179 total tests, 1,111 came back positive. That's a single-day positivity rate of 6.47%. Remember that these are pure diagnostic tests. Illinois does not inflate our daily testing reports with antibody tests. That brings our statewide total of confirmed positive cases to 114,306, with over 800,000 tests run to date. The vast majority of those individuals who tested positive have already recovered or are experiencing a mild enough case that they're recovering at home. As for our statewide hospital numbers, as of midnight last night, we have 3,826 Illinoisans in the hospital with COVID-19. Of those, 1,031 are in the ICU and 592 are on a ventilator. I'm also saddened to report that we have lost another 160 Illinoisans in the battle against COVID-19, bringing our statewide total of lives lost to 5,083. These are real people whose lives came to an end because of this pandemic. They are grandparents and uncles and aunts and parents, cousins, children, friends. They had whole lives that were cut short because COVID-19 knows no boundaries and only seeks to destroy. We can never forget that. May the memories of those who were lost be for a blessing. For those watching at home in other parts of the state, East St. Louis is in St. Clair County, home to one of the pilot contact tracing initiatives the Illinois Department of Public Health has launched to help tackle a public health situation of this magnitude. In this work, I'm proud to announce that IDPH and St. Clair County Health Department will be joined by the East Side Health District here in East St. Louis, a trusted organization that has dedicated itself to community-based health services here in Metro East for over 70 years. It's exactly the kind of partnership that's going to help us reach and support more people, and I'm glad it will become one of our first 2 major contact tracing expansions. I'm proud today to be here with the leaders of that operation. For more on that, I'd like to turn it over to one of the greatest county chairs in Illinois, St. Clair County Chair Mark Kern. Mark?
Wow. Gonna have to remove my mask for that one. So to put this in perspective, because I think all the days seem to run together, on March 14th in St. Clair County, we had our first COVID positive diagnosis. March 16th, our governor came here to St. Clair County to talk about the state's plan and the executive order that he had put into effect the day before we actually had our first positive, limiting what was going on in the state and allowing people to stay safe and telling them how to do that, whether it was through washing your hands or the cleanliness part or telling people to stay home. And it was on that day that we launched our effort here in the county. Through that point, we've worked diligently with all of our mayors, our first responders, certainly with our state representatives, Hoffman, Greenwood, and Senator Chris Belt, all who have been an integral part of this effort to be able to get PPE. When we started out, we were seeking masks and hand sanitizer and hospital gowns. Those things were all in short supply. Their efforts through the governor's office made sure that not only all our first responders and our hospitals and our dentists and our doctors and our long-term care facilities had what they needed, but they made sure they had it in a timely fashion. IDOT trucks pulled up and are pulling up on a regular basis in front of our EMA office, delivering pallets of PPE to make sure that people are taken care of. The people that are out there fighting this fight for us, to make sure they are safe. So we've now entered into, as the governor said, the tracing portion of this project. Testing has been ramped up. Initially, and Liz will verify, inside Health District area at Touche Hospital, when the governor came here at first, we had 14 tests at Touche Hospital, 14 tests for that hospital to be able to run their operation. Now tests are flowing, and just at this site alone, we have the opportunity to do 500 tests a day. That is a major accomplishment in a fairly short period of time. The tracing grant that comes here now will allow us to take people and talk to them if they're diagnosed COVID positive, have people to call them on the phone, ask if they're staying at home, ask who they were in contact with during the point which they were contagious, and be able to make this operation move into the next phase, which is containing COVID, if there are hot spots, to make sure they don't break out so that our county can go back to as close to normal as we possibly can. None of this would have been possible without the state of Illinois and the strong leadership of Governor Pritzker and the strong leadership of his people that are behind me, the state representatives, the state senators that understand St. Clair County and its people and work hard with it every day. Special thanks go out to Mayor Eastern, who's been a strong part of the team, Team St. Clair, as well as Liz Patton with Eastside Health District. Hand in hand, we've worked on this issue, and we appreciate everybody's support. Thank you. I have no X. At this time, I'd like to introduce the mayor of the City of Champions, Robert Eastern, mayor of East St. Louis.
Good afternoon. I'm very excited about being here. Thank you, Governor, for all the hard work you're doing, and I echo everything that Chairman Kearns. You know, this COVID-19 situation and pandemic has been very fluid. You know, that we couldn't have planned for this, you know, so we just executed kind of on the fly, and your execution was well, Governor, so I appreciate that for everything that you're doing for my city, our state, and our county. Yes, the tracing grant will be very impactful here in East St. Louis, but the most impactful thing that we can do right now in order to make that grant even more impactful is get tested. We're standing here at a phenomenal site here at JJK. We need to utilize the site. There's different things that have came out of this COVID-19 that allowed the city and those around us to come together as one unit and unify. You know, we were able to give out free meals with the Urban League. They'll be back June 6th. You know, but all these initiatives and all these things that are happening is a result of COVID-19 and those working together to make a better East St. Louis, a better St. Clair County, and a better state. And if we could not do this without State Representative Greenwood, our State Senator, State Representative Jay Hoffman. So we appreciate those people for working tirelessly, you know, on the behalf of East St. Louis and our citizens. So there's been a lot of people working together. Like I stated, the clergy have came together. They started an initiative, you know, 6 feet in the street, you know, to see what is the new norm that's going to be after the COVID-19, the new norm. So we want to make sure that everybody that has a part in this, I want to just give kudos to those people. I give kudos to everyone that has put their tireless effort in here, and make sure that we got to make sure that we use this tracing grant to the best of our ability so we can get back to the normality of the state of Illinois and the normality of St. Clair County and East St. Louis. So at this time, I'd like to introduce Elizabeth Patton Whiteside.
Good afternoon, everybody. As the Public Health Administrator of Eastside Health District, whose jurisdiction within St. Clair County is East St. Louis, Washington Park, Cahokia, Brookland, Centerville, and parts of Fairmont City, I have been given the monumental task of trying to contain the spread of the coronavirus within my community. And I must say it is a monumental task. Everyone is aware that the Black and Latino adults are far more likely to experience serious illness and death from COVID-19. Underlying health conditions such as diabetes, hypertension, and obesity are some of the risk factors serious illness and death from COVID-19. Underlying health conditions such as diabetes, hypertension, and obesity are some of the risk factors
COVID-19. We really just want the people of Illinois to be safe and healthy. Before I take questions, I feel compelled today to use this platform to address what happened to George Floyd in Minneapolis, and to Breonna Taylor in Kentucky, Ahmaud Arbery in Georgia, and Christian Cooper in New York City, and countless others whose memories we cannot allow time to erase. Events that echo what we have seen happen to too many people, too many times, in too many places, and yet we as a people have not yet found the humanity to stop these vile, horrid acts from happening, to truly contend with the racism that permeates our society, and then to root it out. As a white elected official, I feel a special responsibility to speak out today and to own the obligation that I have to shape public policy in a more equitable direction. Being Black in America cannot be a death sentence.
And right now we are going live out to Speaker of the House, Nancy Pelosi.
Dying of the coronavirus. So sad. We'll always carry them in our hearts, that big number of people. It is a scar on our nation that we could not save them. It is sad for their families, and they are in our thoughts and prayers. On top of that, 1.7 million have been diagnosed. 1.7 million people have been diagnosed. There has to be a stop to this. The answer is testing. We have in our HEROES Act a plan for testing. Testing to open up our economy, testing to open up our schools, testing to heal. But in order to heal, we have to know the gravity of the problem. You know, we talk a great deal about a vaccine and a cure, and God willing, we pray that that will be soon. But we don't have it yet, and we do have testing. And you notice in countries that have controlled the spread and the deaths from the virus, they don't have a vaccine, they don't have a cure, but they have common sense. They have used testing, tracing, treatment, and separation, isolation, where necessary. And that's exactly what we should have been doing all along. On March 4th, the House passed a bill, its first bill on coronavirus. We wrote it in February, brought it to the floor March 4th. It was about testing, testing, testing. Throughout all of our legislation, it's all been bipartisan thus far. It's been about some testing or the masking and the things that we need to prevent the spread of the virus. The CARES Act, we put forth resources in the interim bill on PPP. We put forth a major $100 billion for health, for testing, and for hospitals. And now in the HEROES, and still we have not had from the executive branch the appropriate determination and strategy to test. People are dying, 100,000, over 100,000. People are sick. There's a horrible impact in the communities of color in our country. So many of the deaths, at least 1/3, are our seniors in nursing homes and the rest. And yet, we can't seem to get the executive branch, the President of the United States, to make the decision to show the example of what we can do to stop this. Yesterday, we came here, many of you were with us, with representatives of the Congressional Black Caucus, the Hispanic Caucus, the CAPAC, the Congressional Caucus on Asian Pacific Affairs, the Native American, one of the first Native American women ever to serve in Congress, Deb Haaland, with our distinguished whip, Mr. Clyburn, and Mr. Pallone, the chair of Energy and Commerce Committee. Mr. Pallone talked about what's in the bill, the HEROES Act, the Energy and Commerce piece, which is about a robust and rapid testing initiative, a strategy with a timetable, benchmarks, milestones, and the resources necessary to get the job done. And the job is to save lives. And those who were gathered here yesterday were pointing out how affected communities of color are by this. But there's not adequate testing there. We've got to get a handle on the challenge that we face. And we can only do that if we test, if we trace, and then if we treat, we can reduce the number of deaths. And, of course, the isolation that goes with it, and wearing masks and following common sense and good guidance. So this, I'm here today to just say to you, 100,000 people, how many of those could have been saved? We have example after example after example. Plural of anecdote, we always say in appropriations is not data. But the fact is, it is illustrative of the fact that people are dying who don't have to die. And the data is what we want them to collect. And that's part of the plan, too, to collect the data so we know the impact, so we can save the lives, so we can kill and defeat this virus. As our hearts are broken over 100,000 deaths, we're also very sad about what happened in the case of, in Minnesota. To watch Mr. Floyd be murdered in a video at a time when we're all so sad to begin with. It's always tragic. It has always been tragic. But there we saw it on TV, being murdered on TV. So our Congressional Black Caucus is working with the Judiciary Committee. There's correspondence that will be going to the Judiciary Committee. That's their information to share. We have a commission in the Commission on the Social Status of Black Men and Boys that Congresswoman Frederica Wilson has been pushing for a while now. So there are all kinds of expressions of concern, but not just expressions of concern, plans to take action so that this stops, So again, I spent my time talking to you about testing because it is what's in the HEROES Act. I'll be specific. Strengthens testing and contact tracing by requiring updated testing plan with clear benchmarks and timelines, I mentioned. Providing $75 billion in grants to support testing, tracing, and isolation with special focus on addressing disparities. And that money will be distributed to the states. And we want the tracing to be done by those who are culturally compatible with the communities in which they are collecting data and tracing, and require, again, culturally and linguistically appropriate strategies for increasing access. With all of this, all these deaths, and the need for us to pass so that as law, more specific prescribed direction to the administration who should have done this on their own, Mitch McConnell says, no, we need a pause. We need a pause? Tell that to the virus. Is the virus taking a pause? Is hunger in America taking a pause? Do you see that the children in America have food insecurity to such an extent, even though we have passed legislation to provide more food for children who are not in school because that's where they get their main meals? But we have to be more effective in how that is distributed, and we need more resources, and that's in the HEROES Act as well. The HEROES Act is an answer. It has a strategy. It has three main pillars. Honor our heroes, our healthcare workers, our public safety, police, fire, emergency services, food suppliers, sanitation, transportation, our teachers, our teachers, our teachers. They risk their lives, many of them, to save lives, and now they may lose their jobs, and that's why we have to support state and local government. Secondly, testing, testing, testing. You want to open up the schools, you want to open up the economy, you want to keep people healthy. There's an answer, and it works. Testing, tracing, treatment, isolation. Make a decision, Mr. President, to do just that. Take responsibility. And third, put money in the pockets of the American people. All three of these we've done in a bipartisan way already, and we need to do more. We cannot take a pause. And again, there are many things within there in terms of having safety in the workplace with OSHA, having support of our post office where over last year, 1 billion packages of medicine were sent through the mail. It's a health issue. 90% of our veterans' medicine comes to them through the mail. It's a health issue. Vote by mail. It's a health issue. It's always been the health of our democracy, and now it's a personal health issue as well. And food security. What is their response when they have turned down our request for more funding for food stamps, for SNAP, for emergency food services, for WIC, Women, Infant, and Children, for all of those initiatives? How cruel can you be to say at a time of this economic uncertainty that we are not going to provide more funding for food? Fortunately, there are people around the country in a bipartisan way who are acting upon all of these initiatives. They're causing a drumbeat across America, an echo chamber of America, to say, we can't wait. We need to get the job done. So there we are on that. Now, I'm going to talk to you about what happened yesterday on the floor that I'm very happy about, the Uyghur Human Rights Policy Act, in a very bipartisan way, overwhelmingly. We voted on legislation. Senator Rubio has been a leader on this in the House. Chris Smith, Mike McCall brought the bill to the floor with Elliot Engel, our chairman of Foreign Affairs Committee, Mr. Sherman, Mr. Swazi, and others. Jim McGovern, of course, has been our champion on human rights in China and every place else in the world. So we're very pleased of that. And now as we approach the 31st anniversary of Tiananmen Square, more focus on human rights in China, Tibet, Hong Kong, all of China, including in Beijing, and of course with the Uyghurs. The statement that was made by the Secretary of State about under the law that we passed last fall, which was a strengthening of the Hong Kong Democracy Act, the Secretary of State had to certify that China was honoring the basic law, the terms of the relationship of one country, two systems. The Secretary has stated that he cannot certify that that is the case. And so we want everyone to oppose this law that the Chinese are putting forth to take away that autonomy from Hong Kong. So much going on. So much going on. Again, today on the floor, we are not going to be taking up the bill that was sent over by the Senate, the FISA bill. Yesterday in the morning, the Republican on the Committee of Jurisdiction, one of the committees of jurisdiction, Judiciary, Mr. Jordan, testified in favor of the bill. Sometime after that, the president said he would veto the bill. So all of the Republicans then abandoned their commitment to security and said that they were going to vote against the bill. This has always been bipartisan. Mr. Jordan said in the committee yesterday, I would like to thank Senators Lee and Leahy for their amendment to the House-passed bill, which strengthened the amicus role in these proceedings by extending them to any sensitive investigative matter involving U.S. persons. This was in his testimony in support of the bill yesterday, until the president spoke, and then all of a sudden the commitment to national security disappeared by a tweet. Twinkle of a tweet, as they say, disappeared. So this has always been bipartisan, and I don't have any intention of departing from the fact that on FISA bills, we are always going to have to go in a bipartisan way. And if the Republicans were abandoning their commitment to that because of the president, that means we could not override his veto. So he didn't want to subject everyone to something that was not consistent with what we did just about 2.5 months ago when we passed a bipartisan bill. 2/3 of the Democrats, 2/3 of the Republicans voted for the legislation overwhelmingly, veto-proof, sent it to the Senate. The Senate sent back a bill with 80 senators voting for it, 45 Republicans voted for that strengthened FISA bill, strengthening the protections for American people in it. And then the president said he would veto it. But it's no surprise because the administration, especially those in the Justice Department, really don't want any bill that provides protections for the American people. They want to have all the leeway in the world to do what they do. It's most unfortunate. But we will hopefully go to a conference so that we can represent and debate all of the views in our caucus and their caucuses, the Republican caucus, Democratic caucuses, to come up with a bipartisan legislation, because I do believe we need a bill in order to protect our security and our liberty. And, security and liberty, always the balance that we have. But with all the technology that's out there, we have to take extra steps in terms of protecting privacy and the rest. So with that, I will yield to any questions you may have. But what I just mentioned in closing, 41 million Americans out of work. 41 million Americans out of work. Over 100,000 people have died. More than 1.5 million people infected by this. And we are not taking the strong position, robust, strong position that we must take to do what we know works. It works in other countries. It works in certain communities that abide by it. It has to, we have to put the resources there to make sure that we do the proper outreach to define the problem, to test, trace, treat, save lives. and isolate. Yes, ma'am.
The president is expected to sign an executive order today that will essentially make the social media giants more liable to lawsuits as a result of what he says is censorship. What are your thoughts on this?
It's outrageous, but it's an outrageous situation. While Twitter is putting up their fact check under what the president says about voting, they still won't take off the misrepresentations the president is putting out there by the death of a gentleman whose wife died, and he's asking them to take down the president's misrepresentations. So it's, yes, we like Twitter to put up their fact check the president, but it seems to be very selective, very selective. And of course, you know my view of this, and I've said it before. Facebook, all of them, they're all about making money. Their business model is to make money at the expense of the truth and the facts and that they know. And they defend that. I think Facebook has made tens of billions of dollars during this period of time when people are so reliant on social media. And they testify that they have no responsibility for the truth.
Do you think that they should be further regulated? Do you think that they should be a publisher or a platform?
Well, the fact is that what they are is somebody who's avoiding taxes and regulation. And that's what they're about. And so when you see all they want is to not pay taxes, which they got their tax break in 2017, the tax scam that gave all those advantages to the high end, and they don't want to be regulated. So they pander to the White House. You see what Facebook Zuckerberg is saying today about all of this. They just panders. Tax cuts, no regulation. Our business model is to misrepresent the facts and to be a platform to do that and try to hide under freedom of speech, which is, of course, a complete violation of everything freedom of speech stands for. Freedom. And they knew during the 2016 elections that the Russians were engaged in foul play. They knew because they saw where the money was coming from. It never occurred to them to check on that. So again, what the president is doing is, it's almost seeing people who have been in cahoots with each other. Is there no honor among thieves? That's really kind of what it comes down to. They've all exploited the truth, and some have made money off of it, and some have made political capital off of their misrepresentations. But what the president is doing is silly. It's silly. But let's say this. It's a distraction. I opened this meeting talking about testing, how it's going to save lives, open our economy, send our kids back to school, save lives, and the rest. We're talking about Twitter. So let's get back to saving lives, okay? Yes, sir. All back there?
On a practical level, regarding the next steps for response to coronavirus, isn't it more likely that there won't be anything, serious negotiations taking place until either the $600 UI add-on comes up for renewal or until the PPP runs out of money again? And if so, is there an issue with that?
No, I think that there's a drumbeat across America. Our members have come back with so many positive experiences, of course, all virtual, about what they're hearing in their districts and the rest. And again, the state, local, county governments are so in need because of what they have spent on the coronavirus outlays and what they have in terms of revenue lost. This is desperate need. As I said earlier, our healthcare workers, our first responders, so many people are risking their lives to save lives, and now they'll lose their jobs because their state and local governments and county governments, which provide some of the health care, just don't have the money to. They're either going to have to fire people, reduce services, raise taxes, or all of the above. And we have an answer that cost half as much as what the Republicans spent on their tax scam in 2017, giving 83% of the benefits to the high end. Half of that money helps states and localities stay open, honors our heroes. And again, the testing thing is urgent. If they want to ignore it, then they have responsibility for the increases in infection and death. And the American people, all of the things we're talking about, whether it's state and local, whether it's unemployment insurance, as you mentioned, whether it's direct payments, whether it's food stamps, all of that are stimulus to the economy, in sharp contrast to their 2017 tax scam, which only benefited the high end and had no benefit to the general public, while at the same time adding $2 trillion to the national debt for our children to pay. So no, I think they'll catch the spark. Their tone is changing, as I think you've probably noticed. Yes, ma'am.
On Hong Kong, do you expect U.S. should remove Hong Kong's special trade privileges?
I'm sorry, dear.
Do you expect U.S. should? Do you believe U.S. should remove Hong Kong's special trade privileges? And also, do you expect some sanctions on Chinese citizens and companies in response to the national security law?
We'll see what the administration is going to do. There is an array of options in the bill, the Hong Kong Democracy Act, which was bipartisanly passed House and Senate last year in the fall, and it has certain an array of options for the president to use. We'll see what he does, but I'm sad that the conclusion is. But there's no other conclusion to come to if China is going to pass this Security Act. So we should all be speaking out against that Security Act, not just the United States, the EU. People around the world should be speaking out against it. It's a brazen move on the part of the Chinese government. It's a brazen move. And Hong Kong is so much part of the vitality of trade and commerce that goes into mainland China. You would think that they would want that vitality to continue. But President Xi is a very oppressive tyrant, as you know. The Uyghurs, we passed the Uyghur bill yesterday. Millions of people, I don't know the exact number, but you could say at least 1 million people in education camps, and he says they like it there. He said he liked it. So Tibet, destroying the culture, the language, the religion of Tibet. These are brutal people. They're taking brutal actions, and now Hong Kong very visible. It's really tragic. But I was disappointed to hear the Secretary's proclamation, whatever statement. However, in terms of the bill that we passed, he cannot certify that Hong Kong is able to function autonomously with the actions that the Chinese government is taking. And the bill has an array of possibilities for the president to take action. Their sanctions are included against individuals or other sanctions. We'll see where they go from here. Yes, sir.
Senator Kaine announced this morning that he was sick back in March and April, took an antibody test, came back positive. In light of that and on your overall focus on testing, I'm wondering respectfully, have you ever been tested for coronavirus, either diagnostic test, antibody test? No.
At the time when our colleague, Congresswoman Velasquez, was diagnosed, we had all been here for the unanimous consent on the PPP, the second PPP bill. And so, when you're taking pictures, people look closer than they are. So people said, oh, you were in her company. We were at a press, we signing the bill, the enrollment. And so I said to the doctor, should I be having a test? He said, no. You don't have any symptoms, and your proximity was not such that it would justify that. We don't want to have the test. For a while, there were a scarcity of tests, and the fact is we didn't want to be first in line to get tested when so many people who had symptoms and had justification for it. What I want is to have many, many more tests so that there isn't a competition for them. And I don't think, just as you used that example of Senator Kaine and Mrs. Kaine, that you should have to have symptoms, because you could be asymptomatic and be contagious, if that's the word. And so, so what we'd like to see in our bill is a system where there's massive testing, tracing, treatment, saving of lives with isolation that would go with it. But no, the doctor said, no, you don't need to, and you'd be putting yourself ahead of other people in line. So we don't have it. Yes?
Last question.
Who's your friend?
You mentioned the tragedy in Minnesota and specifically the Frederica Wilson bill. What else are you looking at specifically, House Democrats, that you could do legislatively? What are the tools that you even have to your disposal? It wasn't that long ago that you did a pretty comprehensive criminal justice reform bill. Was that not enough?
Well, apparently not. What we are, I don't want to distribute someone else's letter, but Jerry Nadler, on behalf of the Democrats on the Judiciary Committee, I don't know if it's bipartisan, but the letter that I have is just Jerry Nadler's signature now. They go into them. They also go into the Arbery case tragedy. It's a letter to Attorney General Barr and Assistant Attorney General Draymond. And it has an array of questions and the rest. But we're working with our Congressional Black Caucus, who has been working on this. During the HEROES Act, I spent a lot of time on the phone with them, with conference calls and the rest, with big participation of many people, including, in some instances, the press, to talk about criminal justice and how disproportionately it was affecting the coronavirus, was affecting people in prison and the rest, and stories that went with that. Just one piece of the attention that they have paid to civil rights, to what happens in prisons, the health issue, how they all connect. So we take our guide from them on these particular issues, and the Judiciary Committee has that commission as one option, but it's only one option. Right now, that people just want to get the facts in both of the cases. They want to see federal investigation and action. We saw a murder take place before our very eyes. And so the fact that the police officers were fired, that's one thing, but there has to be some justice in all of this. So again, you heard Mr. Clyburn, I don't know if you were here, you weren't here yesterday, but Mr. Clyburn spoke about this yesterday, about justice. So it's a larger issue, but it's not anything new. And it's been happening for a while. And sadly, at the same time, with so many other deaths, this is so unnecessary. I don't know if you saw his brother and his sister Bridget, on TV talking about him in such a beautiful way, and how sad it was and how unbelievable it was to them that their brother had suffered that fate. It's just so counter to who he was, and how much they miss him and how much they love him, and how hopefully it's some comfort to them that so many people share their grief and pray for them at this sad time.
Do you think that officer should be charged with murder if we watched the murder on TV?
Let's take our lead from them in terms of how these things are sequenced. But we did see a murder on TV, and it wasn't self-defense. Thank you.
All right, that was Speaker of the House Nancy Pelosi wrapping up there. We'll see if Kevin McCarthy will be speaking a little bit later here on News Now. I'm your host, Mike Page. Thank you all so much for joining us on coronavirusnow.com and around the world on our YouTube page there as well. I do have to bring this up, though, because I noticed this during the briefing there with Speaker of the House Nancy Pelosi. Take a look at everyone. This was moments ago, well, during the whole news conference. She has the mask on that she's wearing, but it's below her chin there so that she could speak. Now, here is what I'm thinking, though. If she had any particles that were trapped inside of that mask, she would definitely be inhaling it while she is talking. That is some observation that I'm seeing there. It just doesn't seem healthy. It seems like it would be healthier just to take it off. But then you're also having to deal with the whole situation of touching the mask as well. So it's a really weird way of looking at it, the way that we are all seeing life right now. It's, do you wear it? Do you not wear it? What happens when you're touching it? What happens when you are inhaling those particles that you are trying to avoid, that the mask is trying to trap for you? Does the mask do anything? We don't know. There's a lot of speculation out there, but yeah, it's definitely something to talk about and just wonder what exactly is going on with the mask situation, not just with Nancy Pelosi, but with so many others that are doing it there as well. Just some thought right there, because I couldn't help but notice that there and say, wait a minute, got to be safe. Why don't you take it off? But then you're still touching it as well. Mask debate continues there, no doubt. We continue on here on News Now, bringing you the very latest. Let's go out to New York, giving you an update there by the governor, Andrew Cuomo, live right now on coronavirusnow.com.
People who are put on ventilators is down, so that's very good news. And the number of new COVID cases per day is also down, 163, which is the lowest that has been. So that is all very, very good news from our point of view. The relatively positive news is the number of deaths continues to decline, 74. This is always painful. And we're going to be watching this number to see how far down it actually goes. We have a large state, and the COVID virus tends to attack those who are seniors and those who have underlying illnesses, and will remain a cause of death for the foreseeable future, I'm afraid to say. But we want to get this number down as low as possible, and we're doing everything that we can to do that. We have the best hospitals, the best doctors, the best nurses. They're all working day and night. So we can take a little solace in the fact that we know we have done everything we can to help save those 74 lives. You can't always be successful, but you can always do the most that you can do, and that's what we're doing. And you see, again, the number of lives lost and how that number is coming down, so that is all good news. Yesterday, I was in Washington, D.C., spoke to a lot of people. I met with the president, spoke to congressional members, spoke to Senate members to try to find out what was going on. This is my opinion, so it's worth what you pay for it, since you're not paying anything. I understand what states must do to work their way through this pandemic. The states are taking the lead in the responsibility. I understand that. I understand what governors must do. I am vice chairman of what's called the National Governors Association, so I work with governors all across the nation. And we talk about our responsibilities, and I feel good about what the states and what the governors are doing. My question is, what is Washington going to do, the federal government, because they have a role also in this? Yes, the states are in charge, and yes, the states are implementing their plans, but we need support from the federal government, and that's the role of the federal government. Washington has passed numerous pieces of legislation, and they've successfully bailed out big corporations. They passed pieces of legislation that have a lot of benefits for the rich and the powerful. Now, the question is, what is Washington going to do in terms of passing legislation that helps working Americans, right? Police officers, firefighters, school teachers, hospitals, unemployed people, businesses that are struggling. How do we help them? How do we bring them up? And that's what states do and local governments do, and that's state and local government funding, and they have to provide that. Also, my opinion is Washington should, just for this once, end their proclivity to make every piece of legislation pork barrel legislation. I understand they have to get senators to vote for it, and they have to get House members to vote for it, but that doesn't mean they have to make it a gravy train of pork just to pass it. Maybe you can just pass a bill on the merits of a bill. How about that? Novel, but possible. This is supposed to be a specifically targeted piece of legislation to help restore the economy and repair the damage of the COVID virus. Well, then make the legislation about funding to repair the COVID virus. And you know where the COVID virus has been in this country. You know where it's wreaking havoc. You can count the number of deaths and where they are. You can count the number of positive cases and where they are. You look at the past legislation that came out of Washington and how they dispersed money, and you look at how they wound up making it a gravy train. And every state got a lot of money, local governments got a lot of money, and in many cases disconnected from the COVID virus and the COVID situation. If you take the total funding and you actually look at how much states got per positive COVID case, it's not even close. Some states got millions of dollars per COVID case. New York State, we got about $23,000 per case. New Jersey, we got about $27,000 per case. I understand they have to, quote unquote, buy votes on a piece of legislation. I also understand it's taxpayers' money. And theoretically, a legislator is there to do what's right. And not because that legislator was seduced with large amounts of taxpayer dollars, even though that state wasn't affected. I also think Washington has an opportunity to actually step up and to be smart for a change. They should be talking about revitalizing the economy, not just reopening the economy. I don't believe you just reopen the economy and it bounces back for everyone. I think it bounces back for the big corporations. I think it bounces back for the rich. I think it bounces back for the powerful. That's what happened after the 2008 financial crisis, the mortgage fraud crisis. The big banks that caused the crisis, they were fine just months afterwards. They took all that federal bailout money, they gave themselves bonuses. I remember I was the Attorney General of New York. I chased those corporations to put the bonuses back. But how about the small businesses that closed? How about the corporations that are going to lay off workers now? What's going to happen to them? How about all those blue-collar jobs that are not going to come back right away? All those little retail stores that are not going to come back right away? So it's not just about revitalizing. Not just about reopening, it's about revitalizing. And it's about having a plan and a vision for the future. Okay, we went through this. What's the plan going forward? We went through the Depression, but there was a plan afterwards. We went through World War II, but there was a plan to restore the economy. Where's the plan? Where's the vision? Where's the plan to say, yes, we went through hell, but heaven is on the other side, and we're going to rally and we're going to be better for this. BBB, build back better. We're not just going to return to where we were. We're going to be better than ever before. And to make sure that any of those corporations that took taxpayer money rehire the same number of workers. You hear these corporations now talking about, well, we're going to take this opportunity to restructure. We're going to get lean. You know what that means? That means they're going to lay off workers. That means they're going to boost their profits and their stock price by laying off workers and not rehiring people after the pandemic. Now, that's a corporation's right, but you don't have to subsidize that with government money, right? You shouldn't be giving them government cash, and then they lay off workers, and then the taxpayer has to pay unemployment for the workers they laid off. That would be a scandal, right? Well, if they don't stop it, it's going to happen here. And if they were smart, they'd finally rebuild the infrastructure in this nation, which they've been talking about for 30, 40 years, and they've never done. You want to put people to work, build airports, build bridges, put technology in education, put technology in healthcare, do the things you've talked about for 40 years. But the government was never competent enough to do. And also to Washington, after my conversations, so much of it is, well, here's our politics, here's our politics. Forget your politics, just put it all aside. There's a greater interest than your politics, and that's doing the right thing for this country and for your constituents, and stop the hyper-partisan attitude and the gridlock. Forget the red and the blue. We are red, white, and blue. We're all Americans. That's my opinion. Back to the facts. We're going to focus on the opening of New York City. We have reopened the other regions of the state. We divided the state into different regions because the state has dramatically different facts across the state. We're in New York City, one of the densest urban areas on the globe. We have parts of upstate New York, which are rural areas, which look more like the Midwest, and they had facts more like the Midwest. So we divided the state into regions and addressing the facts in each region. The other regions have all started reopening. New York City, where we had a much higher number of cases than anywhere else in the state, anywhere else in the country, than many countries on the globe. New York City is a more difficult situation. We were attacked in New York City by the coronavirus from Europe. I like to say that because people say, what do you mean the coronavirus from Europe? I thought the coronavirus was from China. Yeah, so did I. So did everyone. That's what we were told. The coronavirus was coming from China. What we weren't told was the coronavirus left China, went to Europe, January, February, and then came here from Europe. Oh, nobody told us. I know nobody told us. They say nobody knew. I don't know how nobody knew, but the cases came from Europe. January, February, March, 3 million people traveled from Europe to JFK and Newark Airport. Why did New York City have so many cases? Because 3 million Europeans came January, February, March and brought the virus, and nobody knew, and nobody told us. No fault of our own. There's nothing endemic to New York City. Yeah, we have density. But we're all watching China. We're looking to the West. And the virus came from the East. It came from Europe. And that's been documented now. So we were the hardest hit. But we're going to reopen as the smartest. And if you look at the curve in New York right now, you see our numbers are going down. You see the curve in many other states, many other parts of the country, you still have the curve going up. So we did get hit the hardest, but we learned. The state has a set of rules and metrics to reopen that apply to New York City just like they apply to every other region. Why? Because what is safe to reopen in Buffalo is the same standard that is safe to reopen in Albany or Long Island or New York City. I'm not going to open any region that I don't believe is safe. And we have different standards across the nation. Different states have taken different standards. You can argue about whether or not we should have different standards of safety in this nation. But that's above my pay grade. I can tell you in this state, there are no different standards of safety. What is safe to reopen is safe. And if it's safe for your family, it's safe for my family. And I wouldn't reopen an area that I didn't consider was safe for my family. That's my personal gauge. So it's the same all across the board with the same rules. Phase 1 reopening is construction, manufacturing, curbside retail by specific guidelines. The other regions have all hit phase 1. New York City is yet to hit phase 1, but that's what we are pointing towards. And then once you hit phase 1, you continue to monitor the metrics. If all is good, you move to phase 2 accordingly. But it is about the metrics. It is about rate of hospitalization, number of hospital beds, number of ICU beds, what's happening on the testing, what's happening on the symptoms that people are reporting, and you monitor those metrics, those facts, and you proceed accordingly. New York City, we have to make more progress on some of the metrics. We have to make more progress on what's called contact tracing, which is very important. After you test, whoever winds up positive, you trace back those contacts and you isolate. In New York City, you also have the added situation of public transportation. For New York City to reopen, you have working New Yorkers who commute on mass transit. And we have to be able to have a mass transit system that is safe, that is clean, and is not overcrowded. And the MTA has really taken the bull by the horns on this one. We never heard of disinfecting a train. We heard of cleaning trains, and then we could debate whether or not the trains were that clean. But to get them to a point where they're disinfected was a higher level, a higher standard than anyone ever dreamed of. They're now disinfecting every train and every bus on a daily basis. They're piloting the use of UV light technology to kill viruses in subway cars. So they're using the best science to get ready for this. In the meantime, we want to focus on New York City hotspots. Because if you look at New York City, there are very different stories within the city. And we now do enough testing. We do tens of thousands of tests per day. We are doing more testing in New York State than any state in the country. We're doing more testing in New York State per capita than any country on the globe, okay? So we're the testing capital. When you do that many tests, you can target exactly where people are getting sick and where those new cases are coming from. And you can look at that by neighborhood, by zip code, and what you see is more of the cases are coming from outer borough communities, more minority communities, lower income communities, new hospitalizations coming from people who are not currently working. They're not essential workers. They're communities where essential workers live, but they're not the essential workers. It's more from what we call community spread. It's in communities that have an underlying healthcare disparity, which is a problem across this country. Populations that have higher incidence of underlying illnesses, and lack of masks, social distancing, particularly with younger people. If you look at the testing results, for example, you have communities that have double the infection rate of the city in general. So the city in general is about 20% infection rate. You have communities that are literally more than double, 43% infection rate. Brownsville, Brooklyn, 41% infection rate. East Bronx, 38% infection rate. Soundview, Bruckner section of the Bronx, 38% infection rate. Hollis, Queens, my old neighborhood, 35% infection rate. Flatbush, Brooklyn, 45% infection rate. And that's why we're here today. You know these communities have a higher infection rate. You know the new cases being generated tend to come from these communities. Well, then target those communities, right? That's part of being smart. Get them help and get them help faster and address the healthcare inequality that is underlying all of this. So bring in more diagnostic testing, more antibody testing, more PPE, more healthcare services for the underlying illnesses. That's where the comorbidities come from. Bring in more supplies and bring in more communication. We're doing all of the above. We're taking on the issue of inequality when it comes to health care, and we're going to take on the challenge of the most impacted communities in terms of COVID. We're working with Northwell Health Systems. Northwell is the largest health system in the state. It's a great organization, and they're going to bring more health care services to the impacted communities in New York City that we're talking about. We're up to now 225 testing sites. I just passed one on the way here today. Many of these testing sites are underused. We have testing sites, drive-through sites that can do 15,000 tests a day. They're only doing 5,000 tests a day. There is no cost to the test. It does not hurt. It is pain-free. I did the test on live TV, didn't flinch. It's just a nasal swab. There's no needle. You can go to the website coronavirus.health.ny.gov and find the site near you. Get tested. Get tested. If you have a symptom, get tested. If you were exposed to a person who was positive, get tested. It's no cost. It doesn't hurt. And there are sites literally everywhere throughout the city. We've delivered more than 8 million masks across New York City to public housing, food banks, churches, and homeless shelters. The masks work. They work. And we have to culturalize the masks. We have to customize the masks for New York to get New Yorkers to wear them. We're bringing 1 million additional masks today. And today I'm signing an executive order that authorizes private businesses to deny entrance to people who do not wear a mask or a face covering. I have been working to communicate this message about masks and how effective they are. They are deceptively effective. They are amazingly effective. And we've made them mandatory in public settings, public transportation, et cetera. But when we're talking about reopening stores and places of business, we're giving the store owners the right to say, if you're not wearing a mask, you can't come in. That store owner has a right to protect themselves. That store owner has a right to protect the other patrons in that store. You don't want to wear a mask? Fine. But you don't have a right to then go into that store if that store owner doesn't want you to. And we'll sign that executive order. And in general, more communication, more education about the availability and importance of testing, diagnostic testing, antibody testing, wearing the PPE, why social distancing makes sense, and communicating this to people. And my main job all through this has been communications. This was not a task government could ever accomplish. I knew that from day one. I know what government can do. I know what government can't do. Tell 19 million people in the state of New York that they have to stay home. Government can't do that. I can say it, but we'd have no way to enforce it. It's up to what people do. And people, especially New Yorkers, they're going to do what they want to do. They're going to do what's smart if you give them the information, if they believe you, if the information convinces them. But they're going to do what they're going to do. So my job from day one has been communicating the facts to people so people can make a smart judgment for themselves. So people had the information to protect themselves, to protect their family, to decide what was smart. That's my job as governor. That's what I've been doing. That's what I continue to do. I'm still trying to communicate to people how important it is to take tests and wear masks, etc. I have, at times, been frustrated that not everybody seems to get it. I have my 3 girls at home, as you know. Family keeps us grounded. You know, family always has a way of bringing you back to reality. My girls have been very good at telling me that when I raise the frustration of communication, they say, well, it's you, Dad. It's You're the one who's not communicating. They've had many helpful hints as to why I haven't been able to communicate effectively or to the level I would like to, that I'm not cool enough. I think I'm cool. Look, I'm wearing a cool mask. I don't have enough edge. One of them said I don't have enough edge to communicate effectively. So I'm trying different ways. They didn't like the state advertising. We're now doing different state advertising. But I understand that I need reinforcements and I need help in communication, especially when I'm in Brooklyn. Even though I'm half from Brooklyn, that doesn't matter when you're from Brooklyn. They want a full-fledged Brooklyn voice if they're going to listen to a Brooklyn voice of authority. So I'm going to bring in reinforcements to help us communicate that message, and I'm pleased to have them with us today. And I want to thank very much two great New Yorkers, two great performers, Chris Rock and Rosie Perez, who are going to join us, and I want to thank them very much. They're going to help communicate this. They're going to do advertisements for the state, and they're going to help communicate this message that it's important for an individual's health, for a family's health, and it's important for all our health. We're one family in New York, one family in Brooklyn, one family in Queens, one family in New York City, and do it for the good of the family. Rosie, it's great to be with you again. Chris, I'm so glad that you're here. I can't thank you guys enough, and we'd love to hear from you, whichever one wants to start.
Ladies?
Oh, thank you, Chris. He's such a gentleman.
What a gentleman.
It's an honor, and it's really good to be here with my friend, my fellow Brooklynite, Chris Rock, and of course, our fantastic Governor Cuomo, who has been such an amazing leader during this crisis. You know, and I'm proud to be partnering with the governor to make sure that my hometown, my borough, my beloved borough, Brooklyn, and all of New York, most impacted communities have their resources they need to stop the spread of this virus and to help spread the word about what we all have to do to beat this virus. In Brooklyn, there's a saying, spread love the Brooklyn way. And I want to extend that to not just the outer boroughs, to the tri-state area, but to all of America and to all the world. Spreading love the Brooklyn way means respecting your neighbors, respecting your communities, and the way you can do that is by getting tested, wearing a mask. That says, I love you and you love me, I respect you and you respect me back. I don't care who you voted for. I don't care who you're going to vote for. All I care is that we get out of this pandemic as quickly as possible and as safely as possible. Over 100,000 deaths is just incredibly heartbreaking. And we can lower these numbers. We're already doing it. And I wish the media would show how effective the governor has been in spreading this message of wearing a mask and keeping social distancing. And for those who are not adhering to the guidelines, just know that you're not just disrespecting yourself, you're disrespecting your loved ones, your communities, your neighbors, everyone. So please spread love the Brooklyn way. Get tested, wear a mask, and let's help fight this virus. We could do it. We could do it. We will rise up. We will stand up. Brooklyn, stand up. New York, stand up. America, please stand up and be safe. Thank you so much. And I just want to say that our governor is a rock star, and he makes me proud to be from New York.
Thank you very much. You guys are the rock stars. I'm just a fan. Thank you so much. Rosie, thank you so much. Chris?
Yes, thank you. I watch you every single day, and you bring me calm. You know, you bring me joy. Didn't Anita Baker sing that? You bring me joy every single day, because I don't know what's going on. I thought I lived in the United States. I thought I lived in a country, and now I realize we have 50 countries, essentially. Right now, we're in the country of New York. I want to say I got the test today. I just got tested to come out here. I got a 65, so just
passed.
Just passed. I'm actually, we haven't been able to perform or do any shows or anything. I'm looking at this microphone right here. I'm like, wow. Can I just say hi, microphone? I really missed you. I know it's been hard, but we're gonna get back together at some point, and it's gonna be even better than the last time, microphone. I will never take you for granted. People need to get tested, and people need to make it a festive occasion. They need to posse up and get tested. Like all the crew is getting tested, and the family should get tested. And if you love your grandmother, if you love your elderly mother, your elderly anybody, you should get tested. And it's not just, it's wherever there are poor people, really. It's wherever people are congested. So yes, it's in East New York. Yes, it's in Brownsville. But, it's also in Garrison Beach. It's also in Marine Park. It's also, so everybody that can get tested should get tested as soon as possible. And I'm just so, Governor called me up, and I'm here to do whatever is required. And, I hope to God that when this is over, you're still a part of the government. I hope this isn't the last, it's like, oh, it's over. No, I hope this keeps going on.
I hope so too.
Yeah.
That would be bad.
That would be bad.
Oh, excuse me, Governor. I also would like to say that to mi gente, oye, wear a mask. Please, the numbers in our communities are staggering. This is not a joke. This is not a hoax. This is real. This is real deal Holyfield. So please, mi gente, love each other and love yourselves. Get tested, wear a mask.
Get tested, wear a mask. It's like when the doctor prescribes antibiotics. He says, take the whole prescription, and if you stop, whatever you came in there for is going to come back worse. So social distancing is what was the prescription. And we need to take the whole dose, or else it's going to get worse.
So true. So well said. And look, it is a new thing, right? This wear a mask thing. It's just a couple of months. Think about it. Nobody heard about it before that. You'd watch TV once in a while, you'd see people in China wearing masks, but nobody did it here, right? So it is introducing a whole new concept to people. And it's not only making it okay, it's making it not okay to not wear a mask. Not wearing a mask is not okay. And that has to be the culture, and that has to be the attitude. It's not okay if you don't wear a mask. It's not okay for you to jeopardize my health. I don't think it's right for you to jeopardize your health, but that's your health. And by the way, you jeopardize your health, you also jeopardize the health of your family when you go home and whoever else you're interacting with, but you don't have a right to jeopardize my health. So it is, as Rosie said, it's respect, it's civic duty, it's humanity. It is New York. New York is 19 million people who start with the premise we can all live together in a very close area, right? Part of that acknowledgement is we're going to respect one another, and we're going to respect each other's space. And we're going to respect each other's air to respecting each other's space, right? We're going to respect each other's air. Wear a mask. Thank you, Rosie. Thank you, Chris. Questions?
Governor, I want to get the status on this bill the mayor is seeking regarding $7 billion he wants in borrowing. My understanding is, you probably know, the bill was laid aside by the Assembly. Is your sense that something can be negotiated here? Like, would you like to see the city come up with an austerity plan, perhaps enact the Financial Control Board to have some controls, or would you rather just not see this bill pass now?
I haven't had any serious conversations with the legislature on it. But you'd have to have serious conversations, right? The first question is, how much aid do we get from Washington? That we're working on. That's why I was there yesterday. That's what I was making the point against state and local aid. What does the state get? What do the local governments get? What does the city get? After you find out what that fact is, what's the shortfall, and what are you going to do about it? Borrowing for operating expenses is a risky proposition, and it has to be done with caution, if at all, because now you're really rolling the dice on future revenues. And the reason the state has to be concerned, and I think the Senate, I spoke to some senators, state senators, who frankly were very smart about this, and they were talking about the history. Look, we've been through this. When you have a local government that basically goes bankrupt, the state has to step in and then puts in a financial control board. We went through this with Erie County, where there's a financial control board. We went through it with Nassau County, where there's a control board. Yonkers, there's a control board. New York City, we went through this situation in the 70s, where New York City was basically bankrupt. The state had to step in. So first question is, how much money do we get from Washington? Hopefully they do the semi-responsible thing. But the second question is going to be, once you know what the Washington funding is going to be, how do you make up the shortfall? And there will be a shortfall. But that's a very serious conversation, because making up the shortfall is forcing you to estimate future revenues. When does the economy come back for New York City? 6 months, 9 months, a year, 18 months, 2 years? And that's a challenging conversation at best. So I don't know. I think the legislature and I think the Senate did the responsible thing.
They would have to do it now. In other words, they're scheduled to go out of session, as you know. Presumably they could come back in September or earlier than that. Would you rather see it taken up then when we know what happens?
Well, they want to know what happens with Washington because they're in the same position with the state budget, right? I haven't made any state budget decisions because I want to see what happens with the Washington funding before you get to step 2. Finish step 1, then go to step 2. What's my state budget going to look like? I can tell you what it looks like if I don't get funding from Washington. 20% cut on schools, 20% cut on hospitals, 20% cut on local governments. But let's see what happens with Washington. And we haven't done that with the legislature, so I think it's the same for the Nassau budget or New York City budget or Erie budget.
Can you clarify exactly what is the guidance now to get tested? Is it asymptomatic and also symptomatic? And are you talking about antibody testing or the testing for when you're ill? And then can I ask you a second follow-up? Why wasn't the mayor here today? When was the last time you talked to him directly? Don't you think that getting on the same page with him would help clarify for New Yorkers what the guidance is towards reopening?
Yeah, first we're on totally the same page because it's only one page. I don't know where you see different pages, right? There's state guidelines, period. And that's it. So there's only one page. So you can't be on a different page when you only have one page. The mayor has his schedule. I have my schedule. I talk to him all the time. So, but there's only one page.
And the guidance on testing, just
the guidance on testing is on the website, but it's now so broad. It's if you have any symptoms, which are basically flu-like symptoms, so if you cough, you sneeze, you have a fever, any symptoms, you're exposed to a person who has COVID, you're an essential worker, frontline worker, healthcare worker, you're going to be in a retail store where you may be open to the public, it's virtually open.
Asymptomatic people are still not being recommended.
Well, asymptomatic who, if you're an essential worker or you're at a retail store, then yes.
You met the president yesterday to talk about infrastructure. One of the things that came up was the fast-tracking LaGuardia Air Train. Did you also talk about fast-tracking congestion pricing out of the USDOT? Not, why not?
We've talked about that issue. I was talking about primarily job-creating activities yesterday. So LaGuardia Air Train would create jobs, also create an air train, which we need. The Cross Harbor tunnels creates jobs, et cetera. So we were focusing on job creation. 2nd Avenue subway, which is in Manhattan, goes up 2nd Avenue. Congestion pricing we've spoken about a number of times. That's not necessarily a job creator, but it is very important for the city and the state, and it requires a federal sign-off that we're still waiting for.
Federal sign-off yesterday, I mean, isn't that helpful on the capital program?
I've spoken to him about that on previous occasions, but yesterday there was a discussion on different topics, which is job generation.
In terms of the executive order, why the decision on the executive order? Are you concerned about conflicts that arise when a store owner says, keep out?
Yeah, you could have, look, it's New York. You can have a conflict if you say good morning, right? So, but you have a private store owner. It's a private store. He's the store owner. He, by executive order, has the right to say, if you're not wearing a mask, you can't come in. You don't have a right to expose the store owner to a virus. You don't have that constitutional right. You don't have a right to expose the other patrons in the store to the virus. You don't have a right to walk into a store and cause all the other patrons to run out because you're wearing a mask, not wearing a mask. You don't have that right. So, yeah, could somebody complain to the store owner? I think I should have the right to come in even though I don't have a mask. Somebody can say that. That person would be wrong, but they could say it.
I have two questions, though. The first is, how much of a heads up will New York City get before a reopening? Will it be like, all right, well, New York City will open in 2 days, for instance? And the other question is, do you have any thoughts on what's going on in Minneapolis right now?
We talk to the city multiple times a day, so, and we have one set of state numbers and guidelines and metrics, et cetera. So we're all watching the same numbers, et cetera. So there's no surprise because we're literally in constant contact. I think the situation was so disturbing and ugly and frightening. It was just frightening that a law enforcement officer anywhere in this country could act that way, especially after everything we've learned. You know, sometimes you say, you rationalize in your own mind, well, this is terrible, but we'll learn from it. How many times do we have to learn the same lesson? I mean, we went through it in New York. We had the Garner case in New York. It's happened all across the country. How many times do you have to learn the same lesson? And look, a prosecutor will do the case. I was a prosecutor. I was the attorney general. I don't prejudge a case. Maybe there are facts that I don't know. But I'll tell you, if I was a prosecutor, I would be looking at that case from the first moment, because I think there's a criminal case there. Does anyone want to add anything, Rosie, Chris?
Governor,
Luis?
You said that you were waiting on clarity from the federal government for federal funding before making any decisions on state budget cuts. But as you wait, which could be a while, has the state taken any measures to control spending, whether it be hiring freezes, not renewing contracts, delaying payments?
Yes, all of the above. All of the above. Look, whatever the federal government does, there's still going to be a shortfall, right? Well, let me take that back. Maybe the federal government becomes enlightened and responsible and actually funds the amount necessary to close the gap, which would be smart and right. But if they don't do that, there'll be a shortfall. We're preparing for a shortfall and reducing expenses all across the board.
And just to add to that, the governor did do an order, and I believe it was at the end of March when everything first started happening. We did an across-the-board hiring freeze. We asked our labor brothers and sisters to forego the increases in their salaries that were guaranteed by their contracts, which they all agreed to do, and that includes the 2% increase for management confidential workers. So we have taken those steps.
Does that
include layoffs? And a second question, because that's just a follow-up to his. Have you been following the city's plans to reopen, like restaurants putting tables outside, the stock exchange telling employees not to take mass transit? So what are your thoughts on those plans? And do you think that those are going in the right direction?
Yeah, let me just a follow-up question, still a question. So it was still two, but that's okay.
Thanks.
I like that though. That's why it's New York City. It was a follow-up, doesn't count as a question. We haven't done any layoffs. We hope not to do any layoffs. And again, we have to see what Washington does because everything will be a factor of that. In terms of opening guidelines for businesses, they are set. You can find them on the website. They apply to every business across the state. It's one set of rules. There are no different rules for New York City than there are for Buffalo, than there are for Albany. I want to be able to say to every New Yorker, I believe it is safe to reopen. I believe it's safe for my kids. I believe it's safe for your kids. And we don't change what is safe from one place to another. So there are no different rules for New York City.
In public transit, is there a threshold that the MTA thinks of amount of riders that's safe? And what is the plan to reopen public transit? Temperature checks, reserved rides, and what will you do budget-wise without congestion pricing?
Yeah, the budget is going to be a problem, but the federal government, part of the funding from Washington is for the MTA, right? That has nothing to do with congestion pricing. And the MTA is going to have a full reopening plan. Socially distancing on buses, subways is not really that possible. That's why the reopening is gauged to metrics on the drop in the virus, because you can't really say to people, the virus is still raging, get back on the subway, get back on the buses. But from the cleaning to the disinfecting, to stopping the hours during the night, which for a few hours the disinfected trains, which I know was controversial, but I think it was right. Those trains have never been cleaner. I think we finally have homeless people getting the care they need rather than sleeping in subway cars, which is long, long overdue for every New Yorker, including for the homeless. So I think that was all very smart. And they'll have a full reopening plan ready to coincide with the economic reopening that we announced. Who didn't ask a question? Anyone didn't ask a question? Yes.
The partnership with Chris Rock and Rosa Perez, what does that mean for New Yorkers, and what exactly are they going to be doing?
They are going to use their voice, their skill, their talent to communicate better than I have. And they're going to be doing an ad that we're going to run from New York State to communicate to New Yorkers just what they said to you today, how important it is to do the testing and wear the PPE, and how it's part of our social responsibility, and it's also smart for individuals. You want to add anything to that, Chris, Rosie?
I would just like to say that in regards to his executive order that I'm so happy to hear about authorizing private small businesses to have someone leave if they're not wearing a mask, if we can have that precedent made, it's going to lessen also the anxiety of going into a store. It's going to lessen, hopefully, the fights that are breaking out in stores when someone sees someone without a mask. It's just, there's enough fear that's going around. And wearing a mask, like we've been stating, is not just about respecting you, yourself, or your community and your fellow neighbors, but it's also respecting the store owners, and it's also decreasing the anxiety, because what's coming out of this pandemic, what a lot of people don't talk about, what the governor does talk about, is also the mental illness ramifications of all of this. When you see people lose their temper inside the stores, it's just because everyone's on their last nerves. Getting tested, wearing a mask, practicing social distancing, washing your hands will decrease all of those anxieties. And giving the stores that authorization, I think, is, I hope and pray that it's a positive step forward so that we don't have to see these crazy YouTube and Instagram videos of people just losing their mind.
Yeah, if I can add, Rosie's exactly right, and I share that thinking 100%. I think this will reduce conflicts. Look, it's one thing you don't wear a mask and you're walking down the sidewalk. That's one situation. You don't wear a mask and you walk into a small retail store, and now you're exposing people to you without a mask, and they're surprised by this, and they're in a smaller, confined space. That is a conflict waiting to erupt, right? So you don't want to wear a mask? Stay on the sidewalk. Don't socially stay within, try to stay within the social distancing guidelines. But if you go in a store and you know you're going to expose the other people, you have to wear a mask. And you're right. That's where you'll see real conflicts.
For Rosie and Chris, what do you see in your neighborhoods in terms of mask wearing?
Well, in Brooklyn, I'm seeing probably 40% people wearing masks. You know, just it's the kids really aren't wearing a mask, and you know, it's sad. It's sad that it's become that our health has become, you know, a sort of political issue. You know, it's almost it's a status symbol almost to not wear a mask.
What are you hoping to accomplish through this partnership?
I'm just hoping to help. You know, I have complete trust in the governor, and you know, we're soldiers for New York. This is, you know, it's 100,000 dead Americans, and I will go wherever, you know, I'm called.
People speak out in the neighborhood, self-policing within the community, people giving others a hard time if they're not wearing masks.
You see that a little bit. You see that a little bit. But most people, you know, New York try to mind their business.
Yeah.
Have you spoken out to other people in the neighborhood?
No, I haven't. I give a nice side eye.
I try to bring some levity into the equation, and I say, hey, do the right thing, put your mask on, come on, people. But, you know, I also see what really boggles my mind. You know, we talk about how the communities of color, communities of low income and poor, when you step into the communities that are affluent, where you see hipsters and yuppies walking around without a mask, I go, what is it? Is it arrogance? Is it an arrogant, defiant act that you're doing? Do you think that you are not going to be affected? Okay, fine, that's your thing, but you're affecting me too. And that I really do not understand, and people are not talking about that. You know, we're encouraging Latinos and African Americans to wear a mask, you know, that come from, you know, low-income communities. Well, you know what? Everyone needs to get on board. Everyone, put your arrogance aside, put your ego aside, you know, and come together. The governor said it's about humanity. You know, so if anything that I could do, be a cheerleader, let Chris tell a few jokes to get people put a mask on, we will do whatever we can to be part of this campaign.
Yeah, also just to reinforce Rosie's point, this is predominantly an issue with younger people. I think part of it is the way this was communicated initially. It was initially communicated, don't worry if you're a young person, this is only about old people and young people won't get it. That turned out not to be 100% true, but I think that was the first message that went out there. I remember there was a video that went all over the place about a young guy who was in Florida partying, and he's on the video and he says, yes, coronavirus, young guys don't get it, only old people get it. I'm not going to let it stop me from partying. I'm going to go when they were partying down on the Florida beach.
And now he's dead.
You can't find that video anymore. But I think that's the way it came out. And so part of this is correcting that. And it's not just one community or another. I think it's young people all across the board, you know. And plus, they're young. You know, they're superheroes. They're Superman, Superwoman. Nothing can affect them. And even, which is not true, but even if it were true, you can kill your mother, your father, or your grandparents, or whoever you happen to come across. Let's take one more, because they have to get to work.
Right now, New York City has the same amount of
Just
deaths.
excuse me one second. Anyone didn't ask a question? Okay, go
New
ahead.
York City has a mix of confirmed and probable deaths, which is now about the same as the amount that New York State is reporting in total. The city managed to come up with a tally of confirmed and probable deaths. Does New York State have any plan to do the same so that New Yorkers can understand really overall what an impact this has had on our state?
Yeah, just so we're clear, some states, different places do it differently all across the country, but they're two different numbers, right? Confirmed death is confirmed death. And then there's another calculus which is probable, but we're not sure. And we'll tell you when we find out. That's probable. So they're two different numbers. Do you know, Melissa, on our count, which one do we provide?
The city provides the probable and the confirmed, and the nursing homes are reported the probable and the confirmed.
And to provide the probable death number.
I'll have to check in with DOH about that. And I think it's only 10 states in the country are currently providing probable and confirmed. So as the governor said, this is an uneven accounting. Even when you look state to state, I think everyone needs to consider that when they're doing the state to state comparisons. But I'll check in with DOH and we'll get back to you.
Yeah, because the probable, you know, confirmed death means confirmed. I don't know what really probable means. Okay, thank you all very much. Chris, thank you. Rosie, thank you.
Thank you.
Now he's dead.
All right, folks, we are worldwide here on News Now, coronavirusnow.com. We're going to continue on here. We got House Minority Leader Kevin McCarthy with his weekly briefing.
Anybody else in his lifetime could. You see, Sam was an Air Force pilot. He flew missions in Korea and Vietnam. He was shot down. He served in Hanoi Hilton 7 years. 3.5 of those years was in solitary confinement. Sam was one of those type of individuals it's just an honor to get to know. But I want to tell you some personal stories about Sam so the rest of the country can know who this real hero was. Sam was on my deputy whip team. And when Sam would come to the meetings, we always had one special chair for him. But there's one thing Sam always wanted: these chocolate Krispy Kreme donuts. And it's amazing. You could sit there and he could eat 3-4 donuts all within a meeting. And I remembered one day we had some new staff, and they didn't get Krispy Kreme. And I heard Sam say something about it. I quickly called another staff member who was still home that lived up by a Krispy Kreme to bring him on down. And when we went to the floor that day, I snuck in a couple Krispy Kremes for Sam on the floor. And when you looked at his face and smiled, you knew that he deserved it. You know, every new Congress, I would buy a number of Sam's books, Captive Warrior. And the reason I would buy them is I remember reading it as a freshman. And for anyone who's ever tried reading this book, you cannot read it in one setting. You will become emotionally upset knowing what he had to go through. Telling of his life story, telling of him being shot down, the treatment, the broken arms, the number of times as a prisoner being put in, he'd tell a story of the North Vietnamese putting a rifle to his head or taking him out to killing him. And at that moment came when he's telling this story, he'd almost smile and he goes, you know what? They're gun jammed. He could find happiness in the most unbelievable times. And in reading this book, it brought me to tears at times, knowing what he had to go through. And I remember seeing him on the floor one day, and I walked up to him as a freshman. I said, Sam, I just finished your book. I just want to thank you for your service. And I have to tell you, I can't believe the things you went through. Sam just hit me and said, oh, you could have done it. No. Very few people could ever have done what he did. Even in the times of his almost daily beatings, he tells at the time when I'd take him to dinner, I'd buy all the freshmen in the book, he would sign it, and he loved Ruth Chris. You know, there's a certain one that he wanted to go to, certain steak he wanted to buy, and a certain red wine. And as we would go, he would tell the stories and we'd give him all the book. And I remember him telling this one story, it's in the book as well, that he was being brought in to one of his captors who would beat him. And he knew what was going to happen again. And as you knew Sam, he still was a hard time to walk, didn't have fillings in his hands from the beatings that he had taken, or his legs being shackled together. He goes to the individual who's his captor holding him, and he tells him, hey, we're going to escape, and we're going to go back to America. Do you want to go with us? He never lost the sight of the greatness of this country. That America is more than a country, that America is an idea worth fighting for, dying for. And he proved it every step of every day of his life. And we lost somebody that walked these halls that was an honor to serve with, an honor to call a friend. And I think he deserves more time than just the time I was able to give to him today. Now let's talk a little bit about this week. It was a historical week. A week we have not seen in the 231 years of history of this chamber. For the first time, the Democrats have now allowed proxy voting. You know, through the history of America, from the yellow fever of 1793 to the Civil War to even this building being burnt down during the War of 1812, to 9/11, to World War II, all of those challenges we've always found the opportunity to meet. That we believe we are essential, just as all those Americans out there are doing their essential work as well, from the doctors to delivery drivers to dispatchers. Unfortunately, the Democrats believe differently. 2 weeks ago, we voted on the HEROES Act, and 12 Democrats could not make it. Yesterday, even though they were given a 2-week notice when to come back, more than 70 voted by proxy. In coming to this proxy decision, the Speaker and Chairman McGovern gave a lot of stringent facts of how this would be used. In fact, the guidelines specifically stated that you must be unable to physically attend proceedings in the House chambers due to ongoing health emergencies. The Speaker insisted voting by proxy was intended to be the last resort, an alternative to traveling to D.C. due to health concerns. And Rules Chairman McGovern promised that this unprecedented step would be temporary and tied to a pandemic. Yesterday, Democrat Congressman Charlie Crist admitted he used the proxy vote to attend a space launch in Florida, an event that's 150 miles away from his district, on the other side of the state. To get there, it took him about 2.5 hours to drive there, about the same amount of time as a flight from Tampa to D.C. But instead of going to work and serving as a voice of his constituents, Charlie decided to play hooky. But in doing so, Charlie sent the House of Representatives a letter that he signed. And in signing this letter, he said, I am unable to physically attend proceedings in the House chambers due to the ongoing public health emergency. But he drove 2.5 hours to watch a launch outside of his district and gave somebody else the power to vote. I wonder if Charlie will cash his check this month. I wonder if those 70 Democrats will still take their check. The question before all members of Congress on their first day is to raise their hand and swear to uphold the Constitution. The Constitution is very clear about this. They expect us to assemble. If you take Chairman McGovern's own words when he first looked at this, he was concerned about proxy voting because of the constitutionality of it. He was right then, but he's wrong now. They believe that Congress can write their own rules. Congress can write their own rules. They just can't write unconstitutional rules. If you take them at their word, they can write a rule that says Republicans only get half a vote, that women cannot vote. That would be Congress writing their own rules. Article 1, Section 4, Section 5, and Section 6. Very clear we're supposed to assemble. Very clear that if you're not at work, they could find a place and get you and bring you. Very clear that someone cannot obstruct you from getting to the work. For 231 years, we found the ability to do that. But why would they want to go against the Constitution to provide proxies? It provides the Speaker more power, that is true. The Speaker, in her own words yesterday, admitted that the crisis is an opportunity. Every crisis is. She's not the only one on the Democrat side that believes that. Congresswoman J. Paul, for me, the leverage is that there is enormous suffering. The number 3, Congressman Clyburn said, this is a tremendous opportunity to restructure things to fit our vision. And last week, even Democrats admitted their legislative proposal was more of a wish list than a serious proposal at that. A pandemic is not an opportunity. A health crisis is not a free-for-all to restructure our government. We instead should be working together to reinforce the promise and progress we are seeing take place in this country. And with that, I'll open it up to questions. Yes, sir.
Same question I had for Pelosi last week on the Scarborough issue. Is it appropriate for a sitting president to accuse a TV host of murder over Twitter?
I think I answered that yesterday. I don't have anything further to discuss about. I wasn't around when Scarborough was here. Look, I answered it yesterday. I don't think there's anything further to discuss. Yes.
A question I asked Pelosi as well. What are your thoughts on this, on the president's upcoming executive order on these social media giants when it comes to this liability issue when it comes to going after certain tweets that people make?
Well, this is one place I'd actually agree that the president should be looking into. It's something we did in the majority. I have not seen the new majority take any opportunity from committees to bring them in. We brought a number of the CEOs in. I agree with what Mark Zuckerberg said when he said that social media shouldn't be the arbiter of truth of everything that people say online. And it's interesting to me with Twitter, if you're going to hire somebody to be the arbiter, you ought to at least look at what they tweeted. Should the arbiter be an individual that believes any states in the Midwest that he refers to as flyover states that voted for President Trump are racist? Or would he believe those who work for the president should be similar to, call them similar to Nazis who worked for Hitler? I would find that a hard truth to see that they were the arbiters. I've watched what social media has been able to do. There's a concern from a monopoly perspective on some. But I think what Mark Zuckerberg said is the approach that they should take, and I think what the president is doing is correct. Yes.
Mr. Leader, the speaker this morning on FISA criticized you and your Republican colleagues for basically doing a 180 on the FISA vote because the president sent a tweet. Wondered if you wanted to respond to that. And second, what is the path forward on this bill? Previously, many Republicans have said these are very crucial national security authorities that need to be there for national security reasons. Do we have to wait for the outcome of the Durham investigation to move forward? What possibly is the path forward here?
The path forward is exactly what I told Majority Leader Steny Hoyer just a couple days ago. I would take a pause because every single day we learn something new. Remember what FISA is, from foreign intelligence surveillance. But it was used for surveillance on Americans. And every day we learn something more. Shouldn't we take an opportunity to correct that? Lo and behold, the speaker is now coming to the same position I told him would probably be best a couple days ago. Maybe she's upset by that. But I think that's the appropriate thing to do. Why don't we get back together, work with the administration, find out any more unmaskings from a past administration of how they misused this FISA and others, and correct it so no American could go through this again. Interesting to me that the former vice president now running for president unmasked people. Ambassadors that were appointed by President Obama were unmasking people. Then look at the time frame of when it was done. after the election. After someone's duly elected to become president, in a time frame of a lame duck presidency from the beginning of January to being sworn in mid-January. Very interesting. While at the same time, they know from their own individuals all what they are professing to the American public about Russia was not true. Yeah, there are some grave concerns here, and they should be fixed.
To follow up, the unmasking issue is unrelated to these authorities.
No, it goes to a part of it. I know that goes a little further, but this is an opportunity to fix it as well.
Are you concerned that the roving wiretap, the lone wolf, the business records provisions, that those are going to put, having those expire, are going to put Americans at risk while you guys...
They don't have to expire. While you work on this bill, you could extend it. But I think the appropriate place to be is exactly the advice I gave to Democrats 2 days ago, that they're coming to that advice today. You should maybe get into conference and find out the differences, just as we do in regular order on any other bill. Yes, sir.
Leader McCarthy, if everything under proxy vote would you think would be unconstitutional, then what about the PPP fixed vote today? Would that be unconstitutional then?
I think everything taken up reads the doubt of whether it's constitutional or not. It brings a real doubt and why the Democrats should not move forward with it. That's why Morgan Griffith yesterday did a previous question to pause using proxies until the courts can decide. It is a legitimate question. It's about the constitutionality of anything they want to move forward. And it's a clean version of what you're seeing with the Democrats saying that this would only be used for members that have problems coming because of health. Well, that's not the case. If only 12 missed 2 weeks ago and more than 70 now, their largest delegation comes from California. More than half of all the Democrats in California stayed home. Is it being used the way the Speaker and McGovern promised? McGovern, even in his first review of it, said there's real questions about constitutionality. So it's not just the scholars that believe this is wrong. They did too. But they chose to try to invoke more power, and I think that is wrong. I also know let's take a couple questions from Zoom and then we can come back. Do we have anybody? Ooh, big echo. Questions, comments? May we go?
Apologies. We will be taking a question from Julie Grace Brefke with The Hill. As a reminder, if you would like to ask a question, use the chat function directly with the moderator. Julie Grace, your line is open.
Hi, Leader McCarthy. Yesterday, the Blue Dog Coalition sent a letter calling for a bipartisan task force on China. I know that initially the GOP task force was supposed to be bipartisan. I was wondering if there were any talks between leaders since that letter went out about maybe opening that up to both parties, or whether the ship sailed now that the GOP's already started to move forward.
Who did they send the letter to? The Speaker or to me? Because let me pause. As many of you know, more than a year ago, I went to the Democratic leadership and I requested a bipartisan committee on China. It took me a number of months to finally get them to agree. We agreed on who would be on it, the same number of Republicans, the same number of Democrats. Because the challenge we have in the next century will be about China. And we should have one strategy coming out of Congress. Not a Republican, not a Democrat, but an American strategy. The Democrats agreed, but when it came for the time to announce it, they backed away. In announcing that we couldn't sit back and wait, now that you found what had come through from COVID through China, the Speaker declined again. I welcome Democrats from joining our task force. The Speaker was asked about China. She was asked about the task force. You know what her answer was? That's a diversion. Is it a diversion of more than 100,000 Americans killed by this virus? Is it a diversion of what China just decided when it came to Hong Kong? Is it a diversion to stand for freedom? Sam Johnson would not have said it was a diversion. He understood what freedom meant because he was denied it for 7 years. I welcome Democrats joining our task force, and I'd allow them because I want America to win the next century as well. Yes.
What purpose does a pause serve in renewing FISA? What do you hope to learn about unmasking in a conference committee to deal with a completely unrelated law?
Well, you're taking two things and merging them together.
No, you
Well,
talked
no.
about two things and merged them together.
Well, then let me state it in the manner in which my head and maybe my mouth did, so you'd understand it better. When I called him 2 days ago, there was a concern that this was not going to be signed. So I said, why don't you pause and why don't we work on this with the administration? Because I'm not interested in doing some political game because I believe FISA is very important. And let's solve the concerns and let's make law. They chose to do differently. So we spent all day yesterday, late into the night, until they finally came to a conclusion that they could not pass it. So what would you do now in this predicament? I would send it to conference. That's what regular order is. You have a Senate bill that the House could not pass. You have a House bill, go to conference, and work on trying to solve the differences. That's the appropriate way to go. Let me go try to go. Huh?
It has nothing to do with unmasking.
Well, I think what has happened, every day we learn more. Every day we learn more of what has happened to Americans. You might say that doesn't take up the three instances of what's happening in FISA that we're taking up at this time, but it also deals with FISA. So there is an opportunity. If you learn new information, are you going to wait 3 years to stop something being used against Americans, or would you take an opportunity now to do something with it? I think there is a window. Let's go back to Zoom.
Our next question comes from Paul Corson with Sinclair. Paul, your line is now open.
Leader McCarthy, good afternoon. Thanks for taking the question. It's on the Twitter versus Trump controversy that continues. The president's tweet wasn't taken down. So does that really constitute censorship to put a link with more information alongside it?
It wasn't taken down, but my belief they put an arbiter of the truth that actually came through to said whether it was truthful or not. That individual with Twitter has his own personal bias. So I don't think that's the appropriate person. If you listen to what Zuckerberg said, he does not believe these social media companies should be the arbiter of truth of everything that people say online. That it's a platform for people to express themselves. That they could say one thing and say another. Twitter seems to be wanting to do something different. And that is what's concerning. Another question.
Yeah, follow up, please.
Sure.
When it comes to Congress's role in this, you've already had a few years to try and strike the balance between free speech and making sure it's an even platform for everyone to express themselves. Where do you go from here as this executive order takes shape?
Well, I think Congress should actually have hearings. When I was majority leader, that's what we did. We had Jack from Twitter come in. We had Mark Zuckerberg. We had Sanjay from Google as well. And the one thing you do when there is a problem and the world continues to change, and think about how powerful these companies are. Almost 90% of all searches go through Google. If you're not on the front page, 95% drop off. Influence what you see and what you know. We watched in a campaign the day after the last presidential election, people talking about the things they did to influence it. Different programs. I watched an election before a California election that Wikipedia put up that California Republicans is Nazism. That's influence. And I think that's why committees should have hearings on this and be able to look before they draft legislation. One more question. No more from Zoom. All right. Yes, sir.
Going back to China briefly, what sort of congressional action would you like to see lawmakers take in regards to China and coronavirus?
Well, the first thing I'd like to see is that it's not a diversion. I'd like to get to the truth. So let's have some open hearings about it. Where did it come from? What did they know? And when did they know it? Then I'd like to go even further. Never again should America ever have to be a supply chain beholden to China. We should relook at many different situations. What's happening in our universities? Why did the FBI have to arrest one of the professors from Harvard, being paid by China? What have they stolen? What is China doing right now while America is trying to develop a vaccine? China and Iran are talking about hacking in, which delays our ability to get that vaccine and even trying to steal it. There are so many questions that need to be raised. But unfortunately, the Speaker has a great deal of control in the House. She believes it's a diversion. So Republicans won't stop there. That's why we put a task force. It's good to see that there are some Democrats who disagree with the Speaker. We welcome them to join that task force because we believe we should look at this as Americans together. Look, the virus is here. We did not invite it. We did not want it, and it came from a foreign land. That's not a diversion. That's a lot of questions. And we will defeat it together. Yes.
You want sanctions or specific legislation about it?
I think there could be a number of actions for it. That's why I would gather all the information, and I would want it to be bipartisan in what we're able to do. Unfortunately, the majority party inside Congress today believes it's a diversion. I don't think those families that don't have family members coming home thinks it's a diversion. I think they should be held accountable. And what's appropriate to be held accountable? Let's gather the information and let's have an appropriate response. Does that work? Yes, sir.
Yesterday, you said about proxy voting that it empowers the Speaker.
It does.
And you referenced the California members. So I spoke to a couple of them, and they told me that basically they had been in touch throughout the day with their proxy, that they had sent very specific written directions as to how they wanted to vote on each item. So I'm just wondering if that's the way that the course they're going in this proxy voting, how does it empower the Speaker?
Speaker gets to control 20 people can control all of Congress. It empowers the Speaker on what comes before the floor and able to do. Did you ask that same question of Charlie Crist? Was he able to be at the launch and be monitoring what's happening on the floor? If those individuals that are monitoring happening on the floor, did you ask them the first question? When they signed the letter that they physically could not come, did you ask them why they could not come? I mean, that's the first thing I would ask, since the Speaker said this would only be used in severe situations and only if you physically could not come. I'm from California. The Speaker's from California. She's from Northern. I'm from Southern. We were able to make it. There's a number of members who were able to make it. So I'm concerned. If somebody was and they had COVID or they're around somebody, understand completely. But that doesn't give them a right to vote. Every single vote we have, there are members who cannot come. The Constitution says we are supposed to assemble. Their constituents loan them the power for every 2 years. They don't loan them the power to give it to somebody else. So yes, how was the largest bill that was ever passed in the history of Congress able to be put on the floor, voted with, never going through committee? The Speaker kept everybody away. The Speaker wrote a bill, then brought you back and only had one choice. Are they ever be a part of the committee and have debate? How well are they monitoring it from the floor? Are they only seeing what television is giving them? Are they able to engage with other members throughout the floor? Those are the concerns that I would have. It's unconstitutional. Yes?
The Uyghur protection bill yesterday.
Yeah.
Passed 413 to 1.
Mhm.
I'm assuming you don't think that bill was unconstitutional.
Listen, a bill itself that I support doesn't mean whether it's unconstitutional or not. It's the manner in which you vote for it. I'm not arguing about whether a bill's good or bad. I'm arguing the structure in which it's passed. Do you follow what the Constitution asked us to do? Why would you endanger a bill like that, where overwhelmingly all of Congress supports it, and have people do it by proxy? In the guidelines for a proxy, it literally says, if you're having problems, the staff could direct how for you to vote. When was the staff ever elected? So it's not the bill, it's the structure of how you perform it. That's what the Constitution requires, and that's what we should do.
I don't think staff advising members how to vote is a particularly new invention.
No, you're not.
Maybe
Again, I didn't clarify what I said. In the guidelines, read the guidelines. If this person who's monitoring what's going on has a problem sending what they're doing, staff can send it in. Well, how do you know that the member told the staff to send that in? I think that's a real concern. Yes, sir. They didn't give you a chair? What's wrong?
We like to keep them far away.
Now, the country now is more than 100,000 dead. The president in late February said the number of cases would be close to zero. He has repeatedly said that this is under control and that it would go away by the summer. Do you think the president gave the country false assurances about how bad and how deadly this virus would be?
No, because I've been in meetings in the Situation Room, bipartisan, bicameral, where Dr. Fauci almost gave me the exact same answer.
That the case would be close to zero in February?
That this would go away like a influenza, that they were prepared for it. He also told me masks shouldn't be worn only if you're sick. So yeah, I think every day people learn something more about this. I think when President Trump made the decision to stop the flights coming from China, when 22 other people sitting in that room thought something differently, yeah, the president made a right decision, even though those who are giving him information didn't have the right information. And if you really want to go back and you really, I know you're concerned about the president, I wish you would be concerned, if you're concerned about those 100,000, such as I am, and their families, let's go to where this started. So when it first came forward that this came out in China, what did China do? Yeah, they stopped flights, but only domestically. They allowed it to go internationally. When President Trump offered to President Xi that we would send our experts and our doctors and others, and they denied, did the president make a wrong decision then? When the World Health Organization told the entire world that it doesn't transfer from human to human, and he still shut down those flights, did the president make a wrong decision? No, he did not. If you are going to try to judge him when you're sitting and looking what China has done, it's appalling to me, your question in itself. Let's stop playing political games about people who lost their lives. Why don't we know that we now have a virus here that came from a far land that lied to an entire world and let flights go knowingly? And while they were doing that, they were hoarding all the personal protection equipment. People are not going home. People have died because of this. And the idea that you want to ask a question politically on that basis, to me, is what's wrong. Our focus should be on solving this. Our focus should be making sure we get a vaccine, making sure we get the antibodies. That's exactly what we're doing. I was just talking to a CEO yesterday of a pharmaceutical company, the fourth one that has BARDA, that they're going through, and it's very promising. They believe they can have the vaccine this year. And what we are doing as a government, by yes, President Trump, were we supplying the funding so we could have 100 million of those dosage if it comes to fruition, that it's faster than we've ever done before. The FDA is approving things that they've never done before. We just hit 15 million tests. Weigh that with everybody else in the world. Have they done that? You didn't ask that question.
The tests have been gone sooner?
I understand the questions you want to ask. I think the health of America is too important. I think what we're continuing to build. Would I want everything? I'd want a vaccine today. I would have wanted our scientists and our doctors to be allowed to go in China. I would have wanted them to be honest with the rest of the world. And the one thing I'd want to is stop playing politics with this and let's save more lives. Thank you for your question. All have a good day.
And welcome everyone here to News Now. We do appreciate you joining us worldwide on Fox 10 Extra, on coronavirusnow.com. We were just listening to Kevin McCarthy there, and we're going to hear him just a little bit more off the top right now. Just hear it for just a moment right here on News Now, everyone.
The first time the Democrats have now allowed proxy voting. You know, through the history of America, from the yellow fever of 1793 to the Civil War, to even this building being burnt down during the War of 1812, to 9/11, to World War II, all of those challenges we've always found the opportunity to meet. That we believe we are essential, just as all those Americans out there are doing their essential work as well, from the doctors to delivery drivers to dispatchers. Unfortunately, the Democrats believe differently. 2 weeks ago, we voted on the HEROES Act, and 12 Democrats could not make it. Yesterday, even though they were given a 2-week notice when to come back, more than 70 voted by proxy. In coming to this proxy decision, the Speaker and Chairman McGovern gave a lot of stringent facts of how this would be used. In fact, the guidelines specifically stated that you must be unable to physically attend proceedings in the House chambers due to ongoing health emergencies. The Speaker insisted voting by proxy was intended to be the last resort, an alternative to traveling to D.C. due to health concerns. And Rules Chairman McGovern promised that this unprecedented step would be temporary and tied to a pandemic. Yesterday, Democrat Congressman Charlie Crist admitted he used the proxy vote to attend a space launch in Florida, an event that's 150 miles away from his district, on the other side of the state. To get there, it took him about 2.5 hours to drive there, about the same amount of time as a flight from Tampa to D.C. But instead of going to work and serving as a voice of his constituents, Charlie decided to play hooky.
All right, we just wanted to listen to a little bit there of Kevin McCarthy off the top. You're watching News Now here on Fox 10 X-Ray and coronavirusnow.com. I'm your host, Mike Page. Always great to be here with you. We truly appreciate you joining us worldwide today on News Now. Let's go to some other coverage. Let's go to our Fox sister station, Fox 29 in Philadelphia. Dr. Mike on deck here for us, bringing us the latest with COVID-19.
Dr. Mike Srianiano with Penn Medicine joining us from Philadelphia. Great to see you today, Dr. Mike.
Always a pleasure, Thomas.
As we head into this grim milestone, you know, over 100,000 deaths here, nearly 300 are healthcare workers. I want to get your thoughts on where we are right now with this virus.
Well, we're in a pandemic, Thomas. There's no question about it. And for anyone who were saying things like, well, it's just the flu, it's not a big deal, we're overplaying this. All you have to do is look at the statistics. This is really the real deal, and it is second only to the pandemic in 1918. And so we need to take this seriously. And here in Philadelphia, Thomas, we have a very close kind of history tie when it comes to that pandemic. Remember that back in the day, the Surgeon General, Dr. Rupert Blue, sent out a warning to all the cities saying, hey, we have a problem here. We should probably curtail things like funerals and get-togethers and socially distance. Well, the city of St. Louis heeded that advice and did fairly well. Philadelphia, however, had a large parade, and that led to mass casualties. And really, that second wave was extremely deadly, especially in Philadelphia. So historically, Philadelphia really is a town that needs to learn from the past, and we need to socially distance and be prepared for what lies ahead. We must socially distance, take this seriously, wear masks, and really be prepared until we have a vaccine and an effective treatment.
Because the haunting truth here, Dr. Mike, is we just don't know if this is an accurate number, right? It very well could be higher. The death rate, the infection rate could be higher as well.
No question that the death rates, numbers of people that have it could be much, much higher. And that can be complicated by the fact we just heard that almost half of the antibody tests may be inaccurate. So we don't really know where we stand with the data. But all I can tell you is from my personal experience being in the front lines every single day since day one, I have seen this, and many, many people have had it, will get it, and are suffering the consequences, both physically, emotionally, and even economically.
What steps need to happen, Dr. Mike, to get back to work safely?
Well, Thomas, I think we need to be very, very careful in how we get the country back into business. We need to get back into business. And I'm seeing it in the traffic in the morning. There's more and more cars, at least in my neck of the woods. So I do think people are getting back to work, but we must be very careful in terms of socially distancing, wearing masks. If people can work from home and get the same thing done, why not? And I think you're going to see that. If you don't need people in a close quarter arrangement, then that would be great. The other thing that we're going to have to do, Thomas, is we're going to have to really rearrange how our offices and our buildings are designed and set up so that people don't get put into harm's way. And that even involves, Thomas, ventilation. We're going to have to change the way we do things, open windows, get that fresh air in circulating to prevent a recirculation of virus that can make people sick.
Do you feel ventilation could be an issue? The virus could very well travel through ventilation?
No question about it. And experts that study aerosol and air and quality of air are really sounding the alarms, Thomas, that this virus really can be transmitted and transferred from one location to another, even through ducts and air ducts. And so there was a study looking at a restaurant where a couple who were positive sat in one part of the restaurant, and another couple from another part of the restaurant actually got sick. And it was felt that it was due to the ventilation system. So this virus and these particles, you don't have to be near someone who coughs to have a problem. Just breathing or talking loudly can aerosolize these viral particles that can be in air and stay there for a long time. So we're going to have to redesign and really focus on how to be safe with our buildings.
Yeah, some say up to 12 feet away. It's a highly contagious virus here. Some health experts say that we're still very, very early in this outbreak. Is that an accurate assessment, Dr. Mike?
Well, I would say we're in the middle of this first wave. That's the way I would describe it. And if people don't respect the virus, then we will have a second peak, if you will. We've already seen the peak come, but what you're observing now is that in some areas where things are loosening up, you're seeing a recrudescence, a repeat performance, if you will, of the virus and the numbers going up. So we are still in the thick of it in the first wave. What I'm worried about is that second peak, if people don't take this seriously, and then in the fall, a second wave when we have schools getting back, everyone getting back together, and I am a little bit concerned about that.
In dealing with the flu season, what is the true gauge that the worst is behind us? Obviously, we don't want to see any more deaths here, but is the hospitalization rate what we're looking very closely on?
Well, we certainly wanted to flatten that curve. We haven't heard that phrase for a week or two because the curve was flattened. If you look back in time, just a month or so ago, New York City was getting decimated. The hospital systems, the emergency rooms, there was a call for ventilators. We were getting overrun. And so that has come and gone by the grace of God. But the bottom line is, Thomas, we could be right back to where we were if we don't follow the rules and make sure that we don't open up too quickly. If we don't do it right, many more people will be sickened and many more people will die.
Where do we stand with testing? I know the Trump administration is pledging 100 million swabs and 100 million tubes in this effort, but where do we stand overall?
Well, I think that we're starting to see more supplies, more ability, more capacity to test. And I believe that Governor Wolf of Pennsylvania basically said, I want everyone to be tested. The same with Governor Murphy in New Jersey. I think that eventually everyone will need to be tested. The problem, though, is we need accurate tests. Now, that PCR test has a fairly high sensitivity and specificity. That's the swab test or the saliva test, the molecular tests. However, we need to work on this antibody test. Those are critical to getting us back and knowing where we stand and how we can, from an epidemiologic point of view, figure out where we go, what do we do, contact tracing, all of that.
How many, there's just so much to take in. How many tests are there for COVID-19 right now? You mentioned the accuracy rate. What's the most accurate?
Well, that's the million-dollar question. I think that you need to vet out these companies. You need to vet out the tests to see if they stand the muster, if they are able to be highly sensitive and highly specific. Remember, Thomas, that early on the FDA waived most of their regulatory oversight with these antibody tests, and then started to look into them more, and tests had to be proven to be absolutely sensitive and accurate. The problem is that there are different types of coronavirus, so that's one element of potential error, and these tests are not 100%. What we need to do is to look at all of them that are out there, find the ones that are the best, and really rely on that technology.
Hydroxychloroquine, a drug many Americans are now very familiar with. Infectious disease specialist Dr. Anthony Fauci has said definitively that this drug is not an effective treatment for the coronavirus. It's based on available data that he's looking at. The French government, I know, revoking a decree that allowed this drug in the hospitals. Italy pulling back as well. Is it time for the U.S. to abandon this drug as a possible treatment option? Should we be using the word ban?
I haven't seen one study for hospitalized patients to show that it actually works. Now, again, that being said, Thomas, I am a data-driven kind of guy, and I want to see the studies, which should be coming out shortly. Does it do anything to prophylax, to prevent the virus? And does it do anything early on in the illness, combined with things like zinc? I think the combination of azithromycin or the Z-Pak with hydroxychloroquine is a dangerous combination, and I wouldn't take it. And I certainly would not want hydroxychloroquine in the hospital if I were hospitalized and on a ventilator, because people have higher risk of dying. That's what the studies show. I still want to know the data on early onset treatment and whether or not it is useful for prophylaxis. If it fails in those two endeavors, see you later.
That's it. I want to get back to the antibody test real quick here, because there's still some confusion. How soon should you seek an antibody test?
Well, Thomas, it usually takes the body about 2 to 4 weeks, depending on your own immune system, to develop antibodies. And so what we test for is immunoglobulin G, or IgG. And that is a sign that you had exposure, or someday, hopefully, you had a vaccine that allows you to then show that you have immunity. And remember the two monkey studies, the rhesus monkey studies, that showed that these antibodies, if you have them, may actually be protective. And that is critical. So that's very encouraging news. But again, you need to wait a period of time after having the virus for your body to develop that antibody protection. And so that's basically the nuts and bolts in a very simplistic way.
Yeah, there was that monkey study, and I believe a llama study as well. There's also new guidance by the CDC that we may need to test twice when it comes to antibody tests.
Well, what we want to do, Thomas, is be assured that it actually is accurate. So many times, if you do an antibody test too early because you're anxious, you know, I 2 weeks ago, Dr. Mike, I think I had COVID-19. I was sick. I had the flu-like symptoms. I had a cough. I had a fever. I want that antibody test. And it's only been a week or two. Well, it may come back negative. And if that's the case, then we may need to repeat it down the road. My advice, and what I'm telling my patients, is look, if we have a confirmed case, we know you had the virus, or you think you had it, let's wait a period of time, and then we will test you in about a month. And then if you want to donate plasma, fine. If you have peace of mind, fine, but you still need to socially distance yourself and you need to wear a mask. And remember, Thomas, there's still some gray zone as to how long someone can be infectious even after they have had the virus. We've said 7 days, then you can go back. Maybe it's 10 days. Who knows? I always have been very, very, very conservative. It's just my nature. And the bottom line is that I don't want anyone coming back if they are potentially still infectious.
Yeah, there's a lot we still don't know. When we talk about these antibody tests, it shouldn't give us a complete peace of mind here. This is more storing away the information that we may have it right, because we don't know if we have immunity from the virus once infected or once recovered.
Well, we don't know that for sure, but like I said, Thomas, those 2 rhesus monkey studies seem to give some credence to the fact that if you have this virus and you develop antibodies, you are protected. That's what I'm hanging my hat on. Again, if it's going to give you peace of mind, that's fine, but I don't want anyone who has a positive antibody test to go around without a mask or without socially distancing. It's not the right thing to do right now at all.
Don't want to be careless. All right, Dr. Mike, our daily advice on staying safe.
Well, Thomas, people seem to be getting back. That's going to help us from an economic point of view, a mental health point of view, and to be honest with you, I think a physical point of view. Getting people back to work is the way we need to go. But we need to do it in a careful, judicious way. And I think if we do it the right way, we will be okay. I'm positively optimistic that we will have a vaccine and we will get through this. It's just going to take some time.
We appreciate your optimism. Dr. Mike Srianiano with Penn Medicine out of Philadelphia. Good to see you. Stay well, Dr. Mike.
Thank you, Thomas. You as well.
Live look at the White House right now. We are less than 45 minutes away from a news briefing from the press secretary. We'll have that for you in full as soon as we get it right here on News Now and coronavirusnow.com. We'll be right back in just 2 minutes. Everybody on coronavirusnow.com, let's take a listen in New Jersey right now as the governor right now is giving an update.
A diverse family lost. 3 more families left mourning, and we mourn with them as if they were our own, because in every way, in fact, they are. We are one state, one people. We rise and we fall as one. And as we move forward together in the days ahead in our restart and recovery, we cannot forget the tremendous toll that COVID-19 has had on our family. And we cannot forget those who will not be with us as we, individually and as a state, rise again. Switching gears, a couple of developments since yesterday. We had a very good, I thought, exchange, about 45 or 50 minutes with legislators from both sides of the aisle. Judy and Pat joined me. I thought the conversation was a good one. The questions were good, a lot on things like youth sports, small businesses, dining, outdoor especially. We're going to be giving a whole lot of guidance both tomorrow and in the coming days on where we're headed. But I thought that was a really good exchange. And again, I want to salute members of both sides of the aisle for being as responsible and helpful as they've been. Had a couple of good conversations with union leaders this morning. The conversation started out with a different objective, but they came back in each case to a theme that you've heard from us almost every day, and that is the need, the absolute overwhelming need to keep firefighters, police, educators, EMS, healthcare workers employed at the front lines when we need them the most for federal direct cash assistance. I was on with Lee Saunders, who runs AFSCME globally, as well as Terry O'Sullivan, who runs the laborers. And they come at this from different perspectives, right? So Lee's got a huge dose of municipal, county and municipal workers, as well as obviously some.
Welcome back, everyone, here to News and Now Live. Listen in as we take a look here of the New Jersey update happening right now. Let's listen on News Now.
But the ones in the warehouses who are sorting through the gobs of packages and mail that we deal with as a country every day, that federal cash assistance is needed. It's not just New Jersey, it's not just blue states, it's not to deal with legacy issues, it's for the here and now, for red and blue, for American states, and to keep our folks employed at the point of attack. Switching gears, over the past several weeks, we have highlighted the need for every New Jersey resident to answer the 2020 census. The more residents who respond online means the fewer residents who may have to receive a knock on the door later this fall. But as we have noted, the census is not just a count. It's about much more than numbers or drawing federal, congressional, or state legislative district maps. The census determines whether or not New Jersey will receive billions of dollars in much-needed federal funding, as I just mentioned. And if you don't get counted, it means that we leave money on the table that will go to some other state. We know for a fact that we were undercounted in 2010, and because we lost out on literally tens of billions of dollars in federal aid and grants. As we begin our restart and recovery, that's a hole we have to work even harder to pull ourselves out of. So first and foremost, if you have not yet, go to 2020census.gov and be counted. And then please do me another favor. Go and reach out to 5 family members or friends or neighbors. Check in, first of all, to make sure that they're safe and healthy, and then urge them to be counted as well. You are their most trusted voices. They'll believe you. And you can help us spread the message that the census is about strengthening our communities and being able to provide for our families. It's about your neighborhood. It's about your children's or your grandchildren's or your nieces or your nephews' schools. And as Judy can attest, it's about being able to provide health care and basic needs for healthy families. We're doing a pretty decent job, I have to say. In New Jersey, bless you, bless us all, right now we're at 62.2% already responded, and that's a full 2 points higher than the national average. But we're still trailing 20 of our peer states. We know we can be number one. I've set an objective to at least be in the top 10, if not to lead the nation. And across the entire Northeast and Puerto Rico, by the way, the top 4 reporting counties are all in New Jersey. Hunterdon, Morris, Burlington, and Somerset. And by the way, Gloucester County is right there at number 11. That's huge. Those are all badges of honor. But we need every county to get on this list. There's no reason we can't hold the top 21 spots in all of our counties. So again, take a few minutes and go to 2020census.gov to be counted. Then make sure your family and friends are counted as well. An accurate count is absolutely vital for our state and our communities. Remember, the census is not just a number. It's about our ability to keep our New Jersey family strong. Next, I want to go back briefly to what we discussed yesterday about testing. Over the coming days, as I've noted, we are preparing to keep moving confidently on our restart and recovery. And the reason we're able to do so is because we're getting the data we need to determine the dates when we could take specific steps. Our hospital data, for the most part, not entirely, but for the most part, is strong. But we also get tremendous data from testing. So I reiterate what I said yesterday. Go out and get tested. The more data we have, the more confidence we can have that it's time to move forward. We were back above 20,000 tests, as I think I alluded to this off the cuff yesterday, recorded on Tuesday. Over 24,000, in fact, to be exact. That's a strong way to start back from the long holiday weekend. Because of this, we now rank 3rd in the entire nation in terms of tests per capita. In this case, tests per 100,000 residents. We've worked really hard to get our testing program to where it needs to be, and we're going to continue to work to make it even stronger and more accessible. Whether it be at our federally partnered sites or a county or locally run one, or at a Rite Aid, a CVS, a Walmart, as of tomorrow, there will be 208 sites open to get a test. I encourage you to go to covid19.nj.gov/testing to find a location near you and to go out and get tested. Now, before I close and turn things over to Judy, I want to recognize one more young person who deserves to be in the spotlight. This is 10-year-old Isabella Raju from North Caldwell. She already knew that she loved to run and decided a month ago that she was going to set a goal to run 100 miles in 4 weeks to raise money for the first responders in her hometown. Isabella completed her run a week early. Admittedly, the last miles were a little different, as she got an escort to her finish line at the West Caldwell Municipal Building from the West Caldwell Police, Fire, and First Aid departments, and apparently Batman there on the left. Isabella has raised more than $3,000, with more still coming in. So to you, Isabella, thank you for your determination and community spirit, and congratulations. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. Well, the Governor has outlined just how important a complete and accurate census count is for the future of our state. Today, I want to emphasize how important the census is on the health of our state. Census data informs the number of community health centers built and the location of hospital facilities and resources for improvements. How many children can access health services? When communities are not accurately counted, that means less federal funding for healthcare services and nutrition and health programs. For example, community health center program investments depend on census-driven indicators to determine which areas are underserved. Family planning funding levels are driven by population counts from the census. Funding support and voucher prices for our New Jersey WIC program, which provides nutritious food for low or moderate income pregnant women, new mothers, and children younger than 5 years of age, is impacted by the census. And census data also affects federal substance abuse treatment grants that the state receives. In 2017, New Jersey received over $45 billion in federal funding for 55 federal programs based on our 2010 census. That included more than $9 billion for Medicaid, nearly $3 billion for Medicare, over $400,000 for children's health insurance, nearly $80 million for community health care centers, and over $18 million for elder programs, including nutrition. This type of support is going to be more important than ever, given the health, social, and economic impacts caused by COVID-19 pandemic. If you haven't already done so, please complete your census questionnaire and encourage others to submit their responses as well. For my daily report last evening, as the Governor shared, our hospitals reported 2,797 hospitalizations, with 740 individuals in critical care and 76% of them on ventilators. There are a total of 26 cases of multi-system inflammatory syndrome in children reported in our state. No new cases were reported from yesterday. There are no deaths reported. The ages of the children range from 1 to 18. 18 of the 26 have tested positive for COVID-19, and 6 are currently still hospitalized. The Governor reviewed the new cases and deaths reported today. In terms of deaths, the breakdown by race and ethnicity is as follows: white, 53.3, black, 18.5, Hispanic, 19.4, Asian, 5.5, and other, 3.4. At the state veterans' homes, the numbers remain the same. Among a census of 654, there have been 384 residents tested positive and a total of 144 deaths, and the statistics for our state psychiatric hospitals remain the same as well. As the Governor shared, our overall New Jersey positivity rate as of May 24th is 6%. In the north, it is 4%, Central Jersey, 6%, Southern, 8%. That concludes my daily statistical report. Stay connected, stay safe, and stay healthy. Thank you.
Judy, we discussed earlier, I'd love to get Ed to comment. I think you and I both thought it was a good idea. There's been a fair amount over the past 24 hours on the airborne nature of this virus and how it spreads. It's another reason that I'm becoming increasingly a disciple for the proper face covering, but the one that really struck me, and I know you've said from day one, as has Dr. Tan and certainly Judy, that there's still a lot more we need to learn about this. We're all of us, not just in the state, but around the world, are evolving in our knowledge. But there were two things that jumped out at me in the reporting, at least. Number one, when someone asked, what is airborne, can you put that into English? And it was when you can smell someone smoking or smell a barbecue, that's sort of what you're talking about, which means you're not, this sort of is beyond the 6-foot dimension. And then secondly, I can't recall if it was in the same reporting or not, that the chances of risk of at least, whether it's infection or at least a droplet hitting you, are 19 times higher indoors than they are out of doors. Which is another reason, by the way, folks, that we're trying to be very, very careful. Not that we're not going to get there. We'll get there, God willing, if the numbers keep going in the right direction. But we got to be exceedingly careful on indoor, sedentary, lacking ventilation, close proximity realities. But Ed, do you want to, if you could, comment on any of that?
Sure, thank you. Briefly, this is what has to happen in order for somebody to become sick. Somebody who has that virus that lives in their nose or the back of the throat or down into the lungs has to put that out in the environment in such a way that you can come into contact with it. Some of those ways are very obvious. If somebody goes ahead and sneezes or coughs, they're spewing out these big particles. You can see these particles. They're spewing them out, and they're traveling a certain amount of distance, almost always less than 6 feet, which is where that 6 feet rule comes from. But smaller particles are also coming out. They're coming out every time anybody speaks. They're coming out more so if you're singing or shouting. They're also coming out to some extent even just from your breathing. Now, those bigger particles, they land to the ground pretty quickly. They end up on surfaces. That's why we say be careful about touching surfaces, wash your hands, and so forth if you do touch surfaces. And that's what's known as droplets. You don't see them all, but they're big and they're relatively heavy, and they come out of the air pretty quickly. However, some of those smaller particles, particularly ones that tend to be generated from things like speaking or other things, may last in the air for longer periods of time and may be able to float in the air longer. Exactly how much of that happens with the virus that causes COVID versus other viruses isn't known for sure, and we still believe that the major means of transmission is through those bigger droplets, but it is believed that at least some of this illness is likely caused by some of these viruses that are floating in the air for longer periods of time. And as the governor mentioned, that becomes more of an issue the closer people are together, and particularly in places like indoors where the air isn't circulating. I mean, the best way to get rid of the virus is to have a breeze or something blow it away. And it's why it becomes even more important to try to maintain social distancing and, as he said many, many times, to continue to with face coverings whenever you are around other people who might potentially become infected by you.
Ed, well said. It's another reason, by the way, I want to get gyms opened as much as anybody in this state, if not this planet. But there's a difference between the way I'm speaking right now and, as you suggested, singing, shouting, breathing heavily, grunting, whatever it might be associated with, running on a treadmill or lifting weights or whatever. We're not making this stuff up. This is real. I was going to make news on this tomorrow, and Mahan will remind me to put this in more detail, but it looks like President
Welcome back, everyone, here to News and Now Worldwide for you on Fox 10 X-Ray and coronavirusnow.com. We're taking a look at the White House right now because we're about 30 minutes away from a White House news briefing if everything is on time. So we will play that for you in full when that does become available for us. Let's take a look at the latest numbers right now with the COVID-19 pandemic that we are seeing. Just under 6 million cases worldwide, and in the U.S., 1.7 million cases in our country here. And unfortunately that we hit yesterday the 100,000 mark for deaths in this country. So we'll continue to take a look at those numbers. Really, we do it every day right here on Fox 10 Extra and coronavirusnow.com. In the meantime, everybody, let's take you out to Fox 2 in Detroit for some politics in focus.
Interviewing the president during these unusual times during a pandemic means social distancing with an extendable boom mic.
He must be pretty strong over there.
It's been about 20 minutes.
Very impressed.
I wish you could be closer. I'd shake your hand.
I know.
It'd be
I know.
like the old days, right?
The old days the president is talking about predates the coronavirus. Since the virus crippled the country, the heavy lifting and strength that's being talked about here is about the Ford workers at this Ypsilanti plant, helping the country and the world recover. President Trump talking exclusively one-on-one with Fox 2.
I'm very proud of what happened here because they're building ventilators here and done a really great job of it. And we have 11 plants now throughout the country that are building ventilators. And our country's totally taken care of, and we're helping the world because many countries in the world, you have 188 countries right now that are suffering with the virus. And we are helping a lot of countries with the ventilators because that's something, you know, you can get a swab, a cotton swab. You can get a lot of things. You can't build a ventilator. But they're building thousands of them right here in Detroit at this plant. So we're very happy about that.
Why should an undecided voter who's on the fence vote for you? You came to the Dana Corporation, said you helped rev up the auto industry.
Right.
Joe Biden says he and Obama did that back in the day. What do you tell an undecided voter who's on the fence?
Well, during the Obama era and the Biden era, car companies and jobs were leaving this country like crazy. And with us, you go up to 2 months ago, and again, we had to close it. Now we're starting it again. We're going to have it back very soon. But we brought tremendous amount of car building back to Detroit and to other areas. What we've done is unprecedented. Nobody's ever seen it. You know, we lost 30% of our car making capacity to Mexico and Canada and other places. And we just signed the USMCA. All of that, much of that's coming back. And you look at plants, we have plants being built for the production of cars all over the country. When I came here, plants weren't being built. It wasn't a thing that people were even considering. And under, Biden doesn't even know where he is. Under Biden, we would lose it all. It would be a very, very sad thing for the country.
It's a tougher fight with Biden now than it was before because of the virus, right?
I don't know. I'm looking at numbers that are very good for me, you know, in terms of the poll. People know that we did it once and now we'll do it again. We're going to have I think we're going to have a tremendous fourth quarter. We're going to have a good transition into the fourth quarter. And next year is going to be one of our best years. We're going to have a great year next year.
We have so much of the state that's shut down right now. Barbers rallied yesterday, salon owners rallied and said, God, we got to get back to this.
Yeah.
When you take a look at businesses that are failing because of the virus and because of the shutdown, you're a businessman turned president. What do you tell them? Is there reversible? Is it okay? Can we reverse this damage?
I think you're going to not only reverse it, but you have to open up. Otherwise, you're going to lose some of these businesses. Florida's open. Georgia's open. Many of these states are open right now. And if you don't open up, you're going to lose a lot of your businesses. They're going to have to open it up. You're going to be put at a big disadvantage. And a lot of the Democrat governors just don't want to do that. And they think it's good politically. I think it's very bad politically. But you take a look at the states that are opening, they're back and really doing well. There's a big pent-up demand. And I hope Michigan is going to be open very soon.
You talked to Governor Gretchen Whitmer yesterday. How did that call go? And also, talk about the people in Midland who are dealing with the flooding.
Yeah, well, I did. I spoke to the governor, and we had a Governor Whitmer, we had a very, very good conversation. I really called about the dams because you need help. Your dam's broke, and we brought the Army Corps of Engineers in. They're here now. Nobody can do it like them. They can fix it. The Army Corps of Engineers is in, and FEMA's in. And so we had a very good conversation yesterday with your governor.
What about Detroiters who really suffered at the hands of this virus? Moving forward, they may be concerned about a second wave. Are you concerned about a second wave? And what do you tell Detroiters who really suffered?
Well, I'm concerned about everything. And you could have a second wave, but it's going to be at a lower key, and it's going to be embers and fires, and we're going to put them out as it comes. We're not going to be shutting down. You could have some embers, you could have some fires where they burst out, but we know how to put it out. And, you know, we saved millions of lives by what we've done, but it's a very difficult process. All over the world, they've done it, and they really had no choice. The places that didn't do it are not doing well. I can tell you, there are a couple of places that didn't do it, and without mentioning names, they're not doing well. So we did the right thing, saved millions of lives. Now we're building up our economy, and I think you're going to see tremendous numbers over the next number of months as we go along.
The president optimistic that things will only get better, setting a safer stage for the future. Mr. President, maybe the next time we talk, we won't have to do this, right?
I hope so. I think that will be a fact.
Thank you so much for your time exclusively here. Appreciate you.
Great.
Thank you, sir.
It's optimistic times, Root, because it's spring in the air and it feels like a new start
for our industry.
As the automaker gears up for reopening, Ford's top boss is beaming with pride and optimism. Ford and GE Healthcare, in the darkest days of the coronavirus, teamed up to make 50,000 ventilators in late March, stepping up when the country needed them, something CEO Jim Hackett says is part of Ford's history and culture.
When building the B-52 bomber, one every 52 seconds, before that, incubators. And I saw 1,000 people volunteer to go in and build these ventilators, in the earliest days. And we've never had an issue with the virus with any of those folks. I couldn't be more proud of the contribution they've made. Our dealers, have continued to work in this period.
Hackett has been at the helm as the CEO of Ford for 3 years. He's seen his challenges, though, as a boss outside of Ford, from his time at Procter & Gamble to Grand Rapids-based Steelcase. But turning off the U.S. economy, something he's never seen.
Calamities like 9/11, I lived through that, but we never, ever, in modern times, ever turned the economy off. So the idea of going off was difficult. Going on is even more difficult because at the time we turned off, people weren't really sure what the virus was. Now, with all the terrible toll it's enacted on our people in Detroit, they rightfully have concerns about safety.
Starting the economic engine of the auto company, Hackett leads his team into uncharted territory, keeping workers safe from a virus on the factory floor. It's not a switch, but a dial. They're going to slowly open things back up.
It is one of the most important things the epidemiologists cite, is to try and keep that distance. And for example, an assembly line job, people would pair up in the vehicle. It was moving. We now have to, eliminate that as part of the sequencing of putting things together. But I also think the screening process, which you're not used to doing as you go into work every day, will happen repetitiously. And in fact, everyone should be looking forward to testing that'll start to come. And testing will give us an additional layer of security as we get reliable tests here early in the summer.
Looking ahead, he's especially hopeful about the launch of new trucks and SUVs, projects that were in the pipeline, a pipeline that was jammed because of COVID-19.
All of our new ideas, the F-150, the Mach-E, and a new Bronco family are all going to be staged to come. And so it's going to be an exciting time for Ford Motor Company.
From the city that put the world on wheels, ventilators and personal protective equipment being made and given to the country in its fight against coronavirus, Dr. Jeffrey Hess, the corporate medical director for General Motors, is now working to make sure it's a safe re-entry when workers come back to make cars, trucks, and SUVs.
We realize how important this is. We know that our employees are relying on us, our suppliers are relying on us, and the communities are relying on us too, because if we're spreading disease in our workplace, we're not helping the communities at all. So this is vitally important, what we're trying to do here.
Vitally important to the economy too. Monday will mark the opening of the majority of North America's GM plants. The company beginning with one shift at a time in each location that's starting back up. Toledo, Flint, Romulus, Lansing, Orion, Saginaw, and Bay City, just some of the facilities close to Detroit, slowly revving back up completely and safely. And that means banking on masks even when they can't social distance.
In our entrance process, what you'll do is, we kind of social distance you as you walk into the place. We make sure you sanitize your hands. You're going to put a mask on right away. And that, we feel, is going to help contain all those particles and little droplets that come out of your mouth and your nose when you talk, when you breathe, when you cough. Keep it in that mask. So it's all self-contained in that mask and not getting out into the atmosphere so other people can breathe it in or come in contact with it.
Safety glasses, temperature and symptom checks at the door, all of that together, they're hoping, making for a smooth transition. But when we say restart, keep in mind, some of the facilities never stopped.
We started out with the ventilator facility, which is in Kokomo, Indiana, and that's been making our ventilators. We have the mask facility in Warren, Michigan, so that's been making the masks. We've had some operations going on in Texas because we're redoing a the truck line, so that we're getting the new truck line ready for production. And there's been about 1,000 employees in that facility.
Plus, warehouses for parts have been in operation too. Close to 5,000 employees have been working through the pandemic, working with the CDC and the World Health Organization and the unions. It's a collaboration that's been in the works for weeks. Safety is not a new concern for GM.
Safety safety has always been important at General Motors. This is not the first time we're worried about safety. We've been worried about safety for a long time. We've been working on it consistently, trying to make sure that our factories are safe, that we don't have accidents, we don't hurt people. That's the key, what we're trying to do. We're just taking that technology and moving it into an area we've really never had to deal with, which is infectious disease, and trying to make sure that that also makes it safe for our employees in the workplace.
And General Motors executives say that health centers will be opening up at all the major facilities to make sure that doctors and nurses are there in case people need them. Something to keep in mind. Coming up tonight on Fox 2 News at 5:30, we're talking to the COO of FCA North America, what he's doing to make sure that everybody's safe when they come back. The lights are on and things are hopping, a contrast from what was happening in this Pontiac factory of I Am Branded. 130 people were let go in March when COVID-19 hit.
Now we are, by all accounts, 95% back at, pretty much full employment. And we actually are looking for employees, albeit in different parts of the business on the production side.
The company used to make decals for companies across the metro area. Well, they branched out and started a new line called Safely 6 Feet. Having lost his business, Jim Whitehead sprang in to fill a need that the vicious virus created.
We have a graphic product line, which is much like the sign that you see over my shoulder. We have various different sign components that help tell the story of how people, should, engage with a workplace or a retail environment. We also have other mitigation devices like Team Shield, which is our acrylic partitions that when two people have to engage in a closer proximity than 6 feet, that helps to mitigate the transfer of COVID-19.
Companies from almost all 50 states have called and ordered. They all need different shapes and dimensions depending on what they're doing. It's different if it's a dentist office or a school.
There's going to need to be visual cues to how you're going to guide the students through their school day. We also are envisioning either freestanding or desktop partitions to help, to help slow that transfer.
Almost 2,500 orders have been filled, and they're outpacing themselves every single day.
I've never seen anything like this in my entire career, where things are literally moving not by the day, not by the hour, but by the moment and by the minute. And so as the phone is ringing, people are reacting to something that was just presented to them that is changing all the time. So we're doing everything we can to try to stay up to it.
Eventually, when there's a vaccine, Whitehead is ready to pivot to what they made before, a day he and the rest of the world can't wait for.
My hope is that Safely 6 Feet becomes a moment in time because we are back to what we consider normalized business, focusing on retail, automotive, hospitality, and retail, which, oh, by the way, all three have been significantly impacted right now. So our objective here is to try to lessen that loss until we can get back to more normalized operation.
If you want your office retrofitted to make sure that it's safe for COVID-19 with all those decals, maybe those acrylic shields, safely6feet.com is the website to go to. It's safely6ft.com.
Live look, everyone, on coronavirusnow.com as we are taking a look here at the White House briefing room, expected to start within the next 12 minutes or so. We will feature it for you in full when that does happen. Let's go back out to New Jersey for a live update.
Ed, any disagreement on covering the nose?
No, obviously the nose has to be covered. We understand that it's uncomfortable. We understand that people have problems with glasses fogging up, understand that it's difficult to see your feet and you have to worry about tripping over things and that sort of issue, and it's not easy. But if you're not covering your nose and you're breathing through your nose, obviously you're expelling particles through your nose. And as the governor said, that's better than coughing and that sort of stuff, but it's not doing everything that it should be doing.
Please, Ian.
Governor, Executive Order 124 made more than 1,000 people in New Jersey's prison system eligible for immediate release during the COVID-19 pandemic. Since then, less than 100 inmates have benefited from this move, and 42 have died. What is your response to today's protests at the Trenton War Memorial claiming your failure to follow through? Have you mentioned any of these incarcerated individuals who have died from COVID-19 in your daily remembrance? And are you responsible for these people who have died in prison from COVID-19?
I don't know that we've mentioned any in our daily remembrances. I don't recall that I have, but I can come back and come back to you on that. I believe, and Matt will correct me if I'm wrong here, and I would like to explicitly ask him, it allowed for the eligibility of a certain number of people to be released, subject to a comprehensive review, including, among other things, where were they going when they got out? Did they have housing? Did they have sustenance in their life? And we take that very seriously and want to make sure that it's not just a blunt instrument that we're using, but we're taking this one person at a time, and we've been committed to that from the get-go. I don't know what the exact numbers are now. Matt, I think, has got that, but also any other color in terms of the gap between folks who may have been eligible versus the amount of folks that we felt we could responsibly release.
That's correct. The executive order laid out a process for 4 different lists of potentially eligible incarcerated individuals. Just on the number, as of 2 days ago, the 26th, these are the numbers that were filed with the court. I don't have the most current numbers as of today, but the Department of Corrections can get them to you. 607 inmates have been approved either for home confinement pursuant to the furlough program or for parole. There were 88 people who were eligible under both programs. 300, as this is again as of 2 days ago, 337 people had actually been released, and the remainder were being processed. And I know that they've made progress even over the last couple of days, so we can get you that information, but it's not less than 100.
And my strong wish that no one would have died in either incarceration, in a long-term care facility, in a hospital, in a home for developmentally disabled, a psychiatric hospital, a veterans hospital. I mourn the loss of every single life in this state, period, full stop. Please, sir, do you have any?
Just let me pull it up here. The Face ID doesn't work.
Didn't mean to surprise you, sorry.
1 second.
Do you want us to come back to you?
No, I'm pulling it up right now. I'm sorry about that. This is from Walt Kane at News 12 New Jersey. We continue to get many calls about problems receiving unemployment insurance. For example, our viewers Stacy, Mike, and Stephanie, among others, say that they have not received their $600 federal supplemental unemployment checks. Is there a problem with the system that's causing this issue? Thank you.
Is that it? May I say this, the best thing I can do, and let me tell you why I say this, because I've had a lot of people come to me directly. I had someone come on behalf of a company this morning where she had a number of folks who were having some issues. I can't think, and this was not the case maybe 2 months ago when the first wave hit us and the systems and the staffing, as good as they've been, they were overwhelmed. They were everywhere in America, and we were no exception. But literally, I can't remember one case that's been brought my way in the past month that wasn't very particular and specific to the individual. There was something. It was the way they filled out the request, the weekly certification. It was something very specific to that. It was a cross-state issue. So the company this morning has got presence in both New York and New Jersey, and there's some cross-state, waiting on New York data in that case. So my best answer to you is, other than you saw the numbers we're putting out and you saw the amount of claims that have been processed relative to the total, is if you could get us the names of those people to Mahen, and we will literally, and we've done this in every case, not most cases, we will follow up directly and have someone at the Department of Labor work with the individuals. Okay? Thank you. Sir, welcome.
Thank you. Couple questions. One about the testing. Can you now get tested without a prescription, without a doctor? Can you just walk up and get tested?
The answer is yes. Depends on where you go, but the answer is yes.
And the tests are free?
Tests are covered by insurance.
Okay, and the other question is, talking about unemployment, a lot of people are not able to get unemployment for one reason or another. I mean, they've been working for a long time. There's a shadow economy out there. And these people have been supporting their families but now they don't have anything. They can't get unemployment. They can't get anything. How are you dealing with these people?
Well, it depends on the individual, right? So it's hard to give a blanket answer to that. I met a guy on the boardwalk from Toms River over the weekend, and I immediately got his case to the commissioner. His team tracked it down, and the guy hadn't been working since 2018, so he comes into the category you're talking about. So there's a whole range of programs that in many cases, that we had existing before we ever heard about COVID-19. The inequities in this state have been yawning for a long time, and so we've been working since day one to try to close those inequities. Everybody from the homeless to the working poor, getting as much federal support, pounding away to continue programs like SNAP and other benefits that come into New Jersey, pushing back on a lot of impetus in Washington that was going the other way. We as a country have an underdeveloped social net. There's just no two ways about it. And while we can take great pride in things like the #1 school system in America, which we are, and we should take pride in among the wealthiest states in America, when we got into office, we had among the biggest inequities and the widest dispersion of experiences in education and income, in job reality and discrimination and whatnot. And whether it's in the criminal justice system, whether it's in the social welfare reality, whether it's in civil rights and social justice, we've been chipping away at that from day one, and we are trying to, as Barack Obama used to say, we're trying to perfect our union each and every day, but let there be no doubt, it is not perfect. And we have a long road still to travel as a state and as a nation. Thank you. You get to bring us out, sir. We're behind you here.
Oh, hey, snuck up on me there. Good afternoon, everybody. 2 quick questions. Governor, just to follow up on the inmate question, Matt said that the numbers he gave out were as of yesterday.
2 days ago, I think.
2 days ago, recently. Are those, when you started the inmate release situation, was that a one-time thing? Is it an ongoing thing that continues to happen? And Judy, we heard about the number of inmates, 42, 43, that have lost their lives to COVID. How many corrections officers or staff have lost their lives to the disease, virus?
So the program is, is that anything else you got? The first question is, this program is an unusual program explicitly because of COVID-19. Now, I guess it's fair to say, Matt, you correct me if I'm wrong here, as we roll, please God, this is not in our midst forever and always, right? So we hope there's an end to this at some point, even if we're changed permanently, which we are in terms of social distancing and handshakes and face coverings. We hope we can get through the war here sooner than later. I assume as long as it is in our midst, this is going to have some sort of a rolling element to it, I would think. And Matt's agreeing with me. And secondly, Judy, do we have the staff number? I know we have it somewhere. I'm not sure I've got it.
Yeah, I don't have it with me today, but I can follow up.
There's no question there have been losses of lives, yes, 100%.
Yeah.
We can come back to you and let you know. And we mourn those losses as well. And again, you look at the long-term care fatalities, that includes staff. We've got heroic folks who've been going in and out of facilities, regardless of what they are, laying their life on the line, nurses in hospitals, doctors in hospitals, postal workers. Amen. Matt, you wanted to add something to that?
Just one clarification going back to Brent's question earlier about graduations. I think I may have misunderstood you. If you're speaking about districts that had already planned purely drive-in events at the district, at the school, the department's going to work with those districts. So this is for non-planned events.
Welcome back, everyone, here to News and Now. Well, we are live and worldwide for you on this 11 o'clock hour on Fox 10 Extra, 2 o'clock for all our friends out on the East Coast, including Washington, D.C., as right now we are taking a live look at the White House briefing room, where we will soon have a White House news conference. That will be happening as soon as we get it, and we will feature it for you in full right here on News Now, like we always do here for you. In the meantime, everybody, welcome everyone here. We'll be looking at that shot, and as soon as we see the press secretary come on up, we'll bring it to you right here on News Now. Let's go to our sister station, Fox 32 in Chicago, for some updates out there.
Good about following the CDC guidelines on what we should be doing. So we are vaccinating every child who needs a vaccine. They can come in, they can get their physical, they can get their vaccines. And we're working really hard to make sure that our offices are safe. Most of our offices are only seeing well patients during certain types of the day, so you're not going to encounter a sick person in the office. We're screening everybody by phone and when they come in and taking their temperature. Everybody is masked. We're minimizing the number of people that come into our office. Socially distancing in our waiting rooms. We're trying to keep our waiting rooms free of people as much as possible. And we're using a lot of enhanced cleaning techniques in our exam rooms. So we are really paying attention to making our offices as safe as possible.
Okay, Dr. Julie Holland, thanks so much for joining us this morning. It's an important message to get across, and I think you're making some parents feel a little bit better about making that important decision. Thanks again.
Thank you so much.
Coming up, as parents across Chicagoland get ready to head back into the office, what are they to do if they don't have childcare? We're going to be speaking to attorney Karen Conti about some of the complications facing workers as the economy starts to reopen.
Parks, concerts, when you consent to come in and you walk in, you are basically accepting the proposal that they make. So it's a contract and it's valid for the most part, except that waivers cannot waive reckless or fraudulent conduct. So if Disney knew that one of their employees were sick, say, and let them work anyway, it could be that a lawsuit brought against Disney could succeed because you can't waive your really bad reckless conduct.
Right. Okay, that makes sense. So does this apply to workplaces also? Because the question here is, can you make your boss make you sign a waiver as more people are heading back to work?
Yes, that's probably going to be a little more iffy. And this is why we have workers' compensation laws that basically say that if you get hurt on the workplace, the boss has to pay through insurance. So you really can't waive your rights as far as that goes. Also, there's OSHA, which is the Occupational Safety Health Act, and they provide that there has to be a safe workplace. So having your employer do that is probably going to be a little questionable.
Yeah, a little more difficult. Okay. And speaking of work, many people will be going back as we enter into phase 3. So do employees have any say about coming back, not only because of safety concerns, but here's another issue. It's really important that's been coming up. Daycare centers, they're not going to be opening in many parts until phase 4. And we're not even sure the schools are going to be opening in the fall. So can parents say to employers, I can't come back to work because I'm worried either about my safety or I don't have childcare? Do they have that right?
Well, they have that right, but they also might be fired for that reason. And listen, the laws are the laws. Let's just talk about that. But there's no courts open. And do you really have the money to hire a lawyer to fight? So clearly, you have a right not to go into a workplace that's unsafe. But if it's just, I don't feel comfortable because I might get the virus, that's not enough to justify you not going back to work. And your employer can certainly fire you for that. And if you don't have daycare, childcare, a very unfortunate situation, I understand that. But the boss doesn't have to accommodate you because there's no law requiring the boss to say, hey, you know what, you don't have childcare, I'm going to pay you or give you a job at some other point. So I think that people are going to need to get their ducks in a row and they're going to need to figure this out in a brand new way.
Yeah, and have a discussion with the employer beforehand, because I'm sure a lot of them are going to be very sympathetic. Okay. Also, you and I talked about this, was it last week or the week before, about one particular company adding this surcharge for COVID-19. So now it turns out a lot more businesses are now announcing that they're either going to be adding this surcharge or some type of COVID fee. And we're hearing not only from the restaurant industry that they're going to be doing this, but also hair salons and other businesses. Can they legally do that?
They can legally do it only if they disclose it beforehand. So they can't just plop that surcharge on your receipt and say, now you have to pay it, and we didn't notify you. It has to be prominently displayed somewhere in the facility, on the website, or you have to be told about it, because it's just not fair. Now, certainly, businesses are going to be raising their prices, right? Because the food is more expensive. There's going to be more precautions that need to be taken. And so, of course, they can raise those prices. There's no question about that. But when they actually issue a surcharge, it must be in writing somewhere so you can consent to it.
Okay, and I'm getting a quick wrap here. Final question for you. The state of Illinois requires we wear a face mask when we go inside grocery stores and public places. Can you be arrested or charged if you're not wearing one?
You certainly can. It could be disorderly conduct, reckless disregard for the safety of others. It can be child endangerment if there are children involved. And it could also be assault and battery if you happen to sneeze or if someone is offended because they think that you have the virus. So, they could use the criminal laws. Sure, they can. I don't think that many states are really doing that. But just out of an abundance of caution, you should wear it because you could be charged.
Okay, Karen Conti, always answering questions when we need you. Thanks so much for joining us this morning. So food pantry donations, as we all know, have been more important than ever before during this pandemic. But here's something that you might not have thought about: the need for providing food for pets. The Kibbles for Canines Service Dog Food Drive is set for this weekend and will help our veterans feed their service dogs. Now, Brenda Lee is from the American Legion, and she is joining us this morning with some friends to tell us all about this. Good morning to you.
Good morning.
It's so nice to see you. Okay, tell us about this food drive and the need for this kind of help.
So we are hosting a service dog food drive this Saturday and Sunday from 9 a.m. to 2 p.m. We are the Howard H. Rohde Post, located at 241 East North Avenue in Northlake, Illinois. And this food drive is for our service dogs. We have Canine for Veterans. They supply medical and dog food to these heroes that, they virtually are the lifeline to some of our veterans that suffer from PTSD, which we don't feel gets enough awareness. And they were hit hard, as all not-for-profits were when the pandemic hit. They've received no funding. They are considered non-essential, and we want to get them what they need and get them the food that they need. So the auxiliary unit here at 888, we're going to put this drive on. And we have Bugs with us. He is also a service dog. So he came out to be with us today.
Oh, you know what?
We have.
I think you really brought this home, saying that they have not been getting the funding that they need. And, we want to do anything we can to help our veterans. And it's, as I said before we came to you, it's not something you normally think about, is providing food for their pets, but they need help as well.
Right. Yes, they do. And, we were fortunate. We have 4 veterinarians, hospitals. We have Northlake Animal Hospital that is more than willing to help us, take donations in. If somebody can't make it out here, we're not going to stop. We're not going to stop with Sunday. We have an email address. It's kibblesforcanines@gmail.com. They can, donate to us. Our helpers are going to be out here respecting the COVID guidelines. They'll wear their masks. They'll take the food out of the drive cars for you. All you got to do is pull up and drop it off. And, we have Michael Tellerino here, who is also the CEO of the Canine for Veterans, and they do a lot. They really do.
Well, it sounds like you're making it easy for us to help. So what is the website that people can go to get more information?
So we have a Facebook page. It's the American Legion Auxiliary Unit 888 Facebook page. And you can get us there. You can email us, like I said, at kibblesforcanines@gmail.com. You can contact us. My phone number is 708-567-7431. We'll be more than happy to take anything anybody, wants to give us. It is unopened dried dog food or treats. And there again, Knoll Animal Hospital in Carroll Stream is helping us. Lombard Animal Hospital and Lombard and Addison Animal Hospital.
Well, Brenda,
they are more than willing to take that.
It sounds like you guys are doing a wonderful thing, and I know that's pure love when you're giving out your own personal number live on TV. So keep up the good work and do what you can, and we so admire, and hopefully we'll be able to help you out. Thanks for joining us this morning.
Thank you. Thank you.
Coming up, even with schools closed, you can still keep your children interested in reading and writing. Brittany is going to be speaking with Redwood Literacy about some fun activities even the most reluctant students are going to love.
Well, we don't know yet if and how big of an impact this year's abrupt start to e-learning will have on our kids' education. But there are a few things parents can do at home to help get their kids engaged and interested in reading and writing. And joining me this morning is Becky Sinclair from Redwood Literacy. Good morning, Becky.
Good morning. Thanks for having me.
Well, first off, please. Thanks for being here. First off, tell us a little bit about about Redwood Literacy.
Absolutely. So Redwood Literacy specializes in teaching students with dyslexia, dyscalculia, and dysgraphia. We use a lot of research-based methods like the Wilson Reading System and individualized instruction to help students learn to read.
Well, what are some ways that parents can help their maybe reluctant readers at home during quarantine time while schools are closed?
Absolutely. There's so many great, simple, engaging ways that we can help our kids to learn at home, even if they're not the type of student that wants to sit down and read for an hour at a time. 150 of the most common words in the English language actually make up 50% of everything that we read and write. So this is where we're going to get the most bang for our buck. As you can see in the video, one of my favorite ways to do this is with simply chalk. So writing words on the sidewalk in a hopscotch format or lily pads where students can read the words and jump and get that movement piece in is a great way to practice those high frequency words. Additionally, as you can see here, we can use a Nerf gun game where parents can simply use Post-it notes to write those high frequency words on a wall or on windows, and use a Nerf gun to have the child spell the word and aim and shoot those words, again making it super engaging for the child. Students with dyslexia need 3 to 10 times the amount of repetition to kind of solidify those skills and those concepts. So don't shy away from repetition as you're working with your child at home. Another favorite is audiobooks. This is a great one for parents that are juggling working from home as well as teaching their kids. Learning Ally and Audible through Amazon are great resources for this. You can have your child listen to an audiobook. This really works on building background knowledge, increasing fluency, and helps with the vocabulary acquisition that so many struggling readers really need support in. So have your child listen to an audiobook and draw a picture of what's happening as they listen is a great way to engage students in those foundational reading skills at home.
Well, you've got some great ideas there, and I think you hit on some key points there. Some fun ways to keep them engaged by making it fun, making it feel almost more like a game than just doing work. If people want to get some more information or learn more about Redwood Literacy, where can they go?
They can go to redwoodliteracy.com. We have audiobook lists online for different grade levels, and we're also coming out with a writing series on our Instagram page. So definitely check out Redwood Literacy on Instagram as well for lots of different resources there.
Awesome. Well, thank you so much for joining us this morning. We appreciate it, and some great tips, I think, for parents on what they can do in helping keeping their kids engaged.
All right, everybody, welcome here to News and Now on Fox 10 Extra. We were listening to some of Fox 32's coverage. Let's go right out to the White House. It is just beginning for the press secretary to start the briefing.
In Minnesota of George Floyd, the death of George Floyd is absolutely tragic. That video that we saw, that I saw, that my staff saw, that the president saw, and the president put out a statement last night that at his request, the FBI and the Department of Justice are already well into an investigation as to the very sad and tragic death in Minnesota of George Floyd. I have asked for this investigation to be expedited and greatly appreciate all of the work done by law enforcement. My heart goes out to George's family and friends. Justice will be served. I can tell you that as I'm briefing you at this moment, the president is receiving a briefing from the Attorney General, Bill Barr, on this, and the Deputy Director of the FBI. So that is ongoing as I begin this briefing. Secondly, I want to transition into some news from SBA and Treasury that was announced that today the U.S. Small Business Administration, in consultation with the U.S. Treasury Department, announced that it is setting aside $10 billion of round 2 funding for the Paycheck Protection Program to be lent exclusively to CDFIs. Those are community development financial institutions. CDFIs work to expand economic opportunity in low-income communities by providing access to financial products and services for local residents and businesses. So we're encouraged to see that. And then finally, before taking your questions, I wanted to address what has been going on Twitter and with social media. I believe it is time to, quote, get the facts about Twitter and other social media platforms targeting their bias against President Trump and conservatives online. If we were to judge the bias of Twitter and its top employees by their own words, the case would be an easy one to make. Twitter's head of site integrity has tweeted that there are, quote, actual Nazis in the White House, and no fact check label was ever applied to this absolutely outrageous, offensive, and false claim made against the White House and its employees. But let's judge Twitter based on their actions, not based on the words of its top employees, and its actions are no better. President Trump recently received a so-called fact check label for a tweet. It was a false fact check and an accurate fact check, but nevertheless, Twitter moved forward with it. Dan Scavino, the deputy chief of staff here, was the first user in the history of Twitter to receive a so-called, quote, manipulated media label for posting a video that played a verbatim clip. It is no coincidence that these two unbelievable interventions by Twitter were targeted against the President of the United States and one of the President's top advisors. This is bias in action. And while big tech is quick to censor the president, quick to censor some of his top employees, they are very reluctant, it seems, to label some of the actions by Chinese officials, some of the misinformation that has been spread by China. For example, to move off of Twitter and move to Google, they created a search engine for the Chinese Communist Party, which blacklisted searches for human rights and allowed for easy surveillance. Facebook and Twitter have both taken paid advertising that spread disinformation about China's mass imprisonment of religious minorities, and Twitter has allowed Chinese officials to use its platforms to spread misinformation about the coronavirus, undermine the pro-democracy protests in Hong Kong, and more. And then back in March, a Chinese official began spreading a conspiracy theory on Twitter, an egregious one, that our U.S. military was responsible for the spread of the coronavirus. And that tweet, that disinformation, it took all the way until today when we raised concerns about it to get a fact check. So they appear to be very hastily eager to censor President Trump and some of his employees, but a little reluctant when it comes to China. It's a bit befuddling. But no one believes in the First Amendment more than the president. The president will take action to ensure that big tech does not stifle free speech and that the rights of all Americans to speak, tweet, and post are protected. And finally, I just want to note one other action of Twitter that I learned just before walking out here, that on the Mueller report, their anti-Trump headlines were anti-Trump by a ratio of 76-1. That's extraordinary, and it's not just bias aimed at President Trump and his employees. It's also aimed at everyday Americans. It's aimed at the movie Unplanned, as Twitter suspended their account and then came up with an excuse in the aftermath. And then just another example, that liberals are allowed to incite violence against the Covington kids who were in the end proven right, and their video was taken out of context, and yet these individuals were allowed by Twitter to incite violence. It's very disturbing to see. So those are some of the president's concerns, and with that, I will take questions. Jim. That's a very nice tie, Jim, by the way.
Thank you very much.
Yes.
Yesterday, the U.S. hit 100,000 deaths from the coronavirus. That happened at around 6 o'clock yesterday evening. It took until about 9 in the morning for the president to recognize that on Twitter. What took him so long?
Look, the president recognized that landmark before we even hit it. The president, that was, after all, it was the impetus behind him lowering the flag to half staff. He did that for several days, and that was an acknowledgement of that number approaching, and he acknowledged it in a tweet this morning.
But we hit 100,000 yesterday evening, and it took 13 hours, some odd hours, for him to recognize that and tweet about it.
And far in advance of that benchmark, as I noted, he lowered the flag to half staff. The president has said, you mentioned 100,000, but the president has said one death is too many. He takes this very seriously. He said before, this is the hardest part of his presidency. It's something that no one wanted to see happen.
And on Twitter, shouldn't the president be fact-checked? Especially this president who has made so many false and misleading statements that has put, fact checkers to work across the world. I mean, he's uttered some 18,000 false or misleading statements, according to the Washington Post. If there's any president out there who should be fact-checked, any political leader out there should be fact-checked, isn't it President Trump? And aren't you trying to silence fact-checking by going after Twitter like this?
Look, well, first I would say I disagree with all, if not almost all, of those assertions that you're making there, because look, if you're going to get into the fact-checking business, there's no one that should be fact-checked more than the mainstream media that has been continually wrong about a number of things. To give you a list of some of the most egregious ones, that ABC News in December of 2017 falsely reported that Flynn would testify that the president directed him during the campaign to make contact with the Russians. That was false. In 2017, your network, CNN, botched their WikiLeaks email exclusive and were forced to make on-air corrections. CNN's Jem Sciutto, another CNN one, dropped a fictional bombshell in 2018, July, claiming that Michael Cohen would tell federal investigators that the president knew of the Trump Tower meeting. And there are many more, not to just put the onus on CNN there. So if anyone needs to be fact-checked, I think it should be the media.
There are news outlets that make mistakes from time to time. We own up to those mistakes. We correct those mistakes.
Not always. I have many you guys haven't owned up to. I could get to.
We do on a regular basis. The president never owns up to any of his false or misleading statements or outright lies. You have pledged in this briefing room to never lie to the American people. Are you saying that the President of the United States has never lied to the public before?
I'm around the president. His intent is always to give truthful information to the American people. And you mentioned that the media apologizes for their mistruths. I mean, I'm sitting here looking at other headlines in the New York Times saying there aren't enough ventilators to cope with the coronavirus. In fact, we had an excess of ventilators we've shipped around the world. Washington Post, U.S. health system is showing why it's not ready for a coronavirus pandemic. We were ready. There's many more I could get to. I could, on the coronavirus specifically, I could spend the time going through these, but I don't think that's what the American people want to hear.
Yes. On the Minnesota case, does the president agree with the firings of the 4 police officers, and does he believe that they should be prosecuted?
I haven't talked to him about that specifically, but let me tell you this, that he was very upset when he saw that video. I was on Air Force One. I don't know if it was the first time he saw it, but he certainly saw it again on Air Force One. He was very upset by it. It was egregious, appalling, tragic, and it prompted him to pick up the phone, or the chief of staff to pick up the phone and say, we need to expedite what was already an FBI investigation. He wants justice to be served.
Yeah.
Yes, Jeff right there.
Thanks, Kaylee. Can you give us an update on when the president plans to sign the EO on Twitter and social media? And can you also give us an update on his plans for China and Hong Kong? Is there an order coming on that as well?
So thank you for the question. First, I would note with regard to the timing of the EO, that should be later this afternoon is what we're hoping for, hopefully before 5 p.m. But again, it could change. It's still in the works, but we are getting closer. With regard to Hong Kong, I would just say, reiterate what I said 2 days ago, but I would also say that China's decision to impose a new national security law in Hong Kong lies in direct conflict with its international obligations under the principles of the legally binding UN-registered Sino-British Joint Declaration, and that Secretary Pompeo determined that Hong Kong does not warrant different treatment under U.S. laws because Hong Kong no longer remains sufficiently autonomous from the PRC. And then anything further, I'd refer you to the State Department for now.
Just one more somewhat related. The House recently passed a bill about a minority group in China, the Uyghurs, if I said that correctly. Does the president plan to sign that? And is the White House going to treat bills, or does the White House see any concerns about bills that have been passed by proxy as not being constitutional?
So we would, first, let me say we would encourage Nancy Pelosi and the Democrats and others to come back to the Hill. It's more productive to have those members here. The Senate has convened meeting. The House can do the same, and they can do it in person. But with regard to the Uyghurs, that's a very important question. We haven't received the bill yet, so the president hasn't been able to look through it, and I won't get ahead of him on announcing one way or the other on that. But I would note that the Trump administration continues to take actions to hold the CCP accountable for its highly repressive campaign against the Uyghurs and other religious and ethnic minorities. Paula.
Hey, Kaylee, thank you. On vaccines, in order to achieve herd immunity, you need about 80% of people to get this vaccine. Currently, only about 50% of Americans say they'll receive it. So will the administration make the vaccine mandatory?
So the vaccine, let me just note that we're working aggressively to get one, and we would like to get one by the end of the year. Everything does not depend on a vaccine. Vaccine's an important component of this, but there are also therapeutics. We're seeing there's not necessarily a tie to reopening and an increase in cases, so that's encouraging. And I would refer you further to Alex Azar, who's made extensive comments on a vaccine and the necessity.
It's clear if you guys will make it mandatory, if you'll use your federal powers, how you'll use them potentially to encourage people to get this vaccine, because if you don't have herd immunity, elderly people, immunocompromised folks, they may not be able to go about their business again.
Yeah, I would have to talk to the president. I haven't talked to him about his views on making it mandatory or not, so I'd have to talk to him and get back to you on that. Yes.
Thank you, Kaylee. I wanted to ask you a question, first of all, about the comments in your statement that you made. At the conclusion of your comments in regards to George Floyd, you said that justice will be served. What do you mean by that? Do you mean that those officers who've been fired should be arrested? Do you mean by that those officers who've been fired should be prosecuted? Do you mean that those officers who've been fired should be convicted? What do you mean by justice should be served? Will
Yeah,
be served? Will be served?
I'll leave that to the justice system to work out, but the president...
What do you mean when you say
Those
justice will be served?
That's in the president's statement, so I'd refer you back to his statement. But he's being briefed on this right now, and we'll have more announcements as they come.
And
Yes.
another matter in regards to what you said in your statement, in regards to the executive order, I realize it hasn't come out yet, and I realize we haven't seen the language, but we have seen reports. I work for Fox, and we've seen reports that it relates to the Section 230 of the Communications Decency Act. And interestingly enough, former Vice President Joe Biden has also called for the repeal of Section 230. He says that it should be revoked immediately. But as you know, an executive order does not trump the law. An executive order can't, for instance, repeal the law. It can't in any way amend the law. So what would be the intent behind this executive order without getting ahead of what the president intends to sign?
Yeah, I don't want to get ahead of that, but the one thing I will say more broadly, you referenced that section, I think that would be included in what I'm about to say. There are various shields in place that essentially shield some of these social media companies and allow them to censor conservative users, and we're not able to see what happens behind those shields. That section was one of those shields you mentioned, so we're looking at ways to remove those shields to shed some light on what is happening and some of the decision-making behind the scenes. That's generally and broadly the idea, but I won't get ahead on any specific announcements that should come hopefully before 5 p.m. John.
Kaylee, I want to follow up on Jim's question on fact-checking and Twitter, but first a clarification. Has the president spoken to the family of George Floyd?
Not to my knowledge. If he did, without my knowledge, that could have happened, but not to my knowledge.
Do you know if he intends to, or will you get back to us on that?
I can ask him, and I can get back to you on that.
Okay. Regarding the fact-checking, I mean, the president clearly said things in these tweets that are not true. Do you not acknowledge that?
No, I don't acknowledge that.
He said, for instance, that the governor of California is sending out ballots to millions of people, anyone living in the state, no matter who they are, how they got there. That is not true. California is sending out absentee ballots to registered voters, not to anybody.
Yes.
That's just not true.
So let me address this in detail on the issue of ballots. And I'm going to lay out some of the president's concerns, and in that I will get to the California example. First, I want to note that there is a Pew study done that shows there's plenty of reason to believe that in the mass mail-in system that there is fraud. They estimated that approximately 24 million, 1 out of every 8 voters registered in the U.S. are no longer valid or are significantly inaccurate. So these are people who are on voter registrations that have not been maintained, that have not been kept up. More than 1.8 million have been deceased, they estimated. And then when you look and drill down into some of the examples that we've seen in states, Nevada I read about this last week, and it just really struck me as a perfect example of what the president is concerned about with mail-in ballots and the fraud that can be inherent in that. There were ballots, because Nevada mass mailed them out to voter rolls, that were piling up in apartment complexes, outside of apartment complexes in Las Vegas, sitting around in trash cans. This is how we're protecting ballots. It's extraordinary. Postal workers, one 36-year veteran carrier said she's never seen anything like these influx of absentee ballots. All of the people had moved or died when she set out to deliver on her first delivery route, and this happened just recently. You can go read the articles from last week. She found 65 ballots of people who had moved or died on her second carry, 100, and then as the week progressed, thousands just sitting in crates. I mean, this is extraordinary. This is not how we should be protecting U.S. ballots. In South Carolina, the Democrats sued to force a rush transfer of mail-in voting, and this happened again recently. I think it was last week. And mail-in ballots for South Carolina turned up in Maryland. There's another example of 700 suspicious mail-in ballots in Dallas, and an individual charged with second-degree felony illegal voting. And he's accused of visiting a woman in April to collect her blank absentee ballot, filling it out, and forging her signature. I mean, this is extraordinary. And then you go on. There's a New Jersey example of over 3,000 ballots that were seemingly set aside. And going to California, you mentioned, California is one of those states that's notorious for ballot harvesting. And in 2018, the registrar in Orange County said that they reported that his office had people dropping off maybe 100 or 200 ballots at a time. And somehow in LA County, 112% of LA County is registered to vote. So the problem is this: when you don't clean your register and you send out your entire register, auto send out these ballots, they end up in trash cans like in Nevada. They are subject to fraud, and that is extremely troubling.
But Kaylee, I asked you a very specific question. The president said that California was sending out ballots to everybody in the state. That is a false statement. It is not correct. Will the president correct that, acknowledge that what he said is simply not true?
There is an executive order that was put into place recently by Gavin Newsom that would auto-send to voter rolls, and that would lead to what the president was suggesting.
Yes. Excuse me, Kaylee, to registered voters, it's not to everybody, it's to registered voters.
Yeah, to everyone, including dead people on the voter rolls, including to the mysterious 112% in LA County. That's not just everyone, that's everyone plus an extra 12%. And if you're not concerned about that, I'm sorry. I mean, the media is very concerned about the security of our elections, but when it comes to mail-in ballots, all of a sudden, the concern for election security just melts away.
But Kelly, you yourself have voted by mail.
Thank you very much.
Brian.
Research on mail-in ballots. Research has shown that, one, it doesn't benefit either party. It increases voter participation. Secretaries of State of both parties are still pursuing it. And fraud is not widespread. And so why is the president continuing to tweet about this and to give the impression that there's widespread fraud in the use of mail-in ballots when he himself used a mail-in ballot? The big question is, some are concerned that the president may be laying the groundwork to cast doubt on the election. Is that what he's doing by bringing this up?
Well, I appreciate you bringing up this question, and specifically the component about the president using mail-in ballots. There's an important distinction, and I think it's lost upon a lot of people, but it's important to make, is that the president is okay with mail-in voting so long as you have a reason. He's not okay with mass mail-in voting where you auto-send, as I said, to all of these voter rolls with people who are dead that are subject to fraud. That is the case. I listed off for you, I think 3 of the 5 examples I gave you were from just this week and last week. So this does happen.
Well, and research has shown, Stanford University did a research study that showed that there wasn't widespread fraud in these vote by mail, and that it didn't benefit either party and increase voter participation. So why would the president be against that?
Yeah, it is subject to both parties. This can hurt both parties. I would note that a bipartisan commission, led in part by President Jimmy Carter, a Democrat, concluded that mail-in ballots, quote, remain the largest source of potential voter fraud. So moving the entire country to that system doesn't make sense, and doing so in a hurried fashion ahead of November. Just go look at the Democrat Iowa caucus and how it worked out when they tried to move to a new system.
Trying to
And
lay
then
groundwork to cast doubt on the results of the election.
Finally,
Is he laying groundwork to try to cast doubt on the results?
No, he's certainly not doing that. And I would finally note there's an additional concern that was very well laid out by the Wall Street Journal editorial board, that in 2016, minorities and first-time voters were more likely to have mail-in ballots thrown out. So that is another troubling concern. In fact, 319,000 of those total votes were rejected. Yes.
Thank you. Back in November, President Trump went up to Walter Reed. He said it was for phase 1 of his physical. When does he plan to complete phase 2 and release the results to the public?
Yeah, I don't have an update on the physical, but because you asked that, I'll specifically inquire about that today and try to get back to you. You what?
He does plan to do it?
Yes, he does. Yes. Yes.
Thank you. Thank you for doing this. I wanted to ask you about, President has completed his 2 weeks of hydroxychloroquine. Have you spoken to him what he's feeling about? Is he feeling better? What's his feedback about that?
I did, and thank you. I know that you emailed me a question to that effect, and I didn't have time to follow up with you via email, but because I saw that, I went into him just before coming out here, and I asked him that, and he said, quote, he's feeling perfect, quote, he's feeling absolutely great after taking this regimen, and quote, he would take it again if he thought that he was exposed. So he is feeling very good. And I also would point folks, there's a very, very well done piece. It's very thorough with a lot of medical experts laying out about prophylaxis use of hydroxychloroquine by Tina Hessman-Say at sciencenews.org. It's very well done. She talks about the nearly 200 clinical trials around the world, including 28 involving healthcare workers. In fact, at Henry Ford Hospital in Michigan, 3,000 healthcare workers are taking it as part of a trial, and there's some really excellent information there about the use of prophylaxis for this.
A number of Indian American doctors have been writing. I have seen some of those letters. They are supporting President taking hydroxychloroquine. Some of them have themselves taking it. Have you seen those too?
Yeah, absolutely. Well, there's a lot. It's not specific to the president, these doctors, but they just talk in general about what they've seen. For instance, Sarah Lofgren, an infectious disease doctor at the University of Minnesota Medical School in Minneapolis, they're testing hydroxychloroquine there to prevent COVID-19, and she said when used alone, we're not seeing major issues. Out of the thousands of patients, we're not seeing things that some people are concerned about. And I would just note that it's important, of course, always, if taking hydroxychloroquine, get a prescription from your doctor. Doctors are the ones that need to be prescribing this. But that being said, I think that some of the hyperbole around this drug that has been on the market for 65 years, been approved for use in 3 other maladies, and has been approved for off-label use, when there's a lot of hyperbole about this being unsafe, some of the things I've seen reported out there, there are consequences deterring people from being recruited into actual clinical trials. I have some quotes from a New York epidemiologist and others conducting trials saying they're having trouble recruiting people because some of the myths that are out there. So it's important to note that this drug has been safely used by millions of people for a long time.
One more on China.
Yes.
President yesterday tweeted about he wants to mediate between India and China on the border dispute. China has been behaving very weirdly, very aggressively with its neighbors in the last few weeks, in particular in South China, so you must have seen on the Indian border side. What's the message President has to these countries?
Yeah, I'd refer you back to the president's tweet on that one. Yep. Yes, Christian.
Thanks, Kaylee. We saw reports that before swearing in John Ratcliffe as DNI, Rick Grinnell declassified a trove of documents related to the Russia investigation. The president hinted that those could be made public sometime soon. Does the director plan on doing that anytime in the near future?
Yeah, so those, I believe, are under a process of review by the DOJ, so I'll refer to them on that. Yes. Tom, do you have a question? I thought I saw you had your hand raised. No?
Kaylee.
Kelly?
Yeah, back there.
Yes, hi. Thank you. I want to ask you about Russia's recent actions in Libya. The U.S. AFRICOM has been issuing statements recently about U.S. actions there, and in their statements they're saying that Russia is clearly trying to tip the scales in its favor in Libya, just like it did in Syria, by deploying military aircraft likely to provide close air support and offensive fires for the Wagner group that is supporting joined Libya's LNA fight against the internationally recognized government. What's the White House position on this? Do you agree with the U.S. AFRICOM assessment that their actions, the Russian actions in Libya, are destabilizing the region?
Yeah, we encourage de-escalation in Libya, and for more, I'd refer you to the DoD. Chanel?
Thank you, Kaylee. If Joe Scarborough were innocent, couldn't he sue the president for defamation? And then, in turn, couldn't President Trump's attorneys immediately depose Joe Scarborough and allow him to go on under oath and explain how this 28-year-old woman was found dead by his desk with multiple skull fractures? Would the president welcome a defamation suit from Joe Scarborough?
So on that, I would just refer you back to some of my previous comments that the audio on the Don Imus show was very disturbing, where there was a lot of laughing and joking about this matter. That certainly is not a laughing and joking matter.
Do you think that Scarborough has grounds to do so?
So I have no further comments other than to just point back to the Don Imus audio. Who hasn't? Yes. Do you have a question? Yeah.
When were the states first notified that they would have to take the lead in COVID-19 testing? I know the CDC was working on it early on, January, February, there was a problem with the test. When were the states told, hey, you have to prepare and take the lead here in testing your population?
So I don't have a precise date for you, but I know the way the process went, where the states came up with the plans that they thought they would need to have adequate testing in order to reopen. Those plans were given to us, and Admiral Joie meticulously went through all of those plans, ensured that we had enough supply to shore up those plans that states had, and to make sure that states had enough to safely reopen. So that was how the process went, and the president has done really extraordinary work with testing. 300 to 400,000 tests per day is a pretty good number, a very good number, I would say. More than 15 million done, beating the world in testing numbers, and under 10% positivity is at least the barometer given by the WHO as what's necessary. And nationally, we're at under 10% positivity. In fact, we're at 7.5% positivity rate. So we are doing quite well on testing. Is there anyone who hasn't gotten a question? Because right there.
Yeah, thank you. Has the president heard from his counterparts regarding the G7 summit? Is it actually going to take place in June at the White House?
We do aim for it to take place then. It's gotten positive reception. I inquired about this 2 days ago and was told it's getting very positive reception from world leaders. So we do intend for that to take place here.
Yeah, perfect. Thank you. You yourself have been able to vote by mail several times. Do you think anyone with health concerns, who has health concerns about going to the polls, should have that same convenience, that right?
So what I would note again is the distinction between absentee voting and having a reason, and mass mail-out voting, where ballots are sent in a widespread fashion to people who are dead but on voting rolls, and those ballots end up in trash cans. That's a state-by-state consideration. I'll leave it to states to determine what is a valid reason. But there are, if you're an elderly person who's unable to get to...
They're doing this out of health considerations for a lot of their residents. And if they want to pursue that track, is there anything wrong with that?
Again, you're asking, I assume you're asking with relation to the pandemic that's going on. None of us know where we're going to be in November. I'd first note that. We don't have a crystal ball. But what I would say is that there are real concerns when you don't do in-person voting. And South Carolina is a great example where Democrats literally sued to force rushed mail-in voting. And what happened? You had ballots from South Carolina ending up in Baltimore. That is not a tenable system. And as states start to reopen and we see people out at beaches in Florida and we're not seeing these mass spikes, and we see people safely going to restaurants and social distancing and washing their hands and doing all of the wonderful mitigation techniques put forward by our experts, they're reopening society and they're doing so safely. And I think there's a way to continue our great civic duty of showing up and voting in a way that is safe. And the same way it's safe to eat at a restaurant, it's safe to go to a beach, we can vote in a safe fashion. And I think that's something that is good and to be celebrated as we head to November. All right, I think I took everyone's question. Thank you so much, guys.
Thanks.
And that was the briefing in full. In just a moment, we'll have it on our YouTube page in full for you, so you could always watch that on demand. You are watching News Now, part of FoxandPhoenix.com, worldwide on coronavirusnow.com as well. In the meantime, everybody, let's just show you a little bit from earlier today. Governor of New York, Andrew Cuomo doing a briefing.
States are in charge, and yes, the states are implementing their plans, but we need support from the federal government, and that's the role of the federal government. Washington has passed numerous pieces of legislation, and they've successfully bailed out big corporations. They passed pieces of legislation that have a lot of benefits for the rich and the powerful. Now, the question is, what is Washington going to do in terms of passing legislation that helps working Americans, right? Police officers, firefighters, school teachers, hospitals, unemployed people, businesses that are struggling. How do we help them? How do we bring them up? And that's what states do and local governments do, and that's state and local government funding, and they have to provide that. Also, my opinion is Washington should, just for this once, and their proclivity to make every piece of legislation pork barrel legislation. I understand they have to get senators to vote for it, and they have to get House members to vote for it, but that doesn't mean they have to make it a gravy train of pork just to pass it. Maybe you can just pass a bill on the merits of a bill. How about that? Novel, but possible. This is supposed to be a specifically targeted piece of legislation to help restore the economy and repair the damage of the COVID virus. Well, then make the legislation about funding to repair the COVID virus. And you know where the COVID virus has been in this country. You know where it's wreaking havoc. You can count the number of deaths and where they are. You can count the number of positive cases and where they are. You look at the past legislation that came out of Washington and how they dispersed money, and you look at how they wound up making it a gravy train. And every state got a lot of money, local governments got a lot of money, and in many cases disconnected from the COVID virus and the COVID situation. If you take the total funding and you actually look at how much states got per positive COVID case, it's not even close. Some states got millions of dollars per COVID case. New York State, we got about $23,000 per case. New Jersey, we got about $27,000 per case. I understand they have to, quote unquote, buy votes on a piece of legislation. I also understand it's taxpayers' money. And theoretically, a legislator is there to do what's right. And not because that legislator was seduced with large amounts of taxpayer dollars, even though that state wasn't affected. I also think Washington has an opportunity to actually step up and to be smart for a change. They should be talking about revitalizing the economy, not just reopening the economy. I don't believe you just reopen the economy and it bounces back for everyone. I think it bounces back for the big corporations. I think it bounces back for the rich. I think it bounces back for the powerful. That's what happened after the 2008 financial crisis, the mortgage fraud crisis. The big banks that caused the crisis, they were fine just months afterwards. They took all that federal bailout money, they gave themselves bonuses. I remember I was the Attorney General of New York. I chased those corporations to put the bonuses back. But how about the small businesses that closed? How about the corporations that are going to lay off workers now? What's going to happen to them? How about all those blue-collar jobs that are not going to come back right away? All those little retail stores that are not going to come back right away? So it's not just about revitalizing. Not just about reopening, it's about revitalizing. And it's about having a plan and a vision for the future. Okay, we went through this. What's the plan going forward? We went through the Depression, but there was a plan afterwards. We went through World War II, but there was a plan to restore the economy. Where's the plan? Where's the vision? Where's the plan to say, yes, we went through hell, but heaven is on the other side, and we're going to rally and we're going to be better for this? BBB, build back better. We're not just going to return to where we were. We're going to be better than ever before. And to make sure that any of those corporations that took taxpayer money rehire the same number of workers. You hear these corporations now talking about, well, we're going to take this opportunity to restructure. We're going to get lean. You know what that means? That means they're going to lay off workers. That means they're going to boost their profits and their stock price by laying off workers and not rehiring people after the pandemic. Now, that's a corporation's right, but you don't have to subsidize that with government money, right? You shouldn't be giving them government cash, and then they lay off workers, and then the taxpayer has to pay unemployment for the workers they laid off. That would be a scandal, right? Well, if they don't stop it, it's going to happen here. And if they were smart, they'd finally rebuild the infrastructure in this nation, which they've been talking about for 30, 40 years, and they've never done. You want to put people to work, build airports, build bridges, put technology in education, put technology in healthcare, do the things you've talked about for 40 years, but the government was never competent enough to do. And also to Washington, after my conversations, so much of it is, well, here's our politics, here's our politics. Forget your politics, just put it all aside. There's a greater interest than your politics, and that's doing the right thing for this country and for your constituents, and stop the hyper-partisan attitude and the gridlock. Forget the red and the blue. We are red, white, and blue. We're all Americans. That's my opinion. Back to the facts. We're going to focus on the opening of New York City. We have reopened the other regions of the state. We divided the state into different regions because the state has dramatically different facts across the state. We're in New York City, one of the densest urban areas on the globe. We have parts of upstate New York, which are rural areas, which look more like the Midwest, and they had facts more like the Midwest. So we divided the state into regions and addressing the facts in each region. The other regions have all started reopening. New York City, where we had a much higher number of cases than anywhere else in the state, anywhere else in the country, than many countries on the globe. New York City is a more difficult situation. We were attacked in New York City by the coronavirus from Europe. I like to say that because people say, what do you mean the coronavirus from Europe? I thought the coronavirus was from China. Yeah, so did I. So did everyone. That's what we were told. The coronavirus was coming from China. What we weren't told was the coronavirus left China, went to Europe, January, February, and then came here from Europe. Oh, nobody told us. I know nobody told us. They say nobody knew. I don't know how nobody knew, but the cases came from Europe. January, February, March, 3 million people traveled from Europe to JFK and Newark Airport. Why did New York City have so many cases? Because 3 million Europeans came January, February, March and brought the virus, and nobody knew. And nobody told us. No fault of our own. There's nothing endemic to New York City. Yeah, we have density. But we're all watching China. We're looking to the West. And the virus came from the East. It came from Europe. And that's been documented now. So we were the hardest hit. But we're going to reopen at
Wait a minute here, everybody, on coronavirusnow.com. The governor there of New York saying that no, it didn't come from China, it came from Europe there for New York. But when it originated in China, then went to Europe, still from China. Don't understand that. You always get to pass on that one. I got to bring that up there for you because I don't know why they always get a pass like that. Live look at the White House here as we continue on coronavirusandnow.com, showing you that White House. We just saw the briefing wrap up there moments ago, and we have it for you in full on our news briefing on our YouTube page there, so you could see it there in its entirety whenever you'd like. All right, folks, in the meantime, just got a little extra time left on Fox 10 Extra. Let's bring it back to you here.
We're crowded, and the MTA has really taken the bull by the horns on this one. We never heard of disinfecting a train. We heard of cleaning trains, and then we could debate whether or not the trains were that clean. But to get them to a point where they're disinfected was a higher level, a higher standard than anyone ever dreamed of. They're now disinfecting every train and every bus on a daily basis. They're piloting the use of UV light technology to kill viruses in subway cars. So they're using the best science to get ready for this. In the meantime, we want to focus on New York City hotspots. Because if you look at New York City, there are very different stories within the city. And we now do enough testing. We do tens of thousands of tests per day. We are doing more testing in New York State than any state in the country. We're doing more testing in New York State per capita than any country on the globe, okay? So we're the testing capital. When you do that many tests, you can target exactly where people are getting sick and where those new cases are coming from. And you can look at that by neighborhood, by zip code, and what you see is more of the cases are coming from outer borough communities, more minority communities, lower income communities, new hospitalizations coming from people who are not currently working. They're not essential workers. They're communities where essential workers live, but they're not the essential workers. It's more from what we call community spread. It's in communities that have an underlying healthcare disparity, which is a problem across this country. Populations that have higher incidence of underlying illnesses, and lack of masks, social distancing, particularly with younger people. If you look at the testing results, for example, you have communities that have double the infection rate of the city in general. So the city in general is about 20% infection rate. You have communities that are literally more than double, 43% infection rate. Brownsville, Brooklyn, 41% infection rate. East Bronx, 38% infection rate. Soundview, Bruckner section of the Bronx, 38% infection rate. Hollis, Queens, my old neighborhood, 35% infection rate. Flatbush, Brooklyn, 45% infection rate. And that's why we're here today. You know these communities have a higher infection rate. You know the new cases being generated tend to come from these communities. Well, then target those communities, right? That's part of being smart. Get them help and get them help faster and address the healthcare inequality that is underlying all of this. So bring in more diagnostic testing, more antibody testing, more PPE, more healthcare services for the underlying illnesses. That's where the comorbidities come from. Bring in more supplies and bring in more communication. We're doing all of the above. We're taking on the issue of inequality when it comes to healthcare, and we're going to take on the challenge of the most impacted communities in terms of COVID. We're working with Northwell Health Systems. Northwell is the largest health system in the state. It's a great organization, and they're going to bring more health care services to the impacted communities in New York City that we're talking about. We're up to now 225 testing sites. I just passed one on the way here today. Many of these testing sites are underused. We have testing sites, drive-through sites that can do 15,000 tests a day. They're only doing 5,000 tests a day. There is no cost to the test. It does not hurt. It is pain-free. I did the test on live TV, didn't flinch. It's just a nasal swab. There's no needle. You can go to the website coronavirus.health.ny.gov and find the site near you. Get tested. Get tested. If you have a symptom, get tested. If you were exposed to a person who was positive, get tested. It's no cost. It doesn't hurt. And there are sites literally everywhere throughout the city. We've delivered more than 8 million masks across New York City to public housing, food banks, churches, and homeless shelters. The masks work. They work. And we have to culturalize the masks. We have to customize the masks for New York to get New Yorkers to wear them. We're bringing 1 million additional masks today. And today I'm signing an executive order that authorizes private businesses to deny entrance to people who do not wear a mask or a face covering. I have been working to communicate this message about masks and how effective they are. They are deceptively effective. They are amazingly effective. And we've made them mandatory in public settings, public transportation, et cetera. But when we're talking about reopening stores and places of business, we're giving the store owners the right to say, if you're not wearing a mask, you can't come in. That store owner has a right to protect themselves. That store owner has a right to protect the other patrons in that store. You don't want to wear a mask? Fine. But you don't have a right to then go into that store if that store owner doesn't want you to. And we'll sign that executive order. And in general, more communication, more education about the availability and importance of testing, diagnostic testing, antibody testing, wearing the PPE, why social distancing makes sense, and communicating this to people. And my main job all through this has been communications. This was not a task government could ever accomplish. I knew that from day one. I know what government can do. I know what government can't do. Tell 19 million people in the state of New York that they have to stay home. Government can't do that.
$10 billion for the last 20 years. It will take all of us from both sides of the aisle working together to make sure that we can protect Michigan families and Michigan businesses as we try to move forward. So I want you to see some of the things that we have done over the course of the last 10 weeks. This slide shows the amount we have invested to flatten the curve, to save lives, and to keep Michiganders safe during this time. It's kind of hard to see, but I'm going to give you some of the highlights. We've spent over $25 million in our hospitals, $22.8 million to direct care workers, $3.4 million in our nursing homes, $5 million to federal qualified health centers, $5 million in community mental health grants, $251 million on PPE to protect our healthcare workers and first responders. This includes everything from hospital gowns to ventilators to sanitizer to N95 masks and hospital beds. $101 million for childcare. $8.5 billion paid to Michigan workers through unemployment to help families put food on the table, along with the grants and supports to small businesses to help ensure those that have spent a lifetime building their small business can continue to operate once this is over. It's easy to look at the slide and just see dollar figures, but let's be very clear. Each of those expenditures represents people whose lives and livelihoods have been protected during this uncertain time. COVID-19 is a crisis unlike any we've confronted before. But because the vast majority of people in our state have been doing the right thing by staying safer at home, We've begun to phase in sectors of our economy: construction, manufacturing, retail, and more. And if we all continue to keep doing our part, if we don't let our guard down now and we continue to take this seriously, we will be able to announce more steps forward in the coming days and weeks. But Michigan and states all over our country need our federal government to step up and to help our efforts. We need flexibility and financial support from the federal government to support essential services like health care, education, public safety, and transportation during this crisis. Every state, as I said, every state in the nation is confronting a budget crisis that threatens everything from the education of our kids to our public safety to the health care that we all so desperately rely on. The nation's governors, both Democratic and Republican, have worked tirelessly to protect our people. On March 23rd, Republican governors wrote a letter to Mitch McConnell, Chuck Schumer, Nancy Pelosi, and Kevin McCarthy requesting direct assistance to the states in the form of block grants. They said, and I quote, "COVID-19 has put an unprecedented burden on state governments. States are spending heavily on the response to the virus at a time when many are at the end of their budget year and revenues are down because of limited economic activity. A block grant to each state would provide the certainty we need to continue providing critical services at a high level when they are needed now more than ever." And Governors Larry Hogan and Andrew Cuomo, the chair and the vice chair of the NGA, issued a joint statement in April calling on the federal government to provide assistance to states. Right now, the language in the CARES Act does not allow states the ability to use federal funding for existing items in the budget, even if they've been affected by lost revenue due to COVID-19. Congress needs to come together soon so that Michigan and every state across our country can account for the COVID impact to our existing budgets. Neither the virus nor the economic distress stops at state line or party line. We need our partners on both sides of the aisle in Washington to come together and pass a plan to aid states in our recovery. We need them to provide sufficient and flexible aid to mitigate this economic crisis that every one of us is going through. None of us can afford to let this devolve into a partisan issue. COVID-19 does not pick sides. Senate Majority Leader Shirkey said, "I'm ready to roll up my sleeves and go to work to arm wrestle with the federal government when it comes to funding our schools." Now that's the enthusiasm I'm looking for in my partners here in Michigan and our partners at the federal government who represent all of us here in Michigan. President Trump called this a war, and that's exactly what it is. So we need to act like it. In World War II, Americans dropped everything they were doing so that they could build planes or tanks. They rationed food and took care of one another. They worked together. They recognized it was a temporary sacrifice. It was until we had beaten the enemy. Our enemy now is not one another. Our enemy is a virus called COVID-19, and we must work together to fight it and to protect Michigan and Michiganders from the economic impact it has caused. Michigan is not alone. States across the country are facing budget challenges due to COVID-19. That's why my administration has taken a number of actions to mitigate the impact this virus has had on our state budget. I've taken a 10% pay cut through the end of the fiscal year, and my executive team and cabinet have taken a voluntary 5% pay cut. State employees have stepped up, and they have made sacrifices to be a part of the solution. Their sacrifices yielded over $80 million in gross savings to our state. I've also signed an executive order to implement a temporary hiring and discretionary spending freeze. These choices have been hard, and they weigh heavily on me every day. But it was the right thing to do in order to ensure that the essential services we provide will continue and to find savings where we can. It is a start. But $80 million in savings is not much when you're looking at a $3 billion problem. I'm hopeful that our partners in the federal government will do their part and work together to provide relief for states like Michigan. Moving forward, these are my budget priorities for Michigan families. I've always said that the budget is not just numbers on a spreadsheet. It's a statement of our values. During these unprecedented times, we must work together to ensure resources for our schools, our communities, and our workers. And that means prioritizing funding for school classrooms and literacy programs to help our kids get the skills they need. This is my top priority as we work on the budget. And based on his previous statement, I hope and believe the Senate Majority Leader shares that commitment. It also means funding police and fire protection to protect our local communities. It means continuing to ensure workers are safe when they go back on the job, paying first responders hazard pay for their critical work on the front lines, and extending unemployment benefits to those who will struggle to get back into the workforce. We also have a responsibility as leaders to protect the health and safety of Michiganders. Moving forward, I will work to prioritize funding for vaccine research at Michigan's research universities, continuing to support our Rebuilding Michigan bonding program to start fixing state roads right now and keep drivers safe, and paid sick and family leave to protect workers on the job. There's a lot we need to get done beyond the budget. Going forward, I'll push a policy agenda that prioritizes greater access to health care and high-quality child care for families. We'll support worker retraining through the Futures for Frontliners program to provide opportunities to our frontline heroes, the front line of this pandemic. This program will offer tuition-free college opportunities for the people who have risked their own health to take care of everyone else. It will help more workers acquire technical certificates, associate degrees at community colleges, and potentially bachelor's degrees at our universities once this crisis is over. A return to school plan that actually prioritizes the safety of our kids and equity in our classrooms. And we must support the small businesses that have been impacted by this virus. That means helping to implement changes they need to make in order to keep our workplaces safe. Means providing grants to small businesses that have been negatively impacted by COVID-19 and enhancing consumer protections that protect consumers' pocketbooks and public health. My guests here today will talk about the importance of these priorities for Michigan families, like high-quality child care. Our child care workers are some of the heroes on the front lines of this pandemic, people that often are overlooked, and yet they're working hard on our behalf because they're helping the front line go to work with confidence their kids are going to be okay. Daryl will speak in a moment on the importance of getting back to work on Rebuilding Michigan plan to ensure everyone can drive to work and drop their kids off safely. Over the past 12 weeks, I've dedicated all of my attention to protecting Michiganders from the spread of COVID-19. Now is the time to work hard to ensure support for our working families is in the state budget. I want to be clear, there are no easy solutions here. There will be hard choices, but I am eager to work with the legislature to advocate for the support that we need from the federal government. I know we have shared priorities when it comes to protecting the people of our state, and the vast majority of these issues are not partisan in nature. They're crucial to ensure important services for everyone in this state. I'm ready to work with everyone who wants to help fix problems. We've got to do this right. So I'm hoping that President Trump and Senator Mitch McConnell will do the right thing and provide states like Michigan with the budget supports we need to protect our families. We can't do it on our own. We need a partner in the federal government. This is a crisis unlike anything we've ever seen. I know I've said that many times, but the enormity of this is substantial. I'm hopeful that our federal partners across the aisle in Washington, D.C. will take action to give us the support that Michigan and all states in our country need right now. It's on all of us to work together and to get it done. And with that, I'll ask Dr. J to come and address you.
Thank you, Governor. Today we announced 56,014 cases of COVID-19 in the state and 5,000 372 deaths. We continue to see reductions in new cases in all regions across the state. However, there is variability in how the disease is spreading regionally. The northern lower peninsula and the upper peninsula continue to see low rates of cases, and the rate of cases remains relatively unchanged. Southeast Michigan has seen reductions in cases for 7 weeks. It is down to about 20 cases per million people per day. Most areas of the state have reached or almost reached this milestone as well. Western Michigan has seen reductions in case rates for the past week, and the local health departments in that area of the state are diligently working to track any new cases and outbreaks. If positive trends continue, we will be able to continue moving forward with the next phases of the My Safe Start plan. I encourage people to go to our new dashboard that was announced this week, www.mystartmap.info, to understand how the disease trend and risk level looks in your area. But I want to caution people, moving forward with reopening the economy does not mean that the risk of the disease has gone away. We still need everyone to do their part with social distancing, wearing a mask, cleaning frequently touched surfaces often, and hand washing. If we do not, this disease still has the ability to spread and to kill many more people. So we cannot let down our guard. As we slowly reopen the economy, we also continue to work to expand testing. We know that testing is critical to our ability to be able to understand how prevalent this disease is across the state. During the last week, the average number of diagnostic tests per day was about 14,400, an increase of 700 tests per day compared to the previous week. We are nearing the state's goal of 15,000 diagnostic tests per day and are looking forward to continued expansion beyond that number. We've seen some key successes in recent weeks, working in close partnership with the Michigan National Guard and our local health departments. The National Guard has tested over 44,000 individuals in the state this month and has distributed an additional 19,000 testing kits to our partners across the state. Testing efforts have included individuals in prison, many of the county jails, and a rapidly expanding number of nursing homes and long-term care facilities and community testing sites. We're taking further steps to expand testing throughout Michigan communities, particularly in underserved urban and rural areas. The governor's executive order, announced on Tuesday, allowed testing without a doctor's order. And the Michigan Department of Health and Human Services has expanded testing eligibility criteria to include a very broad range of people. The overwhelming majority of Michiganders can now get a test. All you have to do is call our hotline at 1-888-535-6136 or visit our website, michigan.gov/coronavirus test, to find a testing site nearest you. We know that testing is just one component of containing this disease. We also have to quickly reach out to individuals who test positive and reach out to their contacts so that anyone who may be infectious is appropriately isolated from others. We are aggressively ramping up this effort called contact tracing. By the end of this week, the state will have trained more than 500 volunteers to conduct contact tracing through our new centralized platform. We also stand ready to hire additional staff to support the efforts of our local health departments. Over the past month, in partnership with local health departments, we have doubled the speed at which we are contacting COVID-19 positive individuals to conduct case investigation interviews. We've also implemented a new centralized contact tracing platform that reaches out to every known contact of a positive case within 24 hours. We're making great strides. But for this very important contact tracing effort to work, we need the help of the general public. If someone calls from the state or local health department, please answer the phone. It is so important that we talk to you. Please know that we are not monitoring your movements. We won't ask you for your social security number. We won't ask you for your credit card. We're simply trying to alert you that you've had close contact with someone with COVID-19. If you test positive for COVID-19, it's also critically important that you tell the health department staff about your personal contacts. Some people have been hesitant to share this information with us, but if you do not do so, we cannot notify other people of the risk, and more people could get seriously ill or even die. And if a health department staff person tells you to self-quarantine, even if you have not tested positive, please take it seriously. We know that people can spread this disease to other people even without having any symptoms. So staying home if you have been exposed is critical to stopping the spread of this virus. I remain thankful that so many of our citizens are adhering to social distancing measures and wearing masks. This has truly made a difference. Testing and contact tracing are making a difference as well, but we need everyone to continue to do their part. Through our combined efforts, I know that we can prevail against COVID-19 in Michigan. And with that, I will turn it over to State Budget Director Chris Culp.
Thank you. 2 weeks ago, we reached agreement on economic and revenue figures at the Consensus Revenue Estimating Conference. Facing a $6.2 billion loss of revenue over the remaining of this year and next is not news that any state budget director wants to hear. But we knew that the COVID-19 would create tremendous challenges for the budget, which is exactly why we need help from Washington, just like every other state. Given the uncertainty in the economy created by COVID-19, we now have another revenue estimating conference planned for this summer. Another couple months of tax collections and economic data will give us additional information needed to finalize the FY21 budget. We know the legislature will have its own ideas on how to address these budget challenges, and I'm ready to work with them. But with a general fund that has been flat for more than 20 years, there's very little left to cut from state government without impacting essential and critical services and programs. Over 80% of the state general fund and school aid fund support schools, local communities, public safety, and health care. I believe that our legislative leaders agree that this is an unprecedented challenge, unlike anything we've seen in our lifetime. We will need to work together and find common ground to solve the budget challenges in front of us. I know that there is a statute that calls for a July 1st budget submission from the legislature, but I also know that we need information from our next revenue estimating conference and additional information from the federal government before we can put together a plan that makes sense, so the budget timeline is going to have to be different. You know, even before COVID-19, the spending pressures on the general fund were significant. Those pressures include a growing transportation earmark out of the personal income tax and inflationary growth in Medicaid costs. Right now, the language in the CARES Act does not allow states the ability to use federal dollars for existing items in the budget that are affected by the loss of revenue. Congress must come together so Michigan and all of the states across this country can account for the COVID impact to our existing budgets. The State Budget Office is already starting a comprehensive review of everything in the state budget, working with departments and agencies on various budget scenarios. We are forced to take a hard look at everything. But the fact of the matter is, department budgets are already skinny, and there's simply no way to cut our way out of this just by looking at state budgets. 3/4 of discretionary state spending goes out to other entities, as I said, like schools, local governments, healthcare providers. The state's rainy day fund currently stands at just over $1.2 billion. Even if we used every single penny in that fund, we won't be able to solve or close our budget problem. A broader solution is needed, and Congress must come together to provide it. Without more funding and more flexibility in existing federal funds, state and local governments will be unable to provide existing critical support for education, public safety, and health care. So let me close by saying that Michigan is a well-managed state with a good credit rating and a healthy rainy day fund. Our revenue shortfall is a direct result of COVID-19 and the economic toll it has taken. This is a 50-state problem. This is as bad, if not worse, than the Great Recession. And the only way we made it through that recession was with direct support from the federal government. We need them to step up again now. Ms. Brown?
My name is Jamie Brown. I am a registered nurse in Kalamazoo and president of the Michigan Nurses Association. I am a critical care nurse who works directly with COVID-19 patients, so I know firsthand the terrible impact it has had. One of my saddest cases as a nurse in my 16 years was a man in his 50s that passed away from COVID-19 with only me at his bedside instead of his family. His wife was also in the intensive care unit, and luckily she has survived. There are kinds of tragedies still happening every day in our state. Nurses have been on the front line of this pandemic every step of the way, working to protect our patients and our communities while also trying to protect ourselves. Like some of my colleagues, I have sent my children away to keep them safe. On behalf of nurses across Michigan, I want to thank Governor Whitmer for her leadership. She has always put health and safety first throughout this challenging time. Without her actions, there would have been more illnesses and more deaths in our state. We cannot forget the tremendous cost of the human life of this virus. The economic cost of this virus has deeply affected people's lives as well. We see our patients, that families all across Michigan are hurting, whether it is unemployment, high medical bills, or struggling to keep a small business alive. Layoffs and underemployment are hitting all segments of Michigan, including nurses and other healthcare workers. We have to use every resource to help working families recover from the economic damage that has hit our state. Anyone can look at the numbers and realize the state alone cannot fix this. We need the federal government to provide the support Michigan needs to get back on our feet. There is hope of putting people's needs first if the federal government will give Michigan the financial support we need. That includes funding for our healthcare system with the understanding that the government money will go to supporting the frontline workers who are our first line of defense. We need flexibility in that federal funding so we can invest in our own Michigan priorities. We need our leaders to work together to find solutions. The Michigan Nurses Association is eager to continue partnering with the governor as our state moves forward together.
Good afternoon. I'm Daryl Gallen. I'm the training director at Michigan Labor's Training and Apprenticeship Institute. We're the training arm for the Labor's Union. We have an organization of 13,000 members in the state of Michigan, and we work hard at rebuilding this state every day. I spent the first half of my career in infrastructure repair and heavy highway work. And the second half of my career I spent at the training center, basically teaching what now is young adults and how to work productively and safe in construction. Currently, I help manage 4 training sites in the state of Michigan, and we train between 4,000 and 5,000 students every year. Prior to this pandemic, most of our training took place in a traditional classroom setting, so 15, 20 students in a class sitting literally a foot or 2 apart from each other. We know now currently that we can't do it that way. So then that was our challenge, what do we do? Can good come from bad, So we had to look at the situation. The pandemic forced us to think about alternative teaching methods. Shortly after shutting down the training centers, 2 of our big signatory contractors called me. They said they were wondering how to deal with the coronavirus outbreak and what they were going to do. We needed to adapt quick, right? We needed to learn how to train from a distance. We needed to teach our contractors what they needed to know how to clean and disinfect hazardous areas and what protocols they needed to follow to maintain a safe workplace. So we took action. We learned to use the different virtual classrooms like Zoom and that. And then me and my coworkers, we learned online training, right? So really quickly, we went out and purchased the LMS system, and we built 5 classes because we were like, we're having a conversation. Well, what do they need? You know, what do our contractors need to work during the current pandemic? So we put together a COVID-19 awareness for construction class, an infectious disease control class, a bloodborne pathogen class, and a hazardous communication class. So then our contractors were able to go online, still maintaining social distance, and take those classes. And those 5 classes provided the foundation for our workers to be able to go out, clean, disinfect, and work safely in construction in a productive manner. The governor is right. This call to the federal government to help support us during the crisis is important, right? We need to have the resources to repair our crumbling infrastructure. Nowhere was it more evident than the surrounding flooding in the Tittabawassee River, so I spent my Memorial Day weekend up in the village of Sanford. Not just me, we had 58 different, I had coworkers, contractor partners, apprentices, and volunteers out there. We removed and hauled off all the damaged property and debris from the failure of the dams, and you know, that's infrastructure gone bad, right? But that disaster that resulted from the flood is only a small part of our infrastructure problem. Our union is proud. We have always stepped up in times of need to help our community, but we would much rather be working to fix our current infrastructure than spending time cleaning up messes after that infrastructure fails. I really do. I struggle. I have trouble understanding why we just can't try and come to an agreement on the age of our infrastructure and what we can all do to fix the problem. I think we could, and we have learned from the terrible experience that happened in Flint with the water lines, right? We know lead lines need to be replaced. Our roads and bridges have a life expectancy, and many of them are past their expiration date, riddled with potholes. But a lot of us take infrastructure for granted. A lot of people say out of sight, out of mind. The Flint crisis reminded us we don't really think about water lines. They're underground. We don't see them, right? We turn on the faucet, we get a drink. It's not that big a deal. But investing in infrastructure has always been a bipartisan issue. Our union has been proud to support leaders on both sides of the aisle. That we like to support people that understand that these investments create jobs, and those jobs are good for business. But fixing infrastructure takes a skilled workforce. Updating our infrastructure creates jobs that pay our residents a living wage and a decent career for their future. We do need help from the federal government to fix our infrastructure and to put people back to work. Every winter I get really crazy busy at the training center. We always have new generations, Gen Y and Gen Z, pouring in the training center, and they're excited about learning how to fix our infrastructure. And we get disappointed, right, because the funding seems to go away. And all these young people that we train to go to work, the funding doesn't always materialize, and then they drift back to do what they were currently doing. You know, so it kind of breaks my heart. But we're excited to work with the governor, and I'm excited to work with both political parties. We want to hammer out a productive solution to give hardworking Michiganders an opportunity for a career in skilled trades. We know that we can provide a decent wage, decent health care, and a pension where they can retire with dignity while rebuilding Michigan's crumbling infrastructure. And I'd like to thank the governor for the opportunity to share my thoughts today on fixing the great state of Michigan. Thank you. Gretchen?
Good afternoon. It is afternoon. I'd like to thank Governor Whitmer and Michelle Richard for inviting me to Lansing today. I'm Gretchen Preston, the president and owner of Gretchen's House Child Care Centers. I have 10 child care centers in Michigan, 7 of which are in Ann Arbor, where I live. I opened my first child care center in 1982. And early childhood education has been my personal life's work. for 38 years. On March 15th, 2020, we closed all of our centers. We plan to reopen on June 15th. 3 months is a long time to be away from our families. For a child, it seems like forever. My staff of 260 teachers and directors have worked every day to keep in communication with our children and their families by sending videos of teachers telling stories or singing favorite songs. Franny, one of our preschool teachers, created a video with a ukulele story time, and she sent this to her class. That video was opened 120 times. So it's clear that these relationships are strong and vital. While we had to have most of our staff go on unemployment for the last 6 weeks, our administrative team has spent that time helping our staff manage the unemployment system, but also checking out a lot of webinars put out by the CDC, by the state of Michigan, and by our early childhood organizations to learn how we can protect our families and ourselves physically and emotionally when we all come back to work. This is new territory for us. We are all eager to re-engage with our families and each other. Gretchen's House and me personally, very grateful to the funding sources that have been made available to us, the Payroll Protection Program, and especially the Michigan Child Care Relief Fund are lifesavers. This support is critical. I celebrate our leaders in Washington and Lansing for working together to do the right thing. We did hold our breath for a little while. Learning how to get along with others and cooperate is a skill that we work on every day with children. It's gratifying when we see our legislators modeling that behavior. The children are watching, so keep it up. Governor Whitmer is setting a great example for us right now with her strong and clear leadership in this really difficult time. I look forward to seeing the changes that can happen in our state government to make child care more accessible, affordable, and high quality. The monthly child care bill is often the biggest one in a family's budget. Amazing. Our early childhood system needs the same support that our public schools receive. And our federal government needs to give the state similar kind of support. That we know has to happen. I would like to think of our government as our helpers at this time. Fred Rogers said, "When I was a boy and I would see scary things in the news, my mother would say to me, 'Look for the helpers. You will always find people willing to help.'" Thank you.
Thank you, Gretchen. Well, we started with the Gretchen and we closed with the Gretchen. Gretchen, thank you so much. Daryl, Jamie, appreciate it. Director Kolb, and of course, Dr. J. And I particularly appreciate closing with a quote from Mr. Rogers. I love that. All right. With that, I think we should open it up for a few questions.
Governor, a lot of people are asking why there hasn't been a ban on COVID-19 patients in nursing homes. Can you comment on that?
So I clearly am going to hand the majority of answering this question to Dr. J. Obviously, we, like states across the country and other countries across the world, have been learning an incredible amount about COVID-19, it being a novel virus. The amount that we've learned just in the last 8 weeks is dramatically different from what we knew as we were watching the cases exponentially rise. With that, obviously, the clear indication is that our older older people are more susceptible, and in congregate care facilities that is exacerbated. And because of that, we have taken actions to protect people in nursing homes, to articulate early on that we wouldn't have visitors anymore, that it was going to be monitored very closely. We took a lot of actions early on. Clearly, COVID patients being discharged from a hospital, we wanted to make sure that they had a place to go. And so as we have tried to address this so that we kept people safe but also gave them a place to return to, we've had to strike a balance here. And I think, as we continue to learn, we continue to improve. And with that, I'll hand it over to Dr. J to talk a little bit more about our policies.
Yes, it's been incredibly disheartening to see the number of nursing home residents who have gotten sick. Director Gordon, the director of the Department of Health and Human Services, spoke yesterday about our cases being 9% of cases and at least 23% of our deaths, and we believe that is an undercount. So what we've done is made sure that our nursing facilities, they only accept patients if they have the appropriate PPE or if they've been able to create a dedicated unit. We still have to do more work to get this right, to make sure that our nursing home residents have someplace safe to go, and we continue to work on that.
Governor, you outlined your budget priorities today. By laying these out, do you mean to say that you will not accept cuts in any of these areas?
No, what I've said is these are the priorities that I have, that I want to make sure that we protect. Clearly, our ability to do that, though, is dependent on Mitch McConnell and Donald Trump getting this fourth supplemental done. I'm not saying it has to look exactly like what Speaker Pelosi authored, although if it did, that would be great. But we need to find some common ground here, because states like Michigan, all across this country, we're grappling with the same things. And we know that if we have to sustain cuts because the federal government doesn't help us, that they are going to hit, critical things that maybe are even more important in a pandemic, like public safety, public health, public education, and that's what we want to avoid.
And a quick follow-up on your top priority, education funding. Are per-pupil funding cuts avoidable even without federal help?
Well, I think that they are, but it's going to be absolutely essential that the legislature will be a partner in avoiding that. First and foremost, though, the bottom line really is that we need additional flexibility and resources from the federal government. We have a $3 billion crisis, and it is because of COVID-19. We're a well-managed state, but we are operating with the same kind of general fund that we had for the last 20 years. And we have unique needs that we have to meet on behalf of our kids, and that's precisely why it is my hope that the federal government will be an ally to states all across this country and help us make sure that we can avoid these potential tough decisions.
Governor, you indicated a few weeks ago that you would wait till the end of the month to see if Congress acted on providing additional aid to the state to backfill those budget holes that we're going to be facing. What's the time period where you have to start making those cuts if we don't receive federal aid? We're almost at the end of the month. It's my understanding that they are poised to take some action in the next couple of weeks. That's what we're hearing. Of course, no one anticipated that they would take a 10-day vacation associated with Memorial Day. So right now they're not in session, and that's precisely why I think it's incumbent on all of us to keep our pressure, encouragement, whatever you want to call it, support for Congress to take these actions to support the states. It is, we saw the House convene and take quick action. It is now in the ball is in the court of the United States Senate. I am hopeful that my Republican friends from over in the Capitol are reaching out to their counterparts at the national level and encouraging movement. I've had a number of conversations that lead me to believe we may see something in the next, couple of weeks, but until they act, it's still going to be dicey. So is it fair to say that you'll wait a couple of weeks before moving forward on making reductions and cuts?
Well, what we're hoping is that the feds step up and give us the assistance. We need flexibility. I described the exact problem with the CARES Act dollars, that we are precluded from using them to address the holes that have been created because of COVID-19. we need flexibility and we need additional resources.
If the federal government doesn't provide extra assistance, what kind of cuts are we facing to our schools, even with the schools being your top priority? We've heard the numbers from lawmakers, 800 to 2,000 per student. What are you seeing right now as you look at the numbers?
Yeah, I'm not sure where the legislators have gotten some of those numbers, but here's what I do know. There are a number of different ways that we could go about making sure that there's not a proration. It is going to take working together to do that. The best way to ensure that that doesn't happen is for the United States Senate and the President to get this fourth supplemental done so that our schools and our families don't have to worry about whether or not the resources are going to be there to finish out the school year.
Governor, with the Secretary of State offices reopening, using kind of the same logic, why not consider opening up unemployment insurance lobbies, particularly to help with people who have not been able to get their claims filed yet?
Yeah, I appreciate that question. I think that, that's, as we look to offices, we are going to move in concert with what we're able to feel comfortable with the general public. The Secretary of State has made a determination in those offices. I know that they've got strict protocols and that she feels comfortable to do that. At this point in time, I think it is most prudent for us to continue to watch the data and to move when we believe that it is safe for the general public and the private sector too as well.
In an email, a health department official said that your office gave the green light on the contract tracing agreement with Coalhouse that you later canceled, and another email showed that your communications director was aware of the vendor before the contract was signed. Who else in your office knew, and when did you know?
I told you that when I found out about the contract, I told them to cancel it, and I found out about it after it had been entered into by the department. It did not go through the usual process, and that is a problem that we have fixed. With regard to my communications director, he's my communications director. He's an excellent communications director, but he is not a person that signs off on state contracts. So any interpretation from someone at the department that implied that that was a part of his role was absolutely incorrect.
And was there anybody else in your office who was aware?
I can't tell you. I can tell you that I did not know that this contract had been entered into by the department, and as soon as it became known to me, I told them to cancel it, and they did.
What's your reaction to the Safe Salons for Michigan Coalition plan that they submitted as they look for coming up with a plan to reopen and saying, hey, if we do this, can we open?
I'm grateful that these small business owners have come together to be a part of the solution. That is what we need now more than ever. But, I want more than anybody to keep turning the knob and get back into, opening up, re-engaging all of these different sectors of the economy. Anyone who implies that this is something that I don't want just can't even, speak with certainty, because this has been really hard on our state budget. And this has been hard on our people. This has been hard on our family budgets. It has been a stressful time. And I'm as worried as anybody about our economy. But I know that our economy will not be strong if we don't get the public health side strong as well. And that's why we've got to keep following the science. I am happy that this group of leaders came together to promulgate what they think are best practices. There's certainly something that we will examine and build into our plan where it makes sense as we re-engage. And just know that as people keep doing their part, wearing their masks, staying home, knowing that being home is safer, it's okay to go out. But be smart when you do. Wear your mask, stay away from others. The more we do this, the more likely and sooner we can take that next step. And that's what every single one of us, I think, wants. I'm incredibly proud of our state. When I look at how we rank compared to other states in this country, we have pushed that curve down. We have saved thousands of lives in Michigan. We have made it more likely that we can keep turning this dial and re-engage. which means it's a shorter economic pain. I'm not minimizing the anxiety that people are confronting, but the fact of the matter is we've got to keep doing the next right thing. And I'd be happy to work with this group to make sure that their expertise is incorporated in whatever protocols that we promulgate.
Governor, have you given any thought on how to repair your relationship with the Senate Majority Leader?
So, I was very distressed to see his comments on the Senate floor yesterday, to be honest. Not only were they just wildly inaccurate, I thought it was incredibly inappropriate, too. He has my phone number and could have called me if he had a question about the veracity of any of the statements or actions that I have taken or my staff, or even if he had simply listened to his own staff, he would have known that what he said was totally inaccurate. We have serious issues to confront, and to be successful requires every one of us to stop politicizing what's going on and to focus on getting this right. I really believe what Michelle Obama said, which is when they go low, we go high, and so I'm not going to go allegation for allegation. He called me names earlier on. You know what I did? I sent him a cake. That's what going high looks like. I'm going to keep doing that in hopes that eventually his emotions will stop getting the better of him and he'll come back to the table and start to work with me to really make sure that we've got a great agenda that supports the economic rebound we all want to see.
Governor, last question.
Okay.
Governor Snyder named 2 outsiders to a task force to look into what happened in Flint. Why not do the same with the Edenville Dam situation? Doesn't Eagle have an inherent conflict in investigating itself?
So a couple of things. Number one, with regard to Flint, I mean, decisions were made to save money that were at the expense of people's lives. With regard to this dam, it is something that was under federal oversight for an incredibly long time. Private ownership that is, I think there's a lot to be understood about that private ownership. And the decisions that were made require a certain level of expertise to really dig in and understand all of the different machinations here. And because of that, we need the experts to be the ones to begin the investigation. Now, we certainly are opening it up so that FERC has a role here, so that the Attorney General's office has a role. We are ensuring that, I believe even FEMA may be taking a role in that. This is going to take a certain level of expertise that you can't just pick another random department to oversee this. It's got to be done by the experts, and we'll do everything to make sure that we get an accurate portrayal. A lot of this handover happened, of course, before I took office. Certainly a lot of things have happened in the intervening months, but it's been decades of disinvestment that's contributed to the crisis that we have in our infrastructure in this state. And I think everyone knows that that's something that I've been passionately trying to address.
Thank you.
All right, thank you. Oh, are we done? Did you already cut me off? Okay. Before we end, I wanted to acknowledge a couple of nice things. I think it's really important that we do that. So this was a mask that was made for me by an 11-year-old named Kennedy. She sent it to me, and I'm grateful, and I wore it today. This is a bracelet. It is a rubber band bracelet made by a little boy named Gavin up in Alpena. He sent one to me and to Dr. J because he says we all need to band together. I love that. And some other constituents sent this to me, and it is artwork of my dog, Kevin, and it was Dawn and Scott sent that to me. And so I just want people to know I appreciate you. I appreciate you even if you don't agree with me. Thank you for everyone, the vast majority of you who are doing your part. You're making a difference, and I am proud of the work that we have done together. Thank you.
And we appreciate you guys being here with us on News Now. Thank you so much for tuning in, whether you're with us on our YouTube channel or with us on coronavirusnow.com. More updates have been happening across our country as the death toll has also gone and surpassed 100,000 here in the United States. You can see also the number of cases has passed 1.7 million now here in the U.S. as well. I'm going to take us out to Chicago to see their update of COVID-19 in the state and the city as they start to try to learn and reassess how they're going to reopen their economy. We're going to be bringing that to you right here on News Now.
Sickened watching our communities struggle under the weight of racial disparities, of systemic inequities, and of daily injustices. Seeing the video of George Floyd dying on the ground under the knee of a Minneapolis police officer, for me, brought back that trauma of Laquan McDonald's death into sharp focus. And I would believe that that happened for many people across Chicago. And we have to think, but for the grace of God, go Chicago. It's been a painful reminder that while we have been focused on fighting this virus, we know our work in facing hard truths about disparities and injustices is not yet done, and that we have to remain resolute and not lose sight of why fighting these fights is so critically important, even in the middle of, and maybe especially because we're in the middle of a pandemic. We can't rest knowing that Black mothers and fathers in our city still live in fear of getting a phone call about something terrible happening to one of their children. I know I hug my daughter a little longer at night every time I hear a story about Mr. Floyd, and I think about my brothers and men in my family, another Black American that is killed in this way. And it's a generational burden. I know my own mother carried it, and I carry it too. Our communities face some of the most dangerous circumstances we have perhaps ever faced. We need our police to be working alongside of us, supporting us, and protecting all of us. They're responding to thousands of calls for service every day in every neighborhood and doing heroic work daily under the most difficult circumstances perhaps ever. They are adjusting to this outbreak while still called to deal with the challenges they faced long before this pandemic came into focus. Challenges like tackling open-air drug markets that have only gotten more difficult and more dangerous in the last few months, or curbing gun violence, which is always tough, and particularly in the summer months, and is even more demanding when we can't deploy the full protective network of social support that we know is a critical component of violence prevention. Even in these circumstances, Superintendent Brown and I are in lockstep. We are united in our vision for public safety, our shared vision for how to strengthen and deepen the most important thing that the department can do, which is to build authentic, trusted partnerships with the community. And we are united in making clear to our officers that we hold them and that they must hold themselves to the highest standards. We simply can't go backward. There are some communities, particularly in the South and the West Sides, where Chicagoans call for police presence more often. That is their right, and they are entitled to service. They must be able to do so with the expectation that when they call and the police arrive, they will be treated with the same respect and dignity on the South or the West Side that they would in my neighborhood, in Logan Square, or in Roscoe Village, or in Lincoln Park, or Portage Park. Let me also take this moment to clarify some of my comments from Tuesday. I have said that the violent weekend was a fail, and it was. The number of shootings was simply unacceptable. But some interpret my comments as targeting Superintendent Brown specifically, and let me be very clear, nothing could be further from the truth. Superintendent Brown has and will continue to have my unflagging support, full stop. I am 100% plus committed to his success, and I have, what I have seen so far, I have every confidence that he will be one of the greatest leaders that the Chicago Police Department has ever been graced to have. Now, getting through this most challenging time is going to continue to require all of us to be steadfast and vigilant in every neighborhood. But we must also remain steadfast and vigilant in our commitment to fairness, to equity, and to justice. That's how we can make sure every one of us can feel safe. And I dedicate myself to that principle every single day, and today is no different, nor will tomorrow be. Now, let's turn to the purpose of our gathering here today. I want to acknowledge the people who are standing here with me. Our Deputy Mayor for Economic and Neighborhood Development, Samir Mayakar, who has done tremendous, tremendous work throughout this pandemic and is the reason why we have been successful on many fronts. I want to recognize Gary Cooper, actual name, Gary Cooper, who is the CEO of Reaply. And who was responsible for helping us set up our PPE marketplace, and a woman you all know, our Public Health Commissioner, Dr. Allison Arwady. For the past 2 months, our city has undergone an unprecedented effort in response to an unprecedented crisis, turning our lives and our entire economic life upside down in order to keep our city safe from the COVID-19 virus, and to keep our healthcare system from being overwhelmed. Throughout this time, I have been deeply gratified by the service and sacrifice made by countless Chicagoans from every corner of our city and every walk of life. That starts with the incredible work undertaken by our healthcare professionals, first responders, and essential workers who make sure our residents are cared for and keep our entire city running. But our ability to meet this moment would not have been possible without the work and compassion of countless other Chicagoans, people like you, who have stepped up in this time of need in our city in tremendous ways. From the small army of individuals working in our food distribution centers, to our teachers and school staff who have allowed our students to learn online, to every Chicagoan who did their part by simply staying home and saving lives. It's because of your efforts that I am very happy to announce that on Wednesday, June 3rd, the City of Chicago will be taking our first step into Phase 3 of our reopening process by allowing many of our businesses and city areas to partially reopen to the public. As we announced last week, these businesses will include our office-based jobs, professional services, and real estate services with capacity limitations, along with hotel, lodging, and limited outdoor attractions, including non-lakefront golf courses. We'll also see the partial reopening of restaurants and coffee shops with a focus on outdoor space, as well as non-essential retail stores and personal services, such as hair and nail salons and barbershops, with precautions in place to protect workers and customers. We will also be reopening childcare and in-home family daycare facilities, all of which support our work that needs to be away from home. Our Phase 3 reopening for city services will be delayed by a few days, but it too will reopen on June 8th. So for all you parents listening, that means our kids can start using libraries and park facilities west of Lakeshore Drive. These new steps are accompanied by guidelines for specific industries, all of which are now available online at chicago.gov/reopening. I want to take this moment to note that Chicago was the only major city in America who did not cut service to transit systems during this crisis. And Dorval Carter, the president of the CTA, and all the hard-working men and women who made this possible at the CTA deserve our thanks and credit. However, we will still need our travelers to maintain social distancing as we move to phase 3 in our reopening on Chicago Transit. For that to happen, we'll need our businesses to stagger start and end times as much as possible so as not to overwhelm our CTA during traditional peak hours. I also want to remind all of our local small businesses, community-based organizations, and small not-for-profits about our partnership with local startup Reaply to provide them with access to purchasing face coverings, hand sanitizer, and protective barriers from local Chicago vendors so that they can be prepared as we cautiously reopen. We also announced last week our hope is that during phase 3, we will be able to begin reopening other parts of our city, including summer programs, youth activities, religious services, gyms, and yes, our lakefront and beaches. But we'll have to wait to see how these initial first steps go. Which brings me to something that I want to remind everyone about. Let's be clear. Under no circumstances should our move to phase 3 be confused with this crisis being over, because it's not. COVID-19 is still very much part of our present. I can't emphasize this enough. And as we reopen, please understand that we're doing so with the full knowledge that we cannot totally eliminate risk of this virus. The best we can do, and really the best that you can do, is continue following the public health guidance around social distancing, hand sanitizing, and please, wearing a mask in public. Having resurgence in cases is more than just a risk. It's a very real possibility. And we have seen this in other nearby states. All we have to do is look to the north, the south, the east, or the west for examples. And if this happens, we will not hesitate to take the necessary steps, including moving back into phase 2 if necessary. So folks, let's just be smart. Let's follow the guidance. Let's follow the social distancing, wearing a face covering in public, doing all the things that you have done because you know that this saves lives and reduces the spread of the virus. It's for these reasons that phase 3 will only allow for small, non-business social gatherings of 10 people or fewer. And we will still have us wearing face covering and physically distancing when meeting others. It will also have us saying and really pleading that if you are sick, you must stay home. And anyone who's come into contact with someone from COVID-19 must take the necessary precautions, including isolating yourself. And those who have COVID-19-like symptoms must immediately reach out to a healthcare provider. In conjunction with our phase 3 reopening, we are also launching our new public awareness campaign called Be Safe Chicago, across our social media, billboards, radio, and other venues. To get the word out about phase 3, what phase 3 entails, and to help ensure there's no confusion about what it means for our city and our residents, we will be embarking on this public campaign. During our first 2 phases of COVID-19 crisis, our campaign was Stay Home, Save Lives, and it worked, helping us get to where we are today, and we are grateful for everything that you did to make this possible. Now, our job, as we start to cautiously reopen, is to be safe. We may be moving out of our homes, but this phase is still fraught with risk. And the only way for us to be successful is for all of us, you and me, to focus on being safe together. It's in that same spirit that we're also embarking on a new partnership that I'm excited about with the Second City, Chicago's legendary comedy institution, to produce a weekly web series entitled Phased and Confused that will communicate information about our Protecting Chicago 5-phase reopening framework. And lastly, I also want to take this opportunity to ask our residents to take a new survey, a recovery survey, which is available on our city's COVID-19 website, chicago.gov recovery survey. Hearing from all of you is enormously helpful as we develop our phase 3 plans, and we don't want that to stop. So please keep it coming. Fill out our survey and give us your thoughts about what recovery should mean for the city. And help our task force, which is now looking forward to life in phase 3 and beyond. Folks, this is an exciting moment for our city. The world will be watching how we do. And I want to make sure that when those reports start coming out, that Chicago is a model for the nation and the world, that we came out of stay at home in a smart, sensible manner because our residents understood each of our obligations to be safe and the things that we needed to do to get there. I want to express my gratitude once again to everyone who has made this moment possible. Everything we have done to meet this moment has been the direct result of your hard work and sacrifice, following the public health guidance, even at great sacrifice to yourself, and being uncomfortable at moments, which has not only saved the lives of thousands of Chicagoans over these past 2 months, but it's helped lay the groundwork for the transformative recovery that we're all excited to embrace. Thank you for everything. And at this moment, I want to invite Dr. Arwady to give us further details on our city's health metrics at this time. Doctor?
Thank you, Mayor. So I'll note that just in the last 24 hours, the U.S. passed 100,000 deaths from COVID-19. Illinois passed 5,000 deaths from COVID-19. And here in Chicago, we passed 2,000 deaths from COVID-19. So as we are thinking ahead and moving cautiously into phase 3, I want to remind people that these are each individual people, and that the work that we've been doing has helped to save lives, but that we are not done, unfortunately, seeing cases and seeing death, including here in Chicago. And so I'm excited to share the progress that we've made and that we are almost there in terms of being able to start looking ahead. But I'm going to just start from the beginning with echoing what the mayor ended on, that much more important than a specific date or a specific time frame or a specific piece of decision that an industry needs to make about how to keep its business as safe as possible. The most important thing as we look ahead through the summer and all the way to a vaccine is how well people in Chicago continue the physical distancing, keeping that 6-foot distance whenever you can, wearing the cloth face coverings that are about protecting your neighbor as much as they're about protecting yourself, staying home if you are sick, even a little bit sick, or you've been exposed to someone with COVID, and continuing the hand hygiene. Moving ahead does not mean these things go away. And every model that we look at, including the one with Argonne National Labs, which is the one really based on Chicago's population, making sure that the majority of our residents continue to do those things is the difference between continuing to see a decrease over the next few months or potentially getting to a place where we have an outbreak that gets out of control again quickly and we have to take steps backwards. So I'll just go over quickly where we are on the metrics. All of the details are on chicago.gov/coronavirus, and I will be going over tomorrow during the Facebook Live at 11 a.m. actually with the Chicago Department of Public Health epidemiologists whose teams really put a lot of this together if you've got questions. When we spoke last
All right, guys, just wanted to say a quick hello. Thanks for being here with us on News Now. We are taking a look at that latest update and tally of COVID-19 cases in the United States. More than 1.7 million Americans have been tested positive for COVID-19. We are expecting here in the next few minutes some tape playback of something that happened just a little bit ago here this afternoon in the DC area. President Trump signing an executive order on social media that could seek to curb legal protections for the industry. A broad state that comes amid his escalating fight this week with Twitter over the company's decision to fact-check his claims for the first time. Let's go out to that right here on News Now.
Thank you very much. We're here today to defend free speech from one of the gravest dangers it has faced in American history, frankly, and you know what's going on as well as anybody. It's not good. A small handful of powerful social media monopolies controls a vast portion of all public and private communications in the United States, and we know what they are. We don't have to name them. We're going to give you a complete listing. We're going to give you a signed copy of what I'm going to be signing in a couple of minutes, and you'll see exactly what we're doing. They've had unchecked power to censor, restrict, edit, shape, hide, alter virtually any form of communication between private citizens or large public audiences. There's no precedent in American history for so small a number of corporations to control so large a sphere of human interaction, and that includes individual people controlling vast amounts of territory, and we can't allow that to happen, especially when they go about doing what they're doing, because they're doing things incorrectly. They have points of view, and if we go by that, it's actually amazing that there was a success in 2016, but we can't let this continue to happen. It's very, very unfair. And you look at the statistics and you look at what is going on, and I think everybody would very much agree with that. Including Democrats, by the way. I saw quite a few Democrats are saying this is about time something is done. So let's see if they keep that decision after they hear that we agree with them. The choices that Twitter makes when it chooses to suppress, edit, blacklist, shadow, ban are editorial decisions, pure and simple. They're editorial decisions. In those moments, Twitter ceases to be a neutral public platform and they become an editor with a viewpoint. And I think we can say that about others also, whether you're looking at Google, whether you're looking at Facebook, and perhaps others. One egregious example is when they try to silence views that they disagree with by selectively applying a fact check, F-A-C-T, fact check. What they choose to fact check and what they choose to ignore or even promote is nothing more than a political activism group or political activism. And it's inappropriate. You look at what's happened, you look at where they're going, where they're coming from. I think you all see it yourselves. This censorship and bias is a threat to freedom itself. Imagine if your phone company silenced or edited your conversation. Social media companies have vastly more power and more reach than any phone company in the United States, more reach actually than your newspapers by far, more reach than a lot of your traditional forms of communication. Therefore, today I'm signing an executive order to protect and uphold the free speech and rights of the American people. Currently, social media giants like Twitter receive an unprecedented liability shield based on the theory that they're a neutral platform, which they are not an editor with a viewpoint. My executive order calls for new regulations under Section 230 of the Communications Decency Act to make it that social media companies that engage in censoring or any political conduct will not be able to keep their liability shield. That's a big deal. They have a shield. They can do what they want. They have a shield. They're not going to have that shield. My executive order further instructs the Federal Trade Commission, FTC, to prohibit social media companies from engaging in any deceptive acts or practices affecting commerce. This authority resides in Section 5 of the Federal Trade Commission Act. I think you know it pretty well. Most of you know it very well. I would think you know it quite well, right? Additionally, I'm directing the Attorney General to work cooperatively with the states. He's going to be working very much and very closely in cooperation with the states to enforce their own laws against such deceptive business practices. The states have broad and powerful authority to regulate in this arena, and they'll be doing it also, and we encourage them to do it if they see exactly as we've been seeing. It's what they're doing is tantamount to monopoly, you can say. It's tantamount to taking over the airwaves. Can't let it happen. Otherwise, we're not going to have a democracy. We're not going to have anything to do with a republic. Finally, I'm directing my administration to develop policies and procedures to ensure taxpayer dollars are not going in any social media company that repress free speech. The government spends billions of dollars on giving them money. They're rich enough, so we're going to be doing none of it or very little of it. As president, I'll not allow the American people to be bullied by these giant corporations. Many people have wanted this to be done by presidents for a long time. And now we're doing it, and I'm sure they'll be doing a lawsuit, and I'm also sure that we're going to be going for legislation in addition to this, and the legislation will start immediately. And I tell you, I've been called by Democrats that want to do this, and so I think you could possibly have a bipartisan situation, but we're fed up with it, and it's unfair, and it's been very unfair, and we'll see what happens. Any questions?
Mr. President, given your concern with Twitter, have you given any consideration to deleting your account, to just walking away from this platform you've been so critical of?
Well, you know, if you weren't fake, I would not even think about it. I would do that in a heartbeat.
I'm real,
but the news is fake. If you look at what gets printed in newspapers, if only the public could understand where, you know, they're reading a story and they think it's real, and it's not real in so many cases. And I'm not saying in every case. You have some great journalists. You have some journalists that I have great respect for. But largely, I find, at least in a political sense, there's so much fake news, it's disgraceful. I would do that in a heartbeat if we had a fair press in this country. I would do that in a heartbeat. There's nothing I'd rather do than get rid of my whole Twitter account, but I'm able to get to, I guess, 186 million people when you add up all the different accounts and add Facebook and Instagram. It's a lot of people, and that's more than the media companies have, frankly, by a lot. And so if I get a story that's wrong, I can put a social media, I don't usually use the word Twitter, I say social media, but I put something out, and the next day or the next hour or the next minute, everybody's reading about it. So I'm able to refute fake news, and that's very important. I'd like to ask the Attorney General, please, to say a couple of words, and he's very strongly behind it, backing it very powerfully, and again, we're going to be doing this. We're also going through Congress.
Well, as you mentioned, Mr. President, one of the things that I found has the broadest bipartisan support these days is the feeling that this provision, Section 230, has been stretched way beyond its original intention, and people feel that on both sides of the aisle. This was adopted 25 years ago to protect the fledgling industry, and its purpose was to allow websites that were serving as essentially bulletin boards for diverse third-party content coming on, to say that you're not responsible for the content of that third-party information. And it also tried to encourage these companies to take down things like child pornography or human trafficking advertising and things by saying if you act to remove this kind of objectionable material, you won't be liable for taking it down. Now it's been completely stretched to allow what have become really behemoths who control a lot of the flow of information in our society to engage in censorship of that information and to act as editors and publishers of the material. So when they put on their own content, like fact-check content onto other people's content, and when they curate their collection, and when they start censoring particular content, including in many cases at the direction of foreign governments like Communist China, they become publishers, and they shouldn't be entitled to the same kind of shield that was set up earlier. Now, this executive order is a very strong step toward addressing this problem. It sets up a rulemaking procedure that will eventually be under the FCC. to try to get back to the original interpretation and understanding of Section 230. It also empowers the Attorney General to work with state attorneys general to come up with model legislation that addresses this at the state level. And we're preparing federal legislation, which we will be sending over shortly for review at the Office of Management and Budget. So this is an important step to get back to the original understanding. You know, there's a bit of a bait and switch that's occurred in our society. These companies grew because they held themselves out as public forums, as free public forums where a variety of voices and diverse voices could come on and be heard. That's how they grew. That's how they attracted the eyeballs. That's why people joined them. But now that they have become these very powerful networks of eyeballs, now that they've grown by holding themselves out as free public forums, they've now switched. And they are using that market power to force particular viewpoints. And that's wrong. And it has to be addressed not only through this executive order, but I think litigation going forward and by further action on Capitol Hill. Thank you, Mr. President.
Mr. President, do you have any questions for the Attorney General?
Yes, actually, I do. Mr. Attorney General, not only have you been against Section 230 and the President has been against Section 230, the Vice President has said he's against Section 230. Do you believe that the executive order that the President is about to sign in any way repeals or amends Section 230?
No, it doesn't repeal Section 230, and I'm not against Section 230 if it was properly interpreted and properly applied, but it's been stretched, and I don't know of anyone on Capitol Hill who doesn't agree that it's been stretched beyond its original intention. I think this will help get back to the right balance.
Mr. Attorney General, can you give us more details on the legislation both you and the President referred to? What do you want to do in that legislation?
Well, we're still reviewing a number of possibilities, and it'd be premature for me to discuss.
And one of the things we may do, Bill, is just remove or totally change 230. What I think we can say is we're going to regulate it. It's a provision, and we're going to regulate it. You take a look at this as an example. This was just out. Twitter moments on the Mueller witch hunt. So we won. We were in the right. You see what's happened. It's a total fraud. It was a total fraud. 76-1. Okay, 76-1. You look at it. You think that's fair? Twitter classifies the term illegal alien as hate speech. Illegal alien, and viciously. You look at what China. I mean, just article after article. Here's one. This is the arbiter. This guy is the arbiter of what's supposed to go on Twitter. He's the one he thought, and he used CNN as a guide, CNN, which is fake news. He uses CNN as a guide. His name is Yoel Roth, and he's the one that said that mail-in balloting, you look mail-in, no fraud, really? Why don't you take a look all over the country? There's cases all over the country. If we went to mail-in balloting, our election all over the world would look as a total joke. It would be a total joke. There's such fraud and abuse, and you know about harvesting, where they harvest the ballots and they go and grab them and they go to people's houses and they say, sign here. No, it doesn't work out. Now, an absentee ballot, you can't be there or you're sick, and you go and you register and you do all sorts of things to get that ballot, and there's good security measures, but where they send out, like in California, millions and millions of ballots to anybody that's breathing. Anybody in California that's breathing gets a ballot.
But, Mr. President, that's not true. California is...
Excuse me, wait a minute, I'm not finished. So here's your man, and that's on Twitter. And the amazing thing is he's wrong. And even no matter who it is, they will admit that he's wrong, because there's tremendous controversy on mail-in voting. And I can say this, the Republican Party cannot let it happen. Go ahead.
But you know Gavin Newsom, Governor Newsom, has not sent ballots out to everybody in California. They're only going to registered voters.
How many are there? How many are there?
So what your tweet said was not wrong.
Okay,
That was not correct. It was wrong.
Okay. Oh, really? So when he sends out 28 million ballots, and they're in all the mailboxes, and kids go and they raid the mailboxes and they hand them to people that are signing the ballots down the end of the street, which is happening. They grab the ballots. You don't think that happens? There's ballot harvesting where all of us, we had 7 elections for Congress. and they were like tied, and they lost every one of them because they came and they dropped a whole pile of ballots on the table. But you don't think they rip them out of mailboxes? It's all the time. You read about it. You can read about it. Take a look. They do worse than that. In some cases, they won't sell them, like to a Republican community, a conservative community. They don't happen to send the ballots to those communities. And there's no way of checking. No, you have to go and you have to vote. Voting is a great thing. Voting, we would be the laughing stock of the world. And if you just use common sense, you know that's going to happen. But they raid the mailboxes. They can even print ballots. They get the same paper, the same machine, nothing special. They get the same paper, the same machine. They print ballots. And Bill would have to do a great job to catch him doing it, or your state authorities would have to. But you have tremendous potential, and you have tremendous fraud and abuse, but you have tremendous potential for fraud and abuse. Go ahead.
Mr. President, you had said in one of your tweets that you would consider shutting down Twitter and social media companies. Did you actually mean you would want to shut down an American company?
Well, I think it's going to be, I tell you what, I have so much, it seems, influence over Twitter in the sense of people wanting to go Twitter because of what I have. I have a vast number, we have a number of platforms, as you know. We have millions and millions of people. I think this, if Twitter were not honorable, if you're going to have a guy like this be your judge and jury, I think you shut it down as far as I'm concerned, but I'd have to go through a legal process to do that.
How would you shut down an American
I don't know. I'd have to ask the lawyers. I'd have to go through a legal process. If it were legal, if it were able to be legally shut down, I would do it. I think I'd be hurting it very badly if we didn't use it anymore. I mean, we have other sites we could use, I guess, or would have to develop other sites. And I'm not just talking about Twitter. Look at Facebook. Look at the tribunal they set up at Facebook. This woman who, you remember testifying recently in Congress, her hatred was so incredible toward the Republican Party and me that there is no way you can get a fair trial. So this is not like it's supposed to be. This is not like it's supposed to be. So we're going to see what happens. And you know what? I guess it's going to be challenged in court. What isn't? But I think we'll do very well. Yeah, go ahead.
Mr. President, as to potential litigation, can you discuss the timing of that and what is the remedy that you're going to be seeking?
No, what I was referring to, there is litigation going on all the time on Section 230 and its scope, and we would look for appropriate vehicles to weigh in and file statement of interest.
So you wouldn't be filing an individual?
Not necessarily.
Okay, thank you.
Mr. President,
are you worried about the situation on the border between India and China?
India. He loves India so much he's never asked a question other than an India question, and that's okay. I just got back from India, right? I just beat COVID.
You're very popular.
Got back. I know. They like me in India. I think they like me in India certainly more than the media likes me in this country. And I like Modi. I like your prime minister a lot. He's a great gentleman. Great gentleman. Yeah, they have a big conflict going with India and China. Is that what you're talking about?
Yes.
Yeah?
Yes.
They have a big conflict going with India and China. Two countries with 1.4 billion people. Two countries with very powerful militaries. And India's not happy, and probably China's not happy. But I can tell you, I did speak to Prime Minister Modi. He's not in a good mood about what's going on with China.
Mr. President, have you spoken to...
Wait, are you finished?
No, sir. So yesterday you tweeted about you want to mediate between India and China on this issue.
I would do that. I would do that if they thought it would help. If I were the mediator or the arbiter, I would do that. So we'll see. Go ahead.
Have you spoken to the family of George Floyd yet?
No, I haven't, but I feel very, very badly. It's a very shocking sight. Bill and I were talking about it before. It's one of the reasons Bill's here right now, because, as you know, we're very much involved. And I've asked the Attorney General, FBI, and the Attorney General to take a very strong look and to see what went on, because that was a very, very bad thing that I saw. I saw it last night, and I didn't like it.
Do you think those police officers should be prosecuted?
I'm not going to make any comment right now. I can tell you, I think what I saw was not good. Was not good. Very bad. Anybody else?
Mr. President, are you definitively staying in the U.S.-China trade deal?
We'll be announcing what we're doing tomorrow with respect to China, and we are not happy with China. We are not happy with what's happened. All over the world, people are suffering. 186 countries. All over the world, they're suffering. We're not happy. Okay. Thank you very much, everybody.
All right, press, let's go. Come on. Come on, let's go.
Thank you. Thank you. Thank you.
Thank you, everybody. Thank you.
All right, that was President Trump doing some remarks just outside of the White House. Right now, we're just going to go out for just a little bit, out to Massachusetts here. We get a live update right now.
On a very detailed and accurate basis available to people every day. And there have been a number of areas where we started with what I would describe was kind of a baseline and then worked over the course of the past couple of months to make that baseline more and more precise and more readily available as we got better at collecting a lot of this information. And I certainly think that the nursing home story generally, there's an article in the New York Times today that said that if you had to pick a sport that would be absolutely perfect with respect to COVID's ability to infiltrate it and make it miserable, you would pick basketball. And the reason I read that story is because I'm a basketball player, and I agree. But if you had to pick a care delivery model that was absolutely perfect for COVID-19 to wreak havoc on it, and it has across the world and across the country, you would pick a model where people who serve those folks every day put their hands on them a lot. They feed them, and they bathe them, and they dress them, and they recreate them, and they transport them. And then to top it all off, I'd make it a virus that, in the beginning, everybody thought had a couple of days of sort of asymptomatic gestation, but that everybody eventually got it. So everybody started with taking everybody's temperature on their way in the door as the way of judging and measuring whether or not people were healthy. And then, of course, it turned out over the course of maybe a month or so, people started saying, we think there's asymptomatic conditions here that are permanent with respect to some of the people who got it. And now we're to the point where a lot of the research is indicating that perhaps as many as 25 to 30%, maybe even more, of the people who contract this virus and shed it never show any signs or any symptoms in the first place. And that in many ways has a lot to do with the tragedy associated with long-term care here and in other places. We've made adjustments all the way along, not just in data, but also in our approach to supporting the industry, the people who work in it, and the residents. And this last move, which was a comprehensive audit of the entire industry, and we were one of the first states in the nation to actually start testing residents and staff on a go-forward basis. We required that every resident and every staff member get tested in this latest round. And in addition to that, created a very comprehensive infection control program that everybody had to pass and adopt. And I do believe those measures have had some impact on the fact that we've seen the positive test rate in the nursing homes go down, and we've also seen a decline in the death rates. But this one for all of us has been terribly difficult, an enormous tragedy, and something where we have continued to build our data pack as we've gotten smarter about how to collect data and make it available. And as I said before, by almost any measure, Massachusetts' database is as good as any you're going to find anywhere in the country.
Following up on the testing BPH report, experts say that while baseline testing can be helpful, what long-term care facilities really need is a targeted surveillance testing program that involves serology. Does the state have any plans to help coordinate and fund that?
I'm not familiar with the report, but our approach going forward with respect to testing relative to long-term care facilities includes both PCR, PRC, and serology testing. Yeah.
Last question.
Will fund it?
Yeah.
All right, so we were taking a listen right there in Massachusetts as we really try to go coast to coast for you on coronavirusnow.com, taking a live look right now of downtown Phoenix there in the distance. And we're going to keep it local here in Arizona right now because we're going to go out to Phoenix, staying local right now. We have our very own Fox News' Stephanie Bennett here with a preview of her story. Now, Stephanie, so many different pockets of areas are opening up in our nation, but there's still a sector of Arizona life that just isn't normal. How you doing, Stephanie?
Good, thank you, Michael. Yes, you're correct. The Navajo Nation has been hit extremely hard during this pandemic, and as the number of cases start to slow down, they're hoping to flatten that curve by getting the upper hand.
It seems like business as usual. Golf courses thriving, restaurants filled, and parks are packed. But in northeastern Arizona, it's a much different story.
It's been a hard battle, it's been a hard fight. I think our numbers have been all across the board, in this up, down, up one day, down one day, and then up again.
The Navajo Nation is continuing its lockdown until June 7th, as the number of coronavirus cases is now more than 4,800, and the number of deaths exceeds 150.
As Arizona and Utah open up their economies, we can voluntarily keep ours shut, and that's what we're doing because the COVID-19 pandemic is still, I don't know if we've reached our peak yet. Our numbers are still pretty high.
The Navajo Nation has experienced some of the highest infection rates in the country. Home to nearly 175,000 people, it expands across Arizona, New Mexico, and Utah. Vice President Leiser says about a third of families living on the reservation don't have access to running water, making it hard to regularly wash hands. Doctors say multi-generational homes make social distancing near impossible, and underlying health conditions like diabetes are taking their toll.
Never expected anything like this. It's extremely challenging. When we first started out, there were severe shortages of personal protective equipment, or PPE. We, like everyone else, ordered like crazy, and the shipments are coming in.
To help fight back, Navajo Nation leaders are implementing weekend curfews, closing non-essential businesses, and increasing COVID-19 testing. Volunteers are delivering PPE, water, and food donations.
We simply want people to stay home and to stay safe.
Yeah, the Navajo Nation has gotten help from across the country. The international humanitarian group, Doctors Without Borders, normally operates outside of the U.S., but they've sent medical workers to the Navajo Nation to help out during this pandemic. Michael?
Yeah, and Stephanie, how many new cases have they actually seen?
Yeah, well, the cases really vary day by day. They are starting to finally see a downward trend, which is good. They did report as of yesterday 102 new cases, but in the good news, they have had 1,600 recoveries. Michael?
All right, Stephanie Bennett there in Phoenix for us. Thank you so much. We do appreciate that live look at downtown Phoenix there in the distance as we continue on here on coronavirusnow.com. Live look at the White House here as well on this Thursday as we get prepared for the weekend coming up here. We have more coverage for you around the country coming up in just moments.
Making sure I could move it. So good afternoon. I'm very pleased to be here today with the Lieutenant Governor and with Carolyn Kirk, who's the Executive Director of the Mass Tech Collaborative, and with UMass Lowell Chancellor Maloney and with City Manager Donahue. Take a look at some of the work that UMass Lowell has been doing in response to COVID-19, and especially their work with our MIRT program. But first, before I discuss this, I do want to give an update, as I do every day, on testing cases and hospitalizations. Yesterday, we saw another day of numbers that were heading in the right direction. We've had several days in a row now of promising results as we've entered phase 1. Massachusetts is continuing to ramp up our testing capabilities. We're well over 500,000 tests performed to date, which makes us a national leader. The average positive test rate continues to inch down to about 8.5% as we continue to see hospitalization totals decrease as well. This is coming as we start slowly to get back to work, and those are both positive signs. But what it also means is that people have been playing their part. They've been washing their hands, covering their faces when out in public, distancing themselves from others when they can, and everyone is staying vigilant with respect to symptoms. The science, as we all know, and this is clear, doing these things is how we stop and kill the virus, and we all have to keep it up. It's great to be back here at the Fabric Discovery Center. I want to thank Chancellor Maloney for your extensive partnership on this center and so much more. You've heard us say many times that it's a constant battle to get personal protective equipment, so-called PPE, in the door and to support our frontline healthcare workers and protect patients from COVID-19. And while we continue to work a variety of supply chains, we've also looked to our own businesses right here in the Commonwealth to help us produce life-saving gear and supplies. And through some unique partnerships, we've created and funded a program to assist local manufacturers to make their own PPE, even if it's not in their traditional business model. The MIRT team has been working in collaboration with the Command Center to help Massachusetts manufacturers change their operations and quickly start producing much-needed products. Since launching, we've heard from over 750 manufacturers worldwide who are looking to help, and nearly 450 of those companies were located here in the Commonwealth. MIRT's helped those companies identify what types of items are most in need, provided regulatory guidance, helped coordinate supply chain needs and access to testing products, and reviewed product instructions for use, labeling, and packaging. Going forward, it's important that we continue to quality control and test the products we're making using the same benchmarks and standards that others use. Product testing is why we're here today at the Fabric Discovery Center at UMass Lowell. And I just think it's important to point out at this point, the Lieutenant Governor and I have been in this space on a number of occasions over the course of the past 5 years or so. And I think, honestly, I think this floor was nothing but a bunch of pillars. I'm looking at Chancellor Chen, right, the first time we came here. And that was because it was part of a joint initiative between the federal government, the Commonwealth of Massachusetts, and the U.S. Fabric and Manufacturing Association to create, for all intents and purposes, this Fabric Discovery Center here. And there is a lot of really interesting work that goes on in this place, and there has been for the past 5 years. But there is something kind of special about the fact that work that we did with UMass Lowell, with local manufacturers, with the federal government, and with a variety of other folks to stand up a Fabric Discovery Center here has made it possible for this operation, which already knows a lot about making fabrics of one kind or another, to stand up a set of testing operations that can then be used to test masks and test gowns and test other elements that are so critically part of the PPE supply chain. And it just continues to build on this idea that the more we can do from beginning to end here in the Commonwealth of Massachusetts, including testing, a lot of the fabrics and the products are being developed here in Massachusetts, the less we have to worry about some of the issues that come with getting involved in global supply chains, which Lieutenant Governor and I could go on for hours about how much fun that is. The academic institutions and the R&D institutions have been critical to much of the Massachusetts-made PPE production effort, and that includes teams from MIT, WPI, and of course the folks here at UMass Lowell. For N95 respirators, surgical masks, and gowns, Mert's partners now have capabilities to test for a number of very specific factors here to make sure these products work as well as they're supposed to. Mert's coordinated access to this PPE testing, which has served the needs of over 80 companies at this point, including the State Department of Public Health and the Massachusetts Emergency Management Agency. We've also benefited from the world-class R&D centers that Massachusetts calls home, including the Advanced Functional Fabrics of America operation, which I believe has, they got people right here. Yes, Chancellor? Okay. And their CEO, Dr. Sasha Stolyarov, is also here today. There he is. Thanks again for the partnership on so many of these initiatives. Here at UMass Lowell, these folks have conducted 80 tests of filtration efficiency, 82 tests of liquid barrier penetration, and 27 tests on gowns. I asked if they had actually tested any of the Merrow gowns, which is one of the enterprises down in Fall River that's famous for making industrial sewing machines, but is now in the business of making about 500,000 gowns a week. And I was told that while they haven't actually tested any of Merrow's gowns yet, I'm sure they will at some point. We're going to suggest they do. They actually do have a bunch of Merrow sewing machines that are actually part of the operation here, because this is, of course, a fabric discovery center, and they do make the #1 industrial sewing machine in the world. Just a nice little Merrimack Valley, South Coast story. And obviously, with the new equipment that we just saw as part of this tour, they'll be able to increase their capacity here substantially. The Fabric Discovery Center was able to purchase this equipment to test PPE through a grant from the MERT program. It enables high-volume screening of a myriad of materials for N95s, gowns, surgical masks, and other products. And without this kind of testing, it would take a lot longer to produce quality PPE here in Massachusetts and get it tested. Carolyn was saying earlier that as the volume of this sort of material, these kinds of products has become more and more critical to first responders and to our healthcare community, obviously the backup associated with finding places and spaces where you can get the test done started to grow. In some cases you could do it here, but it took a long time because of the backlog. Some of you had to send out of state. Once again, you know, building your own capacity just makes it better, faster, cleaner, and more efficient, and way more customer-centric and service-friendly. And this is in many ways a great example of a pivot that's going to work in the short and the long run for everybody. There are companies also all over the state, from 99 Degrees Custom and New Balance in Lawrence, to Caroline Products in Danvers, to Boyd Technologies in Pittsfield, that have already taken advantage of the testing capabilities here. 27 companies are making face shields, masks, N95s, test swabs, and medical gowns, as well as parts for ventilators, because of the work of the MERT. And many of those products and materials are tested right here through the Fabric Discovery Center and their partners. Aside from PPE, there are other important initiatives underway here to support the fight against COVID-19 for our residents and potentially for other states. The Massachusetts Medical Device Development Center, known more colloquially as M2D2, works with some of Massachusetts' smallest medical device companies and serves as a biotech incubator to give companies access to researchers and resources at UMass Lowell and UMass Medical School. M2D2 is helping with research to support a universal flu vaccine for the biotech company Versatope, and that includes technology for a possible COVID-19 vaccine. They're also working on simple blood tests to detect COVID-19 through more rapid testing for nucleus probe technologies. I think we all know that those blood tests over time could end up being an incredibly important tool for surveillance, especially as we go forward. And we're hopeful that that work will yield good results so we can forge ahead to offer more testing and treatment options to our residents and to others. Finally, I also want to applaud all the volunteers, both students and university personnel, who are working in the fashion masker space. Where'd she go? There she is. who are here and supplying face coverings. These are made with donated materials and distributed to members of the community like the Boys and Girls Club, the homeless shelters, and others. And on behalf of the Commonwealth, please know that we're very grateful to you and to all of the manufacturers for the role you're all playing. We've worked hard to make progress over the last few months, and will continue to do so in partnership with many of the people across the state who have come together to step up and fight COVID-19. That, of course, is no surprise to any of us who know anything about the quality of the ingenuity, imagination, and creativity of the people of Massachusetts. And with that, I will turn it over to our partner here, Chancellor Maloney.
Thank you so much, Governor Baker, and also to you, Lieutenant Governor. And listening to the Governor talk about the great history that we have in partnership in building out this facility, it's no surprise to see the great work that is being done. Know how grateful we all are for, I know I speak on behalf of City Manager Eileen Donahue, who's just been a great partner with me in going through this crisis, and our state delegation, Roddy Mom representing our state delegation. How grateful this community is for your ongoing support. You're always here for the city of Lowell and for us at UMass Lowell. So again, please accept our gratitude. I also welcome Emily Byrne, who's here on behalf of Congresswoman Lori Trahan. And we thank the Congresswoman for her great work that she is doing on behalf of us all. We need that help and support that she's fighting for. And of course, to Carolyn Kirk of Mass Technology, thank you. You were the first one to reach out to UMass Lowell with the governor. We're so grateful to be invited to MERT, this partnership. And I would like to also acknowledge Julie Chen, our Vice Chancellor for Research, who really spearheaded the efforts that the governor was talking about. You know, just a few words about UMass Lowell. You know that as a university, we take great pride in the kind of partnerships that we work really hard to develop with business and industry and community organizations. As the governor said, partnering with federal and state government to make sure that we position our communities and our business and industry to serve the Commonwealth and the nation in the best way possible and to adapt to this ever-changing economy. It's something that we believe is one of our greatest strengths and something that sets us apart as a university. So of course, we're so proud when it was this very strength that enabled us to pivot on a dime as the COVID crisis came into place and the governor turned to UMass Lowell for help, and this community turned to us for help. And we immediately started to allocate and send all of the PPE equipment that we had, as well as this manufacturing of it, working again with MEMA, the city and local hospitals. The Lieutenant Governor was there when we opened a surge hospital right here at UMass Lowell in our recreation center. And of course, most recently, redirecting all of our research efforts, these brilliant faculties, scientists and engineers working hand in glove with industry, and now with this great support from MERT to bring about the kind of testing that the governor referred to earlier. It is with great pride that I acknowledge this incredible team that stepped to the plate from the beginning, working 24/7 to contribute to the solutions. Through this initiative, through MERT, we've been able to provide material testing capabilities, allowing manufacturers to triage underperforming materials. And the governor and the lieutenant governor had a chance to see some of that great work just a minute ago. Already, 400 samples, including respirators, surgical masks, medical gowns, have been tested for entities such as Brigham and Women Hospital, MEMA, and companies like New Balance, Access Technologies, Warwick Mills, Caroline, MassCore, and others. And it's our privilege to work with them to find new ways and improved ways and accelerated, most importantly, accelerated ways of getting this testing done. This all happened right here at this Fabric Discovery Center, and as the governor said, this would not be here without their support. They were here when we did the ribbon cutting, it seems like yesterday, and we celebrated this great partnership that we have. And so to be able to do this work right now really is important to us to be able to make those contributions. And here in our Mass Medical Device Development Center, we are one of 5 technology hubs designated by the National Institute of Health to assist in the rapid acceleration of diagnostics initiative to help speed technology for COVID testing. It's our greatest hope that all of these efforts combined will help us to fight this pandemic and bring it to a close. We know that's a long way away, but we know that the work together, and we want to reassure you, Governor, again, we thank you for your confidence in UMass Lowell and this community, and know that we are here standing in partnership with you to help bring this virus under control. Thank you for all you do, both of you, to the entire administration for your great leadership. Know that we, the Commonwealth, are forever grateful. Thank you.
Tip of the hat to you, Carolyn, on this. But once again, Mert, you know.
It's memorable.
It is memorable. You're right about that. Okay. Steve, I think the floor is yours.
I have a question on another matter in terms of the marathon near Boston today.
Yeah.
Snow marathon. Your reaction to that? Big disappointment?
Well, obviously, the marathon in Massachusetts and in Boston is an iconic event. It's almost like a rite of spring, along with opening day at Fenway. And I know it was incredibly disappointing for the runners and for a lot of the folks who were involved in setting it up and making it happen, that it wasn't going to happen this spring. And I think people had hoped at the time that it would be possible to reschedule it in the fall and pull it off then. But I think we've all concluded that, and I know this is not the answer anybody would want to hear, that for the time being, we are better off being careful and cautious when it comes to really big events like that. And I know there were conversations about how to possibly reconfigure the race, and I personally think that in the end, the city and the BAA made the right decision by erring on the side of caution. But I'm sure everybody's hoping and anticipating that a typical rite of spring here in the Commonwealth, which is the running of the marathon, right around opening day and the celebration of Patriots Day, will be back with us next spring.
Is this a precursor of other things, Fenway Park, Red Sox, Patriots coming up in the fall that you might not see?
Well, I certainly know that there are ongoing conversations between Major League Baseball and the teams and the Players Association about how they might configure a season, and we've certainly been informed about those conversations as they've gone on. They still have work to do to figure that out, but I think all of us are going to try to be as reasonably accommodating as we can be. I do believe that in the end, whatever happens with respect to playing baseball, it's going to start without fans. Yeah.
Governor, let's pivot to nursing homes. When you look at the dashboard for number of cases at nursing homes, the state is reporting it in ranges. For example, 10 to 30 cases at this. Why isn't the state reporting the exact number of cases at nursing homes?
I think we actually did today.
Up until now.
Yeah, well, some of them look, first of all, the work that's been done over the course of the past 60 days, which is how long we've been at this, to create a thorough and comprehensive data pack for the people who are actually working these issues, as well as the public generally, has been an effort that the Commonwealth has put tremendous work into, and by almost every measure.
All right, folks, we are now going out to Arizona right now, where we will be featuring the governor of Arizona. Let's listen in here in just a moment here on News Now, everyone.
Thank you for being here. Looking forward to bringing you up to speed on Arizona's situation, where we are on COVID-19, and also talking to you about how the state of Arizona intends to return stronger. I want to begin again by saying thank you to the people of Arizona, to the elected leaders from different cities and municipalities from around the state for your partnership, for your responsible behavior, for so many good things that have allowed us to steer through this pandemic. It's been an incredible 3 months for all of us. There's more to do, but we're heading in the right direction, and it's a tribute and testament to the good citizens and the common sense that I see everywhere around the state every day, and I'm grateful. Our approach is going to remain calm and steady. We're going to take urgent action when it comes to public health. Now in Arizona, our timing has been later because our situation has been different than what you're seeing in other states, and it will continue to be focused 100% on the state of Arizona. And if we have a situation in a county or a hot spot, we will deal with that directly. And we're going to continue to have our decisions informed by data and public health. This is the White House gating criteria. Centers for Disease Control, along with the federal partners, put this together. It's the symptoms, cases, and hospitals. This is the same information that every governor in the country has been given. There's flexibility provided. You can act statewide or county by county. I'm going to take you through Arizona's numbers. On our symptoms, we're looking for a downward trajectory of influenza-like illnesses within a 14-day period and a downward trajectory of COVID-like cases within a 14-day period. This is Arizona's chart. The blue line is COVID-like illnesses. This is since December 29th. The gold line is influenza-like illnesses since December 29th. If you see the vertical line, about 2/3 to the side, that's when we put the stay home, stay healthy, stay connected order. You can see the downward trajectory in both COVID-like illness and influenza-like illness. You see in this last week a slight uptick in the flu-like symptoms from 1.5% to 1.55. Just something to be aware of. Cases, a downward trajectory of documented cases within a 14-day period, or downward trajectory of positive test as a percent of total test within a 14-day period. Here are our cases by day, beginning with the day that the public health emergency was declared on March 11th. If you take a look at this chart, you can possibly see the beginning of a downward trend. The trend is not here yet, and we do fill these in over the last 4 to 7 days because the information hasn't yet been reported, but you can see these lines getting a little shorter, and this is something that we'll continue to monitor. Percentage of positive tests. Now, there was some misunderstanding around the tests. These are 100% PCR tests or diagnostic tests. There's no antibody test mixed in here, no serology tests. These are all diagnostic tests. The blue graph represents the testing blitz. You can see the increase in testing since we began the blitz on April 12th. And the gold line represents the percentage of positive tests. You see the 5 straight weeks of a decrease in terms of positivity, meaning the contraction of people that have COVID-19. You can see the last 2 weeks from 5.1% to 6% and 6% to 8%. So again, we're testing a lot more folks. We're having a testing blitz. We're down significantly from our high, but we want to see that line continue to go down. That's the trajectory that we want to see. Let's talk about hospital capacity. This is really how we measure not only who has contracted COVID-19, but who is sick and needs care and comfort. The gray in this graph represents availability. The blue represents inpatient beds that are in use, and the gold represents beds that are being used for COVID-19 patients. If you can see across the course of time, beginning on April 10th, that line remains pretty steady, pretty flat, somewhere between 10 and 13% of available beds. The takeaway is we have capacity of hospital beds if necessary. Intensive care unit beds, this is if you're extremely sick. Gray is availability, blue is ICU beds in use, and the gold is ICU beds with COVID patients. You can see the same, you see a slight uptick on May 24th and May 26th, but we're pretty much between 11 or 17 and 20% of available beds here throughout. Ventilators, we have a lot of availability. We have some ventilators in use, and our COVID use for patients with ventilators is pretty flat, consistent, and steady. The takeaway on ICU and ventilators is that we have capacity. If there were to be a spike in the state of Arizona, we are prepared with medical capacity. Testing. We want to have a robust testing program in place for our healthcare workers, including antibody testing and trace contacts of COVID-19 results. If you take a look at our testing blitz, began on April 27th. We've done a total of over 287,000 tests combined. That is over 200,000 diagnostic tests. That's the PCR test, the test that tells you if you are sick today. The other tests that we're applying are the antibody or serology tests. Those tell you if you've contracted COVID-19 and have since recovered. We're going to continue our testing blitz. We're focused on people that are symptomatic. People believe that they've contracted COVID-19 or have been exposed to it. We want to focus on where folks are most vulnerable. Our long-term care facilities, congregate care, assisted living, and state prisons. So I'm joined today on my left by Major General Mick McGuire, who leads up the National Guard and our effort at DEMA, and Dr. Kara Christ, who's the Director of Arizona Health Services, and she's going to take us through where we are regarding those objectives. So, Dr. Christ, welcome and take it away.
Thank you, Governor. So we continue to work on those populations and those areas that have been considered priorities. So we are currently in the process of testing residents and staffs in all of the Medicare certified skilled nursing facilities, and we are working to ramp up the testing in our assisted living facilities. So there's approximately 147 Medicare certified skilled nursing facilities, and there's about 2,300 assisted living facilities statewide. We're also working on getting our correctional officers access to serology testing, so that's the antibody testing. We continue to provide support to Navajo Nation, and then we're continuing to monitor some increasing numbers that we are watching in Yuma County. And so there are a couple of different things that are going on in Yuma County. We continue to provide support and testing for individuals and populations down there. One of the things that Arizona has done in preparation to ensure that we have ongoing hospital capacity is we established the Arizona Surge Line, and we're one of the only states to have this free 24/7 centralized call-in line for hospitals and their providers that they can call if they've got patients that either need to be at a different level of care, either higher or lower, or a hospital becomes is concerned about their capacity or their ability to care for that patient. This was stood up in April. Over the last few weeks since it's been stood up, we have facilitated the transfers of over 400 patients statewide to the appropriate level of care. This is a real-time call that a hospital just has to make one call, and this line can find where the available beds are, where the available care is, and actually facilitate that transfer, taking that off of the hospital's responsibility so that they can go back to caring for other patients. There's an executive order that that will be released that requires the hospitals to actually utilize this. This actually was a partnership that we worked with the hospitals on. They voluntarily have been working on that and have provided resources to help assist the state stand this up. What it does do is it does require more frequent reporting of those beds so that we have a good idea of what's currently available when we need to find it. And then it will require them to accept patients when it's clinically appropriate and when their resources allow. The other thing that it does is it ensures that the patients who are transferred by no choice of their own because the surge line is coordinating their transfer, that it will be considered in-network by their insurance provider, because the last thing we want is for somebody to get transferred to a hospital that's out of network and have a large insurance bill. Thank you.
Thank you very much, Doctor. And now I want to turn it over to Major General Mick McGuire, and I want to thank him for his hard work, his double duty as leading the National Guard and taking over the DEMA effort as well, and talk to us about what's going on in Navajo Nation and the situation with supplies and PPE.
Yes, sir. Thanks, Governor. Appreciate the continued support. I want to first say that we're continuing our efforts to support not just Navajo Nation, but all the tribes we've, in the last week since we last met, have been able to send out some PPE training teams from our Task Force Med to Hopi Nation as well as White Mountain Apache Tribe, as they have also unfortunately had some cases on their tribal lands. We continue to provide Task Force Aviation support. Dovetailing on what Dr. Chris said, our UH-60 Blackhawks are part of that response network for the very remote areas of the country if we need to do transfer for certain patients based on criteria that we've established with health services. So we're proud to partner with them in that regard. And we are actively working with our federal partners and other volunteer organizations to provide staffing, and we have both of the 50-bed alternate care sites operating now in Chinle and Shiprock. As we go forward, we'll continue to maintain that presence, and we're thankful that not only the Guardsmen are supporting the folks on Navajo Nation, but all of the state. President Trump announced today that they'll continue to support that effort on Title 32 502F through mid-August, which I know was a national story recently. So we're thankful for his advocacy and the support of the governor as our Commander-in-Chief to continue that. As we work our way around, we still have the humanitarian mission going with the water tanks. We are post-mobilizing 3 of the 4 of them. The Navajo Nation has things under control in that regard, and we're continuing to monitor the situation there. We have a lot of outpouring of public support and donations, and we are able to execute just in the last week 4 specific missions from the food banks down in Santa Cruz County that have excess produce to move that equipment with our Guard Task Force Logistics and that food and supplies up to the northeastern part of the state. And finally, I would say, as we look at that trucking mission, the governor mentioned the PPE. We have a picture here of the past weekend. Fitting on Memorial Day, we were able to put a mutual aid request in with the state of California in coordination with Dr. Chris' staff. She has 5 folks that they've put on since this has started over in that warehouse, and that warehouse is relatively empty. On Sunday and Monday, we sent 13 trucks out to California. We're able to deliver 10 million surgical masks, 50,000 face shields filled up the entire place. And with the help of just 16 of our guardsmen and women that are there permanently assigned on 2 shifts and Dr. Chris' team, we were able to turn all that equipment around in less than 48 hours and deliver it to all 15 counties. And I can say, as the emergency manager and the commander of the Guard, there's a huge logistical effort to empty that warehouse. 13 full truckloads of stuff, repackaged, sent to all 15 counties. And I feel confident that we've gotten out ahead, at least on the surgical mask issue. We received 25,000 last week as well from Honeywell and their initial N95s. We're still continuing to work resourcing the gown issue, and I'm confident that our local Arizona economy will help us overcome that, sir. Thanks.
Thanks very much, General McGuire. Thank you to the brave men and women of the National Guard and the coordination that you've shown with the Department of Health Services. It's just been an incredible team effort. So let's talk about where Arizona is today. Of course, we're going to return the Arizona way, focused on our state 100%. Our announcements will be gradual and phased in as we come out of this pandemic. We're going to balance public health with returning stronger and believe we can do both safely and successfully. We're going to increase testing, and we're going to maintain strong physical distancing. Again, I want to thank the citizens for their responsible behavior that continues. And we're going to base the recommendations of CDC and health experts as we make decisions over the next several weeks. So I was able to meet with school leaders and superintendents from around the state earlier this week. I want to thank these people. Our hardworking teachers, principals, and superintendents really we all had a curveball that came at us in March. They did, especially because they were in the middle of the school year. They switched almost immediately to distance learning. There were all hands on deck. There was a surge of supplies and hot spots and technology. And by and large, they've finished out this school year or are completing it very soon. And we got together to talk about what's next. What does next year look like and the next school year? So I want to thank Superintendent Kathy Hoffman, who's been a partner and a leader throughout this in looking out for Arizona school children and what's in their best interest and how do we work with educators and teachers. We did a lot of listening in this meeting. We received a lot of input from leaders across the state. I would say the good news was no matter where somebody was or what their role was in the system, they were eager to get back inside a classroom, to get to the front of a classroom. So they're looking for clear guidance. Flexibility was the coin of the realm so that we could tailor guidance to meet the needs of the specific school district and the situation that we still have in the state of Arizona. The announcement today is that schools will resume at the start of this school year. We're planning ahead. Superintendent Hoffman will release guidance for schools on Monday, June 1st. This guidance has been informed, of course, by school leaders, teachers, parents, and public health experts from the Arizona Department of Health Services. In addition, we're going to have an executive order to support our schools. The superintendent's asked for flexibility around childcare ratios for school-based child care programs. So we're announcing a responsible plan developed by health services that will protect children in school-based child care and will allow for increased child care capacity for school-aged children. We'll continue to work with school leaders to ensure the needs of the children around the state are met. In addition, I said that things would be getting back to normal when somebody could say play ball or batter up. I was hoping that play ball was for the Arizona Diamondbacks, but in the meantime, it can be for Little League. Organized youth activities can resume. So whether that's summer leagues, summer schools, or day camps, Those are important. We wanted to provide clarity here. There is guidance to allow youth sports to resume safely and responsibly, so please feel free. Let's talk a little bit about returning stronger in our economy. Part of that is taking care of the 500,000 plus individuals who were displaced during COVID-19, the people that were working just a few months before and all of a sudden had no income and no job. We've worked hard to make sure that no one fell through the cracks and that our social safety net was strengthened and expanded. This is the unemployment benefits paid, and you can see the first real date where there was an increase was April 4th, just not that long ago. Over $1.4 billion that's been put forward in just a few months. That's over $983 million in unemployment benefits. In terms of pandemic unemployment assistance, those are individuals that in the past would not have been covered in a situation like this. Over $513 million put forward, and you can see the overwhelming majority of that over just the last 2 weeks. I want to say thank you to the hard-working men and women in the Department of Economic Security. We continue to make progress. This week alone, we've paid out over $188 million in unemployment insurance benefits and $218 million in pandemic unemployment assistance. DES has served over 700,000 Arizonans. 572,000 plus with unemployment benefits and 139,000 plus with the unemployment assistance for the pandemic. I know that there have been complaints, and I know that there have been frustrations, and we've worked hard to expand capacity, resources, servers, employees that are working there. They work through the weekend, Sunday and Monday of Memorial Day. But over 700,000 Arizonans have been served. There are more that need to be served, and we will work to do that and to get this right. But I want to recognize their effort because it has been extraordinary. We're also going to announce a new director of the Department of Economic Security today. His name is Michael Weishart. He's a career public servant. Started his career 20 years ago at the Department of Economic Security. He has his undergraduate degree from Arizona State University and his MBA from Arizona State University. He's been instrumental inside the agency in the creation of the Department of Child Safety. He led the effort on Arizona's Second Chance Centers, our enrichment centers for childcare for essential workers. Michael has been at the Department of Economic Security for 20 years. He has never seen a director promoted from within the agency. To our knowledge, he is the first director to be promoted from within the agency, and we have confidence that no one knows this agency better than Michael Weishart and that he will serve the people of Arizona well going forward. I also want to give a special thank you to Tom Betlak, who came out of retirement to take the lead at the Department of Economic Security in the most stressful, high-pressure time in the history of the state. He's an incredible public servant. It's when the state needed him most, he answered the call. He's also committed to providing assistance and counsel to Director Weishart through this transition. I'm thankful to Tom Betlak for everything he's done for the good people of Arizona, and I'm also thankful that he's going to help Michael Weishart with the onboarding to the leadership role at the Department of Economic Security. I want to talk about our local communities. We were able to meet with mayors and supervisors from around the state yesterday. The federal government has forwarded dollars to the state to not only support the state, but our local communities. I wanted to listen to the people on the front lines, and that's our mayors and our county supervisors in both urban and rural areas. We were able to have a couple of listening sessions with these folks. They told us what was most important to them, and we were able to make an announcement yesterday as to how we were going to disperse these dollars. There's $2.8 billion that was forwarded from the federal government to the state of Arizona. We were able to take these resources to local communities with $441 million for Arizona counties, cities, and towns. These are direct payments. They have maximum flexibility and minimal red tape for our mayors. In addition, we have $150 million in express pay resources. This is going to be Major General Mick McGuire working with local municipality to fast-track FEMA reimbursements for coronavirus-related expenditures. If you look at this $2.8 billion, we've got half of it that has gone out to local governments for their use, what is best and most necessary. I've always believed that the government that governs best is the government that's closest to the citizens, and we've got half the dollars in their hands. And with that, we'll take some questions.
Start with you and Howie. Hi, Governor. I appreciate what you're saying about sports, and I've got a question on that in a second for youth sports. But in the meantime, the Prescott Rodeo, the world's oldest rodeo, starts exactly in a month from now. Will they be able to have a rodeo, and will they be able to have people in the stands? Because without people in the stands, they ain't making no money.
Well, I hope everyone can hear the question. The question's the Prescott Rodeo's a month from now, and can they have a rodeo, and can they have people in the stands? The answer is they can have a rodeo. In terms of people in the stands, there will be more to follow on that. Of course, what we want to see today is strong physical distancing. But you're talking about July. That's light years away in the world that we're living in and the change that we've seen in the state of Arizona week to week. So there will be more to follow. But yes, the Cowboys and the Bulls can get ready.
Now, let me just follow up. I just want to follow up on the issue of youth sports. You said that they'll be able to gather. Again, this isn't like the NBA with negotiating. What about, again, people in the stands, parents on the sideline screaming? Are they going to be able to have spectators for these youth sports and these summer camp sports?
So in terms of youth sports, of course, the negotiations are complete, and they're ready to have the first opening pitch for Little League. And we're proud of the players and the parents. This idea of physical distancing, responsible behavior is something we're going to continue to talk about. It's going to be important in any of these settings. There's going to be guidance that's put out by the Department of Health Services, but youth sports can resume. And do you want to talk a little bit about the guidance around that, Dr. Christ?
Sure. So there will be recommendations that involve limiting the number of parents or spectators that a child can bring, physically distancing before and after the game, not sharing drinks, snacks after the sports. If there is shared equipment, making sure that you're disinfecting it before and after, so that we do have recommendations that have been developed for our youth activities.
Thank you. Thanks, Howie.
Thank you. Governor, on reopening schools, that's firmly in phase 2, and you're not there yet with your testing. That's a big leap to tell the parents of 1.1 million school children that it's safe to go back to schools when we have the most crowded classrooms in the country in this state. That's an anticipatory thing. Why, and you and Dr. Chris can both talk about what are you going to have to pull that back if things don't?
So I want to talk about this decision from a public health perspective. So I'm going to let the public health expert address it. Dr. Chris?
So for schools, we know that we've had daycare or childcare in place where kids have been in a congregate setting. There are a lot of recommendations. When we met with the superintendents of the school, there are multiple plans that they are putting into place so that children or teachers that are at risk can either do distance or virtual learning, that there are opportunities to reduce class size, and that there are disinfecting protocols and a lot of safety things put into place. And this would be very flexible for both the families and the employees of the school district. The thing as a mom that I can't stress enough is that school supplies so much more than education. And so it's important to get these children back into school, back into a normal routine. Of course, it's going to be a new normal. Washing hands, hand sanitizer, physical distancing, not mixing at lunch, not doing big assemblies. And so they will be back to school, but it'll be a new normal.
Go to Stephanie and then Nicole.
I guess this question is for Dr. Chris. So this week, in terms of daily statewide hospitalizations, we saw two larger numbers than usual, 911 on Tuesday and 945 yesterday. Are you concerned about that? I mean, I think to members of the public that can look alarming. So how are you explaining that?
So the data that you're talking about is the self-reported data on the hospital metrics that the hospitals report on inpatient and emergency department rooms. And yes, over the last 2 days, we have seen an increase in the number of COVID-related inpatients, emergency room visits. We will continue to monitor it because it's self-reported a day or two. That may be a reporting issue. What we're going to be looking for is trends in that data over weeks. The encouraging thing to us is that the relative percentage of COVID patients has remained relatively stable over the last few weeks, but we will continue to monitor. We are looking at that data every single day.
Nicole, go ahead.
Governor, thank you for your question. Health data analysts, they cannot replicate your data for a declining trajectory, not even from the own dashboard. You ask the public to trust you, but we're not giving the public a way to verify the data. FEMA says in their May 7th report that Arizona did not meet one of the gating criteria to open, but then you let your order expire 8 days later. Are you cherry picking the data, or are you going to give the public the data to verify it themselves?
Nicole, the data that I put forward is from the Department of Health Services. The guidance that we follow comes from the Centers for Disease Control. FEMA is in charge of supplies, and your information is wrong, and your question is misleading.
FEMA told us that our
FEMA is not does not
saying?
set guidance. FEMA does not set guidance. I have a meeting every week with the leader of FEMA, Dr. Deborah Birx, Dr. Anthony Fauci, and Robert Redfield. CDC sets the guidance. Dr. Christ, will you let them know where we are on phase one, please?
So we do clearly meet the phase one, or the criteria to be in phase one. So what FEMA presented in that model was hospital utilization, which is not part of the gating criteria. Of course, it's something that we're monitoring for our resource needs, and we appreciate that FEMA provided the model to us. But for the COVID-like illness and the influenza-like illness, that's calculated a much different way than just the reporting of the beds. And we have clearly met that for quite a while.
I think it said syndromic cases on that as well.
Yeah, and so what we're looking at, syndromic actually is the percentage of those visits. It's a whole algorithm that is used by the Centers for Disease Control and Prevention, and we do meet that.
Are we in phase two then?
We're in phase one.
Then how are we talking? Are we talking about schools in person then?
We're in phase one.
So schools in person?
Go ahead, Billy.
Okay, just real quick on schools, Governor.
Yes.
And for the doctor as well. Did you say that parents who don't feel confident sending the kids back to school, because we know that young people can carry this virus and be asymptomatic and then spread it, parents and teachers that don't feel comfortable sending the kids back to school, is there going to be a virtual option across the state? In other words, if a teacher is over 65, doesn't feel comfortable going back in the classroom with 30 kids running around, they can do that from home?
Thanks very much, Billy. We think that this is important because of where we are today as a state. Plus, we know so much more about COVID-19 and the virus and who it affects today than we did at the beginning of March. And that was really something that we heard from all of the educators and all of the superintendents. That's why I said that the coin of the realm was flexibility. We're going to have folks that have an underlying health condition that need to be protected, and they won't be able to go back to this temporary normal that we have. So the idea is around flexibility, that we maintain the idea of distance learning where needed, that we do the right things that Dr. Chris talked about in terms of guidance. So it will look different, it will feel different, but the idea is that kids will have a more traditional routine school day where possible and safe. Do you have anything to add to that?
That was perfect.
We'll stay over there. We're going to Craig next. Dr. Chris, thank you for being here today, and Governor, thank you very much in general. On April 29th, Doctor, that you said that if a judge disagreed with your department's decision to withhold information about COVID outbreaks in nursing homes, that you would happily release that. There's a special action in court, and a judge could rule tomorrow. But the private attorney that the state hired has said if the judge rules in favor of the media outlets and against the state, the first thing that he may do is to ask for a stay.
2/3 of the 700 individuals in higher ed have already made that commitment as well to the fall.
We're going to go to someone going to ask a question. We'll go to Melissa first. So round it up.
Good afternoon. So my question is about DES. Obviously, the Department of Health Services has a dashboard where they update people on a daily basis, providing some transparency and accountability about how the coronavirus situation is going. From our viewers, we're hearing a lot of confusion, not only about how the process works, but how the state's improving. So would you be willing, or why don't you, put up some sort of dashboard or daily updates about number of calls taken, number of claims approved, number hold times for calls, number of cases that are actually kind of in dispute or being investigated? Would you do that to give Arizonans a better idea of what DES is doing on a daily basis to improve?
So the first focus right now, Melissa, is to get out benefits to people that need it. Like I said, there's been over 700,000 Arizonans who have been displaced. The department has worked very hard, and the men and women in that department have been working overtime, weekends, and holidays to get that done. In terms of some type of dashboard beyond that, we're very hopeful as we reopen our economy, we're going to be moving people off the unemployment rolls and onto the employment rolls. But we also look at this as an opportunity to make DES more user-friendly, to take better advantage of technology. I want to say this the right way, but unemployment wasn't something that was a concern over the last 6 years. Arizona's been among the fastest growing states in the nation. We've had more jobs available than we've had people to fill them. We went from an average number of folks that were on the rolls and falling off the rolls for 6 years, and then all of a sudden 700,000 claims within a couple months. So yes, we can work on a dashboard. Priority one is to make sure nobody falls through the cracks.
My question's regarding schools. A lot of them are already struggling financially. Are there any plans to provide them more, funding to be able to implement things like social distancing, to buy hand sanitizer, these types of things to keep students safe when the new school year begins?
Thank you, Giselda. That was definitely part of the discussion that we had with the superintendents is what were the needs of the schools, how would we work on flexibility for people with that underlying health condition, and what the cost would be. So part of the reason that we distributed all the state and federal dollars to our local municipalities were to deal with the situation of COVID-19. We're getting a real handle on where we are in terms of state revenues. We've not spent all all the federal dollars at this time. We also have education dollars that came to the state that provide flexibility in addition to our state budget on top of our rainy day fund. So we do have some options, and we'll want to make the proper decision so that we can successfully reopen our schools in a safe way for our kids, our teachers, their staff, and employees.
Okay, thank you.
Can you wrap it up here? We'll go back to Howie. Dr. Christ, I just want to make sure you said, in terms of reopening schools, that they provide a lot more than just education, which sounds like you're making a balancing test that what they provide outweighs the risk of all these kids together. Are we essentially saying the benefits of kids in school outweighs the risk of having the kids together and bringing disease home to their parents?
So what we're saying is that from a public health perspective, schools provide nutrition, they provide safe environments, they provide physical activity. All of this is important for the ongoing health of these kids, especially as they grow. And so we are looking at it from a holistic public health approach. We are weighing it against the risk of transmission of the virus, and that's one of the things that we're taking into account with the flexibility is those kids that may have family members that are high risk, and how do we account to keep them safe while we're still meeting the needs of the children.
We'll do one more from Michael, and we'll wrap it up with the other Michael.
I know this is a little bit out. President Trump tweeted about 12 minutes ago that Valley Metro is getting $100 million for the light rail. I was hoping to get your comments on that as well.
I haven't seen the tweet.
Literally says, very exciting news for the Phoenix area. Department of Transportation is committing $100 million to the Valley Metro for a 5.5-mile light rail system with 9 new stations connecting underserved areas to churches, emergency services, and more.
Well, if we've got federal dollars coming to help grow the state and transportation infrastructure, I can't say anything except that that's a good thing.
Governor, just real quick on the subject, so Trump, which is the president has said that mail voting is subject to fraud, it cheats people. We have something like 80% of Arizonans who vote by mail. What's your thought on mail voting?
I think in Arizona we've done a very good job on making it easy to vote and hard to cheat. And I think it's important as people expand the options in their own election system, that they make sure that there are safeguards there. And I'm proud of the elections that we've been able to run in the state of Arizona, the options that we provide our citizens in the state. In our state, we're going to work overtime to make certain that no citizen is disenfranchised from their vote. In closing, I want to say thank you, everyone, for your time. Thanks to all the Arizonans that are working so hard and behaving so responsibly. I want to say a special thank you to General McGuire and what he and the Guard have done, and Dr. Christ for your hard work. I'm excited for our new director at Department of Economic Security. I'm thankful to Tom Betlak. And if you're looking for a headline, it would be that play ball is going to happen with Arizona Little League, and that get ready for school in the upcoming year. Thank you.
They were our mothers, fathers, wives, husbands, and children. Pam and I and the Commonwealth of Virginia join with their loved ones in mourning their loss. We know that grieving is not an event, but a process, and these families continue to live with their grief every day. We also join the Virginia Beach community, which was forever changed by this tragic event. Everyone felt this loss, from the co-workers to the first responders who ran toward danger and saved lives, to friends and neighbors. We are all proud of how the community has rallied to support the survivors and families in the immediate aftermath and in the year since then. We saw the compassion and kindness in people, and we continue to see it today. While the current pandemic limits our ability to come together physically, it does not limit our ability to honor the memories of those that were lost. So today, please join me in remembering Laquita Brown, Ryan Keith Cox, Tara Gallagher, Mary Louise Gale, Alexander Gusev, Joshua Hardy, Missy Langer, Richard Nettleton, Catherine Nixon, Christopher Rapp, Bert Snelling, and Bobby Williams. Please join me in a moment of silence in their memory. Thank you. I know Virginia Beach remains strong. I urge you all to wear blue this week.
All right, guys. I will just apologize right now. Pregnancy brain is getting the best of Christy here today. Looking at that TVU screen, that was my fault. Definitely had some issues here with my brain working correctly today. But we do have a live update to bring to you right here on our News Now stream. Everything should be working a-okay now. So we do have an update coming from it looks like this is the California update. So we're going to head out there because we always like to go to live events. So here's Orange County in California.
We are. I'd like to address the fact that in comparison to all our neighboring counties and the state as a whole, Orange County has the lowest rate of confirmed cases and the lowest rate of COVID-19 related deaths. Overall, COVID-19 positive test percentages are at 5.1% and has decreased from 6.3% 2 weeks ago. Orange County is testing more. A decreasing positive test percentage is a good sign. The dine-in restaurants and walk-in stores opened last Saturday in Orange County. On Tuesday, barbershops and hair salons opened their door for businesses. While Orange County opens all these businesses, we ask Orange County residents to keep in mind our safety precautions so that the health of those in our community is protected. Before I address the actions that were taken by the board on Tuesday, I want to speak about something that occurred during the board meeting. At Tuesday's Board of Supervisors meeting, we heard from many constituents that are upset with the recent facial coverings order implemented by our county health officer, Dr. Nicole Quick. Many expressed their desire to see it amended or repealed. Unfortunately, during the public comments, Dr. Quick received a death threat. While many people have strong emotions related to the facial coverings order, it is never appropriate to intimidate or threaten violence, particularly with our public health director. As a chairwoman of the Orange County Board of Supervisors, it is my job to ensure the public safety of our residents. This includes our hardworking staff at the healthcare agency. Regardless of any differences of opinion, no one deserves to be threatened or intimidated in the way that Dr. Nicole Quick has been. She has been a hardworking partner in this crisis. I strongly condemn this behavior, and it should never happen again. At Tuesday's board meeting, the board joined me in unanimously supporting a resolution that declares all houses of worship as essential in Orange County. A large number of Orange County residents rely on their houses of worship for spiritual guidance in their lives and communion with those that share their faith. Religious institutions are often used as a safe haven for those in tough situations at home. This resolution will help those who need a safe place and extra support from those in their community. Additionally, the board also yesterday voted to allocate $75 million of CARES Act funding to small businesses across Orange County. While I would have preferred the funds go directly to cities to be distributed to their business communities, the board voted to split the funds by the districts, with each district receiving $15 million each. Of the $15 million allocated to my district, I will distribute these funds to each city based on population size. It's no secret that our businesses have been struggling, and I intend to get this emergency money to the cities in my district within the next few days. Time is of the essence, and ensuring this money goes straight to businesses without bureaucracy getting in the way is of the utmost importance. This money needs to get to these struggling businesses as soon as possible. Finally, the economic toll the coronavirus has taken in Orange County and the state of California has been nothing less than disastrous. Our state has seen over 4 million unemployed and a $54.3 billion deficit in the state. Families are struggling. People are out of work. We've done our best to help the taxpayers of Orange County during this time, and I believe this week's announcements are a step in the right direction. As we continue doing everything we can to help families to get back on their feet, I am pleased to announce today there will be no new tax or fee increases in next year's budget for Orange County. The last thing our residents need in the midst of this crisis is more taxes and more fees. Today's press conference will have Dr. Clayton Chow, Director of Healthcare Agency, and our CEO, Frank Kim, who will be available to answer any questions. And thanks for joining us today. And Dr. Chow, it's your turn.
Thank you so much, Chairwoman Steele, for your words of support for the hardworking staff and the unfortunate incident that happened this last Tuesday. As the director for the healthcare agency, I also would like to repeat that I would not tolerate such behavior. Good afternoon. My name is Dr. Clayton Chow, Director of the Orange County Healthcare Agency. I would like to provide an update on the business reopening in Orange County. We have received some questions from local businesses and community members about the state reopening guidelines that I hope to answer today. The state's COVID-19 reopening guidance for specific industries should be followed. Details are also available on our website at ochealthinfo.com/novel coronavirus. So here's the update for businesses activity that can open. Counties that have been graded a variant by the state, like Orange County, can open hair salons, barbershops, It's important to note that all parties must wear face coverings and personal protective equipment. No procedures or services that require touching the face are allowed. Church services, funerals, cultural services, and protests can resume. These activities must be limited to less than 100 participants if they are taking place outside. If they are taking place inside, they must be limited to 100 participants or 25% of the facility's capacity, whichever number is lower. Update on business that cannot open at this time. Nail salons or spas, gym and sport clubs, gymnastic, dance, and ballet studios, Little League and all other sports camps, private and public schools. College courses must follow distant learning protocols regardless of lab requirements. Public pools, even in private neighborhoods. And public pool means if you ever need a permit from the environmental health science, then your pool is categorized as a public pool. Weddings with groups are not allowed yet. Private gatherings in a person's home are limited to those in the same household. Business webinars. So we know there's a lot of question from the business owners. So the healthcare agency, in partnership with the Orange County Business Council, is pleased to host 3 Zoom webinars for our business community. Title, Are You Ready to Reopen? So the first one will take place today at 3:30. In fact, that's why I have to run right after this to get ready for that webinar. And today's webinar will be for retail business. The second will be Friday, tomorrow at 3:30 p.m. for restaurants. And the third one will be Saturday at 3:30 p.m. for other business sectors. Interested businesses can RSVP to eTeam, that is ETEAM, at ochca.com for meeting information. Let me repeat the RSVP email address again. Is eTeam@ochca.com. Now I would like to invite my boss, CEO Frank Kim, for the question and answer portion of this press conference. Thank you.
Good afternoon. I'm Frank Kim, the County Executive Officer. Moderator, do we have questions from the media?
Our first question comes from the line of Nick Gerda from the Voice of OC. Please go ahead.
Hi, Frank, can you hear me okay?
I can.
Excellent. Yeah, thank you guys for taking questions again. I had a question for Frank on the county workforce. I understand in some departments, half or more of the staff have been working from home. So curious where the county is at in bringing people back to work, if you have numbers on that. What kinds of safety measures are being put in place to protect workers and the public as people return back potentially to their county jobs? Will the county be following the Cal OSHA safety guidelines? And have you given guidance to all departments on this, or are you generally leaving it to each department head?
Thank you for that question. So the county is a business like any other in Orange County, and we're following the guidelines from the state and our local health official. So to answer your question, I think it's not a simple answer because we have 17,000 employees distributed over dozens and dozens of different sites. So we're doing what most businesses in Orange County are doing, where we have public counters. We're putting in the plexiglass, and that will be done, I think, in the first week or so in June. So once that is complete, then you'll see us begin to phase in the opening of those public counters. So I expect that to occur within the mid-June to end of June timeframe. That's consistent with what I hear from my counterparts in other large urban counties. In terms of businesses and departments, they're all a little different, right? So if you're at John Wayne Airport, that facility is continuing to operate, and you may have some administrative staff that are telecommuting, and they're able to maintain their productivity doing so. So long as they can remain productive, I've encouraged my department heads to continue telecommuting. We have set up a strike team of our human resources group, our risk management group, and our facilities group. And the three of them have come together and established a checklist for each of the facilities that we have county employees in. So department heads are required to go through and check off all of the requirements in the facilities guideline. And once they have met that need, then it's up to each department head to start phasing in their employees appropriately. And again, where they're able to continue to productively encourage employees to telecommute. So I think the answer to your question is, of course, we will meet any Cal OSHA requirements. That is a requirement. We will look at the California Department of Public Health because we take guidance from them. We will speak to our health official, and we will follow our checklist that we developed internally. So we're going through that process right now, and what you'll see is essentially a phased reopening of county government. Next question, please.
Great.
Our next question comes from Paul Anderson from City News Services. Please go ahead.
Yeah, hi. San Diego County is going to be allowing passive use of the beaches. Wondered if Orange County is going to follow suit soon as well, or if you've been in touch with the state on that.
Can you repeat your question? I didn't hear the first part of that.
San Diego County is going to be allowing passive uses on the beach, like sunbathing, and wondered if Orange County has been in touch with the state and is also to follow suit soon as well.
Thank you for that question. So we are in contact with the state regularly in terms of how they're managing their beaches. As you know, in Orange County, I believe the greatest proportion of our beach frontage is operated by the state, Bolsa Chica and other state beaches. So we are in regular contact with them. Our understanding is the state is going to open up all of their parking, and we are following suit. And starting next week, all of our parking lots will be open as well. We're also in communications with local cities to ensure that our beach practices mirror those within the communities that we are a part of. So I think your question is, are we moving forward with passive use? That is something that I have not spoken to my staff about, but I suspect that they're already working on it. I just don't have that understanding today. But it's a good question. I'll follow up with my park staff, and Molly will be back in contact with you, Paul, and give you an update in terms of where we're at. But I would like to move ahead with passive use. I think it's important. We certainly have individuals within our community that for certain physical limitations or other things can't engage in the constant movement, and we don't want to restrict their access to our beaches. We would like it available to all members of our community. So I'll have that conversation. If we can do that safely within what's allowed, you'll see us take those next steps.
Our next question comes from the line of Ian Wheeler from the Orange County Register. Please go ahead.
Thank you. Probably either Dr. Quick or Dr. Chow could answer this, but I have questions on the recovery data provided starting Tuesday this week, and kind of in two parts. I'm hoping for an explanation of the epidemiological benefits of estimating recovery data as it's been done, and an explanation a bit about the 28-day case count window that's being used as opposed to another window of days and case counts. The second part is that there had been pressure by the Board of Supervisors to provide recovery figures. So I'm wondering if the board hadn't asked for them, would the healthcare agency have released these estimates?
I think the answer is yes to both of those. I know that our board members have asked for recovery data. Certainly our chairwoman has asked that on numerous occasions. I have asked the same as well from our healthcare staff. I think their concern always is that when you're showing data on the website, if it is not 100% accurate and you're using estimates to provide information, I think there's always a concern that there will be members of the public that review that and they want to challenge that data. And we thought that during a time when we're in crisis, having the most accurate data, ones that we can stand behind, were very important to public messaging. But as time went on, absolutely, I think it was critical for us to show that this COVID infection for many portions, a significant portion of our population, was not having as significant an impact. And our ability to show that most individuals recover well from COVID, we think that that also is an important message to share. So it's really balancing those two things. And what our healthcare agency did was they followed up with other counties that were providing recovery data. And we spoke to them and said, number one, how are you calculating it? And we looked at all of their methodologies, and we tried to put one together that got as close to being as accurate and representative of what we are seeing within our Orange County COVID population. So Dr. Chow had to move away because he's doing that business recovery retail seminar at 3:30, so he did have to step away. But what I'll do is I'll make sure that your questions related to the epidemiological basis, others, are responded to by our PIO. Molly has your information, and she'll be in contact with you later today, Ian. Thank you for that question.
Our next question comes from the line of Spencer Custodio from the Voice of OC. Please go ahead.
Hi, thanks for taking our questions. This one, I guess, is for CEO Frank Kim. The OC is Sheriff. I know he's not there, Don Barnes, but Sheriff Don Barnes had indicated that, hey, we're not the mask police, and then he also indicated that his deputies will enforce through, education, kind of like how they did the Gavin Newsom stay-home orders earlier on. But he also said that he wouldn't be enforcing the limitations on church gatherings, the large congregation. And I'm wondering if, Frank, of your office or anybody at the county has been able to work with them on some kind of way to approach the state limitations on the gatherings, and if there's also any more clarification on the mask issue.
I'm happy to address that. Number one, you have to, I think, first understand that Sheriff Barnes is local law enforcement for a certain portion of the county. He does not have direct law enforcement responsibility in cities that have their own police department. So I don't think it would be fair to say that he's got this responsibility across the entire county. I think he made it very clear that he would find it very difficult to enforce a mask ordinance or go into a church and enforce the limitations on the number of members of the congregation that are participating in a church service. And I think it's really not appropriate for me to speak for him, but I think from a county administrator perspective, I think what I believe that he is sharing with the community is that, number one, our job within the county is to provide information, to provide guidance, and the best information that we have to help people maintain the appropriate safeguards so that this COVID infection does not spread more widely than what we can help to prevent. And I think the challenge in that is that we're getting direction from the state, and sometimes that direction changes from week to week or from day to day. And then there's a requirement for the healthcare agency to then respond. And then it gets further complicated because our health officer, her authority derives from the state health officer, who is an agent of the state. So then we get into multi-jurisdictional guidance. And I think we have really endeavored to make Orange County residents understand the best practices in reducing the spread of COVID. So if that means that we are issuing a health order on face coverings, if that we are asking individuals to maintain the strict requirements that we receive from the state in terms of the number of gatherings within a church service or a private meal at a home, those are things that we're sharing with you. But I don't think that there's any intent for us to go out and station a law enforcement official, whether it's in an incorporated city or if it's a city patrolled by the sheriff's office, to do a count or to enforce certain mask requirements. That is not what I believe law enforcement will do. But I think it's really important, and I hope this message is not lost. It's really important for the residents of Orange County to understand that health orders that come out of our local health official, that is her medical opinion about what is best for Orange County residents to limit the spread of COVID. I understand that there are different opinions in terms of whether individuals want to follow that or they believe that it is healthful or not. But I think we all need to understand this issue of COVID is relatively new. The medical science sometimes is different depending upon the article or the journal study that you read. So a lot of it is based upon, I think, common sense. It is evolving from week to week. And I would hope that individuals understand that as we give order or guidance or strong recommendations, they're coming from an honest place of understanding and trying to digest all of the new information that is available and trying to provide the best guidance, or in some cases, an order for Orange County residents. And I hope that that is how, that's the spirit in which our Orange County residents receive that message. We are not out to have strict enforcement. We're not out to cite individuals. We are not out to station deputies or police officers in your community. That is not what we're doing. We're out here to communicate with you, to give you information, to encourage you to be as safe as possible. And I think in that message, I speak for myself and the other officials within the County of Orange. Next question, please.
Our next question comes from the line of Margaret Carrero from KNX. Please go ahead.
Hi there, CEO Kim. Hoping if you could specify a little bit more and kind of clarify what that face covering order means. Sorry, it's so loud. Also, any indication at this point that some of these new cases that we're seeing linked back to any protests or people being back out more, out at the beaches, more community transmission? I know we've had a lot of them in the skilled nursing facilities, but any link to community transmission in the new cases?
No, we don't have any evidence to suggest that the rise in cases has anything to do with those individuals that were participating in protests or those individuals that were out enjoying the wonderful beaches in Orange County. What we know is that we did have a strong spike in terms of infections that occurred within our skilled nursing facilities. We did have an outbreak that occurred within a homeless shelter environment. So a lot of what we're seeing is directly associated with that. And our health officials also identified that we are seeing a rise in community transmission. So I think that is the concern we have, is that as we reopen Orange County, which is fantastic, and I can't thank our healthcare staff enough for the work that they did day and night to complete that attestation. Dr. Quick and her team, they worked 4 or 5 days straight, late into the evenings, to accomplish that for our Orange County residents and businesses. So I don't want it to be lost that we don't appreciate what they did, but as that happens and we reopen our economy, I think that we all acknowledge that we will be interacting more with one another. And with that comes the additional risk of potential virus transmission. And I think that is the reason for the health order, to reduce the potential spread of that viral transmission. In terms of what does it mean, I think the most common sense way for me to explain that to most residents is to say this. If you are out of your home and you're interacting with either a business or at your workplace, or you're in a public space, and you cannot maintain your 6 feet of social distancing, the order requires you to put on mask. That's really what it is to say that if you can't maintain that 6 feet of social distancing, it requires you.
All right, and it does look like we lost that shot there. So sorry about that, being in the middle of their press conference. But we will continue to move along here on News Now. Thank you again for being here with us. Going to take us out to Illinois, where they had an update with their governor just a little bit earlier here today.
Illinois total, which brings our total confirmed cases to 115,833. Yesterday, many of you may have noticed that we passed a grim milestone, if you will, of over 5,000 lives lost. We are at a total of 5,186. I would be remiss if I didn't offer my condolences and my sympathies to the families of all those who have lost loved ones associated with this virus. We are all truly sorry for your loss. Fortunately, an additional 104 individuals were reported to have lost their lives in the last 24 hours. So among those that have passed associated with COVID, almost 44% were those in long-term care facilities. And as we've known from the beginning, nursing homes and other congregate settings have always been at increased risk for outbreaks. On March 14th, we reported the first COVID-19 case in a long-term care facility in Illinois. IDPH was on site immediately to provide guidance on infection control practices, to ensure proper donning and doffing of PPE, and to assist with mass testing. This plan was put into action with the full support of Governor Pritzker, and we can't thank him enough for his encouragement and always wanting us to be proactive in all of our responses. I remember going to that first facility in DuPage County to support the team that consisted of the nursing home staff, as well as local health department staff, IDPH staff, and our infectious disease consultants. Of course, it's helpful to be there to see firsthand what's happening, and it was a great example of collaboration. We do understand that the burden of disease in facilities is high in these high-risk congregate care settings, but we're ensuring that swift action is being taken, and we know that facilities must immediately notify public health officials of any confirmed COVID-19 case, whether it's a staff or a resident. And this notification should also confirm that that specific facility is notifying all staff members, all residents, residents' families, and their representatives by the end of that day. Our dedication to this population has never wavered. We continue to support long-term care facilities. We continue to promote the health and safety of everyone therein, the residents and the staff alike. As a state, we are definitely headed in the right direction. We have successfully met the metrics to advance into phase 3, but we must still proceed with caution. The risk of contracting the virus remains, so I implore that we continue to practice the use of face coverings, washing our hands, and be physically distant as much as possible, with a minimum of 6 feet. Let's continue to do the hard work that is necessary to get us to the other side of this pandemic. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. And I want to begin today by bringing your attention to the charts that are here to my left, reflecting how each of Illinois' 4 regions has fared in meeting our Restore Illinois metrics. All of this data is updated every day for you to track for yourself on our IDPH website, dph.illinois.gov/restore. But I wanted to bring the May trends to your attention in recognition of the end of phase 2 for all 4 regions of Restore Illinois. As you can see, each of the 4 regions has hit the 3 requirements for moving into the next phase: at or under a 20% positivity rate and increasing no more than 10 percentage points over a 14-day period, and no overall increase, so stability or a decrease, in hospital admissions for COVID-19-like illness for 28 days, and available surge capacity of at least 14% of ICU beds, medical and surgical beds, and ventilators. Starting tomorrow, all areas of the state are eligible to reopen in accordance with Restore Illinois Phase 3, which offers specific guidance on how things like outdoor dining, outdoor recreation, manufacturing, retail, personal care services, and offices can move forward with safety measures in place. All of that is available on the Department of Commerce and Economic Opportunity website, where you can find it at illinois.gov/business guidelines, illinois.gov/business guidelines. I want to let parents and kids know that we have provided guidance to day camps and youth sports to allow the return of those activities for children across the state. Summer activity is so important for overall health, and the doctors have given instructions for counselors and coaches so that summer programs can be restored with safety measures. Later today, we will also be posting recommendations for houses of worship, providing more guidance for houses of worship in Phase 3. Having received many plans and ideas from responsible faith leaders, IDPH has reviewed many detailed proposals and has provided guidance, not mandatory restrictions, for all faith leaders to use in their efforts to ensure the health and safety of their congregants. This includes suggestions on capacity limits, new cleaning protocols, indoor gatherings of 10 persons or less, a reduction of activities like sharing food, and the safe conduct of outdoor congregating. The safest options remain remote and drive-in services, but for those that want to conduct in-person activities, IDPH is offering best practices. Additionally, with Phase 3, horse racing will be returning to Illinois tracks, boosting the industry in a key season, especially for thoroughbred and harness racing. The Department of Agriculture has worked with the IDPH, with the Illinois Racing Board, and industry leaders to develop guidelines for racing, allowing those whose livelihoods depend on these races to get back to work, and allowing spectators to watch from home and place wagers online and over the phone. And while it's still at least a few weeks off, I want to affirm that the 3 metrics that have brought us from Phase 2 to Phase 3 will be the same as those that will move us into Phase 4. Just as this 28-day period of tracking started when we moved from Phase 1 to Phase 2 on May 1st, our next health metrics calendar will restart tomorrow and run for the same period, meaning that regions that meet the metrics could move into Phase 4 possibly as early as Friday, June 26th. That's the earliest possible date, and we will be watching the metrics closely in hopes that we will move forward expeditiously. But our goal is, and always has been, to keep people safe from this coronavirus while we restore more of our normal activities. So it's important that we remain careful about continuing to wear face coverings, washing hands, maintain 6 feet of distance, wiping down surfaces, using hand sanitizer, and other mitigations. Let's not move backward, but instead, let's move forward together. Because Restore Illinois is a plan that has 4 regions, Northeast, North Central, Central, and Southern, we will restart our tracking of the data for each region beginning Friday. As always, individual townships, counties, municipalities can choose to operate on a stricter schedule and with stricter metrics. With that, I'd like to talk today about long-term care facilities, which have been at the center of our COVID-19 response since day one, and which will continue to be a central focus of our work, especially as we safely reopen sectors of our economy. The overwhelming majority of long-term care facilities in Illinois are privately run. In response to the COVID-19 crisis, some of those facilities have acted proactively, some only reactively. CDC guidelines have provided those facilities with the roadmap for managing infection control through this crisis. But at the state level, we've gone beyond CDC guidelines to provide free testing of residents and staff by our IDPH nurses, consistent communication of best practices, and individual facility consultations with infection control experts. And we have delivered PPE to every nursing home in the state and to all counties with long-term care facilities. Of our roughly 1,100 long-term care facilities that care for elderly Illinoisans, over 900 have been connected with directly and in person by the IDPH Office of Healthcare Regulation, IDPH consultants and coordinators, IDPH's teams of nurses, or members of the Illinois National Guard. That includes visits to provide help with testing or staff PPE training or support for existing staff to administer tests or a whole host of other supports. Our IDPH consultants and coordinators interact regularly with the statewide network of 97 local health departments, which remain the front line of communication and support for private long-term care facilities in all elements of our COVID-19 response. Our state's response teams going into nursing homes have evolved over the course of this pandemic, so I want to bring you all up to date. We now have two groups of nurses fanning out to long-term care facilities around the state. One group of 200 IDPH nurses who are doing focused COVID-19 infectious disease control surveys to monitor compliance, and who can also conduct swab testing, train existing staff to take specimens themselves, and review and improve each facility's PPE use and hygiene practices. And a second group of 100 contract nurses, which we doubled at the end of April, who are also monitoring for infection prevention and control, but also providing additional testing assistance. We now have 10 teams averaging visits to 2 homes a day each, potentially as many as 140 a week across the board. Those teams are ensuring best practices to keep residents safe and helping test residents and staff for facilities that have requested assistance when they cannot manage it themselves. Some long-term care facilities opt out of the free assistance of IDPH's response teams, sometimes because they choose to take their own specimens using IDPH swabs, or because they choose to work with their county or city health department instead. Others work with their local hospitals and health centers to source and conduct tests. To date, we've sent about 45,000 testing kits out in 200 shipments, up from 18,000 swabs to 68 facilities back in late April. Still others have declined the free visits and even the free testing supplies from IDPH entirely. As I've explained, these are largely private entities, and even as we work to ramp up regular testing of all our long-term care residents and staff, my administration has received some pushback from owners and industry representatives, making it difficult to secure compliance across the board. As a reminder, from the beginning of this crisis, we've put our long-term care facilities, and especially our nursing homes, among the highest priorities of our COVID-19 response. In the earliest days of March, we implemented strict protocols at our state-run veterans homes and congregate care facilities and provided similar guidance to the hundreds of privately owned facilities statewide. And at our March 5th briefing of the General Assembly, we offered copies of those recommendations to all state legislators to get their help in instilling a sense of urgency in long-term care facilities in every corner of the state. Many facilities have been great partners, and they should be applauded. But long-term care residents are some of our most vulnerable Illinoisans. That's why strong compliance from many isn't good enough. To counteract any heel-dragging at any privately held nursing homes, the Illinois Department of Public Health is today filing a rulemaking requiring each facility to develop its own individualized testing plan and document an established relationship with a testing lab, whether it's a commercial lab, a local hospital lab, or our state labs. This new rule will require nursing homes to conduct testing when experiencing an outbreak, when an outbreak is suspected, periodic testing even when there is no sign of an outbreak, in line with new federal guidance issued this week, or when directed by IDPH or their local health department to do testing. The rule also mandates compliance with infection control recommendations at large. Test results should be used to identify asymptomatic cases, to confirm infection in symptomatic cases, to evaluate quality indicators, to follow up on infection control programs, and to support decision-making. To be clear, this rule doesn't deviate from our existing priorities, but it gives IDPH, a regulatory agency, additional teeth in securing buy-in from these private entities. Administrators who decline to provide a testing plan will be found in violation of the rule. The challenge of protecting elderly Illinoisans who live in congregate settings, many of whom have underlying conditions, is evident in the heartbreaking percentage of illness and death that have been seen nationally in LTC facilities. COVID-19 is unrelenting, and it has visited its worst effects on older Americans. But our state will continue to use every resource at our disposal and the collective medical experience from across the nation to protect our seniors throughout this crisis. And with that, I'm happy to take questions from members of the media. Tina?
Governor, what is the punishment there if these nursing homes do not abide by this rule?
A typical IDPH regulates nursing homes, so they have the ability to issue violations as they do with other regulatory matters.
And that would be like a licensing thing, or could it include a fine? Or?
It's typically a fine, yeah, but it can involve their licensing too.
Okay. Governor, you said, I think on Sunday, the legislature did not pass that measure that you wanted to punish businesses if they didn't follow the executive stay-at-home order.
Mm-hmm.
And I'm wondering, are you planning to file any other sort of rule? I know we're going into the reopening phase, but what will happen? Do you want any sort of other emergency rule in place should these businesses not abide by your plan?
Well, we're continuing to look at that, but I will say that, what we've been left with because of the inaction by the legislature is the removal of licenses, which is something we didn't want to have to pursue.
So as of right now, if they don't follow, they can have their licenses removed?
They could.
Okay. Regarding some other legislation that failed over the weekend, there was a FOIA bill along with a bunch of other things in this one bill. Your administration said you did not support that. So can you tell reporters in the state what it will look like for the FOIA process right now? Will we have delays for X amount of weeks, and what is the reason for that?
Well, I can't speak to all the other levels of government and how they will respond. I mean, we know what the FOIA laws say today. As I've said from the beginning, in the midst of the pandemic and in this emergency, it's taken us a little longer to be responsive, but we are responding to FOIAs as fast as we can. But again, given that some of the staff are at home, some have been ill or otherwise unable to respond, we're just asking a little bit of forbearance for small periods of time, but we are responding to FOIAs as requested.
And that's notifying people that there are delays at every instance?
That there will,
there will be delays, your department or your administration?
I think I've made that, I've made that clear, and I think we've notified people as much as we can and are required to, but it's our intention to fulfill the FOIA requests.
Okay. A question for Dr. Ezike. I know we've talked about nursing homes a lot over the past 2 months. Is there any sort of metric of nursing home residents that have died of unrelated to COVID, maybe from other illnesses that kind of were exacerbated by maybe lack of visitors or something like that?
Yeah. So again, when you're dealing with this population that obviously has the major risk factor of being elderly and has the additional risk factors of having multiple comorbidities, it's really hard. I don't think there are any individuals in that group that don't have 1, 2, 3, multiple of those high-risk factors. So I think all of those fatalities, as unfortunate as they are, would absolutely be COVID deaths. In terms of did someone die of a broken heart, I don't know how to assess that. So I don't really think there's a metric that I could give that could really get to that.
Yeah, I just mean, is that being counted as it's a separate subset of people who have died in nursing homes during this time of unrelated illnesses?
I don't think there are any that would satisfy that criteria where they had no other medical problem, that they were completely healthy, and that this infection was just a coincidence, and that there was not something related to the COVID. I think every one of these deaths had a direct tie to the COVID infection, and that spurred on. Again, they had other conditions, definitely, but this COVID absolutely had some kind of contributory role.
I have a question for the governor from Kelly Bauer from Black Club Chicago. A Chicago church has asked the Supreme Court to overrule your stay-at-home order. Do you have any concerns about this action or the fact that churches continue to hold services with millionaires like Willie Wilson paying their fines?
Well, multiple federal judges have reviewed and upheld the approach that we've taken with our executive orders with regard to houses of worship. So, these courts have recognized that there's a public health crisis that's ongoing and the need to take steps to protect public health, as we have, including as related to religious services. I think we all are aware of circumstances in which there have been infections that have been spread during religious services that were held with many people packed together. The Attorney General's office will be filing a response as is required in the case that you're referencing.
Okay. How will you protect and provide relief to workers who don't feel safe returning to work next week in Phase 3?
Well, the first thing we're doing is imploring and providing guidance to employers that the employees should look at too. All of that is available again on our DCEO website. And employees that find that employers are not following that guidance should report that their employers are not following it. And of course, that should be reported either to the Attorney General's Workplace Enforcement Office or the Department of Labor, both of which have the ability to enforce it.
But for employees who just might not feel safe going to an office yet next week, what do you advise those? I know you've said private businesses should use their discretion.
Private businesses need to use their discretion. In fact, especially when it comes to the most vulnerable, people who have pre-existing conditions, employees should make those, to the extent they are able to, make those known to their employers so that their forbearance can be given to them for that. But, obviously what we're looking for here is a common decency that should come from employers. And then, of course, we'll rely on enforcement wherever we need to.
This is from Greg Hines from Cranes. Some other states, including some with Democratic governors, are making deep budget cuts rather than counting on federal help. Why are you plotting a different course? Are you prepared to make more cuts in this budget if the only help you get is Federal Reserve loans that have to be repaid?
Yep. So, as I've said all along, this is not a time for governments, state governments particularly, to be cutting services, especially a government like ours where agencies have been hollowed out over a number of years. As you saw, I've attempted heartily to try to build back up some of those agencies, but I've known, and I think everybody else has known, it would be a multi-year process to do that because it took many years to slash and burn those agencies. So, look, I also recognize that if the federal government does not step up to the plate, that we're going to have massive cuts. Everybody understands that, and we will have to revisit this, right? But the legislature will meet for sure in November for a veto session, and perhaps sometime in between, and we'll be evaluating whether or not the federal government did do what I think everybody hopes and expects that they will do. Again, we're not in a unique position. What other states have done certainly is some states have put forward cuts that they might put into place if they're unable to get support from the federal government. What we've said is, look, we'll be working very hard to do that, but our sincere hope is that making cuts now would be so bad for working families and for people who've been out of work now as a result of COVID-19 that what we'd like to do is maintain state government as it is, again, still hollowed out to some degree, as it has been over the years, and then we'll manage through as the next month or so reveals whether the federal government will step up.
This question's from Jim Leach from WMAY Radio. The Restore Illinois website today says the central region is not meeting one specific metric for Phase 3 reopening, which is the hospital admission change. Is that one metric alone enough to delay moving to a new phase? Does the state have flexibility in determining how to use those metrics?
Actually, I saw the updated numbers from today's numbers. When those got added in, I think in the last hour, you'll find that as it happens, the central region is now meeting all those requirements. But even if it had been the number from yesterday, it's very, again, the idea here is stable. And, when you talk about 2%, that's stable.
This is from Dan Petrella from the Tribune. With the start of phase 3 coming tomorrow, how long will it take to gauge whether loosened restrictions lead to any increase in infections, hospitalizations, or deaths? How is IDPH prepared to respond if that occurs?
Once again, the whole purpose of each phase and the reason there's a 28-day period involved in each phase is to monitor when you make the changes. Yes, we all have to watch, and 1 day, 2 days, 7 days, even 14 days isn't enough. We see that in other states, it sometimes takes 3 weeks, even more, before you really start to see the effects of an opening up. So that's why we have a 28-day period for each phase and a monitoring period of 14 days or 7 days, depending on which metric you're looking at.
This is from Leisha.
Oh, I'm sorry. You asked, what would we do if? Yeah, and again, that's spelled out in the plan that it's possible that if we have a surge, a spike, and we need to quell that spike, we might potentially have to move backward in the phases. That's not something any of us wants to do, but certainly it wouldn't allow a region of the state to move forward if it wasn't meeting the metrics that we've set.
Could there be restrictions loosened in between that next phase, just as the restaurants and bars you offered up last week?
Look, that's not our intention, but it always is true that more information becomes known, and it allows us perhaps to make adjustments. And as we learned, for example, about outdoor dining, that if you maintained the social distance, and again, this is from experience, also the advice of epidemiologists, that, as we've learned more, I've always said that we can change the playbook as we go, but it's not our intention. I mean, we think that the science is pretty good that's dictated where we have gotten to and where we're going, and I would remind everybody that Illinois was just named as the only state in the United States that was meeting the guidelines that were set by the federal plan for reopening that was put together by Dr. Fauci and presented as the federal government's plan.
This is from Leisha Bushek from WILL in Champaign-Urbana. Will maximum SNAP benefits be provided to all recipients in June as they were in April and May?
I do not believe that there is a change in SNAP benefits going into June, but I will double check that. I believe that we're continuing on as we have.
Okay. This question.
I'll give you one more and then we'll go to Chris.
Sure. It's a little twofer, but it's a casual question from Rich Miller from Capitol Facts.
It's a casual question.
It's a little bit. Okay. Governor, do you plan on eating outside at a restaurant this weekend? Why or why not? And once again, are you going to be cutting your hair and going to a barber shop anytime soon?
Well, you can tell I need to have my hair cut, that's for sure. I don't have any plans to dine outside over the weekend, although I did my wife's birthday was this last week, and we have a little patio at our house, so we did dine outside, just our family together. Oh, I'm going to get my hair cut at some point. I don't have an appointment yet, and I understand that appointments are hard to come by at this point, so I'll get to it as fast as I can.
Governor, good to see you again, twice in 1 week.
Craig, you look like you might need a trim also.
I have a haircut appointment Saturday morning.
There you go. You got right on it.
So I guess first of all, just another quick aside question. Is Friday going to be the last of the daily press conferences, and are we moving to weekly next week?
I don't think we've made any decisions about that. I mean, our intention is to make sure that you are regularly updated. And as you've seen, I've been here every day. I think we made one adjustment, and that was to allow all of you and all of my staff to have weekend days off. But we're still providing the information that you're seeking over the weekend. And again, we'll always have press conferences when there's a need to make sure that we get information out. But right now, the plan is to continue as we are.
All right. You were asked a little bit about churches, but today 5 churches in Lake County filed a lawsuit against your administration. Stacey Baca, my colleague at ABC7, says the pastor at Zion Christian Assembly of God says that they run a food pantry up there, which gets state funding. 30 volunteers feeding 1,200 people a week, but they can't have more than 10 people on Sunday for phase 3. How do you respond to that discrepancy, which they says just frankly is not fair to them?
Well, as regards a food pantry, I was in East St. Louis yesterday at a food pantry, and like many nonprofit organizations, they've had to make adjustments in order to keep their patrons safe, to keep the people who use the food pantry safe. I know that lots of organizations have made those adjustments. Nothing is directed here at a religious organization that happens to have a food pantry. It's really the idea here for everybody, for everything, and food pantries specifically, is just to make sure that those who get served are served in a safe environment. So, we provide guidelines for different kinds of food service and organizations, and grocery stores and so on. So I think those would apply here too.
Sorry, I didn't ask the question well, I guess.
Oh, I'm sorry. Maybe
the pastor's saying they have 30 people in working the food pantry.
Mm-hmm.
If they can have 30 people to work a food pantry, your guidelines say they can only have 10 people in a service.
Yeah.
And the discrepancy there has frustrated the pastor and resulted in this loss.
Well, again, we have guidelines that are now available this afternoon will be this afternoon on the DCEO website, and those are our best recommendations. We're not providing restrictions. We're simply providing the best recommendations that we can for keeping people safe. So we hope that the pastor will follow that guidance and those recommendations for his services, his or her services.
But if there's not restrictions, then you're not going to be asking for any enforcement on churches who would violate the 10-person guideline?
As you know, I have never encouraged any police enforcement or any other kind of breaking up of gatherings. What I have said is that pastors should use their judgment and the science and data and should follow the recommendations that have been made. But I realize that some have ignored that.
A couple of questions on IDES. Republicans held a news conference today calling for an audit, the Auditor General to audit what went wrong. Your response to that?
Well, I think I've been very transparent about what the challenges have been. And indeed, if you look at virtually every state in the United States, you could look in the Midwest at Michigan and Missouri and Indiana and Wisconsin. I mean, all have had the same challenges. They're challenges of staffing, they're challenges of the systems that were put in place. Nobody expected to have 10 or 20 times the number of filings that have been made, as have been made over the last 2 months. And again, we've been trying to build that ship and float that boat at the same time. And we're doing the best we can. And 1.2 million applications have been filed, and those filings have gone through. So there are people who remain. There are some people that need arbitrations. There's some people who have challenges because they put something wrong into the system they need to take out of the system, and you can't make easy alterations once you've applied. You may have changed your name for some reason from the last time that you were receiving unemployment to this time. And so those are some specific circumstances that people have to talk to somebody about or use the chat bot that exists online.
Do you support an audit, though? I mean, is that a political move by the Republicans?
Of course, that's the right of anybody, but I will just say that we've been very transparent about what the challenges are. If their goal is to figure out what didn't work right, I have stood here I don't know how many times over the last 2+ months and told people what hasn't worked right and how we've been trying to address it. And again, we've brought in some of the biggest, most robust companies in America to help us rebuild those systems so that we could, on the fly, make sure that we're meeting the needs of people across Illinois. But there's no doubt about it, like many other states, some people have, it has taken longer to file and get claims delivered upon than any of us would like.
Moving on, Tara Molina with CBS asks, how do you respond to the claims IDS workers made in their report last night, despite what IDS spokespeople say that they maintain they're just pushing applications through with obvious errors to make up for understaffing?
They can't push through applications with obvious errors. There literally are federal regulations that would prohibit that from happening.
John O'Connor with AP says, Governor, I know the budget relies on CARES funding to balance but has the state received any CARES funding to date, and if so, how much, and has any of it been spent, and if so, for what purposes?
I would disagree with the sense of precarious funding. The MLF is not a precarious mode of funding. It's something that was provided by the Fed because states are having these significant challenges. We're just one of them. I'm sorry, the other part of the question that had two clauses to it, yeah.
Has there been any CARES money received?
Yeah, so yes, as you know, in the prior CARES Act, there was COVID relief dollars. There were COVID relief dollars that can only be used for expenditures related to COVID-19. So it doesn't cover lost revenues related to COVID-19, only to expenditures. So for example, PPE, contact tracing, testing, those are the areas that you can use the funding for, but you can't use it for, to replace the lost sales taxes as a result of the economic impact of this crisis.
A couple of questions about schools reopening in the fall. Elizabeth Matthews and Greg Bishop both asking. Matthews saying, Dr. Fauci said he's unsure if schools will be in session this fall. You've said you hope that they will reopen. What might that look like? What do you tell juniors who are going to enter the senior year? And Greg Bishop wanted to know, how do you ensure parents that their kids are going to get a quality education?
Yeah. Well, I have a junior in my own home, and so this is a relevant question to those of us who have a junior. Look, it's unfortunate that we can't see that far into the future with this virus. What we are trying to do is to set the foundation for any outcome. But again, my hope and desire is for us to have all of our kids back in school in the fall, and I know some schools have already chosen across the nation. Some states have chosen to do that. Some are in the position that we are still considering, whether it is safe for our kids. But the most important thing is the kids and the people who work there, the teachers and the administrators and the paraprofessionals, we have to keep all of them safe. And so to make sure that we have the right conditions for that is what we're looking to do.
Benjamin Zamora with Telemundo said a new study by the University of Chicago Poverty Lab found that uninsured and undocumented residents are most likely to be in need of COVID-19 testing, and that there's still a lag in testing in areas where they live. What is the state doing to improve testing ability for them, and your message to the undocumented people still fearful to be tested?
Well, I can't speak to all undocumented communities. I mean, I absolutely agree that we need to make sure that testing is available to everybody. First, I would say all testing that we are involved with, and I think we have over 260 sites across the state, all that testing is free. So anybody who needs a test that meets the criteria can go get a test, and those criteria have expanded vastly. To be clear, an undocumented resident of our state has the ability to get a test. There's no citizenship requirement, and you're not required to fill out a form that reveals your citizenship. There may be some federally qualified health centers that have a form with that question on it. You are not required to fill that out in order to get a test. So that's one thing. And then providing the health care that's needed by undocumented residents is also something that we are doing in the state, making sure that people have the ability to get cared for if they get COVID-19.
Believe it or not, I just have two more. Dave McKenzie with WBZ says there's a huge gap in information about the types of workers getting sick with COVID-19 throughout Illinois as public affairs try to contain the spread of the virus. How is this impacting the state's ability to track and prevent more of the outbreaks? And does the state plan to do anything about this? Also, why is more information not made public? I don't know if that's for you or Dr. Z.
Is this a question about, about the careers of the people who are?
That's what it sounds like, the types of workers getting sick.
Types of workers. Yeah. And we have a very good idea because we know that some outbreaks are taking place in certain work settings, for example, and you all have heard about, for example, pork processing or other meat processing plants is one example. But I'd like to ask Dr. Ezike to come and answer the question about the record keeping around it.
Sure. So IDPH is a master collector of information. We have millions of pieces of data that come into us every day from all different sources. In terms of the actual data regarding people who are being tested and people, obviously some of those tested will then be positive. Again, whatever is put into our databases is what we have. And so I think it is imperative that everyone hears that those forms, whether there's a form that an individual has to fill out, whether it's a healthcare professional that's assisting with papers being filled out, whether it's in a doctor's office, where it's in the drive-through sites, like everything that's put in there, like that's what we have. So if people just say, I'm just going to write my name and I'm going to leave off the date of birth or I'm going to leave off the address, then when we're trying to figure out who this positive case belongs to, we put it in this bucket that has no address until we're able to chase down that information. And we don't know if this is belongs to one of the which of the restore regions it belongs to, or which county had this positive. So again, all of that information is essential. The more information we have, the more information that's given to us, the more that we have to be able to put out in terms of identifying types of occupation, location. We do know from some of our outbreak investigations that you have a specific location when you've gone through the contact tracing and the interviewing, where you've tried to go back and think of all the places, work with the person to identify all the places that they've been, and then you would say maybe, oh, I went to the grocery store on this day, I went to a place of worship on this day, I went to this health club, this place to get hair, nails, massage. So when we get all that information, and then if you get a cluster of people that in that same time frame all identified like a specific locale, that's how we then can put things together like an investigator to say, wow, there were around the same time we have all these people that frequented this one location, and then you try to hone in, then you try to go to that location, find other people who may have been there at the same time. So again, once we get the critical information that allows us to do further investigation, to have more, and then we have more data fields populated in our database, and then we can put out summaries of more intense information. So again, the data that we get is what we can give out, and so we want to implore everybody to be very comprehensive in all the forms they're filling, and that involves individuals, that involves local health departments, that involves hospital personnel, lab personnel, everyone to work together so we can have as much data so we can answer all these questions.
The most important data, though, that we nearly always get is, of course, how to contact the person with their test results. I just wanted to make sure that sometimes there's missing data on a form, but always there's some way to contact the person to make sure that they know, because that's the most important person involved here, is the person who's being tested.
Craig, this is your last one.
Charlie Myerson at Chicago Public Square. I don't know who wants to answer this one. As large office buildings prepare to reopen after weeks standing by, mostly idle, researchers are sounding a warning about the potential for bacteria that causes Legionnaire's disease being in the pipeline. So what guidance do you have for building managers and for people returning to work in those buildings?
Well, there are lots of buildings, as you know, that are in areas that have had Legionnaires or Legionella detected in their pipes. There's one obviously terrible circumstance in Illinois of the Quincy Veterans Home where there are staff at that home too, so workplace where there's Legionella. But in terms of dealing with Legionella, I mean, this is a problem that the state has dealt with for many years. It's not like we need new guidance about how to deal with Legionnaires or Legionella. So it's not really a new endeavor.
Okay, we'll go to questions from online. Hannah at the Daily Line, two very important metrics to get the state to phase 4 are even more widespread testing available to everyone, regardless of symptoms, and contact tracing on more than 90% of cases. To that end, she has two questions. What's the next big testing metric? How will the state get there with federal support of the National Guard sites going away? Does the state have a large order of testing supplies or test machines coming in?
There are many testing machines that exist in the state, and of course, as I've talked about before, contracting with the existing owners of those. They may be hospitals, they may be doctors or others, or commercial labs, is part of our effort to scale up, obtaining swabs. You've heard me say this over and over. How will we scale up? These are all the same things that we've been doing, but more and more and more. In terms of what our goals are, we need to do many more than we are. I mean, I would point out that we're currently, as I've said many times, we're among the large states, second highest in terms of per capita testing. We're the third highest in overall testing among the big states, and so we're going to, and again, the goal is to get to a much higher number, and you've seen us do that. I mean, back when at the near early on when I talked about us needing to get to 10,000. It took us a few weeks before we were able to get from where we were to that 10,000 number, but we moved pretty quickly from 10,000 to 20,000. We're averaging now about 23,000 a day, but you've seen us hit 27 and 29,000. So, we're going to keep ratcheting that up, and the goal here is to make sure that everybody, whether it's at nursing homes, at our priority locations, gets tested on a regular basis, but also as we are reopening many businesses across the state, that the businesses where there are more at-risk individuals, that they also have the testing available to them.
And then for Dr. Ezike, how many people have been hired for contact tracing? How long will it take for them to be trained? Will the state have enough people by the end of June to move into phase 4?
Right. So just a clarification, when we think about the metrics to move into phase 4, they are the same metrics that we needed to graduate, if you will, into phase 3. So the information regarding the metrics around contact tracing, those are, I guess, internal goals that we all know that we need to. The more contact tracing, the more aggressively we can identify cases and identify potential cases and have people stand down before they have the chance to infect others. So that's not what's going to hold other people back. We're working aggressively to get that online and to get people hired and to get the curriculum. We have some pilot local health departments that we're starting with first, and then we're going to expand. So we will not have the contact tracers in every part of the state next week, but we will branch out and keep growing until we get the full capacity that we need. But again, that is not going to hold the state back, but we know that that is an important part of the master plan in order to keep our state safe, to be able to quickly, rapidly identify people who are positive and be able to identify their contacts so that they can stand down before they potentially infect someone else.
Sarah, at the Chicago Daily Law Bulletin, an emergency rule filed May 22nd suspends the 30-day time frame for an IDPH inspection that arises from a nursing home complaint, except for allegations of abuse and neglect. Why was this rule needed? Does it apply to inspections by local health officials?
So at the state level, I think the feds understood that in the midst of this pandemic that we were going to be focusing on COVID response and trying to address the nursing homes as they are clearly the highest risk setting for the entire state, for the whole country, for the whole world. And so they wanted us to focus on the COVID response, but of course made that exception for things that would be considered an immediate jeopardy. So for things, essentially IJ means some offense that's so egregious that you could immediately have to suspend a license. But so other things have been put on the back burner as we progress, that might be loosened, but again, we're following the federal guidelines.
Jim Haggerty at Rock River Times. Governor, we've heard from people who say they're not going to return to restaurant or bar jobs but stay on unemployment until something else comes along. Will those who make that decision run the risk of losing their unemployment benefits?
Well, that's a decision the federal government would make. I mean, there are regulations around that. It's able and available, I think, is the standard here. And so that's not really a decision that we'll make at the local level.
Shia Politico, churches, gyms, theaters, they all seem to think they can operate in a way that's safe. To what extent are you rethinking when to let them open to more people and customers instead of just 10 people in this upcoming phase?
Theaters and gyms, you're throwing those together. Well, those are a bit different. Gyms tend to be smaller, although I know there are some that are quite large. But and we have provided guidance for certain activities at gyms and fitness centers. But theaters, I think there's a common belief that the experts seem to tell us anyway that it would be difficult for us to open theaters in the near future in phase 3.
Cole from WCIA, how are malls meant to move forward during phase 3, and will businesses and malls operate differently than other businesses?
Mm-hmm. Now, Dr. Ezeka, do you want to address that? Malls, indoor malls, I assume we're talking about.
So
outdoor malls would be different.
Yeah, so most of the guidance were thinking of businesses as solitary individual businesses, and so the rules that applied in terms of capacity, how many people could be in the store, how many people per 1,000 square feet, so those I think would continue to apply for individual stores, and then if they happen to be within the context of a mall, I don't think the rules change. So I think it's still the rules that are prescribed, or the guidance, I should say, the guidance that is prescribed for individual businesses, whether it's a personal care facility, the same rules would apply in terms of what services can be done. There are, I think some of the things that might be hard to implement would be some of the recommendations surrounding like extending the hours so that you have lower population density, if you will, in any one establishment at the time. Your ability maybe to flex the hours might be limited by the hours of the mall in general. But otherwise, I think the individual facilities and businesses follow the same rules that are prescribed on DCEO website and our website.
This will be our last question. It's from Brian at the Southern Illinoisan. Governor, there has been a growing COVID-19 outbreak at the Pulaski County Jail, which also serves as an immigration detention center in rural Southern Illinois. Recent reports from ICE state now 29 detainees have tested positive for the virus. This is in a county with multiple challenges in regards to access to health care. In response, there have been calls from advocates and public health professionals for IDPH to inspect detention centers and ensure the health of those who are held by ICE. How do you respond?
I know that we are prohibited. Maybe I could turn over to Dr. Ezeka. I know we're prohibited from inspecting a federal facility, but I'm not sure how it would apply here to a county jail.
Yeah, so we have, again, that is a federally run facility, but in Pulaski County, the local health department has been involved with that. We have offered consultation. We have reviewed the methods that have been employed surrounding that outbreak. We actually did see that they have taken the appropriate measures to mitigate the outbreak. So we are partnering with our local health department. Obviously anything that happens within our state affects all the residents of the state in terms of the employees that work there and go home are returning to their communities. And so we have been partnering again with the local health departments. We feel that a lot of the measures and steps and the mitigation strategies that have been employed have been appropriate, and so we continue to follow in that outbreak.
Okay, thank you, everyone.
Thank you.
All right, guys, thanks so much for being here with us again on News Now. We do appreciate each and every single one of you who tune in with us each and every single day. Latest numbers coming in from the Johns Hopkins University site does show that we do have more than 101,000 deaths here in the United States. And unfortunately, we do still have a huge number of cases here in the U.S. We have more than 1.7 million Americans. We're sitting at a current total of 1.715. So that number is up on your screen. As you can see also, we do have many other countries whose numbers have continued to increase here in the last few days. Brazil has now topped that 410,000. Also, Russia is getting near that 380,000. UK over 270,000 now. We're going to continue along. Going to actually go to a new. Going to head on over to a new interview. It just came in from our Q13 Fox News station out of the Seattle area. They're talking with someone about how the county is the county with the highest unemployment rate in the state. So they're talking with the chair of Snohomish County, and they are currently sitting at 20.2%. Now, this is in the month of April due to COVID-19 outbreaks. So let's listen into that interview again right here on News Now.
It's hard to see these unemployment figures. I wouldn't say that it's necessarily a surprise how bad they were for the month of April, but knowing that Snohomish County has the worst unemployment rate in the state right now, how does that sit with you?
Well, I think it's unfortunate. It puts us in a really difficult situation. You know, the numbers that came out yesterday showed that we're currently at 20.2% unemployment rate, which is over 90,000 Snohomish County residents. It's almost twice as much as in the 08-09 recession. So I think it's really difficult, and it just goes to demonstrate the really negative impacts that the COVID-19 shutdown has had on our local economy here in Snohomish County.
Did you expect it to be that bad?
No, I don't know that I did. I mean, you know, initially we saw kind of the buildup, but I think the 20% number is really significant. So I don't know that any of us expected that. And, you know, the fact that, you know, we're still in the shutdown in Snohomish County, I think signifies that this may continue to grow.
What should we make of the fact that Snohomish County, out of every county in the state, has the highest rate? Is there anything that we know to attribute that to?
It's a good question. I've been thinking about that since the number came out. You know, what distinguishes us from, you know, our neighboring counties, say King County. I mean, we do have Boeing in Snohomish County. So that could be a factor. You know, they're a very large employer, and we've seen some of the things happening there. But I don't know what the reason in particular is that ours is so much higher.
So when it comes to, you know, what do we do about it? And I think that's, you know, the big question. You want to try to make the situation better. How much can you do absent, you know, being able to change the current mandates that are keeping people out of work? I mean, what can you do locally?
It's a really good question. And, you know, like you said, a lot of this depends on the state level and the decisions that are made, you know, coming out of the governor's office regarding the shutdown. Here locally in Snohomish County, we are trying to do everything that we can to support our local businesses and support our workforce. So a couple of actions that we've taken just recently. The first is that the county council appropriated $73 million in federal CARES Act funds. And a large portion of those funds went toward small businesses and workforce development. We've had over 1,000 grant applications. I think there were over 800 in the first 24 hours for that small business grant program. And the second is the county executive and I have stood up an economic and workforce recovery task force where we're working with hundreds of local businesses and other sectors on the ground to get ideas and learn what the particular hardships are that they're facing and see what we can do, if anything, at the local level to help address those, or if there are state issues, what we can do to advocate on behalf of these businesses and others to the governor's office.
I don't know if you've heard it, Nate, but I continue to get emails, some from people who live in your county who have been unemployed this entire time and are still struggling to get access to the unemployment benefits they're entitled to. I mean, do you know what's going on there? We're giving Nigerian scammers benefits, and so I'm trying to figure out why folks who live in our state who are entitled to them are having such a difficult time.
Yeah, and I've been receiving a lot of similar emails and phone calls. I think it's incredibly frustrating for people who are unemployed and are being told that these these options are available. I mean, I've talked to people who have spent hours on the phone, given tens and hundreds of phone calls to ESD and just haven't been able to get through. And so I think it's incredibly frustrating. And as you've mentioned, there's been quite a few issues going on with that at the state level, and I think that needs to be rectified. And we need to make sure that we're providing the services that we need to those who are unemployed as a result of this.
As you'd mentioned, Snohomish County, we have no expectation for King, Pierce, Snohomish to get out from underneath phase 1 of the mandate by June 1st. It's just not a reality based on the governor's criteria and where the numbers are at. So I think, as we see the May numbers, there are going to be some counties that improve because you have counties that have slowly started to transition into phase 2. But if we don't see that at all in Snohomish County for the month of May, I mean, I guess how much worse could the numbers get than 20%, really?
Yeah, exactly. I think the unemployment numbers are so high. We really want to do what we can to ensure that those, don't continue to rise and obviously go back down. And, I think the criteria that have been set up for particularly larger counties to go into phase 2 are so incredibly difficult. I mean, if you look at Snohomish County's numbers, we peaked at, I think, around 137 cases per day. That was in late March, early April. And the last number I've seen is that we're at around 29 cases per day. So that's, a little over a 450% decline. I think we've shown that we're heading in the right direction. And I think that's the frustration for a lot of people is that, we are on a downward decline. I don't know that we ever get to, under 8 cases a day per 100,000. I think I could have gray hair by the time we get to that point. And so I think it is worth considering reevaluating those criteria for particularly some of the larger counties.
Yeah, and it's a hard conversation to have, and I know it's not a politically correct conversation to have, and people will spin it all sorts of ways, but given where your case numbers at, and you were talking about just cases, not fatalities, which have also dropped off significantly. When you try to square that with, as you said, 90,000 people in your county being out of work, some people struggling quite a bit. I mean, as the governor, if you were in his seat, how do you balance those things and try to figure out if okay, the health impacts we're seeing, is this, can we equate that to 20% unemployment?
Yeah, it's a really good question. And I appreciate, and I think everybody appreciates the very difficult position that the governor's in. It's certainly not fun to be the one responsible for making those sorts of decisions. What I would say is I truly do believe that there's a way to prioritize both public health concerns, make sure we're prioritizing people's lives, particularly those who are most vulnerable, the elderly and those with underlying conditions, but also prioritizing our local economy and, the thousands of families whose livelihoods are being devastated by this. I think we can, I've talked to several business owners who have already been set up with, plexiglass in their businesses. They have PPE. They figured out ways that they can physically distance. And I think the big frustration is that we've seen that happening with large retailers, but these smaller and medium-sized businesses have not been allowed to open in the same way with the same health and safety precautions. So I think it's really important that we maintain those health and safety precautions and follow those guidelines. The businesses that I've talked to have been more than willing to do that. They just want to be trusted and given the opportunity to open safely. And I think we need to do that.
So at this point, just to be blunt and to be clear that no one's saying, let people die and we don't care about health and safety, because I think you just made it clear with that answer that you do, but to be very blunt, do you believe that the current case count justifies continued closure of the economy?
I don't know. Again, I think if you go back and look just at Snohomish County's numbers, a 450% decline to where we were in late March, I think we are on the right trend. And where they started out with the shutdown, I think the initial goalpost was, preserving medical capacity and ensuring that our hospitals aren't overrun, which is important. And then I think the goalpost shifted a little bit to flattening the curve. Now we've more than flattened the curve. We're on the downward trend, even in Snohomish County and some of the larger counties. And I think, I and others are really at a loss for what the newest goalpost is. Are we going to stay in a shutdown until there's 0 cases and we've got a vaccine? That could take months, even years. And so I just think we need to be considering the economic concerns in addition to those very important public health concerns and finding a good balance.
As a local leader, is there a frustration there that you don't really have a lot of say in the destiny of your county when it comes to the economy in this situation? Because really the ball's in the governor's court.
Yeah, it is frustrating. And we have been communicating with the governor. I've signed on with several other local leaders in Snohomish County on, I think, 3 letters to the governor's office on issues ranging from, residential construction back when that was a major issue to a letter on behalf of our small businesses asking to reopen safely, kind of like I've mentioned with PPE and physical distancing. And so I think between our communications with the governor's office and some of the programs I've mentioned through allocating Federal CARES Act funding and the Economic and Workforce Recovery Task Force, we're trying to do everything we can locally, but it is very frustrating that we don't have that decision-making ability.
When we talk about, and you had mentioned that the unemployment numbers you're seeing are twice what they were during the economic downturn in 2008, 2009, that took a while to recover from, if memory serves me correctly. And so when we look ahead to recovery from this in your county, do you think that given the circumstances, it will be just as easy as opening it back up, or even once things are open, do you see this being an extended recovery process?
It's a really good question. I do see it as a very much extended recovery. You know, a lot of these businesses I talk to, and we've got more businesses that are closing down permanently every day. Those are businesses we won't get back, right? And so all the people who work for those businesses, the families that those businesses take care of, you know, potentially won't come back at all, and they'll have to find new work. And so I don't think it'll just be a matter of, you know, once Snohomish County is allowed to reopen or move into phase 2, you know, we'll snap out of it. I think it'll be a very long and gradual process.
What's your message, Nate, to the people in your county who are struggling right now financially?
I think the message is, you know, do everything we can to communicate the needs and concerns and struggles that we're facing, particularly to the state. I'm happy to do that. People can always get in contact with me through my office, and my contact information is at the Snohomish County website. And I'm happy to advocate on behalf of our residents and business owners. But I think we really need to communicate what the struggles are. And like you mentioned, Brandy, you know, the top priority is ensuring the health and well-being of our citizens, you know, especially those who are most vulnerable to this virus. But we also have to be sure that we're watching the economic health of our particularly of Snohomish County here locally and of our state. And so I think we do need to find a true balance.
And finally, we're expecting to hear from the governor at 2:30 this afternoon. We don't really have a good indication as to what he's going to be talking about, but he's yet to address these latest numbers for unemployment. And he also hasn't addressed publicly yet the unemployment fraud that we saw and how the state's going to deal with that. Is there anything in particular that you'd like to hear from the governor today at 2:30?
Well, I would like to hear maybe a little bit more information on how these larger counties like Snohomish, King, and Pierce, maybe if there's an ability to set some different criteria for those counties, because as I mentioned, the current criteria just really isn't reachable, I don't think, for our counties, at least in the near future here. And, you know, when we're talking with businesses who have been months now in a shutdown, every week that we ask them to go longer is a high potential for them to go out of business permanently. And so I think it'd be great to hear a different set of criteria that could allow us to move into phase 2 or toward a safe reopening in a more timely manner.
Okay, anything I'm missing that you wanted to make sure to add?
I think you covered it really well. I mean, I think in summary, you know, I want to make sure that we're prioritizing public health. I also think that there are safe ways that our small and medium-sized businesses can reopen using PPE, physical distancing, and other methods that our larger retailers have been doing this entire time. And I think that's the message that we should be sending.
I just remembered I should ask you about this. Any thought on the Boeing layoffs that we're seeing reports of this morning?
Well, it's always disappointing. Boeing's the largest employer in Snohomish County. I think that they've been going through a really tough time with this, and appreciate you know, the difficult decisions that are having to be made. But it is really difficult on our local economy here in Snohomish County, just because we are so dependent on that, and so many of our residents work for Boeing. So we'll do everything we can to work with them and make sure we're supporting them however we can.
Continue our fight against this dangerous virus and allow for enhanced emergency response efforts. I have twice used my authority to renew the state of emergency. And today, after consultation with Lieutenant Governor Duncan and Speaker Ralston, I've decided to renew the state of emergency for a third time through 11:59 p.m. on July 12th, 2020. This declaration, as you know, plays a critical, important role in our battle against coronavirus. It allows for enhanced partnerships between the private and public sectors for our healthcare infrastructure, procurement of supplies, and coordination across all levels of government. As we continue to take measured steps forward, the public health state of emergency provides flexibility for a cohesive response across government and within our communities across the state. Over the past few months, we have seen frontline workers, law enforcement, teachers, business owners, elected officials, community leaders, and hardworking Georgians from every corner of our state join together in this fight. Now, with enhanced testing capacity and encouraging data, we are seeing a slow, careful transition to a new normal. Already, several state agencies have begun to phase into limited in-person operations, and the legislature, as you know, is making plans to return to the state capitol to resume the legislative session. Across the Peach State, businesses are reopening their doors with robust safety precautions in place, and customers are slowly but surely returning. This progress is encouraging as we fight to stop the spread and revive our economy. But the status quo is never acceptable. We cannot rest on our laurels. From day one of this Georgia journey, we have used data, science, and the advice of healthcare professionals like Dr. Toomey to chart our path forward. Our next step, like the ones before, puts the health and well-being of the citizenry first. Today, I signed a new executive order to extend specific safety precautions, outline guidance for overnight summer camps and summer school, and outline important rules for reopening shuttered businesses. The shelter-in-place order for Georgians who are 65 and older or medically fragile will continue through June the 12th, 2020, with exceptions for necessary activities including work, medical appointments, grocery shopping, home health services, and related categories. I want to thank all of those who have followed this advice and for those who have helped the vulnerable loved ones navigate these difficult times that they have in their lives. In this executive order, we strongly encourage all Georgians and visitors to wear face coverings in public to help mitigate viral spread. And restrictions remain intact for nearly every Georgia business to keep employees and their customers safe. For several weeks now, gatherings of more than 10 people in a single location have been banned in Georgia unless there is 6 feet between each person. Given favorable data and relying on Dr. Toomey's advice, we feel comfortable incrementally increasing that number to 25. That means starting June the 1st, 2020, you can have gatherings of more than 25 people in a single location if you have at least 6 feet between each person. Small weddings, recreational sports, and similar events will be able to resume with a little more flexibility, but we are continuing to ask everyone to remain vigilant. Please continue to follow the public health advice as you engage in these activities. Wash your hands, keep your distance, wear a mask if possible, and let's continue to protect the medically fragile and the elderly. At this time, live performance venues will remain closed. I know that these closures are tough on business owners and their employees, but we will continue to watch the data to ensure the health and safety of our citizens. I will tell you that we are working closely with those business owners, associations, and stakeholders as we prepare for the future. Starting May the 31st, 2020, overnight summer camps are permitted in Georgia if they meet 33 specific criteria for reopening in addition to the requirements for operating a non-critical infrastructure business. Starting June 1st, 2020, bars and nightclubs can decide to reopen if they comply with strict sanitation and social distancing rules, all crafted to reflect industry practices and mitigate health risk. To open their doors, bars and nightclubs must meet 39 mandatory measures to ensure patron well-being. And just to name a few of these, they include screening workers for illness, limiting the number of people in the building to 25 people or 35% of total occupancy, requiring the facility to be thoroughly and regularly sanitized, only serving drinks to seated patrons or those in designated areas, limiting party size to 6 people, and preventing patrons from congregating. To provide clarity for banquet facilities, private event facilities, and private reception venues, we are adding them to the same category as restaurants and dine-in services so that they have clear directives for operating. This change will help as these facilities reschedule important events for families, especially weddings, in the coming weeks. My executive order specifically addresses the return of amateur as well as professional sports. Starting June 1st, professional sports teams and organizations which engage in practices or other in-person operations must operate by the rules or guidelines of their respective sports league. In addition, all amateur sports that continue in-person operation must follow the guidelines for non-critical infrastructure organizations. Many school districts have reached out for guidance on holding summer school. I want to specifically thank Superintendent Woods and his team for helping us develop appropriate safeguards for educational leaders as they plan for their students' return. Starting next month, schools and districts can hold summer school for students if they comply with 11 mandatory criteria. That includes screening workers and students for illness to prevent viral spread, enhancing campus sanitation, encouraging regular hand washing and hygiene, and keeping students separated to minimize exposure. We know firsthand how important it is for some students to be able to return to campus for in-person instruction, and these measures will accomplish that goal without compromising safety. Operators of amusement park rides, traveling carnivals, water parks, circuses, and other temporary amusement rides shall not begin operation until June the 12th, 2020. To open at that time, they must comply with 33 mandatory requirements, in addition to all the requirements for non-critical infrastructure businesses. We want to thank and say that we are grateful for the guidance that we have received from the stakeholders to develop these rules and prepare for future reopenings. As we have said for many weeks now, one of the most critical battlegrounds in our fight against this virus remains in our long-term care facilities, specifically nursing homes. Over the last several weeks, the Georgia National Guard has worked closely with public health officials and the Department of Community Health to test nursing home residents and staff. Right now, 48% of all COVID-19 deaths in Georgia are connected to long-term care facilities. The earlier we test, the earlier we can intervene and try to prevent severe outcomes. As of yesterday afternoon, we've tested 66% of nursing home residents and 36% of all staff. That is in addition to the nearly 2,000 infection control missions conducted with more than 900 facilities receiving 2 or more mission visits. This is a top priority for us as we continue to work around the clock to protect our most vulnerable, and we will continue to do everything in our power to keep these Georgians safe. Since we began the rapid increase of our testing capacity in mid-April, we continue to remind the public and those in the media, the more that we test, the more cases that we will see. That is especially true with our efforts to test high-risk populations like we've been doing in our nursing homes. The multiple public-private partnerships around testing that were created in a matter of weeks to fight this pandemic have exponentially increased our testing capacity, but the nature of COVID-19 testing and reporting can sometimes lead to delays in mass reporting of results. Dr. Toomey and her team at Public Health continue to work with our private sector partners to streamline these new processes and ensure our testing data is timely as well as accurate. Starting next week, Public Health will move to a daily 3 p.m. update on the COVID-19 website. This change will give them more time to coordinate with healthcare facilities and providers to verify information and check its accuracy before publication. We remain encouraged by the numbers that we are seeing in testing, hospitalizations, and a wide variety of other data points across the state. We are also encouraged by the new treatment being rolled out for patients in Georgia in partnership with the Trump administration. This week, the Department of Public Health would distribute over 18,000 vials of remdesivir to 85 hospitals across Georgia. This shipment will enable these facilities to treat roughly 1,670 patients. I greatly appreciate the President and the Vice President and the rest of the administration for their continued support with critical supplies like remdesivir as we continue to fight the invisible enemy together. Speaking of the Trump administration, we had a call this week with the Vice President and the nation's governors to discuss how states are moving to safely reopen their economies and get Americans working again. We also had a very productive call with Admiral Polufchek and GEMA Director Bryson to ensure Georgia continues to receive the critical supplies as we take measured steps forward in our reopening process. And just this afternoon, we received some fantastic news from the President. He will be extending full federal funding of the National Guard activities through mid-August. That authorization was set to expire next month. And as you know, the 3,000 men and women currently deployed in the Georgia National Guard have been absolutely vital to our fight against COVID-19. They have helped deliver millions of pounds of food to students and Georgians in need. And they've been the backbone of our testing program, as well as doing life-saving work in our nursing homes and long-term care facilities. And I want to thank the President for this. There was many governors across the country that were asking for this extension, and he has listened to them, and we are grateful. This is a huge help to our state's ongoing war against this invisible enemy. As I've said many times before, the level of access and responsiveness from the President, the Vice President, and the Trump administration, in my opinion, is unprecedented. And that has been a huge benefit to our state as we combat this virus. Before I turn it over for questions, I did want to mention a couple of other important items. First, we continue to lag behind, as I mentioned the other day, in our 2020 census count. The form only takes a few minutes to fill out. So I want to continue to encourage all Georgians to take the time and get it completed. This initiative literally shapes the future of our state. So we need as many Georgians taking part as possible, and we continue to have a long way to go to meet our goals. All you have to do is visit my2020census.gov, call the 1-844-330-2020 number, or mail back the paper form that you received in the mail. Also, many people have asked for guidance on attending in-person services at places of worship, especially in light of the President's call to action for governors to reopen churches and religious facilities. As you know, here in Georgia, we never close places of worship, but we encourage congregations to hold online or drive-in services to mitigate the risk of exposure. Now, many churches and religious institutions are beginning to reopen their doors for traditional services. And we ask that Georgians continue to heed the public health advice if they decide to attend in person. Please use social distancing, wash your hands, protect the elderly and the medically fragile, and continue to prioritize your health. I want to thank again all the faith leaders who time and time again have answered the call and held remote services as we battled the spread of the coronavirus. I know that was a tough decision, but your leadership has literally saved lives in our state. Finally, we are urging all Georgians not to hold off on important medical appointments. I cannot stress this enough, and I've said it all week long. Do not risk a bad health outcome by postponing a necessary checkup, screening, or procedure. Healthcare systems are literally having to furlough workers in the middle of a pandemic, which is really hard to imagine, but it's because of this decreased demand for traditional services. Please get these appointments on your calendar and help us get our healthcare providers back to work. Now we'll be glad to take questions, and again, I have Director Bryson, Dr. Toomey, and General Cardin here if you guys have something for him.
Governor. You're announcing you're easing these coronavirus restrictions at the same time that some data showed that the number of coronavirus cases continues to rise. How do you reconcile easing the restrictions at the same time where there are more cases being reported?
Well, as I mentioned earlier, I guess it was a couple of days ago or 2 days ago when I was in Macon, and mentioned again this morning to a bunch of our friends in the media, we had a large dump of test results from a private sector vendor over the weekend. They had a big backlog, around 15,000 cases that tracked back to April. You know, the bad news was they had a big backlog of cases. The good news is they're now caught up, and they dumped those all into the system over a 2-day period. I think it was Saturday and either Monday or Tuesday. So we feel like that is the reason for the spike in the cases. I can assure you that Dr. Toomey and I and our whole teams continue to watch that data. I'll be glad to let her speak to that. But none of that is being caused by any one incident anywhere. We think it's just because those tests were all dumped at one time. Our numbers continue to look good. They look even better today. Our hospital bed capacity continues to look good. I just got a text a little while ago from Piedmont. Their COVID patient number in their hospitals is up slightly, but they were telling me it was all due to nursing home patients that they're getting, so that continues to be where our battle is. I will say, I think the good thing about where we are right now with the testing that we're doing, with the contact tracing, and literally just the teams that we have in place, you can see really what great work everyone did in Hall County, and we continue to do. I know our Insurance and Fire Safety Commissioner, General John King, is going to be doing a town hall tonight with some of the members of the Latino media. He continues to do outreach to that community, which was where we saw the spike in cases. They have really gotten on top of that. The hospital is reporting that they feel like they have reached their peak. We had the mobile unit up. Thankfully, I don't think it's had to be used yet, or sending patients to other folks, other places. If it was, it wasn't much. So we are moving to those places of concern very quickly. We're continuing to do that in some of our nursing homes and long-term care facilities. So nothing in the data that we're seeing right now alarms us. Obviously, I wouldn't have made these moves if Dr. Toomey was not comfortable with that. And I don't know, Dr. Toomey, do you have anything you'd like to add on testing or contact tracing or the numbers?
No, thank you. As I had mentioned, we are looking at hotspots and very aggressively go into those areas to ensure that we have followed up on anything that's of concern. And so that Ipsen increase clearly showed up in the data. We had some other high-risk facilities tested, particularly around the Macon area. We had some other high-risk workers, infrastructure workers that were tested, and that also showed up in the data. But that represents us identifying high-risk areas and going in quickly and following up. So I felt very comfortable at that point, particularly because the data trends have been staying very, very favorable, and we'll continue to follow this. Our contact tracing has progressed very, very rapidly and successfully, and we have on board by Monday we will have 800 contact tracers, so we will beat our goal of having 1,000 before the end of next month. We'll have 1,000 by mid-month or even earlier in June. But the one plea I have for you is please encourage people to cooperate with us. Contact tracing will not be successful if people we contact don't answer the phone or refuse to be part of this process. It's only will be successful if we can get people to cooperate, to identify others that they have been exposed to, and to try to stop the spread of the virus quickly. That's the intent of this. It's not to be intrusive or to violate civil liberties. Quite the contrary. It's to protect the public and stop the virus most effectively and quickly as we can. So I think a plea to the public now is an important message to get out. Thank you so much.
Governor Camp Archit Tashagri with Next Star Media Group. The question about masks, I know that this is an ongoing, everyone is a little perhaps, should you not, who should be wearing the mask and when? Because there are some people that are like, it's optional, perhaps not. Can you clarify that on masks specifically?
Well, we don't have a mandate for anybody to wear a mask. I think that's part of the public health guidance. I'm glad to let Dr. Toomey speak to this. You know, wearing a mask helps prevent you or me from spreading the virus if we happen to have it, especially if we're asymptomatic and we don't know it. So if you're wearing a mask, you're protecting other people. Not everybody's doing that. We're asking them to do that. I feel like I've been asking them to do that in a reasonable way by, you know, doing it when it makes common sense. And Dr. Toomey and I have talked about this. You know, if you're going out for a run and you're moving and you can stay away from folks, you know, you don't necessarily have to wear a mask, although I did see someone running the other day with a mask on, which is fine. But if you're going to the grocery store, or if you're running in to pay for your gas or getting something at a convenience store or pharmacy, you know, it's a good idea to wear a mask. You know, if you're in those stores and you see somebody that doesn't have a mask on, you know, it's a good idea to socially distance yourselves. I mean, I think the good thing is even people, it seems to me, that aren't wearing masks, most of them understand social distancing and how important this is to continue this fight that we're in. And that's really our message. I mean, look, that's one of the hard things of all of this now that we're in two battles, the battle to continue to defeat the virus, but the battle to reopen our economy, is to make sure that people know that we're still fighting both battles, not just the newest battle, and that we can't forget all these things that got us to where we are. And, you know, somebody was asking me about college football games and what I thought about that and what I thought that would look like. And, you know, nobody wants to go back to the old days of college football than I do. What it looks like, I don't know. But I do know this. It's like Dr. Fauci said the other day on our call with the governors and the vice president. If people will continue to follow the guidelines, we don't necessarily have to have a second wave. You know, we can keep mitigating where the risk is so low, it really allows us to continue to open things up even more than we have. That's what I'm asking people to do.
Thank you.
Governor, hi, Carolyn Ryan with CBS 46. You mentioned on June 1st that bars and restaurants would be able to reopen. Over the Memorial Day weekend, there were reports and some video also that's come out of some large gatherings and parties that took place in some bars and restaurants in the Edgewood area of Atlanta, large crowds in the streets. I'm wondering if you saw any of that video and what your reaction to that is, and also what consequences these establishments might face if they don't follow your guidelines.
Well, we've got some pretty strict guidelines in here, and we'll enforce them as we've been doing. Like I've mentioned this whole time, you know, I've directed Colonel Val, Lieutenant Colonel Wright, Commissioner Williams, and all the DNR Rangers and the rest of the state law enforcement team that we have out there that have been on the road helping with this, is look, we want people to comply. We want to be a government that helps people comply. We realize a lot of these things are not easy. Sometimes people may not understand them. For the most part, you know, in the high 90% of people, they have been trying to comply with the guidelines, and we've been giving them further guidance. For people that didn't realize that, we've been issuing them verbal warnings. But if we have large crowds that are out of control, we will take much stronger action than that. I have not seen that. I know I saw some of that around the country. But I also would say that in our orders, and in our orders that I signed earlier today, the local law enforcement has local control to help us on the enforcement side of things. I know that there are some mayors around the state that have been taking action over the weekend to make sure that people were in compliance. I would hope that they would all do that. We stand ready to support them, but we got to have somebody that calls us and complains about that. I don't know if that happened in that case or not, but I can assure you if they did, we would have responded to it, and we'll continue to do that, because we're not going to put up with somebody putting Georgians' health at jeopardy. What we will do is try to help people be in compliance to continue to further the spread, mitigate the risks, and get back to where we can continue to operate in this new normal that we're in.
Thank you.
Governor, I wanted to ask about the order allowing pro sports and amateur sports to start up again. You said that they will be able to start, I believe, June 1st, as long as they comply with their own organization's guidelines. You spoke briefly about you don't know what it's going to look like, but have you been working with these organizations, such as college football, such as the Falcons or Atlanta United, about what this might look like, about whether or not to allow fans back in the stands?
Yeah, we have been talking to kind of all of the above. Most recently, more of the pro sports teams that are in the process of reopening right now. Much of that's been covered with the Falcons and what, I know there's a lot of ongoing talks with Major League Baseball and negotiations with the players, and so I don't really know where all that is. What we're trying to do, working with those organizations here in Georgia, is give them the ability to start training to get ready. I mean, these are, highly skilled athletes, especially for the pro sports teams. I mean, the ownership has hundreds of millions invested in these athletes. So we're very confident that they are going to protect them. I mean, it'd be the worst thing in the world for them to have somebody that they're paying a lot of money have a bad health outcome because of coronavirus, because they weren't getting good medical advice. So I feel very confident that the organizations have the proper public health people that are helping them, the proper medical folks that are helping them. Dr. Toomey and her team, we stand ready to work with all of these folks. We've been doing that with all kind of different industries, and we'll do that. But I'm very comfortable with organizations like MLS and the NFL, Major League Baseball, with them coming up with league rules. I mean, they are not going to put their players in jeopardy. And if they want to eventually get fans back in a stadium, and we're not really addressing the games here, this is talking about operations and potential, practices with limited amounts of people. They're going to also have to have guidelines that are comfortable for the public to want to go back to those settings. And we stand ready to help them do that when the time is right, obviously with the advice and guidance of our public health officials.
Hi, Governor Kemp. As the conversation continues to grow about the possibility of protests happening over police brutality, just wanted to see if there was any concern from your office or any plans being put in place just in case that were to happen.
Yeah, no concerns from me. I spoke to that earlier today. Certainly understand the reasoning for people wanting to protest, and I'm certainly in support of them doing that as long as they're taking the proper actions to get the right permits. I know I can confirm that our folks have been talking to the organizers of the protest. They want to have a peaceful protest. We stand ready to help them do that. I want to make sure that anybody that's coming to state properties, whether it's the Capitol or public streets or anywhere else, is in a safe environment, and we'll have our law enforcement there to help maintain the safety of those folks, but also the safety of our citizens. I think a great example is down in Brunswick. There's been many protests down there, some of them very large. All of them have been great. We've been working with the organizers. Sheriff Neil Jump of Glenn County has done an amazing job. He's kind of the lead there. We have support services for him. Captain T.K. King has been on the ground for us with the Georgia State Patrol, standing ready to support and help the sheriff if needed, but they have been talking to the organizers to make sure that they know they can be comfortable knowing that they're going to be able to have a peaceful protest, and we're going to help protect them to do that. But if there's outsiders that are coming in that maybe have a different idea of how they might want to protest and start turning to violence or other things, which these groups have not wanted to do, that is a situation that we will deal with very swiftly. It is our intention for everyone to be able to express their First Amendment rights in a safe way, and we're going to continue to support and do that.
Thank you, Governor Kemp. This is actually a question for Dr. Toomey.
Dr. Toomey, you mentioned in this press conference and past press conferences that you're kind of making a plea for Georgians who are being contacted through contact tracing to kind of comply and isolate. If you're having these obstacles now as the state continues to reopen and take steps, how do you, for a lack of a better word, convince people that have been come in contact to isolate?
No, and that's a wonderful question, because I see you all as part of our team that's going to help educate the public about what this is and how it's going to work. I met today virtually with the Georgia Chamber. I had met previously with the Metro Atlanta Chamber to engage the business leaders to be part of this process as well. I have their commitment to continue with us as we move forward with contact tracing, both not only to educate their employees, but also to work with us proactively on testing and education, and as leaders in their community can help also promote the importance of continuing with us. We'll be having a very active communication campaign. I mentioned that we're developing a video that isn't quite ready yet, but will be shortly, that will be airing in both in Spanish as well as English, and so we will be able to try to reach as many people as possible to educate them about this process. But to me, that the business community reached out to me, I didn't reach out to them, is evidence of the fact that I think it is recognized how important this is, and that for Georgia's economy to succeed, we have to succeed in stopping this virus, and it's going to require that full court press with all of us working together. Thank you.
Last question for you, Governor. Just with regards to the RNC, just wondering if you've heard anything further on that, and if you've gotten any positive feedback with regard to your pitch to have it held here in Georgia.
You know, I haven't really heard a whole lot about that. I know, that kind of went quiet here the last 24 hours, but I know there's been a lot of other issues that folks have been focused on, so I'm not real sure where that stands. I think, my comments were pretty clear. We'll see what happens on that. All right, thank you, everybody.
You've been watching Governor Brian Kemp update us on Georgia's fight against coronavirus. We'll have much more on Fox 5 News at 4:30, starting right now.
Fox 5 News at 4:30 starts right now.
Thank you for joining us for Fox 5 News.
I urge you all to wear blue this weekend in memory of them. Tomorrow, all localities in Virginia will have entered Phase 1. This includes Northern Virginia, Accomack County, and the city of Richmond. As a reminder, in Phase 1, non-essential retail and houses of worship may open at 50% capacity. Restaurants may have outdoor seating at 50% capacity. Gyms and fitness centers are allowed to conduct outdoor fitness classes, and salons and barbershops may operate with strict requirements for social distancing and face coverings. Again, I want to reiterate that just because a business is allowed to open doesn't mean that it must open. Also, starting tomorrow, everyone needs to wear a face covering in an indoor public space. As I have said, a face covering does not have to be elaborate. You can find plans on the internet to make your own mask out of cloth, even a bandana. And I would just like to take this opportunity. As you may imagine, I have had a lot of folks offer me masks and send them to me. I have one of them on today, and so I just wanted to publicly thank all of you for thinking of our best interests. Face coverings are a good idea because we know, and the CDC agrees, that face coverings in public reduce transmission of this virus. And it's just the right thing to do to protect the people around you as well as workers. If you shouldn't go into a public place without shoes or a shirt, you shouldn't go in without a face covering. You can see beside me and on the screen here a graphic that reminds people of the importance of wearing a face covering. We'll be sharing this with business groups so that they can print and display it if they so choose. It will be available on our website with translations into other languages. Now, I know that there are questions about how this is enforced. So I'm going to ask our counsel, Rita Davis, to come and discuss that with you. Rita, welcome.
Thank you, Governor. Rita Davis, counsel to the Governor. The enforcement mechanism in Executive Order 63, which is also amended Order of Public Health Emergency 5, is not a new process. It is a statutory process by which all orders of public health emergencies are enforced. This standard statutory process has been used in all 5 orders of public health emergency issued by the State Commissioner and in conjunction with the Governor's executive orders to date. It was not created specifically for Executive Order 63, and it is not new. Executive Order 63, however, relying on that very standard enforcement mechanism in Title 32.1 in the Health Code, provides 2 avenues by which the Department of Health or any local health department enforces the State Health Commissioner's order. The first is a civil process by which an injunction is obtained to enforce the public health order. The second is a warrant issued by a magistrate. Those are the procedures by which the Governor has repeatedly stated he expects any enforcement to take place. But even then, the Governor has stated that only gross, egregious, and repeated conduct in violation of the order should rise to the attention of the Department of Health. And although the Governor does not expect business owners to enforce Executive Order 63, he does encourage them to take the opportunity to educate a non-compliant patron regarding the importance of wearing a face covering while inside the business. What is important to remember in all of this is that it should not be the responsibility of the Virginia Department of Health to make sure you are wearing your mask. And it certainly should not be the responsibility of law enforcement or a business to make sure you are wearing a face covering. Rather, it is the personal responsibility of each and every one of us to comply with Executive Order 63. It is the right thing to do, and it's the right thing to do to protect oneself, to protect one's family, and your fellow Virginians.
Thank you, Rita, and we will be available, obviously, at the end of this if there are any further questions on this particular issue. We will all remain in Phase 1 for a minimum of another week so that we can continue to collect more health data. But our trends are encouraging. We are testing more people, and the percent of positive tests continues to trend downward. We continue to add to our testing capacity. Our testing is a combination of public testing events and tests that you can get at your doctor's office, medical clinic, or at pharmacies that are offering tests. Today, I'm really happy and excited to announce that 39 CVS pharmacies in Virginia will start offering testing using self-swab kits with an employee watching to make sure that you do it correctly. You can see on this slide where the CVS locations are in Virginia. This is just one of the partnerships we're working on to ensure that testing is widely available across Virginia. And to help Virginians understand how easy it should be to get a test, I intend to get tested soon as well. I'll have more updates on that next week. I also want to give you some updated PPE numbers as we continue to get shipments in and distribute those supplies through local health departments, regional healthcare coalitions, and localities. We sent out 200 shipments this week, including more than 30,000 N95 masks and more than 143,000 surgical masks. A shipment through our Northfield contract also landed yesterday with PPE, including more than 2 million K95 masks and nearly 5 million gloves. And now I'd like to briefly talk about our beaches. Last weekend, I visited Virginia Beach to check on how their comprehensive plan for reopening the beach worked. And from what I saw, it worked very well. Virginia Beach's plan for social distancing and sanitation is a model for other beaches to follow. So today, I'm announcing that as of tomorrow, other public beaches in Virginia may open to recreational activities as well. Social distancing will be required, and we will still maintain restrictions similar to what you saw for Virginia Beach. No large gatherings of more than 10 people, no tents, no alcohol, and no group sports. I expect everyone to follow the restrictions so that people can be safe while enjoying our beautiful beaches. Today, we are also revising our orders to allow NASCAR and other vehicle and horse racetracks to run single-day events under strict guidelines starting tomorrow. As a matter of fact, NASCAR will be running a race on June the 10th in Martinsville. These events will not be open to the public, and no spectators will be allowed, among other restrictions. Because these are open-air events with spacing between the participants, we believe there is minimal risk in allowing them to go forward with restrictions. We continue to devote our resources and energy to fighting the coronavirus. But I think it's encouraging and hopeful to also remember that we are committed to using every tool we have to help Virginia's economy recover. This week, we announced that Microsoft will invest $64 million to establish a new software development and research and development hub in Reston. This will create 1,500 new jobs, and we're glad to have all of them. And we expect to have more jobs announcements, including in rural parts of our state, in the next few days. We all know that while we have a health crisis, we also have an economic crisis. That's why it's so vitally important that we continue to create jobs and support our economy. Additionally, the foundation for a new wind turbine was just installed in federal waters off of our coast, just off of Virginia Beach. This is the first turbine foundation in U.S. federal waters and marking an important step as we continue to move toward a 100% carbon-free energy grid by 2050. In recent days, our DMVs have been slowly reopening a small number of customer service centers with appointments and other protective measures. Because there is a lot of demand for these services, I am extending the time Virginians have to renew expired licenses or ID cards. If your license or ID expires before July the 31st, you'll have until August the 31st to renew it. I'm also happy to announce that the federal government just agreed to extend Title 32 status for our Virginia National Guard. That means the federal government will continue to help pay for the work the Guard is doing to support our COVID response. They continue to do amazing, amazing work, especially with the testing that they're carrying on throughout our Commonwealth. As I've said before, if you see them at these testing sites, please, on behalf of all of us, thank them for their efforts. And finally, I want to speak to all the high school seniors, the college seniors, and the graduate students who would be participating in formal graduation ceremonies this spring. You have all worked for years toward the goal of graduating, and now that you have reached this milestone, you cannot celebrate it together with your classmates, friends, family, and teachers. And I know this must be very, very difficult. Tomorrow evening at 5 o'clock, Pam and I are thrilled to be hosting Virginia Graduates Together, a virtual statewide celebration of all of our graduates. This celebration will be carried live on Virginia Public Media, Blue Ridge PBS, WHRO, as well as streaming on Facebook Live and YouTube through these stations and WETA. I would really encourage everyone to tune in to support our graduates and we have some very special guests you won't want to miss. This is a happy time for our graduates, so please be part of that celebration. I want to congratulate every graduate in Virginia. I am proud of you, your hard work, and your accomplishments, and I look forward to you all doing great things, especially here in the Commonwealth of Virginia. Now we'll have our Deputy Commissioner of Population Health, Dr. Lori Furlano, speak to the health update, and then we'll be glad to take your questions. Dr. Furlano, welcome.
Sorry, I just got to put my glasses on here. Hi, good afternoon. On behalf of Dr. Oliver, I just wanted to provide a quick update on the numbers. Today, we have a total of 41,401 cases. That represents 1,152 new cases as of today in the last 24-hour reporting period. And we have a total number of deaths of 1,338, and that's 57 new deaths in that same reporting period as well. All the other data that Dr. Oliver typically reports out on race, ethnicity, breakdowns, et cetera, I neglected to bring that with me today, but that's available on our website for your convenience. Thanks.
Be glad to take your questions.
Governor, yesterday one of my colleagues, Karina, interviewed a number of businesses with varying responses about the mask enforcement. Some will, some won't. Are we forcing business now to choose between health versus wealth?
Henry, I enjoy your questions. The question was, are we choosing between health and wealth? And the way I would answer that, Henry, is that I've said many a times, and I hate to repeat myself, but we're obviously in the middle of a health crisis. We're also in the middle of an economic crisis. And as soon as we can get the health crisis behind us, our economy will rebound and we'll get back to hopefully where we were prior to COVID-19. But until we can get the health crisis under control and behind us, our economy is never going to recover completely. And I think the message, not only to consumers, but also to the businesses, and I'm a business owner, this recovery is consumer-driven. Consumers, and there are many Virginians that are following the guidelines and want to protect themselves and want to protect others. And so I would just encourage businesses to keep that in mind. And if consumers are on the sidewalk or wherever and don't feel comfortable going into a place of business, they're not going to go, and nobody's forcing their hand to go. So I would just encourage, you've heard me say this before, we are all in this together. And we can all hopefully choose to be part of the solution. And I don't think we have to make choices between health and wealth. They're both can be present at the same time. And I think we've done so well. I won't reiterate all that as a Commonwealth, where we are with our flattening of the curve and our hospital capacity and ventilators and our ability to test and the PPE. We're where we are today because of Virginians. And I say thank you to all of them. And we've got a long road ahead of us. And the only way we're going to get through this is to, put the politics aside, put the jabs aside, and just be part of the solution. And that's what I encourage Virginians to do.
Luann Rife with the Roanoke Times.
Hi, this is Amy Friedenberger from the Roanoke Times. The University of Virginia's weekly run of the model shows that with restrictions lifted May 15th, that cases are going to surge by thousands a day this summer, larger numbers than what we're seeing right now. And I'm wondering what your thoughts are on this model, and if cases were to spike like this, would you put business restrictions back in place statewide or regionally?
The second part of your question, if we see cases spike, if we see hot spots, again, we have better ability to test, we have better ability to do the tracing. And so if we get to the point where there are hot spots or areas that are having difficulties with numbers that are not going in the right direction, if you will, then obviously we'll make those adjustments. But you know, as far as the University of Virginia model, I would have to sit down. I haven't looked at it in the last few days, but we have put in a lot of restrictions, especially holding Northern Virginia back for 2 weeks, Richmond, Accomack County. I don't know if the amount of testing that we have available and will have available plays into their model. So there are a lot of variables, but I guess it's just a general statement. We are looking at the data. I'm looking at today what we have available. Obviously, the models are important. We have been following those, but we will just take this on a day-to-day basis. And again, as we move forward, and I think something that Virginians know, or want to know, because I'm asked often, is when are we going to go into phase 2? And the earliest that we'll do that is a week from tomorrow, which will be June the 5th.
Hi. There are many Virginians who are doing the right thing, but there are many that, for whatever reason, have different convictions about what that is. What would be your guidance to a business that is facing a customer that very much wants to come in but doesn't want to wear a mask? And can they rest assured that if, to avoid a confrontation, they just decide to let them in, that their operating license won't be removed?
Yeah, the question is what to do if someone doesn't agree with the mask policy. And you know, Mel, I would reiterate that the intent of this is to do the right thing and to take care of those around you. It's not to lock people up in jail. And I would just tell you personally, as a business owner, if someone comes into my office and doesn't have a mask, I would, in a very nice way, say, would you mind wearing a mask for the safety of all of us in this office? And as a matter of fact, that's what we've done. And people have been very cooperative. Now, what the business, Mel, would choose to do after that, certainly you could say, well, you know, I'm in a medical office, for example, and my workers are very important to me, and if you're not willing to wear a mask, and by the way, we have some right here, then we're not going to offer you service today. But I would encourage nobody, and certainly we don't want businesses to be in the practice of enforcing this. I don't want, it's an awkward position for them to be in, and certainly don't want confrontations to occur. So I think, again, I would just ask people to do the right thing and think of others, and we'll move forward like that.
Bill Atkinson with the Progress Index.
Thank you. Governor, perhaps this question can be answered in hindsight, but if Northern Virginia and Richmond had not asked for their extensions like they had, is it a possibility that, in your opinion, Virginia possibly entering phase 2 this Friday and tomorrow, actually, instead of next Friday?
The question, if I heard it correctly, if Northern Virginia and Accomack County on the Eastern Shore and the city of Richmond had not asked for a delay of 2 weeks, would we be going into phase 2 sooner? The answer to that's no. The reason why we are waiting another week is because of the incubation period of this. We want to be very careful and deliberate as we move forward, and we just don't have the data yet to move into phase 3, and we'll continue to follow that. I've had discussions with our epidemiologists as early as recently as a couple of hours ago, and so we'll continue to monitor the data, and as soon as we feel comfortable that the trends are moving in a positive direction, then we will make the announcement as to when we can go into phase 2.
Yeah, you mentioned on Tuesday that you don't want law enforcement to become involved with the enforcement of the new face covering requirement, and you also don't want businesses to be responsible for enforcing it. But I've been told by VDH that they won't be conducting inspections of businesses, and also actually just got a statement: if we receive information about an individual or individuals being non-compliant, we are going to encourage callers to bring the issue to the business owner immediately while the violation is occurring. So given that the enforcement does seem to lie, with the business owner, and law enforcement shouldn't become involved, what should a business owner do if someone refuses?
Kate, in your case, I mean, if there's a person that repetitively chooses not to wear a mask, and I think in your question you said what does the business do in that case? And rather than having the business enforce that, the business would report that to the VDH, and then it would continue from there. So.
And would law enforcement become involved at all if a confrontation occurs?
I think you're asking a couple questions. The question was, would law enforcement be involved? Let me go back to the discussion I had about being a business owner. If someone were at my place of business and I nicely asked them to wear a mask and they chose not to and it became confrontational, then I would call our security and the law could be involved, but it wouldn't be about not wearing a mask. It would be about being confrontational, and we would follow a different a line of enforcement in that. But as far as if there's a person that's repetitively not following the rules, then the business could notify the Virginia Department of Health, and then that investigation would take off in a different direction.
Mike Murillo with WTOP.
Governor, thanks for taking my question. Do you have any concerns in Northern Virginia with much of the area now laying out their plans to, in the near future, reopen? You have Prince George's County, you have D.C. You're getting a lot of areas in the D.C. region now reopening. Do you have any concerns about maybe a spike in activity because all the areas are reopening and moving to phase one?
That's a great question, and the question is, do I have concerns as we reopen Northern Virginia, Accomack County, the city of Richmond? Do we have concerns about the number spiking? And obviously we'll be following that very closely, but the reason that we've been able to allow those regions to move into to phase one now is because we have had a decrease in the percent positivity. We have had a decrease, specifically in Northern Virginia, of those hospital beds that are being used by COVID-19 patients. We have a better ability to test. We have been doing a lot more testing, as you have probably seen in Northern Virginia, and we have PPE. So, and we also have great leadership in Northern Virginia. The mayors and the council members have been following this data closely, and they, with collaboration from the health department, have requested to move into phase one. So we feel comfortable moving forward, but we will obviously be watching the numbers as we move forward.
Yeah, you said the earliest that the state could move on to phase two is next Friday. So given that the minimum was meant to be 2 weeks for areas that are just starting phase one tomorrow, Richmond, Northern Virginia, will they also have the opportunity to move potentially to phase two along with the rest of the state, or do they have to wait?
This is a great question, and you know, if they're ready, and we'll obviously, the question was if the earliest date to move into phase two for Virginia is June the 5th, which is a week from tomorrow, will the 3 regions that chose not to enter phase one until tomorrow, will they have to wait? And we'll have that discussion, but if they're comfortable, Jackie, and again, I'll speak with the leaders in those areas and obviously look at the numbers, but if they're comfortable, I would really like to see everybody in Virginia, you know, moving together at the same time. So.
Roger Watson with the Farmville Herald.
Yes, thank you, Governor. If a community has experienced significant case increase since the phase one reopening, could that county request delaying its entrance into phase two when that transition occurs?
I think if I heard the question correctly, if we all choose as a Commonwealth to move into phase two, if there are certain areas that have concerns, obviously, could they delay moving into phase two? And again, that's a discussion that their local leaders will have, and we'll discuss that at our level and make that decision. But as I've said all along, we have a floor, and nobody's going to go faster than our floor. But if an area is not comfortable for any number of reasons, we'll certainly be open to their discussions.
Governor, last week the Virginia Poverty Law Center and I think a dozen or so lawmakers asked you to put forward a temporary moratorium on evictions. Is that something you're considering? Why and why?
Well, Ned, I appreciate the question. The question was regarding evictions, and as I've said all along, these are difficult times for all of us, but especially for individuals that are threatened not to have a roof over their head. So we have several I guess, pathways in place, and I've talked about those a number of times. I could go through that again, but I don't intend to, as of today, changing anything moving forward. But I would just encourage the landlords and the tenants and all of us to know that we're in difficult times and really find ways to work through this, so that just like we talked about utilities, I mean, this is about people having a roof over their head during a pandemic, and so we all as a society need to come together to figure out how to do that.
From the other side of things, I've heard landlord groups encourage the state and local governments to use federal emergency grants to help people catch up on it. Is that something you've talked about at the state level or experience?
Yeah, and I've actually got my Secretary of Finance here, and there are means to use the relief funds, and I just, off the top of my head, I will have to get back with you on that. I'm not sure if we can use those funds for that particular reason. But you have heard me talk about flexibility, and so the more flexibility we have from the federal level as to how we can use those funds, the better we're able to do things like that. But I will try to get back with you on that. Yes, thank you for the question.
Greg Hambrick with Inside Nova.
Governor, to circle back to this situation of masks and a business owner's rights, can you speak a little bit more clearly to a business owner's right to refuse service to anyone who might not wear a mask?
Rita, do you want to answer that? Did you hear the question?
No, sir.
If a business can refuse service to someone on behalf of them not wearing a mask.
Thank you, Governor. As I understand the question, it's whether a business owner can refuse service to someone who refuses to wear a mask. Is that correct?
Yes. Just to state clearly, the governor had spoken to business owners trying to work with customers who don't want to wear a mask and encourage them to. But business owners have the right to refuse service to someone who doesn't wear a mask, correct?
Well, I think as the governor has stated, business owners have the opportunity to have a discussion with someone who is not compliant about the importance of having a mask and wearing that mask. If that patron still refuses to be persuaded by the business owner, certainly the business owner can ask that patron to maybe return at a different time when they are more convinced they should be wearing a mask. Thank you.
Governor, I think the last 2 days, the daily deaths have been at their highest point. Is that a concern? And I assume it's too soon to attribute that to any reopenings, given the...
Yeah, the question, Laura, I appreciate that, is that the last couple of days we have seen a large number of deaths, and certainly every death is one too many. Laura, I maybe could talk about when they come in, and yeah, thanks for that.
Hi, the question was about the death data, and death data is a lagging indicator, so it does take time, mostly because of we have to wait for death certificates to come in to validate that information, so it does typically lag behind. So you're right that not only would it be, even if it were real time, it would be a little too soon to attribute it to a phase 1 reopening, but even further so because of the lag.
David McGee with the Bristol Herald Courier.
Yes, thank you, Governor. I wanted to ask, you said that the data is trending in the right direction, but it seems like over the last few days you seem to be adding about 1,000 or more cases per day. Can you address that aspect of it?
The question is the trending of numbers, and certainly we look at the number of new cases, and a lot of that depends on how many we're testing. And so, as you've seen the last few days, we've tested in the ballpark of 10,000, some days a little bit more than 10,000, some days less. And so the more we're testing out there, the more positives we're seeing. But our percent positivity rate, I mean, if you look at today, is around 11% off the top of my head. So So those numbers, the percent positivity tend to be trending down, and that's we're looking at both of those, but certainly you all remember the curve, the yellow curve that comes down, that continues to head in that direction over a 7-day period. So again, we'll follow that very closely, but we're testing more, which is what we've been asking for. We're seeing more positives, and we'll continue to follow the percent positivity.
Governor, two-parter, one regarding back to the mask order. I believe the council talked about the right to refuse for those not wanting to wear a mask, but for the exceptions in there, such as the medical conditions, do businesses still have a right for someone who falls under the exception portion? And then the other part, I had missed this on Tuesday, but you had extended the state of emergency declaration indefinitely, as far as I can tell. Can you explain just why you did that?
So two questions came, and I appreciate it. The first is exceptions, and if you look at our guidelines, there are obviously individuals that have exceptions to wearing, or that allow them not to wear a mask, and I think that's just their word. And if someone says, for example, I'll just give you an example, asthma or COPD, chronic obstructive pulmonary disease, and they have a problem with oxygenation, and obviously wearing a cloth mask is not in their best interest. So all of those exceptions, if someone came in a place of business, again, putting myself in that position, if someone said, I've got asthma, COPD, or my child has this or that, we really don't feel comfortable. I said, sure, just maintain your social distancing, and you're welcome to be in here. So I think everybody would work with them regarding their exceptions. The other question you asked was our state of emergency, and why is that important? The state of emergency allows us to do a lot of things. It allows us to use our National Guard, as you know. It also allows, I'll give you another great example, it allows us to work with Medicaid and have telehealth compensated. And so what we didn't want to happen was just, well, on June the 10th, we've got to go from, for example, seeing patients through telehealth. Now all these patients have to come into our office, or would be required to come into our office. So it gives us a lot more flexibility, and rather than set a definite date, I just wanted to do it an undetermined date so that we would have more flexibility. And those are just two examples, but there are a lot of other things that it allows us to do as well.
Tracy Agnew with the Suffolk News Herald.
Hello, thank you. My question is, has Accomack County, do you believe that they have met the metrics for entering phase one as far as the percent positivity trending downward, hospitalizations trending downward, and the other metrics that you've been watching?
The question is about Accomack County, and we have been in contact with the leaders in Accomack County. We've also spent a lot of time, spent a lot of resources doing testing in our meat processing plants. National Guard, as you probably remember, was working with our nursing homes on the Eastern Shore. The Virginia Department of Health has been there. The CDC has been there. So a lot of efforts have been placed in Accomack County. And yes, working with their leaders, we feel comfortable. And we also, by the way, did community testing. And I remember the community testing was like 2 to 3%, so it was fairly low compared to the meat processing plant. So bottom line, we feel comfortable moving into phase one in Accomack County. Their leaders do as well, and we'll continue to follow the trends there.
Governor, can you give an example of the kind of cases that might attract the Department of Health's attention? These sort of egregious, repeated. Is this someone like traveling between businesses? I'm just trying to imagine like what the scenario would be in that situation. And then just a sort of broader question. I mean, it seems like mask wearing has become sort of politicized. Are you concerned at all that this order would just inspire a backlash rather than compliance?
Well, let me answer the second part of your question first. It's about masks being politicized. And I made the point earlier, Ben, that we need to get the politics out of this. This is about a health crisis. This is about taking care, making sure other people are safe. And it's about getting the health crisis behind us so we can move forward with our economic recovery. And so, again, I can't lead everybody to the water, but I'm going to lead as many people as I can. The second part, or actually the first part of your question, is what type of case would we find where VDH, through the health code needs to be notified. I could give you all kinds of scenarios, and I think it's very difficult to draw the line anywhere in particular. But I would just encourage everybody to, as best they can, to follow our guidelines. I just wanted to, in closing, again, remember the over 1,000 people that have lost their lives in Virginia. Remember the families and loved ones of our fallen victims in the Virginia Beach tragedy a year ago. And as we move forward, there's still a lot of questions, a lot of issues that people have, and two that I'm going to address on Tuesday that I've heard a lot of questions about. One is youth sports, and we're in the summer months, and we really want to encourage our families and our children to get out there and be active and get some fresh air, but want to make sure they do it safely. And so we'll have some guidelines to provide Virginia on Tuesday regarding that. The other question that I hear, and Pam and I have two children, they're grown now, but if I had children at home, I would be asking this question is, when are our children going to be safely able to get back into our schools? And I just wanted to let you know that there are a lot of people, we're having a lot of great discussions led by our Secretary of Education, Adif Carney, our Superintendent of Public Instruction, James Lane. We had a meeting this morning regarding that. And so we'll have some more announcements on Tuesday. But we're going to do everything that we can to make sure that your children can get back into the classrooms and that they can get back there safely and responsibly. And I just wanted to let you know a lot of discussion, a lot of effort is going into that decision, and I'll have more to say about that on Tuesday. So in the meantime, I appreciate you all viewing today and hope all of you have a good weekend, and we'll look forward to being with you on Tuesday. Thank you very much.
This morning, the county executive will be bringing remarks to let us know what our incremental modified phase 1 will look like for Prince George's County. She will also be making announcements in regards to the task force that will help our county move forward. So first you'll hear from County Executive Alsa Brooks, followed by our Chief Health Officer, Dr. Ernest Carter. Then we will hear from Dr. Charlene Dukes, President of Prince George's Community College, followed by Bill Von Haney, who is a Senior Vice President and Chief Strategy Officer for Exelon.
Good morning, everyone. I first want to thank you all for being here this morning. And before I begin anything, we are here this morning. Dr. Carter is with us. We're going to hear from him just in a moment. But I do want to extend to him a very personal, to offer our condolences to him. He lost his beautiful mother this past week, and in spite of his own loss, he has continued to push for us. So we continue to be amazed by his leadership. I want to thank him, thank his entire team at the Health Department for the just magnificent leadership they have shown in commitment to all of us, as well as all of our employees throughout the government who have just been phenomenal. And so I want to thank them for continuing to work so hard for all Prince Georgians. This morning, I am especially delighted as well to have Dr. Charlene Dukes, who is president of our community college, Prince George's County Community College, and who is also, we are also joined by Mr. William Von Haney, who is the Senior Executive Vice President and Chief Strategy Officer for Exelon Corporation. They are with us, and you will hear from them a little later this morning regarding their leadership over the task force that we have stood up, and I want to thank them for being here. We're just so excited for them to lead this for us. Today we have 14,627 cases, as well as 478 deaths as a result of COVID-19 in Prince George's County. And as I have said over and over again, what that represents for us is almost the unthinkable, that we have had 14,000 plus of our residents who have become ill and who have suffered, as well as nearly 500 families who have had to grieve the loss of a loved one as a result of COVID-19. And so you've heard me say many times, and we continue to say how personal this is for us, and we continue to offer our thoughts and prayers to those who are grieving losses, and to say that we're all in this together. The last few months have been simply unbelievable. The hardships have been so great. The pandemic in so many ways really does hide the hardship, but they are there, one after the other. Many have felt isolated. This has just been a really tough time. And so what it reminds us of is that we are so grateful for the discipline and sacrifices of Prince Georgians who have had to make those sacrifices so that we could save the lives of those that we love and care about. And I am just so grateful for the actions that Prince Georgians have taken to make sure that they have adhered to the advice that we've received from the medical community, telling us to social distance, asking us to cover our faces when we go into public spaces, asking us to stay home when we wanted to come out. So this has been a tough time, but I am really grateful, and I want to say that Prince Georgians have done a great job of adhering to that advice. And because of their sacrifices, I believe that we will soon be able to move out of the shade of this pandemic, and that we will continue to find ourselves in the familiar warmth and care that our county is famous for. But you know what? I want to remind us also that we must continue to be vigilant. The truth is, and I know that Dr. Carter will tell you this, is that the coronavirus will be with us for a while. COVID-19 is still very present in our community, and so we should be mindful that we have to still be careful, cautious, and vigilant. This is not yet over. We are doing everything in our power to stop the spread of this virus in our community. We're doing everything in our power to keep all of you safe. And because of your discipline and because of some of the decisions we were able to make, I believe that starting June 1st, our county is now prepared to take the first step forward. You heard me talk about the executive order that Governor Hogan established, and that he laid out his roadmap to recovery. And during that roadmap to recovery, he talked about 4 pillars: expanded testing, improved contact tracing, increased supply of personal protective equipment, and hospital surge capacity. I told you that those would be the areas that we would be working on, and sadly had to say a couple of weeks ago that we were not quite ready. I believe that we have taken really substantial steps toward being more ready now to open, to begin some incremental and very cautious opening on June 1st. And the reason that we believe that we are more ready now is because when we talked about additional testing, and the testing is so critically important for us, we wanted to make sure that we could not only test those who were symptomatic, but we also have to have the capacity to begin to test some who are asymptomatic as well. By the time we test symptomatic individuals, they may have had the opportunity to expose so many to the virus. But we'll begin now. As of June 1st, we are now opening an additional site to test in Chillum. We will continue to test individuals at our Cheverly site. We will also be opening additional sites on June 8th and June 15th. And we believe with the combination of state, local, and private testing, we will now have the capacity to test up to 9,000 individuals at a bare minimum each week. Dr. Carter and all of the healthcare professionals tell us that we need to be able to test at least 1% of our entire population per week. And we believe that now, as a result of all of the combined efforts, we are now able to test that number of 9,000 tests per week. We are also increasing our capacity for contact tracing. We currently have 50 contact tracers, but beginning next week we will train, and I've told you about this, we're doing some cross-training of our county employees. We've also secured a number of contract employees as well as volunteers who will be doing the contact tracing so that we are comfortable that by the end of next week we will have the ability to have 150 contact tracers working to contact trace. Our surge plan was also effective. We've identified resources for health workers and additional hospital capacity for our residents. We have monitored very closely the amount of med surge bedding. We've also made sure to really monitor ICU beds to make sure that we have the capacity to care for those who are sick. As I told you, Prince George's County has been hit particularly hard by this virus, which means that unfortunately when Prince Georgians become ill, they become very, very ill. And so we've had really a lot of concerns around ICU capacity. What we know now is that we now have the ability to have free about 40% of our ICU bed space. Means utilization in the ICU is now down. It was at one point, utilization was up near 80%. We are pleased to see it start coming down, although it is still very high at about 60% utilization. So we're now more comfortable that we have further ICU capacity left. With our PPE, we've been able to secure additional gowns, gloves, and masks for our immediate testing needs through the National Strategic Stockpile. I want to thank Governor Hogan and the state who did send to us 160,000 isolation gowns last week. And that includes an additional 40,000 that went directly to Doctors Hospital. We've now begun the distribution process for the remaining gowns, but we are comfortable that we have now been able to secure the amount of gowns that we need. We're working also to secure additional masks and gloves and other items that we are expecting to continue to come in to make sure that we are able to care for those who are on the front line, our healthcare workers, essential workers, and others who may be exposed to COVID-19 but for those supplies. All of the other groups, facilities, and businesses will receive PPE as it is available to us, and we need to be very transparent about the fact that all of these resources are not in an abundance. So we will follow the CDC guidelines in terms of how we distribute those items, beginning with hospitals, nursing homes. We have a whole list that we will have to adhere to as we distribute PPE. It will be, of course, according to how much we have and receive, but we will follow the CDC guidelines in terms of how we distribute those items. This is all to say that Prince George's County has the resources in place that we need to take the first step toward a phase 1 opening. I can tell you that we have not made this decision lightly. You know me, so you know that this is the case, is that we care deeply for the people who are here, and we decided very early on that we would take our advice from scientists and health professionals who would tell us when it was safe to reopen our community in a gradual and incremental way. We have followed their advice, and we told you that there were certain declines that we needed to see over a 2-week period, and I'm very pleased to tell you that Dr. Carter tells us, and he is a very cautious man, that we are starting to see some of those declines. Although our numbers and cases are still too high, we began the week of April 26th, for example, we saw 2,370 new cases. During the week of May 10th, we saw a 13.5% decrease in our total number of cases from the prior weeks, and our numbers continue to decline. The rate of death from COVID-19 is also going down, again, although it is still way too high. What we can tell you is that 3 weeks ago, over 70 residents per week were dying. The rate of death has continued to drop, and we are now seeing approximately 60 deaths per week. The loss of life from this virus has been terrible, and it is still a great concern for all of us. I am grateful that we're seeing some declines, but we must continue, again, to be vigilant because 60 is still too many. So coronavirus is still with us, and we are asking people to still be mindful that we still have coronavirus present in our community. We have also seen our bed usage decline from a high of 192 on May 9th, and last week we averaged 64 beds in use, down from 68 the week before. So we are seeing incremental declines. They are continuous, and as we've said along, as we approach reopening, we will continue to accept the advice from our medical professionals, and we will make decisions based on what they tell us. I am now comfortable that it is time to lift the stay-at-home order. Although, again, I want to be very clear that we urge all those, especially those who suffer with the underlying chronic health conditions, to be very careful. And we ask those individuals to be careful and to stay home as much as possible. But in this new incremental and modified phase 1, we will reopen retail stores with curbside pickup only. This means that you can order something online or by phone and go to the store to pick it up. and that it should be brought to you, that item, by a store employee. Manufacturing will also reopen with appropriate social distancing, use of PPE, and following CDC guidelines on cleaning high-contact surfaces, and all employees must be trained on CDC COVID-19 guidance before returning to work. Barbershops and hair salons will be allowed to open for hair services by appointment only, with one customer per 200 square feet, and use of PPE. This includes face masks, gloves for all employees, and customers must also wear masks along with appropriate floor markings to create adequate social distancing. Employees will not be permitted to have clients waiting in a sitting area in the salons. All CDC guidelines for cleaning high-use surfaces must also be adhered to. Restaurants may open with outside seating only, and there can be no more than 6 people seated at a table. Tables must be at least 6 feet apart, and no more than 50 people will be allowed at any outdoor restaurant establishment, regardless of space. Employees, again, must receive health screenings prior to their shifts, and all CDC guidelines must be adhered to. Additionally, all employees must wear face coverings, and restaurants must have sanitizer, hand sanitizer, and appropriate hand washing facilities available. There will soon be a concierge portal available, and this concierge portal will allow restaurant owners to apply for the appropriate expedited licenses, as well as to help. We know that this whole process is very different, even for our business community, and so the concierge service is intended to give that guidance, as well as to help to expedite the licensing process. Information on how that portal will operate will be available very soon. We will announce that. Houses of worship can open for gatherings of 10 people or less. Otherwise, they must maintain their online services, and will continue to give guidance as we move past phase 1 as to how we will operate there. Our farmers markets will be able to open for carry-out only, maintaining proper social distancing, mask wearing, and following CDC guidelines for cleaning high-usage surfaces. Childcare facilities will be open for essential employees and for employees who are returning to work as a part of our modified phase 1. In addition to the use of masks and gloves for all employees, and having a social, again, all of the social distancing and other guidelines do still apply. Car washes may open with automated systems, but drivers and passengers must stay inside of the vehicle at all times. And so there are some things also that we have previously mentioned that will continue to remain in place and remain open. These include, but are not limited to, our parks, which, along with the golf courses and tennis courts, will remain open. I heard so much about these golf courses. People were very, very happy about the golf courses, but the tennis courts will remain open with appropriate social distancing measures in place. We believe for phase 1, we will keep the basketball courts and playgrounds, however, will not be open at this point. Fitness facilities will remain closed as well. You must also continue to wear masks inside of all businesses, and businesses must continue to enforce social distancing. For our county government, our buildings will remain closed to the general public, and employees must continue to telework. But I do want to reiterate again to thank all of our employees, because the county government has remained open throughout this entire process and operational. This pandemic has also forced us to reassess the way that we operate government. And so what I can say is that there have been some really valuable takeaways from the COVID-19 experience about how to maximize efficiencies, and we will continue to provide the services and resources that our residents need and deserve. One that I've heard a lot about is bulky trash collections, because Prince Georgians have spring cleaned like nobody's business during COVID-19. And because of that excellent spring cleaning, they have wanted the return of the bulky trash collection service, and ours will be prepared. We're preparing to resume that on June 11. So go ahead again this weekend and continue to spring clean, and we'll begin to make those appointments to come out and pick up those items. We have added virtual services also for a number of our agencies, and we'll continue to offer virtual services so that we can protect the health and well-being of our employees. We are also, for now, we're also offering additional testing for our essential workers, and those individuals can simply call our Chevrolet testing site, and they do not need to display symptoms to get a test. So for those who are even asymptomatic beginning next week, you can contact our Chevrolet site at 301-883-6627, make an appointment, and go there to get a test. Regardless of the status of county businesses, again, we want you to know that we continue to work hard for you, and we are cautiously optimistic that as we prepare to enter phase one, that we will be able to continue to see the declines that are very important to us. Finally, I want to talk to you about our Prince George's Forward Task Force. We want to make sure that Prince George's County opens with the best support possible. We're looking forward. And again, what we believe about the coronavirus is that we lost a lot, and we believe that there's a lot also to gain. And so we're moving forward with a look toward improving as we go into the future, that when we stand up after the coronavirus, we believe that we're going to move forward in a way that is stronger than ever before. And so over the last few weeks, we have worked to create a task force that is capable of responding to the unique challenges that COVID-19 presents for our community as we reopen. And this task force, I have to tell you, is like no other. This is a dynamic group that can respond to challenges actually in real time and provide high-quality recommendations based on cutting-edge data. Moreover, this task force will help us to mend, heal, and protect our community should COVID-19 strike again. And so I'm proud to announce the Prince George's Forward Task Force. We have assembled a group of experts in public health, business, and government to create a nexus. The task force will combine new data with expertise to provide well-reasoned recommendations on how our county should deal with this pandemic forward. The Prince George's Forward Task Force will generate a final report. However, we will implement the recommendations of the task force in real time. This way, we believe that we will be able to maximize the benefit to our residents. The task force will work on several broad recovery categories, including health recovery, education recovery, human and social services recovery, economic recovery, and government operations. We will work to recover from COVID-19 and to reimagine how our county approaches each of these areas. In the end, the goal is not to get back to where we were. The goal is to go faster and farther for our residents than we ever have before. And so thanks to the work of our directors, our chairs, and our internal teams, we already have a clear set of issues for the task force to consider. In many cases, we've gone a step further to create specific goals. For example, our business recovery strategy will include work to improve and ensure that small businesses have access to credit and financing. This is a huge issue for many of our businesses, and that is one of the areas we will work on. And so we realize, again, that that we have a lot of work to do, but I am so grateful for our task force co-chairs who are here today, Dr. Charlene Dukes and Mr. William Von Haney. You'll hear from them in a moment. In addition to our co-chairs, we've put together a group of experts for this committee. The chairs of our subcommittees include Thomas Graham, the founder of T.H. Graham and Associates, who will chair the Economic Development Subcommittee. Dr. Darrell Pines, who is president of the University of Maryland at College Park, will chair the Education Subcommittee. Dr. Joseph Wright, the interim president and CEO of the University of Maryland Capital Region Health, will chair the Health Subcommittee. Rosie Allen Herring, president and CEO of United Way of the National Capital Area, will chair the Human Services Subcommittee. And former Maryland Governor Martin O'Malley will serve as chair of our Government Operations Subcommittee. The task force will also work with several outside organizations on our county's recovery, to include the Maryland Transportation Institute as a part of the University of Maryland. We've chosen to partner with these organizations because they each bring a unique set of skills and information to the table. The Maryland Transportation Institute is a premier university think tank that offers access to an exciting transportation data platform that we know will be very helpful to us. With their partnership, the task force will have access to cutting-edge data that shows locations across Prince George's County that are at or near safe capacity. This location information will help us identify where we need to go to prevent new COVID clusters. In addition, MTI will provide us with daily statistics about the trends in mobility, social distancing, and other useful health variables. MTI will also provide the task force with valuable data visualizations of trips throughout the county, along with helpful statistics on visit trends to different categories of businesses. We'll be able to identify hotspots that are prone to new outbreaks, and we'll also identify patterns of interest so that we can respond to them in real time. The Prince George's Forward Task Force represents our best effort. We've assembled the right team, the right information, and the right advice to get our county back on track. And so I'm so proud of the task force. I want to thank them in advance for the work that they will do. Our county is moving forward into a new chapter, and the shape of this virus is well known, but so as well is the resilience of our county, and we are just excited in many ways to see where we go beyond COVID-19. We know that we are almost there. But to reopen safely, it just requires that we all continue to use good common sense, the common sense that will allow us to not only protect our own families, but that help us in our affirmative obligation that we have, not only to care for ourselves and our families, but to care how our neighbors fare and how our colleagues and others fare as well. And I believe that if we continue to adhere to the advice of the medical professionals, we're going to be able to take this next step and on and on and on. So again, I want to thank you all so much for what you've done as Prince Georgians, to your discipline and your sacrifices. Together, we're going to make it to the other side of the coronavirus, and I'm just really grateful for everyone who has helped us to get there. So right now, I would like to welcome Dr. Charlene Dukes to the podium for her remarks. I'm sorry, I didn't. Okay, actually, we'd like to hear from Dr. Carter. I wondered, I didn't see his name here, but Dr. Carter, would you come up, please, and offer your remarks?
Thank you, Madam County Executive. Good morning. Prince George's County has come a long way in the last 2 to 3 weeks. We've flattened and now reducing the curve, and we're happy about that, but I'm cautious. New coronavirus cases are going down. 3 weeks ago, we had a peak of 2,370 cases. Since then, it's declined to around 2,000 cases a week. And that's good news. Sadly, dozens of our fellow Prince Georgians have died from COVID each week. And as we continue to mourn their deaths, we can tell you we've seen an overall pattern of decline in deaths for 3 weeks. The county reached a peak of 74 deaths in the 3rd week in April. Since then, we've seen a 16% decline. While we're still gathering reports from last week, we believe we will see a further reduction. We've seen a steady decrease in the number of COVID hospitalizations in the county. The average number of patients hospitalized due to COVID is now 181. That is a 26% reduction. We've exceeded our goal of having at least 30% of our hospital beds available for care. This is an important marker. It lets us know that we will continue to have the capacity to appropriately care for anyone with any condition in our hospitals for the foreseeable future. The health department and our hospitals have worked very hard to scale up bed capacity along with the state in the last 2 months. We now have 40% of our ICU beds available and over 55% of our general medical surgical beds available. However, we are keeping an eye on this. We meet every week, multiple times a week, and we're staying in close contact with our hospital systems because it's so important. Bed capacity continues to expand as they bring newly built spaces into operations. Now, testing. Testing is seeing a rapid improvement. More than 80,000 county residents were tested last week. We're still receiving testing data and hope that to receive them soon. With the opening of additional health department testing sites, we know we'll have the capacity to hit our testing goal as one of the metrics we are addressing for moving forward and loosening the restrictions in the county. Something else we took a very close look at is the positivity rate. 3 weeks ago, our positivity rate was more than 40%. It's now 20%. The shrinking positivity rate shows our testing capacity is casting a wider net. That gives us better information about how much of the virus is spreading in our county so we can make informed decisions about reopening and moving forward. And we keep a careful eye on this. The more residents we test, the better chance we have to contain the virus. That's where contact tracing comes in. We've trained dozens of county employees, contractors, and volunteers to be tracers. We have approximately 150 people doing the important work as of next week, and they're being trained, and they're coming online. Here's how tracing works. The health department is notified if a person tests positive for COVID. We call that person and ask where they have been recently. We make sure that we understand who they've come in contact with. We then notify those other contacts and tell them to self-quarantine for at least 2 weeks. That's to make sure it doesn't spread to others. That is why we're having appropriate numbers of contact traces. Having the appropriate numbers of contact traces is so important. The state has also stepped up, and they are supplying contact traces for us, and a significant number. We do not disclose contacts who may have been exposed to a person who's positive for COVID-19 without the permission from that person. I want to be sure that everyone understands that contact tracers will not ask you for your social security number, payment information, or your immigration status. That's very important. This takes teamwork. If you get a call from us, take it seriously and take the right actions to keep everyone safe. Our supply of personal protection equipment is growing steadily, as the county executive has pointed out. We've worked hard to secure enough support to expand our testing operations and to make sure we have enough personal protection equipment for those hospital staff and for our staff members and other people who are working on the front line. Gathering enough PPE is going to be a critical operation for us, and we continue to fight to make sure we have enough. While we're still in the fight to help our residents right now, and we are prepared for another possible hospital surge just in case. Taken all together, this means we're seeing enough progress to gradually begin to reopen Prince George's County, and I mean gradual. We're not going to go too fast, and that's important to know. I am so grateful for our brave hospital and healthcare workers. I am so proud of the Prince Georgians who have made this very difficult life adjustment. But they've done it. You have done it, and you've done a great job. But the work's not over. We've got to stay strong in this fight. We don't want to backtrack, and we don't want to be forced to close up shop again. We must continue to stay 6 feet from each other in public. You still have to wear your face covering at the store and on public transportation. Keep a mask with you. Please continue to clean your hands often and stay at home as much as possible. We don't need an order to tell you this. You should know you need to stay at home as much as possible. Do not get complacent. Stay disciplined and stay safe. Thank you.
I want to thank you, County Executive Also Brooks, for your steadfast leadership and commitment to Prince George's County. Dr. Carter, for your attention to the health needs of our community. The Prince George's Forward Task Force is the most critical undertaking of this administration, and I am honored to co-chair the task force that will assist our county executive in navigating the uncharted waters in which we find ourselves with COVID-19, a pandemic that is impacting each one of our families, our neighbors, and our friends in ways that we could never have imagined in the 21st century. A pandemic that is highlighting the systemic nature of our very existence, one that is ravaging communities of color and those who are low income. It illuminates the times in which we find ourselves. Each of the task force members, Co-Chair Von Haney and I, have a responsibility to be thoughtful, strategic, collaborative, and forward-thinking as we work with county government, listen to national, regional, and local experts, respond to community concerns, and be data-driven. We will offer insights, perspectives, and recommendations that speak to all of Prince George's County, north to south and east to west. We'll focus locally as we also think regionally. Because of your leadership, Madam County Executive, the membership is comprised of a broad array of individuals who represent a variety of sectors and understand collective thought, collective action, and collective impact. We'll begin our work, as you've noted, in a structure designed to focus on recovery in 5 key areas, each with a subcommittee chair. The Health Subcommittee, as has already been mentioned, will be chaired by Dr. Joseph Wright, Interim President, CEO of the University of Maryland Capital Region Health. The Education Subcommittee will be chaired by Dr. Darrell Pines, the incoming President of the University of Maryland College Park. Human and Social Services Subcommittee will be chaired by Ms. Rosie Allen Herring, the President and CEO of the United Way of the National Capital Area. Tom Graham of T.H. Graham and Associates will chair the Economic Recovery Subcommittee, and the Honorable Martin O'Malley, former governor of the state of Maryland, will chair the Government Operations Subcommittee. And each of them will be joined by an outstanding array of Prince Georgians and Marylanders who are committed to ensuring a thriving Prince George's County as we all look forward to a different normal. Make no mistake, we have heard the county executive loud and clear. This is a task force that must and will provide recommendations across a broad spectrum of public policy areas. We know our charge: to speed our recovery and to protect our community. Recommendations will be undergirded by one fact and all of its complexities. Post-COVID-19 will be different from pre-COVID-19. It is a somber time, it's a time that none of us would have predicted. We look forward to doing our part to change the trajectory of our community through the work of these 5 subcommittees as we race to discover new solutions and new opportunities. Thank you, County Executive Also Brooks, for your trust in us. And now, please welcome Mr. William Von Haney, co-chair of the Prince George's Forward Task Force.
Good morning. Thank you, Charlene, and thank you, County Executive Also Brooks, for including me on this important task force. I am Senior Executive Vice President and Chief Strategy Officer of Exelon Corporation, and I am honored to be here today and honored to join you in the task ahead. County Executive Also Brooks, Dr. Carter, you, the entire county leadership, and your staffs have done a remarkable job over the past few months responding to this unprecedented crisis. Thank you so much for what you have done. I'd also like to recognize and thank our county's healthcare workers, first responders, and other providers of essential services for your commitment to one another and to this community. 2 of our families of companies, Pepco and BGE, are proudly providing a vital service to Prince George's County: energy that powers the life-sustaining work, keeps essential lights on in hospitals, grocery stores, and other essential institutions. We are committed to our customers in Prince George's County, and we are proud to be a major employer in the region. I've spent much of my career dealing with the complicated problems of modern businesses face, at the same time, I've had the opportunity to help guide non-for-profits, large and small. I've also dedicated a large portion of my work over my career to issues of diversity and inclusion, work that has helped strengthen small minority and women-owned businesses. I also chair the crisis management team for Exelon, which is addressing the challenges our company faces during this pandemic. I am hopeful that I will be able to bring to this task force some of the learnings that we have had at Exelon in dealing with these issues to provide safety for our employees, to provide safety for our customers, and to ensure that vital services are not only protected but enhanced as needed. As has been said by several of the speakers today, this task force is unique. It is one that must provide feedback and recommendations quickly across a broad spectrum of policy areas. We need to ensure that we rise to the county executive's challenge. We must recover from this pandemic, and we must be ready if the illness returns. This task force is also very well equipped for the challenges ahead. County Executive Alsobrook has assembled a truly exceptional group, starting with Dr. Dukes. To have a deliberative body composed of our brightest leaders is a feat in and of itself. Thank you for doing that. It will be a pleasure to work with this group. To combine that leadership with the very cutting-edge data resources that the county executive alluded to will make this very powerful indeed. Strong leaders make strong decisions with good information. Today, we are starting an important process in our recovery. The Prince George's Forward Task Force mission is broad but very clear. We must help Prince George's County recover from this pandemic and strive to move the county well beyond where we were before this all began. I know that we can accomplish that goal. I commit as co-chair to ensure that we do everything possible to use our time and resources effectively, quickly, and successfully. In addition, I commit to using my expertise in business and not-for-profit work to help speed up our economic recovery more generally. By working together to get the right information, we can maximize the economic relief of major projects and programs at every level. We can create new career opportunities for Prince George's County residents. We can reignite and create new businesses. We can bring tourists here to visit. We can sustain real estate projects that are in the pipeline, as well as create new ones, and implement a mass transit program that connects residents with businesses and employees with their workplace. I know that through hard work, the identification and implementation of strategic and data-driven solutions, our task force will develop innovative, successful solutions for the problems that we face. The sooner we begin, the sooner we can make an impact in Prince George's County. Thank you again, County Executive Alsobrook. It is a real honor for me and for Exelon to help in this very important task ahead.
Okay, and just briefly, before we take questions, I do want to mention that we have made an update to our county's dashboard earlier this week that also provides daily updates and weekly totals, so it's drilled down a little bit more specifically. Now, to that end, anybody have any questions?
You know, well, I appreciate the concern of our residents. They are very wise, and they have also been, they've taken this seriously. That's what we've urged them to do, and we encourage people to continue to do it. So if people still feel, the fact of the matter is, if they still feel that this is a dangerous time, they're right about it. And so I'm glad that they understand that, and they should know that we share that concern, and that we have taken a very cautious approach, which is why we're doing a very incremental phase 1 opening. We're behind much of the state because we recognize that Prince George's County's concerns are unique to Prince George's County. And we're not taking any chances with the lives of our residents. And so I'm heartened to hear that our residents still do take this very seriously, and they do. They are not kidding. And you know what? And they should. But they should know that, again, as you've heard even from our co-chair, Bill Bonhaney, I love what he said when he said that good leaders really make good decisions based on good information. We'll make sure that the decisions we make are based on good information, health information, science, scientific information, and that's what they should know.
Steps a couple of weeks ago. You have the data, you have the numbers, you also have your emotions. Was it a hard
I do. I feel very comfortable that we are ready for phase one. We set out the criteria that we would use, including those metrics about hospitalizations, and you've heard that the infection rate has declined. You've heard that we have now hospital capacity to care for those should we see an increase in numbers. As we test more and more, we expect to find the numbers will increase. And so we want to make sure that as that is the case, we're able to accommodate people. And so I feel very comfortable that we are making a good decision in opening the way that we are.
And then, since we're in the patient species, next week the governor said if the trends continue, he might go ahead and go with stage 2. You gonna take it that day and make another decision, or do you feel like you're gonna have to stay, you're gonna have to be in this phase for 2-3 weeks?
So what we'll do is to continue to look at the numbers as they relate to Prince Georgians, and we'll make the decisions that are best for Prince George's County. The governor is making decisions for the state, and he recognizes and appreciates that we are very uniquely situated because of our geographic location to Washington, D.C., for example. So we are coordinating with the District of Columbia. We have coordinated with Montgomery County. We share some of those borders. And so that's the information that we'll continue to monitor. And we'll make decisions based, again, on science and medicine. And we'll also confer with our neighbors and make decisions that are best for us.
One more question from Ms. Tracy Wilkins, who asks, unemployment claims, been a struggle statewide. Do you have any information about the impact that difficulty in filing claims has had on Prince George's, and has there been any discussion with the governor about that particular subject?
And so this is a struggle that we share statewide. We have unfortunately had over 80,000 Prince Georgians who have had a need to file for unemployment, and they are experiencing the same stresses and strains as the rest of the state. This new system was difficult to navigate because of the volume, and so we are working as best we can to assist all of those who are experiencing such time of uncertainty and fear. And devastation, but we're no different than the rest of the state as it relates to trying to access that system. I know the state is working to try to improve it, and but it's just a difficult time, and we're experiencing the same challenges in terms of accessing that unemployment. I've been hearing a lot of concerns about it, and so we're just hopeful that it will be repaired and can help people more quickly because they need it. Donna, can you come up for a moment? We have an expert, and none better, so we want to have her to address this question. Thank you.
Thank you. So there's no, I'm sorry. Sure, Donna Perkins, and I'm the epidemiologist with the health department here in Prince George's County. This is such an unprecedented situation where there are massive amounts of data coming in about cases, about possible cases, possible related deaths, and really what we're all doing is the best we can to coordinate that information. The state has reports that come to them. We actually have reports that come directly to the county. So what my team does is we work very diligently to reconcile those reports, and we have a constant feedback loop happening with the state. So they update their list, we update our list. And so when you see slight differences in the numbers, it's simply just the nature of what we're dealing with. Where we're dealing with such large numbers of reports, we want to make sure we're giving just the best information possible, the most accurate information about the health and wellness of our residents. So we're simply in that constant process of making sure that that data is being updated as quickly as possible, and have worked very closely with our state partners to ensure that that happens.
Well, this is important work. I mean, and just to say, my mom basically had 3 tenets for me. One of them was to make sure that I helped other people. That was our first tenet. The other tenet was not to start something that you're not going to finish. So those things that's why I'm standing here right now, because she passed that to me. And so this work is exquisitely important, I mean, in terms of what we're doing. You just met Donna Perkins, who basically spends 15 hours a day, if not more, making sure that our data is correct. Because we don't want to come to the stage and say something we're not really sure about. Like, for instance, the positivity test rate. We've been monitoring the positivity test rate since we started this entire project, because we know that it's an important variable to know about in terms of how well we're doing with testing. Now, my mother would have wanted me to come here and tell everybody that we're monitoring that rate. You understand what I mean? So that's and the other last thing I told you was 3 things. The other thing is that keep your mind open for learning. And that was the 3 things my mother had as her pillars. So what I'm saying is that that's what we all have to do in Prince George's County. We have to keep our mind open for learning. So when we say something like positive test rate, look it up. Make sure we're saying the right thing to you. When we say you need to social distance, we didn't come up with that out of the clear blue sky. This is something that's important to do to stop the spread. So you have to keep your mind open for learning. You have to continue to do what you do, and you can't stop. And you got to help other people. So when you wear a mask, you're helping the other person. And that means the other person should be wearing a mask helping you. So all of the things we are saying, washing your hands, wear the mask, social distance, when we start talking about reopening, we're going to be having strict guidelines about what businesses should do. And if we say, okay, you can't open X, that's because we feel that at this time it's not ready. Based on the science, based on how we do work, that's what my mother taught me. So that's what it is.
All right, guys, do want to say thank you so much for being here with us on News Now. We appreciate each and every single one of you who tune in here to our stream each and every single day. Here's one last look at those numbers of COVID-19 across the U.S. And this number, 1,715,811, is a smaller number than that tested. So we have done a great job with our testing here in the U.S. We do have more than 15.1 million people who have been tested for COVID-19. I do want to just let everyone know that we will be back up and running tomorrow if you want to continue to get more COVID-19 special newscasts and interviews. We do have some different ones coming up, not only talking about blood donations with KTVU and the American Red Cross, but also what is Morning America? Well, one of our news anchors is interviewing, and we also have some interviews with some high school juniors and seniors. What are they going to do about this fall? What are those seniors going to do about going off to college? So it's all going to be coming up again on coronavirusnow.com. Hope you have a great rest of your Thursday night, and we'll see you right back here on Friday.